The doctors kept shouting that the young man had seriously injured his head and leg and was bleeding heavily. And while they were wheeling the gurney, the doctors said that they needed specialists from the neurosurgery and orthopedics departments. What scared the doctor most was that some strange changes had occurred in his head, and in addition, his left leg was seriously damaged. Our hero, lying on a stretcher, heard some incomprehensible voice announcing that the system had already rebooted 90%. And then the computer declared that the artificial intelligence of the Baruda was activated and 100% full. Hours earlier, while at Tewa University Hospital, the students were inspired and amazed by what they were about to see. The group leader asked the children to go into one of the rooms, but only warned the students not to touch anything with their hands. The man said that in front of those gathered was a diagnostic target of artificial intelligence, which was being developed by the university hospital in collaboration with a local company. This unique device is called a Baruda and looks quite impressive. The students, who were watching in amazement the device, which combined a computer and a diagnostic device, immediately began to note that this was truly something unique and unusual. Among them was our hero Lee Soo-hek. Being a freshman, he had seen little yet, but he wanted to learn as much as possible, and therefore he caught every word of the leader. Smiling, Yang Wonjong thought to himself that the boy's reaction was understandable. Since this device was not mentioned anywhere, all the information was kept secret. Baruda had the greatest potential among existing diagnostic artificial intelligences, and was therefore a very valuable development. The director of education and training kept quiet about the fact that he graduated from the fourth best medical university in Korea and came to the faculty of the therapeutic department only because of this device. And he said out loud that the pace of science is rapid, although Baruda is still far from commercialization, but if several variables are adjusted, the accuracy of the readings will be at a high level. After that, going up to the computer, he said that if I download the patient's data, his age, symptoms, time of appearance, and other things, then he fell silent for a moment. The monitor quickly started loading, and after that, the system quickly displayed possible diseases from the most probable to the least probable. Based on this, another researcher explained that the Baruda reported that the person had pneumonia caused by pneumococcus, but unfortunately, the general practitioner decided that it was tuberculosis. Despite this, it is too early to say that the device can replace a real doctor, since the device does not have 5 senses. Therefore, the possibility of error exists. Hearing that mass production of the Baruda would not begin very soon, our hero thought that he was worried about his studies, or rather, the next 100 days, and not about this device. At that moment, the leader wanted to offer the student a look at something, but his attention was drawn to something very important. Turning his head towards the Baruda, the young man asked his colleague what that strange sound was. He added that this whistle was actually coming from the device, but he did not understand how this was possible, since nothing like this had been observed before. The manager placed his palm on the metal and pulled it back sharply, as the surface was very hot. And so I once again noted out loud that something was wrong with the Baruda. One of the specialists explained that he was in charge of the software, so he thought it was best to leave the place, as he had a bad feeling about it. Yang Wonyoung quickly commanded the boys to immediately leave the lab and head outside. The students, who had thought the whole thing was a prank, now thought differently, watching everything that was happening with horror and noting that the device looked strange. Pointing at the Baruda, the young men noted that they noticed electrical discharges, thinking that this huge thing could explode at any moment. And so, at that very second, the crowd immediately rushed to the door, shouting as they went that they needed to save themselves since the device could explode. Although there were some guys who still didn't fully understand what was happening, they really wanted to figure out what had happened. Suddenly, our hero fell to the floor, and he himself didn't even notice how one of his classmates accidentally pushed him. Running out into the corridor, some young people told those who remained to get out as quickly as possible, because the device would definitely explode. Not knowing what had happened, someone ordered the group leader to close the door, which he began to do. The man watched as the remaining students continued to run, knowing that every second counted, even as a voice shouted for the door to be kept open. Lee Soo-hek explained in a frightened voice that he had fallen and then had been unable to get up for a long time because the entire group of people had rushed to the door, so he waited until everyone had finally left. The manager listened attentively to this story. Horror was frozen in his eyes, but he was not going to say anything. But the door was already locked, despite the fact that the guy who remained in the laboratory asked to be released. When Yang Wonjun asked what the manager should do if there was still someone inside, he shouted that it was too late, and if he didn't take such a measure, everyone in the building could get hurt. Our hero screamed and was indignant, calling those people who did not come to his aid all sorts of bad words. Suddenly, the young man's eyes widened in surprise. He realized that something much more terrible was happening than he could have imagined. And the very next moment, there was a roar, which alerted everyone that a powerful explosion had occurred. Lee Soo-hyuk opened his eyes with difficulty, hearing the system announcing its own reboot. Standing in a dark room, the young man did not understand what all this meant, what kind of reboot they could be talking about. But it was even more unclear to the student where he was, since the guy did not remember that there was a room in the hospital or at the university similar to the one in which he found himself. At this point, the computer said that the artificial intelligence of the Baruda was activated, but the data was not found, and therefore new data should be entered. Watching in horror as pages from various textbooks appeared on the screen, our hero heard the system announce that access to the database was complete, and that he only needed to enter the necessary data. Surprised, Lee Soo-hyuk tried to understand what was around him. He realized that these were all textbooks, but he didn't know why there were so many books. The young man began to recognize something. A book on anatomy that he had studied quite recently seemed familiar to him. There was also a manual on therapy. Looking around, the student came to the conclusion that everything that surrounded him, all this literature, was something that he had ever studied or simply read. At that moment, the computer sent a new notification that the data had been downloaded, but the volume was only 2%, which greatly upset the guy. And after that, the system said that there was not enough data, more information was needed. But now Lee Soo-hyuk was happy, realizing that the Baruda was somehow now in his head. The young man thought that this was impossible, smiling at the same time and not realizing that he was under medical devices that were monitoring his vital functions. The young doctor noticed a smile on his colleague's face, and so he called the professor, saying that it was very strange. But the specialists had no time for this. Their attention was focused on the TV screen, where they were reporting on the Baruda apparatus, as well as on the fact that the safety of the device could be improved. Hearing that the production of the device was going to be delayed, Choi Nak-pil, who was the director of neurosurgery, was angry, realizing that this was the only chance to take the first position in the world in the field of science. The doctor understood that no one had time for the patient right now, but he had to shout to the professor, which he still managed to do. And so the young specialist once again explained what he had seen a couple of minutes ago, namely that Lee Soo-hyuk, while unconscious, was laughing. Choi Nak-pil ordered an electroencephalogram out loud, but he thought to himself that it could be the result of an injury or a side effect from surgery. Seeing the director of the hospital at Taiwan University, the professor said that their patient was laughing. For some reason, he was having fun. Lee Hyun-jung didn't believe this since the boy was still under anesthesia, so he asked about it again. Then the colleagues began to discuss that it might have been worth taking a risk and removing the Baruda chip stuck in the guy's head, although the connective tissue of the brain had already wrapped around the chip, and moreover, there was no reaction from the body to the foreign body. Looking down at his leg, the director said that the young man would now limp because his leg was badly damaged. His colleague noted that it was sad, but even harder to tell his family about it. Hearing from Lee Hyun-jung that the young man was an orphan, the professor was delighted, although he immediately began to justify himself, explaining that he was not really happy. The enraged director immediately began yelling at his colleague, explaining that this student had suffered in their hospital through their fault. Moreover, how could a doctor call himself one if he said such terrible things? Turning the conversation to the topic of paying for treatment, Lee Hyun-jung immediately said that there was no need to worry about it. He would make a couple of calls and the money would be collected. Only a few minutes passed, and the young doctor, looking at the machine, reported that Lee Soo-hyuk was conscious. Choi Nak-pil, who had come running, immediately began to inquire whether the necessary drugs had been administered, and learned that they had. The attending doctor suggested that it would not be bad at all to wake up a couple of hours after the operation. Although this confused the professor, since he understood that after a head operation, it would take at least 6 hours to begin to come to his senses. Colleagues understood that if the patient woke up, it was necessary to remove the tubes, although it was scary to do this, since in this case there would be no way back. After a short period of time, the doctor said that he had stopped administering the medicine, and the guy responded to this with positive dynamics. Moreover, it was encouraging that the patient was breathing independently and all the indicators were normal. The professor wanted to understand what state the boy was in, and so he began asking him very simple questions. A minute later, the man once again addressed our hero by name, hoping that he would finally come to his senses. Lee Soo-hyuk clutched his head and screamed as the notifications for more information were turned up to the maximum volume, driving him crazy. For a moment, it seemed to the young man that everything had become quiet, which on the one hand made him happy, but on the other hand, it was confusing, since our hero did not understand what awaited him next. Suddenly, a board appeared in front of Lee Soo-hyuk, but the writing on it was blurry. The young man realized that he had told the system that it was too loud, and at that moment the computer began to provide information in written form, which was much more convenient. A minute later, the computer asked if it was true that the eyes were the organ of visual input, confirmed it, and the guy heard the system announce that from now on, the eye had become an updated organ for collecting information. This was surprising as Baruta began to talk to Lee Soo-hyuk, informing him that she was starting to create a database for each intelligence-gathering agency. After thinking for a moment, our hero asked if they had to conduct the dialogue in this way, explaining that the letters were a little blurry. At that very moment, everything around began to change, which caused real delight in the young man, since he did not understand how this was possible. The student realized that something phenomenal was happening, but it didn't frighten him at all, quite the opposite. Although something suddenly alerted Lee Soo-hyuk, and so he looked carefully in front of him. As Lee Hyun-jung walked down the hallway, he spoke out loud about how the press was harassing him, and they all wanted to find out who was to blame for the incident and how it happened that the young man was hurt. It would seem that there is nothing particularly scary with the patient. He has been breathing on his own for several days, but he has not yet started talking. Has this person's brain really failed? Suddenly, a rather familiar voice brought the director out of his thoughts. When asked where Dr. Shin Hyun-tae was, he said that he was returning from our hero's room. The young specialist explained that today this guy's condition is much better. Moreover, he woke up. Upon hearing this wonderful news, the director immediately asked if Lee Soo-hyuk could be sent to the press so that the student could explain everything to them himself, since the pressure on the doctors was getting stronger every day. After rubbing his head, the attending doctor said that at first glance everything seemed fine, but there was one minor nuance. The young man was not in any pain, but when the therapist asked what the young man needed, he made a rather strange request. Lee Soo-hyuk asked for a textbook and paper to be brought to him immediately, as the young man really wanted to study. It was hard to believe, so the director said it would be best to check the patient's mental state. Rubbing his ear, our hero declared out loud that someone was talking about him. There could be no doubt about it. But suddenly the system reported that there is nothing in common between the itching in the ear and someone gossiping behind your back. The cause of the itching is the accumulation of earwax. After this, the computer hologram began to say something else, but our hero was not interested in it, and so he asked his assistant to shut up. The guy asked why the program started to look so strange, because it was possible to just write messages as before, but now this little man is bringing out the young man. But the system started talking about visual effects again, after which the young man put his hand on his head, saying that all this could just drive you crazy. An hour earlier, while Lee Soo-hyuk was still sleeping, someone persistently called his name. The young man wanted to open his eyes, but something did not let him, and so he continued to sleep. Rubbing his neck, the therapist said that this situation was driving him crazy because the patient was breathing on his own, which was a good sign, but was not waking up. And then he added that it would have been much easier if he had been in the poor guy's place. Suddenly, Lee Soo-hyuk opened his eyes and began to ask if it was true that the department head was in front of him. Seeing the guy getting up, the doctor asked him to lie down and not make any sudden movements. Although our hero insisted that he somehow felt uneasy being in the role of a patient, the young man wanted to say something else, but at that moment his eyes widened as much as possible. The young man looked at his legs, or rather, his attention was drawn to the one that was half bandaged. After thinking for a moment, Lee Soo-hyuk remembered how he had heard about what had happened while he was sleeping, but at the time it had all seemed so distant and unreal. The assistant immediately began to explain what type of injury it was and how it could lead to limited movement, although the student knew this very well. Once again, the assistant was surprised, stating that according to his data, the probability of ignorance was over 90%. Realizing that the program was once again interfering where it didn't belong, The guy shouted at her to stop annoying him, but the doctor took it all personally. Realizing that the young man was not alone in the room, he immediately began to apologize and ask for forgiveness for his indecent behavior. Lee Soo-hak immediately began to explain that he was a little angry because his leg was bothering him and immediately noted that he could pull out the urine collection tube himself. He just needed a syringe. Holding the phone, the guy thought that it was unbearable, before he had only pulled it out from patience. But who would have thought that he would have to do it himself, although he was more irritated by the assistant in the form of a boy. Whenever someone was around, he would constantly whisper something in my ear, which would simply drive me crazy, making me get more and more irritated. Although it was the best artificial intelligence created by the best Korean scientists, it was also very boring. A few days later, the young man felt even better, which made him very happy, and he was also a little inspired by the news that he didn't have to rush back to work. Entering Lee Soo-hak's room, his doctor Shin Hyung-tae asked if he needed anything, adding that he could get whatever was needed. The guy happily immediately remembered about the laptop. Although the Baruda shouted that these should be textbooks, his voice was so loud that the young man could not even concentrate. And so, forgetting about the professor who was standing nearby, our hero immediately turned to his assistant and began to reproach him for thinking only about books. A frightened Shin Hyung-tae began to ask what was wrong with the patient, but he, registering, began to make excuses, noting that nothing terrible had happened. Taking a deep breath, the young man wanted to say once again what he needed, but the Baruda did not stop talking, saying over and over again that they could not do without textbooks. Realizing that it was useless to argue, Lee Soo-hak still asked for the textbooks to be brought to him, and then continued and stated that he still needed scientific publications. The attending physician did not understand why the resident needed such literature, but he explained that he was an ignoramus who could do with learning a little. Left in the ward completely alone, the young man talked about what kind of education there could be. He barely survived. Baruda did not understand why our hero did not want or did not like to study, but he said that this was not the issue at all. He simply could not understand why he needed to immediately study something new. But the little helper said that the purpose of the Baruda's existence is to become the best artificial intelligence in making diagnoses, and for this, data input is required. And so he asked whether it would be difficult for a young man to become one. Since there is nothing special about it, there is no need to remember anything. And he added that he would edit and add everything in such a way as to help Dr. Lee Soo-hak become the best specialist in the world, which discouraged the guy a little. Baruda thought that our hero was refusing this title, but he said that this was not entirely true. There were simply other areas in which he wanted to advance, for example, his personal life. Then the assistant said that with the help of information about the young man, he would show what kind of doctor he wanted to become. Suddenly, a scene from Lee Soo-hak's life appeared on the screen. Several years ago, our hero said that the profession of a doctor is not what it once was, but it still has meaning, and therefore it is necessary to become a doctor and then quit and enjoy life. Covering his eye with his hand, the young man said that everyone does this for money, but he does not intend to be trash. He was just drunk at the time and did not realize what he was saying. Baruda immediately declared that from now on the guy's nickname would be Trash, although he immediately became indignant, noting that this could not be done. And then the assistant asked again about what kind of doctor Lee Soo-hak wanted to become. Perhaps the best trash in the world. Our hero thought he was silent and stared at one point, because he did not know what was best to say in such a situation. Gritting his teeth, the young man desperately understood that he had no other choice anyway. And so he shouted with all his might that he understood everything perfectly well, and there was no need to repeat the same thing. And having calmed down, he said whether it is possible to make it a goal to simply become the best doctor in the world. 5 days later, specialists noted that our hero had been transferred to a regular ward. There were no neurological abnormalities. The guy had recovered quickly. The main thing now was that everything would continue to go well. As he left the ward, Shin Hyung-tae told his patient to rest so that he could be discharged sooner. At that moment, someone addressed the manager, and so the young man turned around and decided to come closer. Professor Lee Hyun-jong asked whether the patient had said anything about monetary compensation, and without waiting for an answer, explained that he himself had donated 30 million won for the young man. Covering his head with his hands, the attending physician said in despair that it would be better if their resident talked about money. And a moment later, he added that Lee Soo-hek had asked him to become the attending physician for one of the hospital patients. This seemed unbelievable to his colleagues. They could not believe that the resident was refusing a 3-month sick leave and dreaming of returning to work as soon as possible. Moreover, the head of the department was frightened by the fact that our hero was behaving very strangely. He would stare into space, then frown and grumble. The guy has read so many textbooks and scientific papers that there is no room to put them in the ward. Moreover, the young man reads all the medical histories in a row. Taking his colleague by the shoulders, the man told Shin Heng-tai that he needed to hold on and keep his cool. And then he added that this guy's the headmaster's student, so it is the headmaster's responsibility to keep an eye on him and help him in everything. The professor was inclined to allow the resident to do whatever he wanted at first, but under strict supervision. Sitting on the bed, Lee Soo-hyuk heard the assistant say that his body was fine, although the guy said that he was just sad. The young man complained that he could have rested for 3 months and done his own thing, but now, under the pressure of the Baruda, he would have to treat patients all this time because he lacked knowledge. The computer assistant tried in every way to cheer up our hero, but he seemed to have no time for it. Lee Soo-hyuk explained that feelings are a special thing and cannot always be controlled by desire alone. Baruda thought that our hero was going home, since he was wearing a suit and only had to put on his outerwear, but he began to put on a medical gown. Taking up his cane, the resident stated that patient rounds usually began around 5 o'clock in the evening. Looking at his watch, the young man decided that he needed to prepare a little in order to show a different side of himself. And heading towards the door, he proudly noted that he had said earlier that he would study medicine, which meant he had to work properly. The assistant wanted to joke about this, but the guy immediately snorted at him with displeasure. Standing in the corridor, the head of the department thought that the rounds were about to begin, but he expected that nothing unusual would happen, but he immediately began to doubt it. The man looked carefully towards the counter where the administrator was sitting and was surprised. Calling out to Lee Soo-hek, the professor saw how frightened the young man was looking at him. In response to a question from his mentor, the resident explained that he was analyzing patient data. Shin Heng-tae smiled and said out loud that he understood everything, but he thought to himself that knowing the patient's medical history was good. Despite this, he was worried about the guy. Although he immediately hastened to change the subject of the conversation, adding that the others should arrive any minute. The doctor was about to say something, but at that moment, Hwang Sung-woo, who was a second-year resident and first-year Yuji-sang, approached. The head of the department noted with a satisfied voice that since everyone was assembled, it was time to begin the rounds. After this, it will be possible to distribute patients so that everyone knows their job. Baruda immediately began to giggle in our hero's ear, although he did not understand why his assistant was getting on his nerves again. However, he still did not calm down, adding that now the most interesting part would begin since he would show himself in action. As the doctor walked through the hospital, he mentioned that there was a patient named Park Ki-tae in the first room, and it would be most sensible to start with him. The second-year resident immediately explained that this man had been hospitalized from the emergency department that morning with a fever. The blood test showed nothing special. The symptoms were a cough with phlegm. The head doctor immediately looked at Hwang Sung-woo and asked what diagnosis he would give. But the guy hesitated, noting that it was a fever of unknown origin. Turning to the others, Shin Heng-tae immediately asked their opinion on the matter. Seeing how the first-year student was talking about what he didn't know, our hero thought that it would be bad for him to interfere by showing his knowledge. But on the other hand, he didn't have any ideas. But a moment later, the head doctor turned to Lee Soo-hek and asked him what he thought about the diagnosis. Hearing the Baruda say that he certainly knew what it was, the resident repeated the words automatically, realizing that he had made a big mistake. But when the guy realized this, it was already too late, since the start had been made, and to go back on his words would have been extremely stupid. The other two residents looked at our hero with displeasure, as if he were an enemy. And while the young man was mumbling something, the little assistant joyfully shouted that Lee Soo-hek, unlike him, knew nothing about the computer. But a moment later, the Baruda said that the guy should not be afraid of anything, but should repeat after him. The young man heard the professor ask him again about the diagnosis, and so the young man said that he had some guess about it. Shin Heng-tae asked out loud if the resident was joking, but to himself he thought about how a newbie could know for sure what he could only guess, and decided that it would be better to send the boy somewhere to a resort. Suddenly, our hero, smiling, announced to everyone gathered that it was leptospirosis, Weil's disease. The other two residents looked at their colleague in amazement, realizing that this was the first time they had heard anything like this. And again, the head of the department thought that most likely his ward had gone crazy, although perhaps he had simply read too many books. But it was strange that he had assumed the illness that he had also thought about. Lee Soo-hek heard the question about why the guy decided so, but he was horrified because the Baruda, who was nearby, also wanted to know why our hero assumed this disease. Staring at one point, the resident decided that the assistant was making fun of him, because he should be the one thinking about the answer to the question, because it was he who suggested naming this disease as the main one. But the very next moment, the concentrated young man thought to himself that he saw everything. A kind of board appeared in front of him, which showed information about Weil's disease, as well as data from Park Kitae's card. 2 hours before, Lee Soo-hyuk had been thinking about the fact that there were only 12 people in his department being treated by the professor. But Baruda proposed studying the case histories of just 2 patients who had not been diagnosed at the time because they needed to train. Our hero had just started reading the information, but his assistant immediately reported that all the data had been saved, and therefore he could move on. Looking at the head, the resident understood that the data was stored in his head, but he could not explain it all based only on the data. However, the Baruda continued to make sure that the young man did not fall silent, but repeated everything after him. Shin Heng-tai didn't understand what was happening to his employee, who was once again staring at one point. He couldn't understand why the boy was acting so strangely after the accident. It seemed that time had stood still. The young man was very confused by all this, but he couldn't give up, and so he sought the strength within himself to start a conversation, hoping for an assistant. Lee Soo-hyuk finally reported that the chart showed that Park Ki-tae had visited the emergency room after suffering from a fever for 3 days. A week before, he had gone down into the sewers to carry out city improvement work. Embarrassed, the young man nervously said that all this could be read in the medical record. He added that 4 days after the fever began, a blood test showed elevated bilirubin levels. Compared to yesterday's analysis, conducted in the emergency department, its increase is clearly visible. If you look at the medical record, you can find out that the patient has jaundice. And while everyone looked at Lee Soo-hek in surprise, he continued to explain that the patient complained of muscle pain, most of all in the back and calf area. Listening to the story, the head of the department thought that in order to make a diagnosis, it is very important to select the most important information, and this young man speaks as if he is a therapist with a lot of experience. If we speak jokingly, one might think that he has something like a Baruda in his head. After this, our hero stated that based on the results of the sputum, it can be said that there is blood in it, but the color is bright. Shin Hyun-tai was no longer interested in the explanation. Now he thought that this man seemed to be a genius, remembering one of his students, as well as director Lee Hyun-jong, who was also a little crazy. The young man thought to himself that while he was speaking, he himself had figured out the symptoms. Moreover, he personally realized what the problem was. Baruda said that if the necessary information is collected, the accuracy of the diagnosis will exceed 90%. Unexpectedly, the head teacher asked what place our hero occupied in academic performance, and hearing that he was 4th, he was a little surprised. The man thought it was the former, but he was glad to have such a guy in his department, since not many people want to go into therapy. Our hero had already started to say what he wanted to a point, but at that very moment he hesitated, realizing that something was wrong. The young man knew perfectly well that antibiotics, which his assistant had listed, were necessary in this case, but everything was not so simple. Suddenly, the doctor's eyes became wild. Determination appeared in them, and something that was difficult to describe, but this something frightened everyone present. Hwang Sung-woo quietly asked the professor if perhaps there was no point in listening to the young man, and it would be better to go on a round, hearing the answer that it was advisable not to touch the colleague for now. Baruda didn't understand what was wrong with Lee Soo-hek, but he made it clear that the computer wasn't perfect either, since he didn't even pay attention to the antibiotics he was suggesting to treat the patient with. Therefore, the resident immediately explained to everyone that the patient was being treated with amoxicillin and that an antibiotic from the same group could not be used, so erythromycin would be suitable for him. The joyful professor noted to himself that his protege never made a mistake, spoke everything precisely and to the point, That's why he said that the young man would be the one to take care of Park Kitae's patient, which was unexpected for everyone. And while Shin Hyun-tae continued to say that our hero deserved it, the second-year resident irritably repeated that this was indeed the case. But most of all, the manager wanted to make sure whether the young man was a genius or just lucky. The man also said that he wanted the boy to take care of Kim Jong-chol, for whom a consultation would be held in a week, promising that he would relieve the young man of duty for 100 days if he made the correct diagnosis. For fellow residents, this was something wild and unreal. However, Lee Soo-hek himself was not interested in being on duty. He wanted to use the chance to compete with the professor. At this stage, it was something very important. Smiling, our hero declared that he would try, but he himself knew that he simply could not miss this chance. After this, Shin Hyung-tae said that they needed to move on, since they had already spent too much time on all of this. Sometime after the rounds, the young man stood in the corridor, immersed in his own thoughts. At that moment, Hwang Sung-woo came up to him and started scolding him, saying that if he didn't know something, then the younger ones were obliged to say the same and not try to show that they were smarter than others. An angry and irritated young man turned to the second-year student, asking where he was going. Baruta asked Lee Soo-hyuk why the man was acting like that, learning that it was all because of him. The computer assistant did not understand what was going on, because he had said everything correctly. But it turned out that the doctor was irritated because someone knew more than him and was talking about it. Our hero had no intention of arguing with anyone, and so he looked off to the side with a grin on his face. The ill-wisher immediately began to shout, noting that the resident still dared to look in the other direction and not at him. And then, raising his leg, he was about to hit his colleague on the leg, but hesitated a little. Covering his face with his hand, Hwang Sung-woo lamented that the young man was now disabled and therefore could not be touched. But the resident was not going to stop there, and so he began to beat his second colleague, declaring that he was obliged to teach his friend how to behave properly. The young man was angry that he was made to look like a fool in front of the head of the department, and this could not happen and should not have happened. Looking away, the ill-wisher thought to himself that no one dares cough while a second-year student is scolding the newcomers. Hwang Sung-woo was about to say something indecent, but at that moment a doctor appeared behind him, who was in no hurry to intervene in the conversation. Realizing that this scene was not very good, the young man immediately began to greet the director. While drinking coffee, the chief asked everyone gathered what had happened here. A few minutes before, the man had heard a colleague say that their victim of the Baruta was a real genius. It was hard to explain, but he felt that this was exactly the case. The surprised professor found it a little strange to hear about something like this, probably because no one had ever taken this resident seriously before. The bullies looked at Shin Hyung-tae in surprise, realizing that he shouldn't be here, especially since he witnessed the fight. It seemed that no one could explain anything clearly. Everyone looked at each other as if they were seeing each other for the first time. However, in reality, the doctor saw the situation completely differently than it actually was, although he understood that Lee Soo-hek had been completely different before. At the same time, the director understood that, most likely, Hwang Sung-woo was drilling the newcomers, although it was impossible to behave like that with their victims, because no one could yet understand exactly what was in the guy's head. Putting his hand on our hero's shoulder, the man decided that he couldn't allow anything bad to happen, and therefore it was necessary to use only one way out of the situation. Laughing, the doctor asked if anything serious had happened between the boys, and then said that he wanted to talk to the young man one-on-one. The residents looked at both of them in surprise. It seemed to them that something completely incredible was happening. After this, Shin Hyun-tae invited the young man to have coffee together, adding that they hadn't seen each other for a long time, which left the guys even more shocked. Peeking around the corner, the residents tried to guess how Lee Soo-hek knew the director so well that they already went to the cafeteria together. Although no one knew for sure, everyone had only one guess on this matter. It seemed like time stood still as the boys tried to comprehend at least something. But then, looking after the doctor and the resident, it dawned on them that Lee Soo-hek was working in their hospital through connections. Standing in the cafe, the director was politely greeted by an employee who asked what he wanted. At that very moment, everyone started gossiping about who it was that came with Shin Hyung-tae and also what they were talking about. Coming out of his own thoughts, the man asked where they had left off. And then he asked the guy how he was finding working in their therapeutic department, although at that moment our hero was looking in some opposite direction. Looking closely at his boss, the young man stated that he had only worked one day and therefore could not say anything specific yet. Lee Soo-hyuk heard the director's encouraging words about not having to worry about his sore leg because often the therapist doesn't require much movement. The young man noted in a thoughtful voice that in fact nothing terrible had happened to him. He was completely fine. A few minutes later, the doctor timidly said that he had already taken up too much of the boy's time, who immediately noted that in that case he would return to his duties. Smiling, the man said that if someone bothers the young man, then he fell silent. But he immediately added that there would be no need to do anything. He shouldn't take out his knife. He needed to report everything to Shin Hung Tai. Our hero was pleased that they were taking care of him, although he did not understand the true reasons, and therefore simply sincerely thanked his boss. The man was pleased that he had managed to warn the young man about possible troubles as well as about his help, and leaving, he finally declared that it was time for him to go, and therefore wished our hero all the best. Looking attentively after his departing boss, the young man did not understand what had just happened, nor why the director had called him. At this time, the Baruta started talking about how it was not time to relax and waste time. But the guy was unhappy that the assistant was speaking when there was someone else nearby who was also trying to say something. It was very distracting. But the little friend was not going to listen to all this. He noted that now was not the time to sit and drink coffee. It was better to return to the department and sort out Kim Chin-chul's diagnosis. And he added that if he kept quiet, the young man would never figure out the man's condition, which was absolutely true, and therefore it infuriated him even more. At this time, a meeting was taking place in the conference room, chaired by Kim In-soo, a third-year resident, who was saying that he had a very important message for everyone. It consisted of the fact that their first-year colleague, Lee Soo-hyuk, got into their medical center through connections. Many of those gathered heard this statement with surprise, their mouths open, and they said that this was something impossible. Another guy noted that it was impossible to believe, since his friend had just sent him a photo of the director and a classmate having lunch together in a cafe. The guys didn't believe it at first, but when they saw the photo, they started discussing how this could have happened. However, one photo was not enough. Now the interest had increased, and therefore I wanted to be informed about what the boss and his subordinate were talking about. To the even greater amazement of the young doctors, it turned out that the director offered his help to Lee Soo-hyuk. Moreover, the professor said that if someone were to offend the guy, it was necessary to immediately report it. Kim In-soo began to ask everyone if anyone knew anything about this resident. At that moment, someone raised their hand, and the initiator of this meeting immediately asked who it was. Yoo Ji-sung, whom the chairman had not been able to remember, suddenly responded. The guy told everyone that his partner was an orphan, so he worked part-time while he was studying at university. He was a tutor because the scholarship was very small. Kim In-soo immediately thought about the fact that Lee Soo-hyuk could have been held back a year because of his part-time jobs. But this did not happen. Moreover, he was fourth in academic performance. Yoo Ji-sung explained that he hadn't seen his friend tutor, so everyone started saying that it was simply impossible to both study and work. And then everyone gathered fell silent, their faces once again showing complete amazement. The guys were almost certain that Lee Soo-hyuk was the director's son, since it was very suspicious that he was no longer young, but still had not started a family. Moreover, they both had the surname Lee, which is why everyone thought that the truth had finally been revealed. At this time, our hero nervously scratched his ear, not understanding why it was itching so much again. The guy jokingly said that someone was talking about him, but he did it only to irritate the Baruta, and then said that his ear was itching simply because it itched. The assistant stated that picking your ear is a bad habit and should be gotten rid of. Baruta heard the young man say that he knew perfectly well what earwax was made of and how the ear worked because he had an excellent grade in otolaryngology, but the assistant continued to scold the young man for still behaving so irresponsibly. Our hero added that he was constantly evolving thanks to deep learning technology, but the computer thought that was unnecessary. Suddenly, the young man stopped in front of Kim Jin-chul's room and saw something that interested him. The door indicated that one could not enter the ward without first putting on a special suit, mask, and gloves. Upon entering, Lee Soo-hyuk immediately looked at the patient who needed to be diagnosed. The man was 49 years old and appeared to be young and healthy, but a couple of days ago, he went to the hospital with a cough and shortness of breath. He had been transferred from there the night before because his temperature had risen to 39 degrees. A chest X-ray showed pneumonia, so they prescribed a course of amoxicillin, but it didn't help. The young man mentally turned to his assistant, but he replied that he had too little information, and therefore he could not say anything specific. Then our hero asked the nurse what she could say about the patient, but she replied that after hospitalization, the condition had worsened. The woman also added that when she was admitted, her blood oxygen level was 95%, but after it dropped below 90%, they had a hard time getting it up to 95% and keeping it there. Looking at the IV, Lee Soo-hek noted that there was enough medication, the blood test showed an inflammatory process, and there was nothing else unusual. The level of neutrophils is so high that it still confirms the infectious nature of the disease. A blood culture test was taken, but it takes at least 10 days. This is extremely dangerous. Everyone understood what could happen before that time, considering that the man is quite old. It was urgently necessary to find out what was causing this disease in order to select the appropriate antibiotic. Otherwise, the patient would die. During the rounds, the head doctor said that if the temperature does not go down by Sunday, the antibiotic should be replaced with levofloxacin. But this drug is a quinoline agent with a wide range of applications. With its use, there is a possibility of improvement, but it is nothing more than a bombardment of the body. Our hero turned to the Baruda again with hope, but he said the same thing as before, that there was not enough information. And while the guy was listening to the patient's lungs, the assistant added that the X-ray showed inflammation in the lower lobe of the left lung, and a change in breathing sounds was observed in this area. And he said again that this was his first auscultation of the lungs, and therefore there was no need to expect anything supernatural from him, but he would save the data he received in the archive. The next minute, the young man's thoughts were interrupted by a loud cough. The patient's wife, who came to visit him, explained that she had also started coughing a few days ago. The young man already thought that the woman was taking off her mask, but she noted that nothing like that had happened. Walking out into the hallway, Mrs. Kim explained that she only sat with her husband for 10 minutes at a time, since her daughter sometimes took over. Lee Soo-hek and his assistant came to the conclusion that the infection definitely happened at home, and therefore it was important to check the girl as well, since it could be an extremely pathogenic bacterium. After this, the woman stated that she and her husband lived in the province, but after he was admitted to hospital, she moved to the city to be with her daughter. This news worried the resident, who became interested in how the woman's relative was feeling. At that moment, her daughter called out to her, and so Mrs. Kim said that the one they had just been talking about had arrived. Coughing, the woman explained that the man was not getting better, and the doctors could not figure out what was wrong. However, now the guy was interested in why their patient's wife had started coughing so suddenly, while his daughter looked absolutely healthy. Looking at these people, the young man realized that there was something strange in this situation. Now the young specialist had no doubt that they had missed something very important. Unexpectedly, Baruda said that it would not be a bad idea to take tests from Mrs. Kim as well, since she looked sick. The guy wasn't going to argue, so he replied that it was a great idea. Coming as close as possible to the woman, our hero suggested that she undergo a small examination, explaining that this would help clarify the situation with her husband. Lee Soo-hek decided to start by listening to the patient's lungs, which was the right decision because he heard gurgling sounds in the lower lobes of the lungs. The young man noted to himself that even he, a specialist without experience, could accurately determine that it was pneumonia, an extensive pneumonia at that. But what was strange was how a woman could become infected with bacterial pneumonia so quickly. There is a possibility that she was not infected by Kim Jin-chol. Baruda immediately confirmed that according to the medical records, the couple had not traveled anywhere, and it is possible that the source of the infection is in their hometown. One thing is clear, the loading is too fast. If this were an epidemic, something like this would definitely be covered in the press, but nothing like this is observed. After thinking about it, our hero decided that he absolutely had to sort this case out. If the young man can make the correct diagnosis of the patient, it will open the way for him to see the professor. Baruda, who heard everything the orderly said, called him a mercantile man, but he immediately added that he was still on the young man's side, because the desire to become a professor, like the desire to become a general practitioner, is wonderful and will allow one to make accurate diagnoses and prescribe effective treatment. Looking closely at his assistant, our hero thought that finally he was not judging him. Realizing that the deliberations were taking too long, Lee Soo-hyuk turned to the woman, saying that there was a suspicion of pneumonia. And looking around, he suggested that Mrs. Kim go to the emergency department. The resident was ready to help with registration so that the patient could be examined immediately. The frightened lady began to ask how serious it was. The Baruda immediately suggested saying that she could die, but the guy said out loud that first it was necessary to make sure of everything. Approaching the office, the resident explained that there were a lot of people at this time, and therefore suggested waiting a little. Suddenly, our hero thought that he would be in the department now, but he did not specify who exactly. Waving at Lee Soo-hek, the young man asked how he was doing and what he was doing in their department. The young man thought to himself that this bearded man, as everyone called him, was annoying all the interns and other residents from other departments, and therefore he really didn't want to meet him. The young specialist asked what his colleague was looking for, and he in turn wondered why this person was behaving so friendly, which was very alarming. The bearded man didn't like this, but he kept repeating to himself that he was the director's son, and therefore he needed to behave as best he could. Our hero explained everything briefly, hearing his colleagues say that after the paperwork, the guy should come to him and he would do everything. It was the strangest thing. Lee Soo-hyuk thought that the resident might have been drinking because he had never been so friendly before. After some time looking at the pictures, the guy saw that the lower lobes of the lungs were darkened, and therefore there was no doubt that it was pneumonia. And if everything is fine with her daughter, then Kim Oh-jin's blood test also showed an elevated level of neutrophils, which means it is definitely bacterial pneumonia, although Kim Se-hee has nothing like that. After this, the young man fell silent. He also did not think about anything, which caused bewilderment in the Baruda. And then he said that he had identified several possible scenarios. If the source of infection is not a human, there is a possibility that only Kim Shin-chol, the main carrier, and his wife were infected, and therefore it is necessary to question the patients again. Upon entering the ward, our hero was immediately met by a worried girl who immediately stated that her mother's cough was getting worse with each passing hour. Our hero's assistant immediately reported that the oxygen saturation level had dropped to 93%, and therefore it was best to use a ventilator. Having done everything necessary, the young man began asking questions again about whether the woman had recently visited a livestock farm or a petting zoo, receiving a negative answer. However, the daughter intervened and immediately stated that her parents had a pet at home, which greatly surprised Lee Soo-hek. In an anxious tone, our hero asked again what animal they were talking about, since this was very important information, but the woman continued to insist that there was nothing special. Holding a mobile phone in his hands, the young man saw that a colleague was calling him. The bearded man was angry. He didn't understand what the new resident wanted from him, but then he decided that it was wrong to behave in this way, and after clearing his throat, he decided to answer the call. With a positive voice, the doctor asked what the young man needed, and then clarified which patient's diagnosis he was talking about. And moving along the corridor, he repeated word for word after our hero, namely that the patient Kim Jin-chul had psittacosis and the antibiotics needed to be changed. But for a moment, Boradak stopped, because he was hearing the name of the diagnosis for the first time. Psittacosis is an infectious disease transmitted by domestic and indoor birds, such as parrots. When infected, fever, lung damage, etc. are observed. For a doctor, the probability of encountering this disease is extremely small, but perhaps this is it, because patients confirm that they have a parrot, which means the probability is 99%. Baruda recommended therapy with antibiotics from the tetracycline group, and our hero decided to choose doxycycline. The guy understood that this was what he had to do, but he had to get permission to change the antibiotics from the unpleasant bearded man, and he didn't want to do that. The patient's daughter didn't like that Lee Soo-hek was so confident in himself. She knew that first-year residents could only voice their assumptions to experienced colleagues. On the other hand, the young man knew that he was right, and therefore there was no time to hesitate, since the man's life was at stake. As he left, our hero said that he would make just one call and then return. Remembering this situation, the young man still felt uneasy, because the bearded man was friendly again, although he had never behaved like this. The guy in turn said that he wanted to report the diagnosis of a patient about whom they were going to hold a consultation. And while Lee Soo-hek was naming the diagnosis, his senior colleague tried to pronounce the word, but all in vain, since he had no idea what he was talking about. The senior resident did not want to change the antibiotic because he did not know such a diagnosis, and therefore began to say that he was in the ward with patients who were in critical condition. Considering this, the guy can report everything to the head of the department himself, especially since he is in the hospital, and you can contact him by internal telephone. The furious young man stood in the middle of the corridor, angry that the first-year student was forced to report to the professor himself. On the other hand, our hero decided that perhaps it was even for the best. After all, if he tells everything correctly, he will earn Shin Heng-tai's trust, and this could be a good chance. Baruta, knowing the resident's thoughts, immediately again stated that he had selfish motives. At this time, in one of the management offices, a conversation was taking place about the fact that a journalist had reported on the recovery of our hero, who had already begun his duties as a doctor. The man putting the cup on the table added that he asked the media not to come again and not to disturb the staff and patients. The director, sipping tea, confirmed that this was the best solution, since the Baruta was not fit for use, and one day it would be launched without any fuss. And he explained that the company was going to sell the devices all over the world, but when they found out about the incident, they were more scared than anyone else, realizing that the machine was very dangerous. At the same time, Shin Heng-tai said that he liked the injured resident. He was smart. The guy was very talented, since he was able to identify Weil's disease. After this, an argument began between colleagues, since Lee Hyun-jong was sure that the young man was crazy, and it was stupid to say the opposite, since he had more experience than the head of the department. But he explained that there was not such a big age difference between them, because he himself entered the university only on the third try. The men didn't have time to finish speaking because someone was calling the therapist on the intercom, and the director was very angry about it. Looking at his colleague, the young man explained that it was Lee Soo-hek. Our hero screamed into the phone so loudly that the doctor almost went deaf, and his colleague almost choked, because he was surprised to hear such a frightened voice of the former victim. Lee Hyun-jung simultaneously asserted what he had insisted on earlier, that the young man was crazy, he was calling at such a time, and also yelling like crazy, and warned his friend not to go to the doctor so as not to get into trouble. However, Lee Soo-hyuk immediately pulled himself together, apologized to his senior, and said that he was just very nervous because he wanted to report on the patient's condition. And while our hero was asking the mentor if he was busy, the man told the director that his resident wanted to tell him something important. Turning the phone on speaker, the doctor let the audience listen to what the boy wanted to tell them. When the young man announced the diagnosis, the director sat in bewilderment, not understanding how a first-year student could know about such a thing. In turn, Shin Heng-tai wanted to know why his protege had such an interesting idea. Taking a deep breath, Lee Soo-hyuk knew that the hardest part was yet to come, this explanation. And so he said that the patient had a cough, the X-ray showed a darkening, and, according to the blood tests, the patient had an infectious disease, which made it possible to determine bacterial pneumonia. The use of amoxicillin from the penicillin group did not help get rid of the fever, which means that the cause of the infection could not have been contact with another person. The director at this time was thinking that there are reasons to start using amoxicillin, but when it doesn't work, it is necessary to look for a replacement. The guy thinks correctly. The young man explained that the patient's wife had developed similar symptoms. She was examined and received similar results. He added that their daughter, who was in constant contact with her parents, had no symptoms and tests did not reveal any abnormalities. Shin Heng-tae smiled and thought that a well-collected anamnesis was akin to solving a mystery, the joy of realizing that disparate facts pointed to one single diagnosis. The manager asked out loud what helped the young man understand that this was the reason, hearing how he decided that the disease was transmitted through water. And a moment later, our hero described in more detail that the couple had a parrot, and if people had psittacosis, then this confirmed everything, considering that the daughter, who was in constant contact with them, was healthy. Putting the conversation on pause, the professor asked the guy to stay on the line and wait a bit. And he himself told his colleague that this was something incredible, since he had never heard such anamnesis, not only from residents with 3 years of experience, but even from graduate students. When the department head suggested inviting Lee Soo-hek to a consultation that would take place next week, the director began to object, saying that it was crazy. The man was worried that the young man was simply lucky in guessing the diagnoses, and that there would be a large number of doctors from different hospitals at the meeting. Shin Hyun-tae asked with a serious voice why the director looked so displeased. But remembering that the resident was on the line, the doctor returned to the conversation, allowing the guy to change the antibiotic. And then he noted that he remembered that our hero was on duty, and therefore allowed him to call if any problem suddenly arose. The surprised young man sincerely thanked the professor for his help. Walking confidently down the corridor, The guy thought that everything had turned out quite well, although he was very worried. The young man prescribed doxycycline to Kim Jin-shul and his wife, and if the medicine works, improvements will be seen by the weekend. But what our hero liked most was that the head of the department said that the young resident had done a great job. At this moment, Lee Soo-hek brought Barud out of his thoughts, who again wanted to say something. The assistant asked why the guy slightly raised the corners of his lips, and he wondered how this little computer managed to notice that. Baruda understood that the resident enjoyed hearing praise, knowing that after it the young specialist's mood improved significantly. But the young man explained that praise from Shin Hyun-tae was very important. His wife was the daughter of the CEO of a large company, and therefore in time, the man would become the next director of the Taiwa Center. If our hero continues to be in good standing with this man, it will be wonderful, since this is an opportunity to grow to the rank of professor. Realizing what was going on, the assistant said that he fully supported the young man in this endeavor. Before entering the doctor's office, Lee Soo-hek asked the Baruda to be silent for a while so as not to give himself away by accident. The colleagues, who were in a relaxed state, looked at the guy with some fear. And he, in turn, could not understand why they were behaving so strangely. The assembled people immediately threw down their cups and trays of food and pretended that someone urgently needed to call them and that they therefore needed to run somewhere immediately. Left completely alone, Lee Soo-hyuk wanted to say something, but he had no listeners left. Scratching his head, the guy thought that everyone had some urgent matters to attend to. After looking around, the young man decided that he would fill out the medical histories and go to bed, especially since it was already almost 10 in the evening. But then the Baruda went berserk, saying that it was necessary to study, although the young man refused, explaining that he was on duty every other day and therefore needed to rest, although the computer proved that this was, on the contrary, a reason to study. And he added that the knowledge gained could be useful, even on duty, without which the assistant would not be able to do anything, since there was very little data. The little friend noted that everyone knew that the young man did not like to study, and therefore, what could he achieve in the future? The resident clutched his head and began to think, as if he were immersed in some memories. After leaving the office, Lee Soo-hek said goodbye to everyone and said that it was time for him to go, and that they would see each other tomorrow. Almost reaching the exit, the young man put his hand in his pocket and did not find his wallet, deciding that he had left it in the office. Returning, our hero scolded himself for being in a state of prostration lately, realizing that the reason could be lack of sleep. The guy thought that if he could do less tutoring, everything would be different. Reaching for the door handle, the young man heard the guys who were still sitting in the classroom praising him. Noting that he was a real good boy, Lee Soo-hek was considered a diligent student, a goal-oriented person who studied harder than anyone else. But despite this, the teenager was pitied because he would never become a professor. To reach this level, you need to go to a master's degree. But our hero will not be able to pay for his studies for so many years. If only he had parents like the others. And so the guy is an orphan who must achieve everything in this world through his own labor. Returning to the present, the resident said out loud that he always knew that efforts alone would not achieve much. He guessed that he would not have a chance, although it was not about dreams, he just wanted to earn money. A moment later, the young man turned his gaze to his assistant, noticing that he had fallen asleep, although he did not even have such a need. Baruda began to justify himself, saying that he had lost interest and therefore decided to while away the time. But in general, everything was clear to him. And he added that the guy believed that in this world, it was impossible to become a professor without money, with which our hero partially agreed. However, the assistant understood that something had changed in Lee Soo-hek, and so he asked him if he still thought that way. Smiling, the young man said that he now had a different point of view, since everything had changed. And he slowly added that whether he liked it or not, Baruda had now entered his life. It seemed as if our hero had an epiphany, as he noted with some surprise that now everything was in his hands. Clenching his hand into a fist, he declared that now it was not just about money. Now he had the power in his hands that could move mountains. Now the assistant was smiling. He liked the fact that the resident reasoned like that. So he asked why a man who had realized so much was just going to go to bed without doing any work. Lee Soo-hyuk was lying on the bed. It was obvious that he was in a very deep and sound sleep. However, the young man had to start waking up because he heard something that sounded like a siren. Jumping up, our hero immediately began to shout what it was and what had happened. The guy realized that his assistant was the cause of everything, and so lamenting, he began to ask what he was doing. Baradu spoke calmly about how he had simply reproduced the most hated sound and that it had actually produced a wonderful effect. Hearing his assistant say that it was time to get up, the young man picked up his phone and, seeing that it was only 6 in the morning, began to get indignant, saying that he had set the alarm for 7 o'clock. Lee Soo-hek complained that the computer didn't care what time he got up, adding that he would have to be on duty with Bordak today anyway. And then he added that he would have to get up because he wouldn't be able to doze off anyway, even if he wanted to. Not much time passed, and the guy was already standing on the threshold of one of the rooms. Mrs. Kim, whom our hero visited, was surprised that her attending physician had arrived so early. Answering the resident's question about her health, the woman replied that she was feeling much better than she had the day before. Looking out the window, the patient happily stated that she began to cough less. Moreover, she felt like she wanted to go somewhere or do something. The young man wanted to further improve the lady's mood and then said that he had already managed to visit her husband, who was also beginning to recover. The young man was very pleased to hear praise addressed to him. At 7 in the morning, Lee Soo-hek entered the dining room. He understood that at this time he should still be sleeping, but since he was already up, he needed to have some food. The guy had a huge appetite, and so after just a few minutes, his tray of food was completely empty. While drinking tea, our hero said with satisfaction that he had eaten well and could therefore begin his working day. The resident thought to himself that he was in a great mood, and all thanks to the fact that Kim Jin-chul and Oh Jin-gang had gotten much better. Moreover, he could eat in a calm environment. Baruda, seeing the boy's satisfied face, immediately asked him if getting up early really didn't have its positive aspects. Our hero decided not to answer, especially since at that very moment his phone rang. It was the receptionist calling to say that they had a 45-year-old female patient who had been referred to them from another hospital because she had been diagnosed with an abdominal mass and weight loss. The resident stated out loud that he would arrive in a couple of minutes, but to himself he thought that it was most likely a cancerous tumor. As he left the dining hall, Lee Soo-hyuk thought that he should call the chief resident of the department, although he didn't want to do so. The bearded man immediately declared that he thought it was cancer, although he asked his subordinate to go and look at the pictures and then write down that it was a hematoma. Folding his arms across his chest, our hero's assistant confidently said that it was not cancer. The young man turned around and looked angrily at the Baruda, but despite this, he still remained silent. After looking at the pictures, the guy mentally conveyed to his assistant the information that they agreed that it was oncology, and it was better not to argue in this case. However, the assistant explained that the diagnosis was wrong since there was no obstruction, and therefore there was no need to rush to conclusions. After thinking about it, the young man realized that something was really wrong, because if we were talking about a cancerous tumor, then the intestines should have already been blocked. At the same time, the patient also experienced weight loss, although she did not say that she had not eaten. If you look at the CT scan, you can see that the area where the tumor is located, the feces have already passed. The intestines are narrowed, but there is no obvious obstruction. And while our hero was complaining that the assistant had not reported this earlier, he immediately stated that since his master was a slow thinker, his speed of information processing was also reduced. And then he added that he was almost certain that it was not cancer, and if so, he recommended postponing the patient's transfer to the hemato-oncology department. At this time, Borodek, who was also looking closely at the screen, said out loud that they had accurately determined the diagnosis. But Lee Soo-hek did not understand how to convey his thoughts to his colleagues, since he had already completed all the paperwork. Moreover, he believed the data from the hospital where the woman had previously been treated. The young man was not so afraid of making a mistake with the diagnosis, because he was only in his first year of residency, and the guy would have remained silent if it weren't for his assistant, who immediately began whispering something in his ear. He asked whether our hero was satisfied with this start to his own career, and whether this was really how doctors who wanted to become the best behaved. And the assistant continued to say that if you treat a woman for cancer when she doesn't have it, it will cause great harm to her health. How can you allow something like that? With satisfaction in his voice, Bordak was saying at that very moment that they would write that the patient had a hematoma. But at that moment, our hero's hand involuntarily reached out somewhere. Putting it on his colleague's hand, the guy addressed him as Mr. Huang, reading the wild surprise in the young man's eyes. With some apprehension in his voice, Lee Soo-hyuk noted that he wanted to say something. The chief resident immediately asked why the young man had done this, adding that he was very scared. Pulling his hand back in horror, the guy immediately began to make excuses, explaining that he himself did not understand how this could have happened. There was silence for a moment. Our hero was wondering why the bearded man was silent, although he should have been screaming like crazy a long time ago. And he, in turn, was glad that at the last minute he restrained himself and did not yell at this guy, who was the director's son. Hwang Sung-woo remembered the words of his senior colleagues who noted that Lee Soo-hek should not be touched at all, since not only the directors, but also Shin Hyun-tae, as well as the pharmacist Kim Jin-en, would stand up for him. And so the resident simply smiled, calmly asking the first-year student what had happened. Our hero was scared, but he still expressed his assumption that the patient did not have cancer. Looking at the young man with even greater surprise, the bearded man did not understand what he was even talking about. However, after a minute he laughed slightly, declaring that he had much more experience. Hwang Sung-woo explained that everything was clear. The patient could not have just lost 10 kilograms, and therefore all speculation was stupid. The young man, with a self-confident air, thought to himself that a newbie was a newbie, but out loud he said that he should listen to him carefully, since he would explain everything in detail. And pointing to the picture, he declared that the specific folds along the edges are a distinctive feature of cancer. Although Baruda immediately noted that he does not know about any folds, it is all fiction. And while Hwang Sung-woo was tirelessly talking about the folds, our hero's assistant stated that the CT scan did not reveal any clear obstruction, and therefore this tumor was related to something else. After that, he congratulated Lee Soo-hek on finally meeting a more illiterate person than the young man, saying that he knew nothing at all about oncology. The bearded man didn't like the way the first year looked at him, so he asked what arguments the guy had for thinking differently. Baruda continued to insist on his obstruction, but the resident was confused by the fact that this was the only argument, albeit a very important one. Hwang Sung-woo, hearing this argument, confidently assured that it was entirely possible. Although a moment later his expression indicated otherwise, since in fact he himself did not know. The young man didn't like being portrayed as a fool, and so he decided to ask his young colleague what diagnosis he would give. Our hero, who could not know the exact answer, looked carefully at his assistant. But he explained that because the processing speed had slowed down, more time was needed. But then he said that he believed it was an infectious disease, which Lee Soo-hyuk said out loud. Making a comical face, the colleague said that if the guy works in the infectious diseases department, then everyone must have diseases of this kind. And after that, he began to say that our hero was simply arrogant, since he guessed the diagnoses twice. But now it's a completely different story. The senior ordinand continued his speech while the young man and the Baruda conferred, trying to come to something logical and most accurate. With his eyes closed, the boy had to listen to the same thing from his assistant as before, that it was necessary to study, and as much as possible, in order to easily find answers. At this point, the bearded man said something about the pelvic area, and it seemed like something clicked in Lee Soo-hek's head at this point. The young man repeated after his assistant, explaining that a contraceptive device was installed in the uterus. However, the senior colleague listened to practically nothing. It seemed to him that the resident was talking nonsense. After this, the Baruda began to throw out various ideas that began to make sense and explained everything that was happening to the patient. He, like our hero, was angry that Borodak still hadn't understood anything. He didn't even try to draw a logical chain, but the infection was connected with an intrauterine contraceptive. The young man himself became interested in how easily he, with the help of his assistant, was able to partially guess the reason. And no longer listening to anyone or anything, he loudly shouted that this disease was actinomycosis. The colleague who was sitting opposite the guy looked at him in surprise and remained silent, because again he didn't know what it was. Shin Hyun-tae heard his phone ringing, but an irritated Lee Hyun-jung said that he asked to turn off the sound when they played golf. It's good that they decided to take a short break now. Entering the room, the head of the therapeutic department justified himself, noting that, firstly, he was a doctor at a large hospital, and secondly, he was on out-of-hospital duty. He added that on the golf court, they are not a boss and a subordinate, but simply men who have come to relax. And turning around, he asked his wife, addressing her as Professor Kim, whether he was not right. Kim Jin-shil just smiled, making it clear that she supported her colleague and husband all in one. Shin Heng-tae, taking the phone in his hands, calmly stated that our hero was calling. But when the director heard this, he became even more irritated. However, the doctor did not care, since he had already decided for himself that the young man was a talented young specialist. At this time, Lee Soo-hek was trying to collect his thoughts, and the bearded man looked at him inquisitively. The young man was upset that the resident wanted to tell the head of the department about the diagnosis, but he was even more angry that the young man had again brought up some strange illness. And besides, he so easily called the professor for any reason. But the guy didn't care what anyone thought about him. He called his boss because the patient's life was more important. He explained that he was calling about a woman who had been admitted to the emergency room and asked if it was a good time for the doctor to talk. Shin Heng-tai asked his colleague if a madman could speak so politely when he heard that they still didn't know for sure what was wrong with the young man. Seeing the director take the menu, the doctor said that he would be free for another half hour while he had breakfast, so he was ready to listen to what had happened. Our hero calmly and in detail began to tell the whole story, starting with the fact that the patient was already in another hospital and then ended up with them. Shin Hyun-tai asked if there really was a tumor, and the guy said that there was, adding that its size was no more than 5 centimeters. Sitting opposite him, Lee Hun-jung began to laugh, claiming that their local lunatic was distracting the professor just to tell him that a cancer patient had been admitted to their hospital. But the young man continued to explain to his mentor that it was unlikely to be cancer, because there was no obstruction, the patient was suffering from constipation, and not from a complete lack of stool. The doctor repeated out loud everything that the resident had told him, hearing the continuation that the intestines remained unobstructed. The head of the department addressed Lee Soo-hek affectionately, which shocked everyone, and asked what the young man thought about this. Placing the phone on the table, the professor told his colleagues that they should listen to what this guy had to say. And turning to the young man, he noted that he had turned on the speakerphone and therefore wished the resident good luck. And a minute later, he asked our hero not to be afraid and to tell him everything he thought about the disease. Lee Soo-hek immediately revealed that the CT scan revealed that the structure of the seals was not uniform and some abdominal tissues were damaged. Visualization with a contrast agent gave ambiguous results. It was possible to establish the shape of the seals that had merged into a tumor. And while the young man was talking about the absence of obstruction, as well as about the intrauterine contraceptive, Shin Heng-tai thought that this was not always a safe method. Sometimes it caused complications. If we take into account everything that the resident just told us, then the most likely disease would be actinomycosis. At that moment, our hero's voice came from the telephone, and he said that if we put everything he had said together, he suspected actinomycosis. The head of the therapeutic department's colleagues, unlike him, were in shock. Their surprise knew no bounds. Jumping up from his seat, the director shouted for the resident to immediately take a photo of the picture. Now the guy was surprised because he did not understand who was addressing him. Hearing that it was the director, the young man almost dropped the phone from his hands in surprise. Lee Soo-hyuk immediately said that he would do everything, seeing how surprised the bearded man, who had been sitting next to him all this time, was. Baruta, seeing the state of the resident, asked him to calm down, but the young man said that this was a great success, because there was a chance to show himself in front of the director himself. Our hero's hands were shaking, but he still tried to take the clearest pictures possible. In a couple of minutes, everything was ready, and the satisfied manager announced to everyone gathered that they could now study the images. A nervous Lee Hyun-jong immediately asked Professor Kim, who specialized in radiology, to look at the results carefully. Taking the phone in her hands, Kim Jin-shil heard the director's question about whether the professor thought the resident was right. The girl was in no hurry to draw conclusions, but what she saw made the specialist's eyes widen in surprise. With embarrassment in her voice, the brunette noted that if we judge solely by the pictures, then actinomycosis would be most likely. She then asked if the young man was really in his first year of residency, adding that she might have believed the diagnosis to be accurate if he had been in his 4th year of diagnostic radiography. The director couldn't believe what he had just heard, but it was simply impossible to doubt Professor Kim's words. Shin Hyun-tai was the happiest of all, saying that he had seen talent in this boy from the very beginning. Remembering that Lee Soo-hek was still in touch, the head of the department asked what the guy would do if the diagnosis was confirmed. Lee Hun-jung didn't believe that his colleague was even asking a first year for a treatment plan, but he decided to listen to what the young man suggested. Our hero understood that it would be best to give preference to penicillin G or amoxicillin, which would work even better in this case. And he thought to himself how good it was that he had a Baruda who could always suggest something useful. The guy said out loud that he would try to prescribe amoxicillin and immediately heard the answer about what he would do if this treatment did not bring results. Slowly but surely, our hero spoke about how, according to his data, drug treatment will help in 90% of cases. At the same time, there is a chance that the drug will not work. And again, the director noted to himself with surprise that somehow the young man even knew the exact figures. And the guy continued to note that it would then be necessary to remove part of the colon. Moreover, it would not be superfluous to consider the possibility of cancer and collect material for a biopsy. He added that despite the fact that the probability of cancer is very small, it is a disease that is important not to miss. While Shin Heng Tai was telling our hero to start the treatment as he had told, the director was surprised to note that this boy had told everything as it should be. And this was in the first year of residency, and after a forced sick leave due to an injury, it's a miracle that such a person ended up with them. Lee Hyun-jung's thoughts were interrupted as an egg roll was placed on the table in front of them. Kim Jin-shil was surprised that they were given such a small dish for 20,000 won, but her husband said that this was absolutely normal in such establishments. The director was so deep in his own thoughts that he didn't even hear his name being called. And while the girl was asking her husband if everything was okay with their colleague, he offered to eat everything themselves, explaining that this man had always been a little strange. And he added that he wrote his dissertation somehow like that, and that's why they also called him a genius for no reason. This is an amazing doctor, a world star of cardiology. Taking a piece of the role, Shin Heng Tai thought to himself that the thesis was astounding. The cardiologist wrote that patients with cardiovascular diseases who needed cardiothoracic surgery could be given stenting. And so the doctor completely turned the views of the world community upside down, and the success rate is 99%. There is nothing more to add. Coming out of his thoughts, the head of the therapeutic department asked his wife if they had any first-year geniuses, since diagnostic radiology is a popular discipline. A little embarrassed, the brunette said that there aren't many talented ones, and some don't listen to her at all. And then, wanting to change the subject of the conversation, she offered to drink some majoli, but her husband refused. Half an hour later, noticing that the girl had eaten and drunk everything, the man was surprised that she could drink the bottle alone. And he remembered that in his student years they said that you might not survive hanging out with some older guys. It's good that he got in earlier than she did. But the man was most interested in the director, who said he was very hungry, but did not touch the food. Lee Hyun-jung was extremely thoughtful. It seemed like he wasn't even listening to what everyone else was saying. And so Shin Heng Tai suggested going out and playing, although his colleagues said that now was not the time for that, since an unusually capable doctor had appeared in their department. Looking out the window, the professor said that it was strange, because the director had previously had a different opinion, but he said that he himself had already become convinced that he was wrong. Despite this, the head of the therapeutic department knew how to separate work and rest, and therefore, taking his friend by the hand, noted that now was the time for play. And after a couple of seconds, he started shouting, asking if his friend was really so afraid of losing the bet. But he also angrily shouted that he was really behaving so strangely because of an ordinary argument. And seeing how the man was trying to lift him up, he screamed even louder, explaining that the problem was their young resident, although Shin Heng Tai asked not to hide behind the boy. The director pulled his hand away and asked his colleague to sit down, saying that he actually had something important to talk about. He said in a serious tone that they would soon have a consultation at the Taewa Medical Center, and that it would happen at the end of this month. And he added that it would be good if our hero gave an interesting report. Seeing the professor's surprise, Lee Hyun-jung asked the man why he was surprised, since he had suggested it first, but he replied that he suggested it because he knew the director would refuse. And then he said that the resident could speak out because such personnel required a special approach. Jumping up from his seat, the hospital chief said once again that all the time, now is not the time for golf. It is necessary to call the heads of other departments. Realizing that the director was leaving somewhere, and quite quickly, Shin Heng Tai asked where he was going, reminding him that they had an unresolved dispute. And then he shouted that for this reason, the man still cannot publish his work in a well-known scientific journal. As he left, Lee Hyun-jung didn't intend to say anything other than that they would see each other at work on Monday. The hall was filled with doctors of all ages. The reason was the holding of a conference of university medical centers. Our hero, slowly but surely clutching his cane, moved along the corridor. Shin Hyun-tai wanted to cheer up his protege, so he told him not to worry and to say everything as he had prepared, adding that he believed in him. Lee Soo-hyuk smiled and thanked for the kind words and noted that he had prepared perfectly. Hearing this phrase, the man thought that if someone else had thrown around such words in this situation, he would have considered it a strong exaggeration. But you can't doubt this guy because he's shown that he's capable of a lot. Most residents just send patients for tests for the sake of it, without knowing how to interpret the results. And this young man always has a reason for this. Moreover, he interprets these results flawlessly. It was thanks to Lee Soo-hek that he was able to cure a patient like Park Ki-tae, who had already developed a septic meningitis caused by leptospirosis, without complications. As he was leaving, the manager said that it was time for him to go, and therefore he would go. Looking after the man who believed in him, the guy was glad that everything turned out this way. Thoughtfully looking somewhere ahead, our hero thought that today was that very important day. Looking at the stage, the young man told his assistant that this was their debut performance, and therefore they needed to give it their all. Although just a few days before this, the situation was completely different, because Lee Soo-hyuk, clutching his head, screamed that this was something incredible. Baruta stated how good it was that the guy hung up, and then asked if the guy was so excited about what the director had told him, hearing that the boss had offered to attend the conference. Of course, the artificial intelligence had no idea about this, which it immediately admitted, but our hero understood what lay ahead of him, and this sent shivers down his spine. He spoke about the best hospitals in the country at a conference of physicians held at the Taiwan Medical Center, which aims to be the first in the world. The cases discussed there are published every 2 years in the medical center's collection of case histories. About 1,000 copies are printed, each edition always selling out. This all speaks for itself. This conference is very authoritative in their country. It is probably even larger than the annual spring conference. And the young man will have to cope with performing at such a serious event alone. Taking up his cane, Lee Soo-hyuk decided that he simply couldn't sit still before such an important event. Seeing the young man go somewhere, the Baruta asked why he was leaving, since he was going to rest while there were no people, but our hero explained that he wanted to study. The assistant said that this was strange to hear from a young man who kept finding things to do to put off acquiring new knowledge. But now everything has become different. And so the resident said that he was going to study because he needed to know more about leptospirosis, and as for the assistant, he would be better off sorting out the information. Baruta liked this attitude, and so he only encouraged the young man, saying that he would do everything that was necessary for his part. It wasn't long before Lee Soo-hek was already taking out every book he could find from the shelf. Looking at the thickness of the manual, the guy was glad that he had managed to find such literature. Our hero had heard about the book he saw in front of him. He also knew that in the 50s of the last century, it was as thin as a newspaper, but now you can kill someone with one like that. Hearing this, Baruta said that this trend shows how rapidly medicine is developing, and he added that it is not enough to just read textbooks. What is described in them is knowledge that is already several years old. There is nothing more to discuss there. After that, he said that it is necessary to read dissertations, and also that every year the medical website updates methodological recommendations on infectious diseases. The assistant, looking around, said that it would not be a bad idea to study the case histories from a prestigious medical journal in the world. Baruta found it strange to hear that the young man was not aware that many interesting things were written in such magazines. And, hearing the boy's excuses, he said that the director and the infectious disease specialist knew about many things while still students. The assistant understood where the young man was heading, after which he reminded him that he himself wanted to become the best doctor, and therefore it was necessary to work hard and strive for the best. Our hero slammed his hand on the table and asked the Baruta to tell him where he could find all the necessary data so as not to waste time. With confidence in his voice, Lee Soo-hyuk said that he would learn everything about leptospirosis before speaking at the conference. One of the guys who looked into the office looked in horror at our hero, who seemed to be talking to himself. Shin Hyun-tai greeted everyone, announced that the conference was open, and noted that their first-year resident, Lee Soo-hek, would be the speaker today. The man asked to welcome the young doctor, although the audience immediately began to discuss among themselves whether the presenters had made a mistake, whether it was true that a resident would be speaking to them. Some professors were indignant, not understanding why they should listen to what was essentially a student. It was simply insulting. Our hero did not hear all this. He walked slowly and confidently to the podium, knowing what he would speak. Standing before the highest-level doctors, the young man was ready to begin. He heard the Baruda express surprise that the boy was not nervous at all, and he only confirmed this, adding that he himself did not believe that he felt completely comfortable. With a smile on his face, the young man introduced himself, noting that he wanted to begin his speech. The young man added that he would dedicate his speech to the medical history of a 49-year-old man who was hospitalized with a high fever of an unspecified nature. At that time, there were no serious deviations from the norm, but due to a slight increase in the bilirubin level, the guy suspected the initial stage of jaundice, which also led to the idea that it could be an infection. Then our hero began to enthusiastically talk about everything he had done, as well as how he had progressed and what had led him to the idea of a diagnosis. What's interesting is that the Baruda who was supposed to be giving the hint remained silent, realizing that Lee Soo-hyuk was actually perfectly prepared. The young man was extremely self-confident, and there was nothing strange about this, since he read textbook after textbook, repeating everything several times. Having told everything from start to finish, our hero noted that this was the end of his story, and therefore he would like to finish his report. The professors sitting in the hall, having listened to everything, told each other that the story turned out to be very interesting, much better than they expected. But there was one doctor who thought to himself that everything went well, but he couldn't let the first-year graduate finish so well. The guy knew he couldn't just leave because it would be impolite, so he asked if anyone had any questions. Unexpectedly, infectious disease Dr. An Kuk-tae from Chilson Hospital took the microphone and said he wanted to ask something. Without a shadow of a doubt, the man said that he had made the correct diagnosis and prescribed the right treatment, guessing that Shin Heng-tae was probably the young man's supervisor. The doctor added that perhaps the resident did as Professor Shin told him, who looked at his colleague in horror while hearing the director lamenting. An Kuk-tae said he wanted to ask a few questions to see how much the boy knew about leptospirosis, and while the doctor stood on the stage, Lee Hyun-jung lamented why his colleague had not warned him that this man would also be coming to the meeting. Although the head of the department immediately stated with annoyance that no one had told him this either, since An Kuk-tae was not on the list, but since he had already arrived, it was impolite to throw him out. The hospital director thought that for a resident speaker, there could not be a worse listener than this infectious disease specialist. He bombards you with questions until you are exhausted, and it gives him pleasure to watch others in an awkward position. And then An Kuk-tae asked what diseases one should be able to differentiate from leptospirosis. Staring intently at the stage, the man demanded that the young doctor name everything by symptoms. Shin Heng-tae closed his eyes and said that he would have to console our hero when this was all over. At the same time, the director covered his face with his hands and complained about the difficult questions, and then said that after the conference, they would buy the young man some expensive alcohol. He added that the guy standing on stage looked like he was about to cry. Lee Soo-hyuk closed his eyes, seeming to have resigned himself to the fact that things would be difficult for him. Although a moment later he smiled and thanked the professor for the questions he asked, which he was ready to answer. The guy replied that a sharp rise in temperature is also characteristic of malaria and dengue fever, but these diseases can be excluded due to the lack of connection between the geography of their distribution and the patient. It is also necessary to differentiate this disease from hepatitis, typhoid fever, rickettsiosis, hantavirus. Hepatitis was excluded based on the results of the first blood test. There are no problems with the gastrointestinal tract. That is, it is not typhoid. Hearing the resident continue to speak confidently, Lee Hyun-jung jumped up from his seat and began to ruffle his colleague's hair, noting that their employee was easily showing this doctor who was who. But Shin Heng-tae noted with displeasure that the director had previously said that the boy was abnormal. But when he showed what he was capable of, the director immediately said that the young man was the spitting image of himself in his younger years. And Kuk-tae was also amazed, thinking to himself that in order to answer the questions, it was necessary to have a good understanding of many diseases. But after all, they were dealing with a first-year student. The resident could at least pretend that he didn't know something, but he just went and laid everything out on the shelves. The infectious disease specialist was not going to give up, and therefore stated that the question was too simple, and that was why it was possible to give answers so quickly. The professor noted that the young man had previously said that the patient suffered from Weil's disease, and therefore he should name the distinctive features of this illness. The guy smiled. He knew that he had hammered into his head almost all the information that existed today about leptospirosis. The assembled listened to our hero in amazement, not understanding how a novice first-year student could memorize everything so flawlessly, because this is something impossible. However, only An Kuk Tai did not like this, and he angrily asked if the disease was really characterized solely by jaundice. With confidence in his voice, Lee Soo-hyuk calmly said that in fact, that was not all. He added that the hallmark of the disease is petechial bleeding, nosebleeds, and as noted in the report, fatal cases are possible due to renal failure. And again, the infectious disease specialist asked a question, to which our hero answered perfectly, saying that leptospirosis can also cause severe pulmonary bleeding. He then added that it is a dangerous infection, since the mortality rate from it reaches 50% if the diagnosis is made late. Looking at all this, Shin Hyun-tae said that it was time to finish, since the professor looked pathetic, but the director sarcastically noted that those who got it from An Kuk Tai probably thought differently. And it was true, the victims who were also in the audience thought that watching this show was a pleasure. It was also pleasant to watch how sweat was running down the back of the doctor's head. At this time, An Kuk Tai was thinking about what the resident didn't know, deciding not to ask questions about diseases anymore. The man decided to ask a bureaucratic question about how leptospirosis is classified among infectious diseases. The professor hoped that such a question would definitely become a dead end, but the young man immediately stated that the disease was classified as a third-class infectious disease. An Kuk Tai asked with some uncertainty in his voice how things had been with this disease before, and at that moment our hero began to give out figures about how this disease was classified in different years. Listening to the answer with horror, the infectious disease specialist noted to himself that he himself did not know in what years these classes were changed. An embarrassed Lee Soo-hyuk told the Baruda that perhaps he shouldn't have mentioned the dates, but the Baruda remarked that he should value his knowledge and say everything he knows. Taking a deep breath, the young man declared that he had indeed prepared for a long time and therefore deserved respect, and then he accidentally let out an obscene expression. Although the young man's eyes immediately widened since he himself realized that he had said something he shouldn't have. Rumors immediately began to spread in the hall. Those gathered tried to clarify from each other what word the resident had said, but those who were offended by the doctor laughed. They declared that this professor was a really bad person, and therefore it was not surprising that Lee Soo-hyuk accidentally used a harsh word. And Kuk Tae was getting angrier with each passing minute, because he didn't understand how he could trap the young man. And just a minute later, the man picked up the microphone again to say something else. Both the director of the center and his assistant could not believe that the infectious disease specialist still wanted to say something. Our hero's assistant also did not believe that this man still had questions. But unexpectedly, the professor asked the resident to tell him about Weil's disease, or rather, about its name. Everyone in the room immediately started saying that this was the most absurd question they had ever heard. Covering his face with his hand, the head of the department noted that this was a disgrace, and the director said that he could no longer look at it. He had already stood up to say that the meeting was over, but at that moment our hero replied that Dr. Weil had given this name to the disease that he himself had discovered and classified. Still holding the microphone in his hands, the infectious disease specialist smiled, but remained silent. Although after a few minutes he was sitting in his place with his head down. Baruda asked the boy if this was the whole answer to the question, saying that the name did not indicate the properties of the disease, hinting that perhaps the answer was wrong, but the young man no longer cared. And he explained that there was no point in saying anything else if the professor wouldn't hear anything anyway, since he was sleeping. Shin Hyun-tae thought to himself that An Kuk Tae would not show up for a long time, and asked out loud if anyone else had any questions. The tired professors heard more in a few hours than they had heard in a couple of months, and therefore, of course, there could no longer be any questions. The director of the center understood this, and therefore decided not to take up any more time from himself or his colleagues, and he decisively declared that the 121st conference at the Taewa Medical Center was declared closed. And then he stood up to applaud the outstanding speaker and the wonderful resident. Lee Hyun-jung did not feel any discomfort in front of the young talent and his colleagues. Shin Heng-tae tried to stop his colleague, but he said that after such a report it was impossible not to clap, The guy did not give it his all. It was obvious that he had been studying for days. The professors looked at each other and clearly felt unsure of what they should do. But a moment later, they began to rise from their seats to also applaud the young man. The head of the department was sincerely proud that he believed in Lee Soo-hek and did not write off his skills as eccentricity. It was that moment when the two colleagues realized what a talented guy they had working for them, and therefore the center had a great future. Blushing, our hero smiled. He had never felt such delight and such pride in himself. The guy understood that such a wonderful day had come for him too. Although Baruda told the young man not to be too happy, since this was only the first step on the path to becoming the best therapist in the world. Looking at his assistant, Lee Soo-hek asked him not to anger him, and he realized that it was not always necessary to be strict, and therefore noted that, one way or another, it was an ideal performance for a debut. Sitting in the restaurant, the young man thanked the professor for the fact that he had succeeded only thanks to his instructions and faith. Other specialists stated that the resident had prepared well, and what's more, he had managed to prove to An-kuk-tai that he was neither the smartest nor the best. The men discussed how the professor had never sweated before, but it was still good for him to come down to earth a little. Baruda, seeing the young man's tension, immediately declared that he was not drunk, but was behaving strangely, and our hero tried to find the right words to explain it. Unexpectedly, Park Kook-jin, who was a professor at Chilsung Hospital, asked Lee Soo-hek if it was true that no one had prompted him. The guy's mentors immediately started yelling at their colleague, saying who he thought their therapists were, or that he thought that only their clinic had the best specialists. However, Woo Chang-yun noted that there was nothing offensive in such thoughts and words, since the new resident had indeed shown himself to be very professional. After this, a small verbal altercation began between the doctors regarding the fact that each would like to have a novice doctor like our hero working in his hospital. Baruda, looking at these quarrels, thought that a whole war had broken out for the sake of some trash, although the young man did not like that his assistant was calling names again. But he added that without his help, the young man would never have been able to deal with Professor An-kuk-tai. Although at that moment Lee Soo-hek was not interested in this, but in how the doctors recalled who lured whom to their hospital. Moreover, the men said that the luring of good specialists does not happen just like that. They are paid a lot of money because they are excellent doctors, and this is an excellent reputation for the medical center. Our hero did not understand who was being talked about, but he heard one professor say something in the ear of another, and the guy's eyes widened at what he heard, because he heard a sum equal to 1 billion. Barud said that one shouldn't be surprised that when Lee Soo-hek becomes the best therapist, he will receive even more money, and he only added that today he took the first step towards this. One of the doctors sitting next to the boy looked at him attentively, but remained silent. The specialist thought that it was a mistake to introduce this resident. He is smart and simple-minded. It was understandable that director Lee Hyun-jung brought the young man to show him off, but Professor Asin Hospital really wanted to lure the young man over to his side. Suddenly the argument became even louder, so several experts decided that it would be best to go outside and get some fresh air. Sitting silently, our hero saw how the men were getting ready to leave. At this time, Professor Woo Chang-yun turned to the guy and suggested that he switch to informal address, given that the situation was conducive. The young man immediately began asking questions about whether the resident had a girlfriend, who said in surprise that he was on his own. After that, the doctor asked the young man if he knew Woo Ha-yun, who was a fourth-year student at their university. Shin Heng-tai didn't like this conversation, so he began to say that a young man shouldn't propose to anyone, explaining that first-year residents were very busy. Hearing a new argument starting, our hero thought that, of course, he knew the girl in question. She was beautiful and a good student. Suddenly, the professor stated that this student was his daughter, although Lee Soo-hek awkwardly replied that he did not know this. Although this was not true, everyone was aware of this. The man explained that he wanted the boys to become friends since the girl also wanted to become a therapist. But Anson Hospital rejected her, and so he suggested that the young man meet the girl on the weekend. Looking closely at Woo Chang-yun, the intern thought that all this sounded good, but there was one problem. It consisted in the fact that it was somehow wrong to agree with the mentor. Realizing this, the professor himself turned to Shin Heng-tai, asking what he thought about this. The man sat there dissatisfied. He didn't like this idea because he understood that it was a pure scam. But the colleague continued to insist that this was not a date. His daughter was still young, and she was a first-year resident, almost a doctor. Although a moment later he changed the conversation to what department the guy would be doing his internship in next month, having learned that it would be oncohematology. In turn, Lee Soo-hek's mentor thought that hematology was considered the best department in the therapeutic department, and Professor Cho Tae-jin, with his character, would not allow absenteeism. Having called over the person he had just been talking about, Woo Chang-yun asked his friend to help him with something. With seriousness in his voice, the doctor asked what had happened. The head of the therapeutic department, Taehwa, did not think that these specialists communicated so closely with each other. However, the man explained that they were old friends, or rather comrades from their school days. He then asked the professor to give the young man a day off when he arrived at their department, explaining that his daughter wanted to talk to the young man and find out how everything was organized at the medical center. The man scratched his head, lost in thought, and said that he could let her go, but there was one condition. And he added that he wants the guy to succeed as well as he did in the infectious diseases department, adding that the young man has almost become a legend, and therefore he will be upset if the same does not happen in hematology. Our hero, looking at the Baruda, smiled. He was pleased that they spoke so well and warmly of him. Standing up from his seat, Lee Soo-hyuk happily declared that he would do his best to show his best side. A couple of days later, sitting in the hospital, the specialist was telling me that hospitalized patients often know the hospital better than the resident, so you need to be careful with them. He added that people need to be given medication on time. It would be bad if complications arose, but senior doctors should worry about this. For a moment, the doctor was silent. It seemed as if he remembered something. And indeed, he remembered a conversation with a professor that had happened recently. And therefore, he realized that this resident was not a simple one, but one with privileges. While drinking tea, Woo Chang-yun asked his colleague to give Lee Soo-hek an extra day off. And after a moment, he added that many people say that this young man is very talented, and therefore he wants to see if this is really so. The young doctor got the hint. He realized that he had to behave naturally with the resident, but give him the opportunity to express himself. Looking at the monitor, the doctor thought how strong our hero's patron was, if even the professor of this department personally came to ask for him. But a minute later, the specialist returned to the explanations, saying that it is more difficult with patients who are only on the path to cancer therapy. In their case, there is a risk of immune deficiency and rejection of the anti-cancer drug may occur. Listening to his new but temporary mentor, the boy thought that he wouldn't be given difficult cases anyway. Baruda immediately began to be indignant, explaining that there would be no practice with such patients. Our hero's assistant still hoped that they would get some difficult but interesting case. Unexpectedly for himself, the resident agreed with the Baruda, although he knew that most of the first years were thinking about how to make sure that nothing out of the ordinary didn't happen during their shift. And covering one eye with his hand, he added that if he had heard himself earlier, he would have thought that he was simply going crazy. But the assistant immediately declared that everything was fine. The guy was learning, that was good, and every day his store of knowledge was growing more and more. And it was true, Lee Soo-hyuk had gone through a lot to get to where he was. Suddenly, the doctor's voice brought the young man out of his thoughts. And while the Baruda noted that they had already heard all this, the resident could not behave so frivolously, and therefore said that he was listening, and very attentively. After this, the mentor said that the guy could turn to him for advice or help, but if someone was admitted by ambulance, then our hero should deal with them personally. The young man was stunned by such a statement. Moreover, it was strange that this was an order from the professor himself. As he was leaving, the doctor said that it was time for him to go, since his shift was ending, and he wished the newcomer a good shift without incidents. Baruda immediately started to say that this man had suspicions of a turtleneck, but the guy said that it was simply because this man had not yet published his dissertation. To qualify, one must publish at least one scientific paper, and this doctor has yet to make the necessary edits required by the scientific journal. Lee Soo-hek felt a little sorry for the man because he knew how much work it required. And then the hero's assistant declared that they had to find a topic for the dissertation overnight, since the guy would be in his last year before he could blink. The young man was dissatisfied, stating that he had only been studying for 4 months, but he did not have time to finish speaking because his phone rang. The young man looked closely at the phone, and seeing a number ending in 3 sevens, he thought about it. The reason was that only such numbers were used to call the ambulance. But the worst thing was that the main one had just left. And Baruta continued to note that this was even for the better. If the patient ended up in a serious condition, it would be to their advantage. The man who was brought in was immediately sent for an MRI, realizing that without this it was impossible to make an accurate diagnosis. The doctor, who was sitting in front of the computer, turned slightly when he heard someone enter. Seeing that a young man had arrived, he immediately asked if it was true that the young man was a therapist. Our discouraged hero timidly said that it was true, and his name was Lee Soo-hek, and he came because he was called. The doctor immediately assumed that the guy had been called by an intern, and then stated that he himself had told him that it was a mistake, since they didn't need anyone. The resident smiled and thought to himself that the hematoma was most likely not the cause of the problem. And he remembered how he had received a call a couple of minutes ago. Lee Soo-hek really didn't want to answer, but his assistant insisted on it because the doctor was on duty. When the young man picked up the phone, he heard someone announce that they had a patient admitted with nasopharyngeal carcinoma who had undergone radiation therapy 3 months ago, a man of 52 years old. Moving along the corridor, the guy knew that with such a disease, surgery was not necessary, only radiation therapy was enough. But now the man was brought in with paralysis. And this was extremely strange, which even the Baruta confirmed, hearing how attentively the young man was simultaneously trying to note something for himself. The intern explained that they had sent a request to neurology to rule out problems with brain function, but just in case they wanted someone else to come in from therapy. Standing before the senior doctor, our hero listened to his apologies related to his subordinate, as well as the fact that he had only been working for them for 4 months. The specialist noted that the patient's problem was related to the functioning of the brain, since there was a disruption in the functioning of the limbs and sense organs. In addition, the symptoms manifested themselves very quickly. Our hero thought that something similar could appear during an ischemic stroke or cerebral hemorrhage, and quite unexpectedly. At that moment, the Baruta began to say something about how he also agreed, but he did not finish speaking because the guy was looking closely at the photo. The assistant, who also wanted to make sure that the diagnosis was correct, looked closely at the screen. The doctors hoped that they would see something serious, but there was nothing. Everything seemed normal. Baruta was confused and asked the young man to wait a bit as he was in the process of analysis. The young man was angry that everything was taking so long, but the computer said that it was Lee Soo-hek's own fault, since his head was in complete disarray. The intern turned to his colleagues, stating that the test results were quite strange, since no abnormalities were found, although the patient was paralyzed, which simply could not be the case. And looking at the picture again, the men said that, judging by the man's condition, something was wrong. At this point, Baruta suggested that the guy request additional testing to extend the MRI to the cervical spine. And then he explained that if everything is okay with the head, you should look in other places. The reason could be in the spinal cord. And realizing that the patient had already been taken out of the cell, he began to rush the resident, saying that the examination was almost complete. After contacting the head doctor, Lee Soo-hek suggested that perhaps the cause was not in the brain and that there was a need to check the lower parts of the neck. The intern immediately reported that the contrast fluid had not yet been injected, and therefore they could illuminate the area below. Everyone agreed that special attention should be paid to the cervical spine, since the reasons for the patient's strange condition should be found. And again, the MRI machine began to move the man into the chamber. In a couple of minutes, everything was ready. Our hero's assistant noted that, as expected, everything was fine with the head, which was illuminated again to avoid mistakes. But there was some incomprehensible area that could not be seen. The senior doctor himself could not understand what they were seeing. If this was a relapse, then why did it happen so quickly, since the man had only been seen for an appointment a month ago, and nothing strange had been discovered then? The video and the endoscope image show the same thing, but the video still indicates that a relapse has occurred. Our hero thought that by looking only at the picture, one could judge the compacted tissues and the lesion that had perforated the back wall of the nasopharynx. And he also shouted that the lesion had eaten away at the spine, penetrated inside and touched the spinal cord, which was the cause of the paralysis. The doctor noted that this was the first time he had seen nasopharyngeal carcinoma act so aggressively, and the young man thought that the prognosis was not the best, but the tumor, which was discovered in time, responded well to treatment. But this is precisely what confused our hero the most. Although his assistant stated that medicine is statistics, and therefore anything can happen. He added that he assumed the patient had a relapse of cancer, and therefore it would be best to begin treatment according to the relapse protocol. Hearing the neurologist say that he would leave his neurology notes and ask the therapist for his opinion after being hospitalized, Lee Soo-hyuk said that he would do everything as needed. Left alone with the intern, the young man thought about the fact that relapse of nasopharyngeal carcinoma happens extremely rarely, and so quickly it is something impossible. Baruta didn't like our hero's attitude, and so he whispered to the guy not to conduct any investigations or invent anything unnecessary, but to act according to protocol. Not much time had passed, and the patient was already being taken out of the diagnostic ward to be sent to a regular one. Lee Soo-hyuk also decided to go out to see the man for himself and perhaps try to figure out what was bothering him about this whole thing. For a moment, the guy stopped. It seemed as if something had really confused him. The young man noticed that the patient's eyes were open, although this was strange. And while the nurse was saying that she herself didn't know why the man opened his eyes, our hero thought that everything was fine with his head. But why then did this man lose consciousness? Leaning closer, the attending asked the patient if he could speak after hearing an affirmative answer. The young man realized that the man's voice was hoarse, and the Baruta noted that judging by the damage revealed by the MRI, there was a high probability that the patient would not be able to move. In this case, it is incomplete paralysis, but in the case of cancer, complete paralysis should occur. The guy didn't back down, having learned that the patient remembered how he had recently lost consciousness. The resident wanted to find out in more detail what had happened to him. The man said that he was in the toilet and then suddenly felt very weak, after which he fell and then ended up in the hospital. It turns out that the body moved perfectly well until the onset of paralysis. This is not just strange, but very strange, and for our hero's assistant. The guy immediately began to scold the artificial intelligence for not knowing something, although it cannot know it if Lee Soo-hyuk did not read the necessary information in order to make an analysis based on it. After this, the young man turned his attention to the patient, telling him that he would take him back to the waiting room and personally examine him again. The man understood that it was for his own good, and so he agreed and turned in the direction where the young man was standing. Suddenly, Lee Soo-hyuk's eyes widened in surprise as the paralyzed man was unable to move. After exchanging glances with the Baruta, who was also confused, the resident now did not understand anything at all, because this man was brought in paralyzed and unconscious. But now he was moving. Once again, bending over to the sick man, the guy asked him to take his hand if possible. Just a moment later, the patient did it, and our hero noted that there was almost no strength in his hand, but the man performed this movement. Baruta, scratching his head, now said that most likely they had jumped to conclusions. It was certainly not cancer. The young man was angry and annoyed. He understood that if his assistant had no idea what the reason might be, then what should he say? Having gathered himself, the artificial intelligence said that first it was necessary to analyze the patient's lesion based on already recorded cases, of which our hero had very few. The young man asked his assistant with irritation why he had to talk about the same thing again, but he said that he was only stating obvious facts. A moment later, the patient, who had let go of the resident's hand a second earlier, suddenly closed his eyes and fell silent, which alarmed the guy. The young man began to ask what had happened to the man, believing that he might have simply lost his voice. Lee Soo-hyuk knew that he needed to figure this out, so he asked the patient to blink twice if he couldn't speak. It was clear that we were talking about some kind of disease that causes unstable paralysis. At this time, in one of the city's restaurants, doctors were celebrating a corporate event in honor of former lecturer Cho. Professor Cho thought that there was no need to worry about the prices, since the hospital was paying for everything. Although everyone was still acting quite reserved, perhaps because everyone had to go to work the next day. Although, on the other hand, there are also doctors who are not at all concerned about many circumstances. It was about endocrinologist Professor Seo Hae-seok, who was enjoying the evening. Turning to his colleague, the man asked how things were going with the brilliant first-year student who was constantly bragging about. Hearing that it was difficult for the doctor to say anything since it was his first day, the professor began to complain that Professor Shin only talked about this guy, and he was already tired of listening to him. And a minute later, he continued to say that he was not at the conference because Professor Onkuk-tae had failed him so badly that he did not want to go to such events unless there was a need to speak. The specialist thought it sounded rude, although So Hae-seok would have been easily put down by any other excellent doctor. And while the man was picking up the bottle, Professor Cho continued to think that one would have to look hard to find such nonsense as in his colleague's report. How interesting, at that time it was difficult to believe that such a person would actually achieve a professorial degree. But this was not achieved by hard work. On the contrary, he is simply the son of the director of the insurance company, Tewa. A typical promotion, but those who paid for it all are unwavering in their confidence. The man didn't have time to drink because at that moment his phone started ringing. Seo Hai Seok immediately reached for someone else's phone, hinting that the specialist was probably being called by some beautiful woman. After looking carefully at the number, the man thought about it, although he remained silent. But a moment later, he announced that they were calling from the hospital, although the patient's condition was stable. But Professor Cho was alarmed that the call did not come from the senior resident. The doctor finally remembered that Lee Soo-hek was on duty today. And smiling, he thought that it was quite possible that something interesting was waiting for him, just like the resident. The man decided to answer formally, saying that it was Cho Tai-jin from the oncohematology department. Suddenly, our hero, who had done this before, began shouting that he was calling to report a patient from an ambulance. Realizing that the young man was yelling into the phone so loudly that everyone could hear it, the professor asked him to speak a little quieter. Lee Soo-hek immediately said that they had received Park Kang-won, who had been hospitalized with stage 2 cancer 3 months ago, received radiation treatment as prescribed by the professor, and was admitted to the department with paralysis. A month ago, this man visited an otolaryngologist. Then he underwent all the necessary diagnostic procedures. He was completely fine. Cho Tae-jin suggested that these were metastases, but the resident explained that an MRI had been performed, but no changes were detected, and the neurologist on duty also agreed with this. And he added that he decided to check the cervical region. The young man did not know how to explain what he saw, and so he said that he would send a photo so that the doctor could look at it himself. While waiting for the picture, the professor was puzzled as to how this could have happened, since the treatment had been quick and had produced excellent results. When the doctor looked at the photo, his eyes widened, and it seemed he couldn't believe what he was seeing. Fearing that it might be a relapse, Cho Tae-jin jumped up from his seat, declaring that he was near the hospital and would be there soon, and the guy should just wait for him. After this, our hero reported that they had taken blood for analysis, but the results had not yet arrived. But the specialist shouted to immediately request a CT scan and prepare a medical history. Less than half an hour had passed and Cho Tai-jin was already there, asking our hero to take him to the patient. As he walked down the corridor, the man thought again that everything had been fine during the examination, and if the symptoms had appeared due to a relapse, he needed to undergo radiation therapy as soon as possible. The state of paralysis cannot be delayed since the person may not recover. And while the professor was worried that he might have missed something, the young man who was walking next to him wanted to tell him something. Our hero dared to say that there was no exact diagnosis, although the man angrily declared that this was all nonsense, since the patient had relapsed. And continuing to walk forward, he explained in the same irritated tone that now was not the time for chatter. It was necessary to conduct an inspection as soon as possible. Not wanting to give up, the guy said that the patient's paralysis manifests itself differently depending on time and position. Moreover, the symptom did not appear gradually. The paralysis came on suddenly, so the young man suspected brain damage. If the source had been cancer, there would have been no hesitation. And he added sheepishly that cancer doesn't squeeze, it just destroys. Cho Tai-jin stopped and finally heard the doctor and quietly stated that it turned out that it wasn't cancer at all. The young man explained that the picture was chaotic, but there were many lesions of a non-cancerous nature. But differentiation was possible because they had not spread in the form of infection. The professor said out loud that they were lucky, but to himself he thought that at first the guy's words seemed like nonsense. But gradually they acquired meaning. Realizing that it would be better not to rush this resident, the doctor asked what the young doctor suspected in this case. Our hero fell silent for a moment and remembered how Baruta had recommended some time ago to simply leave all this to a more experienced doctor, since ignorance of the disease could cause harm. At the same time, Lee Soo-hek's assistant, based on the test results, was inclined to believe that these were infections or necrosis, but not cancer, although such cases are isolated. Although the resident wanted to understand the problem and be sure of what could have caused the nasopharynx damage. There is no infection that would affect the nasopharynx selectively. Autoimmune diseases very rarely affect only the nasopharynx area. Baruta said one possibility is Wegener's disease, but that possibility is also slim. Suddenly, our hero screamed. He thought about necrosis, although the assistant did not understand what was going on. What guesses did the resident have? And he began to explain that the patient had received radiation therapy, and quite strong radiation, specifically to the nasopharynx. Returning to the conversation with Cho Tai-jin, the young man confidently noted that he suspected post-radiation necrosis. The young man was 100% sure of this diagnosis, although he did not know how the professor would react to it. Lee Soo-hyuk knew that he was just studying, so it wouldn't be a big deal if he made a mistake. The doctor thought it was too strange that paralysis manifested itself differently depending on the position of the person's body and his condition. It was strange to attribute it to an infection. Anti-cancer therapy has undermined the immune system, and among the pathogens that cause nasopharyngeal carcinoma, bacteria or fungi are identified that can cause such a severe infection, but the infection is not likely to spread so quickly. However, it should not be ruled out, as it could lead to the loss of the patient. When asked about possible treatment, our hero said that he would prescribe high-potency steroids. The reason is that it is the most optimal drug in the fight against necrosis, since its effectiveness has been proven. Lee Soo-hyuk was a little confused by all of this, because even though he was almost certain of the diagnosis, he still couldn't rule out something else. Baruta agreed with this. He said that treatment with steroids is dangerous, because if the causative agent of the infection is a fungus, then it will cause a rapid fatal outcome. The guy was unhappy that his assistant thought that the resident was completely stupid and wanted to kill the patients. Baruta did not calm down, although the young man asked him to shut up, explaining that the professor was already looking at him askance. The man studying our hero thought to himself that they actually had a rather strange person working in the hospital, although a smart one, and they told him about it. So, Shin Hyun-tae stated that the young man is competent, but sometimes some strange things appear in him. The hospital director also said that sometimes our hero stares into space, and there are times when he even mutters something under his breath. At the same time, experts stated that this man does not pose a threat, and therefore there is definitely no need to be afraid of him. Although Professor Cho still had doubts about the last phrase, because in front of him at that moment stood a young man with wild eyes. For a moment, Lee Soo-hyuk was distracted from his conversation with his assistant, remembering that he was not alone, and therefore it was necessary to return to reality. After clearing his throat, the guy said again that the patient had received treatment in combination with cisplatin, which already indicates a decrease in immunity, so it cannot be ruled out that the infection could have been caused by bacteria or fungi in the nose. Cho Tai-jin listened attentively to the resident and didn't even show that he didn't like anything. Although the Baruta was immediately indignant that the young man repeated everything word for word as he had said, although he did not entirely agree with it. Suddenly, the professor spoke up and agreed with the resident, but the resident continued to explain that if this was aspergillosis fungus, then after steroids there was still a chance, and he fell silent. However, if it is mucormycosis, there is a chance that the patient will simply fade away before their eyes. The man was amazed at how everything could have been thought through to the smallest detail, and then asked again what they should do in such a case. The young man confidently said that in order to reduce the risks and also to direct treatment towards the infection, he would use the hyperbaric oxygenation method. This chamber is a capsule with a high concentration of oxygen in which the patient is placed. It was originally intended to treat carbon monoxide poisoning or infectious diseases, but over time it has been shown to have positive effects in treating other ailments, which is why it is so popular. The man was surprised by the answer, although he did not expect so much from this guy. And a minute later he said that he would fill out the application himself and then asked if there was anything that the resident would like to do. Lee Soo-hyuk laughed sheepishly, thinking to himself that he had thought of becoming a professor of infectious diseases, but he liked hematology too. And then he decided he wanted to do some tissue testing after hearing that the Baruta had exactly the same idea. Deciding not to delay, the young man added that he believed it was necessary to conduct a tissue analysis. This will allow us to understand whether the fungus was actually the causative agent. If the result is negative, we can begin treating the post-radiation necrosis directly. The professor smiled and said that he trusted this patient to our hero, adding that he should report on all actions and that he would take care of the pressure chamber for now. Cho Tai-jin knew that the analysis would be a bit difficult, but he wanted the young man to complete this part of the task. Our hero was about to leave, But at that moment, the doctor asked who the guy's supervisor was. Hearing that it was senior resident Kim In-soo, the professor thought for a moment. And then he said that he saw that Lee Soo-hek did not need any supervisor. He could act independently and report all patients requiring hospitalization to him personally. The young man was embarrassed, but he was pleased that he was thought of so highly, first in the infectious diseases department, now here. After some time, our hero was already standing in the room of his difficult patient and telling him in detail how all the stages of treatment would proceed. The man could already speak a little, and therefore stated that he had no questions, since everything was perfectly clear. The young man was already glad that the paralysis had eased a little in this man, but he wanted to know whether the pressure chamber would have the desired effect, although the assistant did not know this. Lee Soo-hek didn't understand how the Baruda couldn't know this, but he noted that there wasn't enough information yet to give an accurate prediction. And he added that to become a great doctor, you need not only cramming, but also experience. And therefore it does not depend on the Baruda, everything also requires time, and in order to speed it up, you have to work hard. Someone's mobile phone rang unusually, and they immediately reached for it. The girl told her father that she was sitting in a cafe and studying, and there was no one next to her. The brunette stated that she understood everything, and that she would be getting ready very soon. Hyun didn't understand which young man they were talking about, so she asked again. However, she then remembered that it was precisely about him that Professor Shin Heng-tai had been talking lately, even though he was behaving like a child. The man said that this young doctor was unique. If there was a video from the conference, he would show it, and then asked if this young man was not famous at school. Woo Ha-yoon noted that she didn't remember such a thing, hearing that this person, on the contrary, knew her well. At this time, the Baruda was scolding the outstanding person who was being discussed, and he was scolding him because the young man was again sitting and watching something on the internet. Professor Woo Chang-yun suggested that his daughter meet our hero at least once. He noted that she wanted to get into the therapeutic department, and therefore it was better to ask the guy in advance about everything he knew. This would help with employment in the future. And without waiting for an answer, he said that he had things to do, and therefore needed to go, adding that he had already given the guy her phone number. While sipping her cocktail, the girl thought that she would have to meet some brilliant first-year student, but she couldn't even guess that this genius artificial intelligence was counting him out for the fact that instead of watching the video, he could have already started writing a dissertation. The young doctor gave some instructions to our hero, who watched everything attentively and remembered. At that moment, a professor entered the office and immediately inquired about the patient's condition. The senior immediately began reporting, explaining that the discharge of patients who had undergone anti-cancer therapy and had no complications was planned. The man was glad that no one had any deviations, and therefore said that even this happens in their practice, and it is wonderful. When asked about Park Kyung-won's condition, Lee Soo-hyuk said that he was transferred from intensive care to a regular ward 2 days ago, and the amount of painkillers was cut in half. The young man also added that the man can only move around in a wheelchair for now, but he does not experience any severe limitations in his movement, and therefore there will be no complications in the functioning of his nervous system and thinking. After this, our hero stated that otolaryngologists perform endoscopy every morning and evening, and that today's report with images had just recently been brought in. Cho Tae-jin said that this was a huge improvement considering the condition the man was in when he arrived, although the doctor was not happy with the blurry areas. The man thought that the inflammation had subsided significantly, but the hole seemed to have grown larger. It goes right through the spinal cord. If water accidentally gets in there and an infection begins, there will be trouble. The guy advised to continue treatment first. As soon as the situation with dead tissue improved, he suggested restoring it surgically. Although the professor believed that the outcome could be disastrous, the resident said that treatment began immediately, so the intervention could be performed endoscopically. He added that he believes the success rate is high if you restore through the tensor fasciae lata. Thinking to himself that this guy was incredible, the professor made sure that the young man explained everything to him in such a way and not just said that surgery was needed. Next, Cho Tae-jin asked about a certain patient, wanting to know if she had been transferred to the hospital, since when he called to check, the nurses said the room was empty. At this point, another nurse approached our hero and said that she had heard that someone would be admitted to them from outpatient treatment, but a place in the ward was not yet ready. The professor folded his arms and told the senior resident that they would not see the woman today, as their shift was ending, but that Lee Soo-hek would meet her. The embarrassed senior resident was both happy and embarrassed, thinking that he was usually left with the first years. But this month, thanks to our hero, he was very lucky. Before leaving, the professor added that their patient had undergone about 3 courses of chemotherapy with Folfox to treat colon cancer. Then it was possible to completely eliminate the lesion. But after conducting an MRI of the abdominal cavity to track the recovery process and other things, he fell silent, cursing at the computer. When the picture finally loaded, the senior resident immediately said that it looked like there were metastases in the liver, which Cho Tae-jin confirmed, but asked our hero not to talk about it, since a number of examinations still needed to be carried out. And while the doctor was giving instructions, the Baruta said that in his opinion it was thoughtless to cut out the liver because of metastasis, although even Professor Kim Jin-shil signed up to such a necessity. Our hero's assistant wanted to say something else, but immediately began to scold the young man, saying that many of the scientific data were blurred because the guy dozed off while reading the papers. Lee Soo-hek, realizing that he had once again gotten carried away with the Baruta, returned to reality, saying that he would do everything as it should be. And finally, the professor said that they needed to check on the remaining patients and then quickly leave, since he still had a meeting. Having finished everything that was planned, Cho Tae-jin asked the young man to coordinate the tissue analysis for tomorrow. As he left, the man wished our hero a wonderful shift. The senior resident also decided that it was time to leave. But before that, he allowed his colleague to go home after meeting with the patient and also rest. On the one hand, it was nice to hear, but on the other hand, there was some kind of emptiness inside our hero. It was related to what Baruta had said earlier, and so the guy immediately asked his assistant to tell him in more detail why it was impossible to take part of the liver for analysis. Baruta said that he had little information. He needed to find again the information on which the young man fell asleep, recalling that it seemed to be radiology for May 2014. And he added that this was a dissertation he had read, but the full title was not retained in his memory. After this, the assistant said that if our hero felt guilty, he could apologize or bang his head against the wall, which outraged the resident. But the artificial intelligence did not calm down, continuing to say that the guy definitely remembers the video for which he traded his studies, but does not remember the dissertation. The young man was so busy searching that he didn't even notice how some person appeared in the hall. Although after a few minutes, the young man nevertheless turned his head towards the entrance, realizing that someone had come, despite the late hour. The resident didn't know if it was patient Park Sang-ah, as he had never seen her before. Baruta said that the woman did not look skinny and emaciated, and Lee Soo-hek noted that the patient looked quite healthy, even walking confidently. The nurse who came out to meet the woman addressed her and said that she would take her to her room. And while the employee was leading the patient somewhere down the corridor, our hero was watching her closely the whole time. The artificial intelligence assumed that the cause was not metastases, because in that case there would be accompanying symptoms, but there didn't seem to be any. The young man thought he might find something in the outpatient records, but there was nothing special or suspicious. However, the resident understood that metastasis is the most important and dangerous thing that can happen during cancer treatment, so the patient was hospitalized based on the images, and therefore it is necessary to dig into scientific papers. Baruta immediately stated that if he had hands, he would have figured everything out long ago, which angered Lee Soo-hek even more. In order not to waste time, the young man began to search for everything related to radiology. The guy didn't understand why there was so much work, and the Baruta said that if our hero hadn't fallen asleep, then we wouldn't have to resume the search now. Now the assistant was angry, saying that when he wakes up, the resident starts yelling at him, and if he doesn't wake up, he's also unhappy about it. To calm his assistant down a little, the young man said that he could sometimes play the role of a boss and command, especially when it was useful for the cause. Suddenly, the nurse turned to the therapist, explaining that the patient he was waiting for had come to see him. Looking at the woman, Lee Soo-hyuk immediately introduced himself, saying that he was the attending physician. And in a calm tone, he explained that Professor Cho Tae-jin had said that he would come for the morning rounds, but for now the woman should sit down. Park Sang-ah replied that the doctor had explained to her in general terms how the examination would be carried out, but she just didn't understand what it was all for. The guy knew that he couldn't talk about the main thing, and so he noted that she told him that it was necessary for verification, and the professor would tell him about the rest. After this, the resident asked the woman if she had experienced any abdominal pain in the last month. hearing that she sometimes experienced heartburn. Our hero again began to inquire about how much heartburn was bothering him and whether the patient was taking anything, but she said that everything was within normal limits. The young man then moved on to questions about vomiting and nausea, but Park Sang-ah explained that the nausea may have only happened once. And a minute later, the woman was already telling us that in the last month she felt better than before, she began to sleep well, and in general, no problems arose. Having informed the patient that only blood would be taken from her, the young doctor let her go and began to look for the necessary materials. Baruda immediately stated that the questions yielded nothing. Moreover, they confused them even more, because Park Sang-ah did not complain about anything. The AI again didn't like that the guy didn't want to admit that they were one while he was swearing. Lee Soo-hek, wanting to change the subject, said that they should at least look at the video of the abdominal cavity, hearing the assistant say that he remembered that there was something similar to hepatitis. And so that the artificial intelligence wouldn't grumble too much, the guy said that he was lucky because he was fourth in his year, and therefore a good student. Baruda said that this means that among our hero's classmates, there are at least 3 people with a more outstanding brain. After sitting at the computer for 3 hours, the young man noted with despair in his voice that he had found nothing. And so I asked my assistant if he really remembered that it was May 2014. Maybe the month or year was wrong, and I was firmly convinced that there could be no mistake. Our hero no longer counted on anything, realizing that he would most likely have to go home without finding anything. Although the next moment there was no trace of the melancholy left, as the young man noticed something. Pointing to the screen, the resident said it was a video about liver disease caused by gastrointestinal cancer treatment. Hearing the AI say it was 99% true. Realizing that he had finally achieved what he needed, the young man turned on the video. Looking closely at the screen, our hero declared in surprise that this was it, and the effort was worth it. The surprised and at the same time delighted assistant also understood that he now had complete information, and he understood why there was no need to take any fabrics. Smiling, a satisfied Lee Soo-hek said that there was only a little more to wait, and the nice thing was that the professor would be very surprised. The next morning, Hwang Sung-woo came to work in a great mood, wishing everyone a great day. The young man even asked how our hero slept and whether he had had enough sleep, receiving a sluggish but satisfactory answer. The nurses, who knew the doctor well, began to notice that this kind of behavior was unusual for him, and so they wanted to know what was the reason. And while Hwang Sung-woo was clearing his throat, Lee Soo-hyuk thought that this man would not be happy when he heard what he had to hear. And he kept saying that he had been working in the hospital for 3 years already, and therefore how could he not be happy about it, which immediately surprised everyone. And then the senior resident started talking about the beauty of the hospital and other nonsense, thinking to himself that he had simply gone home early and had a good time. A couple of minutes later, returning to reality, the young man asked how the patient was doing, learning that the woman was fine and had slept well. But when our hero said that there was one catch, the guy thought that he should have come earlier. Looking at his watch, Hwang Sung-woo decided that he had relaxed too much, which was unacceptable for a senior. Then Lee Soo-hyuk said something that shocked the doctor, as he stated that Park San most likely did not have any metastasis. The senior resident immediately began shouting that the young man had no right to talk about such a thing, since even the professor himself noted that this was so. If there were any doubts, it was better to watch the video. But suddenly the doctor fell silent, and it seemed as if someone was weighing on him. It was the professor, and realizing this, the young man immediately felt ashamed of his behavior, and therefore the guy could hardly utter anything. Cho Tai-jin immediately asked why the department was so loud, but the senior resident was too scared to say 2 words. Sitting down in a chair, the man stated that he had heard the entire conversation and therefore wanted to know where the conclusion was based that the patient did not have metastasis. Pointing to the computer, our hero asked everyone gathered to watch a video that would provide answers to all the questions. When the video started, the professor said that everything looked as if there were no formations. However, the guy asked if men felt like the boundaries had collapsed a little bit. If you look at the tumors, the boundaries are a little blurry. And then he added that everyone knows that metastases found in the liver, on the contrary, have clear outlines. And therefore Lee Soo-hek carefully watched this video again. The professor, in turn, noted that perhaps it looks that way now, but later these tiny tumors will metastasize. But our hero immediately asked the boss to look at the barely noticeable shadow. And he said that if you compare two lesions, the first lesion is their patient's, and the second lesion is the patient's with metastasis, then Pak San's tumor is not as bright. Cho Tai-jin didn't understand anything, but the young man stated that there was a very good reason for this. Surprised, Huang Sung-woo also asked the guy not to delay his answer and tell him what he had managed to find out. Looking at his astonished colleagues, the young man decided to wait a little to stir up their additional interest, and only then began his story. In Korea, gadoxetic acid is used as a contrast agent in MRI. Baruta, who was keeping an eye on Lee Soo-hek, said that he was taking too long, and if he were in his place, he would have told everyone right away. However, it was important for the first-year student to tell everything in order, showing that he really understood the topic. And so the young man once again clarified that this gadoxetic acid is widely used in their country. It is available in every hospital. The reason is that there are many patients with liver cancer in Korea. This component is very well absorbed by liver cells, which is something that not all specialists, even the best ones, know about. After this, our hero suggested watching the video again to point out that the tumors of patient Pak San and the patient with metastasis are completely different. In women, it is lighter, which means that the acid has been perfectly absorbed. But there is a nuance. This is absolutely normal for normal liver cells. However, if it were colon cancer tissue, the acid would not be absorbed because there are no hepatocytes in cancer tissue, which is very clearly visible in the video. The professor asked in amazement whether it was true that in that case, it was not liver cancer, having heard that, in the opinion of the resident, it was a normal deposition of hepatocytes. The doctor did not understand how this was possible, but our hero explained that the patient used Polfox for chemotherapy, and in addition, a drug called oxaliplatin was used. Suddenly, his colleagues shouted in unison that they understood everything, although Huang Sung-woo thought to himself that he really didn't understand anything. But the guy continued to explain that oxaliplatin is toxic to the liver, and therefore this complication was caused by this drug. At this moment, Cho Tae-jin said again what he had said before, that there were no formations in the liver. There was a moment of silence as everyone seemed to be trying to process what they had just heard. After this, the professor tried to say something, but he did not understand how to describe his delight. An executive car was moving quite quickly along the city roads. Our hero was in it, thinking about how he was chilling out during work hours, although other first years could not even dream of something like that. Hearing the young man praise the expensive car, the Baruta said that it was much more expensive than this one, and its owner was priceless, considering what he could do. But Lee Soo-hek didn't quite agree with this, saying that his assistant couldn't go to the store and wasn't able to cook anything. But he did not calm down, declaring that thanks to him, the young man could actually earn money and buy something. At that moment, the professor looked in the rearview mirror. He was used to seeing the resident's eccentricities, and therefore was not surprised that he was again muttering something under his breath. The amazing thing is that this boy somehow managed to think of deposits, although this is something that would not have occurred to even an experienced specialist. It was quiet in the car because everyone was thinking about something of their own, about what had happened that morning. Huang Sang-woo also thought that he had known the professor for many years, but he had never seen him so happy, especially when they were making their rounds. Entering the woman's room, he said that they would not conduct any further examinations, that it was necessary to simply monitor her health and come back for an MRI in a month. Cho Tae-jin himself thought that when he told the patient the good news, he felt very happy. And after that, the doctor ran to our hero and told him not to eat anything. There were no urgent patients, and therefore it would be better to have lunch together somewhere. On the way to the establishment, the professor asked if our hero knew fourth-year student Woo Ha-yun and received an affirmative answer. After that, the guy answered another question about Professor Woo Chung-yun, with whom they were at the corporate party, but whom he had not yet managed to call. The boss suggested that our hero meet with this man the next day, saying that they didn't have any urgent patients anyway. It was something incredible, and so Lee Soo-hek, of course, agreed, although he understood that he did not know what he would talk about with such people. And after a short pause, the man added that it would be good if Ha-yun came too. She was a very good girl. Only a few minutes passed, and the car stopped at some inconspicuous hall. Looking at the sign, the guy was annoyed. He thought that they would go to a grill cafe and eat something tasty, but they ended up in an establishment that served ox leg soup. Our hero thought that the same thoughts had occurred to the senior resident, who turned to the professor. However, he said with a smile and enthusiasm that he really loves Xiaolongtang and therefore thanked the man from the bottom of his heart. Cho Taijin noted that the food at this place is not just delicious, it is so excellent that you will want to come back again and again. Looking dejectedly at the front door, the guy thought about becoming a professor. It is necessary not only to treat people perfectly, but also to communicate with the authorities. Despite our hero's dissatisfaction, the men had a wonderful rest and switched from work to ordinary life. The next day, Professor Wu Changyun's daughter was sitting in the cafe, carefully reading something on her phone. Lee Soo-hyuk stood on the street and couldn't bring himself to enter, even though he always arrived on time everywhere. Baruda, seeing the boy's uncertainty, told him to think less and do more, or better yet, open the door and come in. Instead, the resident stated that when he found himself in the cafe, he would ignore the assistant, since there was no goal in appearing crazy in front of this girl as well. Looking around, the guy remembered reading the message that Ha-yun had sent. She said that she had heard about the young man from her father and his colleagues and was looking forward to meeting him. The girl arranged to meet at a cafe located near the hospital at 3 o'clock in the afternoon. Baruda scolded the resident for reading this message more than once, even though it was a very ordinary message. Our hero's assistant was also irritated by the fact that he had bought an expensive suit, shoes, and even got a haircut especially for this meeting. Although the guy justified himself, noting that he was an ordinary person who should take care of his appearance, there was nothing reprehensible in this. For a moment, the young man dove into his memories, saying that when he came to school, there was a real commotion. The whole reason was this beauty, whom everyone was afraid to approach, because she seemed unapproachable. The young man was very shy at the time, and therefore did not dream of meeting Ha-yun. Baruda asked if our hero had hidden his last name when he recognized the beauty, but he said that it was not important at all. Looking in the mirror, Lee Soo-hyuk saw a rather attractive man looking back at him. Despite this, the resident thought that he had no hope at all. An orphan, problems with his legs and other nuances. This is not at all what others like, and therefore you can forget about something good. In order not to become despondent, the young man turned to the artificial intelligence and asked it why it had suddenly become quiet, which was unusual for an assistant. And then he said that when you lose something, you always get something in return, and something much better. Heading towards the entrance, our hero once again asked the Baruda what he wanted from him. For a moment, the guy fell silent, because through the glass he saw a girl sitting in the cafe. It was surprising that there was still half an hour before the meeting, and she had already arrived. Perhaps it was a coincidence, or perhaps not. The assistant thought that the young man's thoughts were occupied with Ha-yun's beauty, but it turned out that he noticed that the glass was half empty, which meant that the beauty had arrived even earlier. And again, the Baruda asked the resident not to pretend to be Sherlock Holmes, which made him very angry. The guy added sarcastically that it was precisely because of the artificial intelligence that was sitting in his head that he was having strange dreams. Having dared to enter the cafe, Lee Soo-hyuk once again warned his assistant that he would ignore him. The girl immediately noticed the young doctor who approached her, and therefore immediately greeted him loudly. Our hero smiled sheepishly and waved his hand, hearing the Baruda nearby say that the guy had already failed, since he had a wild expression on his face. The resident was worried and had no idea what to talk about, so he immediately began asking if the student had any questions about the therapy. The brunette said that internal medicine is more interesting to study, although her father assures that other departments are much more interesting. Lee Soo-hyuk thought to himself that this was not a very profitable field. There were many rumors about a dark future. And he asked the girl out loud whether she thought she would ever regret her training, and then added that the practical application of knowledge on a patient is the most interesting thing that can be. Looking out the window, the resident asked what else his companion was interested in knowing, realizing that this was why they had met. It seemed that during the conversation, the young man relaxed, forgot about his shortcomings, and immersed himself in the present. This seemed to be the case with Ha-yun, who was casually conversing on a variety of topics. And only Baruda looked attentively at the boys, but the expression on his face caused extreme concern. The student accidentally glanced at her watch and said that it was already 5 o'clock in the evening. Time had flown by very quickly. Understanding that this was a hint, our hero suggested to his new acquaintance that they get ready. Taking the tray with the food she had eaten, Ha-yun noted that it was time to go for a walk. Walking down the street, the young man finally paid attention to his assistant, asking him how he had managed to remain silent all this time, and also what he had been talking about. He stated that he analyzed this girl based on the data he received and learned something. And then he shouted that the guy could take her hand, although Lee Soo-hek didn't understand how that was possible since they had just met a couple of hours ago. Baruta said that the young man should have no reason not to trust him. Since he was the best diagnostician in the world, he had accumulated data on the emotional analysis of the student. And then he asked if there had ever been a time when artificial intelligence had been mistaken in hearing that such a thing did not happen. The assistant said that there was no need to hesitate. It was necessary to act quickly, looking at the frightened guy. Our hero was embarrassed, looking somewhere to the side. It seemed that he was trying to make a decision, which was given with great difficulty. And while the beauty was declaring that they were coming, the intern had already begun to reach out his hand to hers. There was a fear in Lee Soo-hek's eyes that he had never seen before, but at the same time there was something else that was barely perceptible. The young man, crossing his arms, stared blankly at one point and remained silent. With tears in his eyes, he thought that he shouldn't have done this, but now it's all in the past. Baruta apologized, stating that his analysis was always very accurate, and therefore he himself did not understand where the error came from. But the young man had no time for this. Gritting his teeth, he tried to say something, although he himself did not really understand what exactly. Suddenly, our hero shouted a curse word, so loudly that the nurses passing by the office did not understand who was cursing. The frightened girls discussed among themselves what it could be, although they had no idea who was expressing their emotions so loudly. Covering his head with his hands with despair in his voice, Lee Soo-hyuk said that everything was so good until he took Ha-yoon's hand, and now what to do and how to look the professor in the eyes. Barut immediately began to calm the guy down, saying that he shouldn't take everything to heart. That's the first thing. And secondly, he himself wanted to take the beauty by the hand, and therefore there's no need to blame anyone. Hearing the resident threaten to shut down the artificial intelligence, he stated that it was impossible. You could even ask the neurosurgeon. Suddenly, our hero received a message from his friend. She apologized, saying that she simply did not know how to behave and therefore immediately slapped him, but wants to make amends and invites the guy to dinner. The embarrassed but happy young man said that the girl wanted to meet him, which meant it was a success. Barud looked closely at his host, noting that there was no need to be so happy. He added that he had just finished studying the cause of the error that had occurred and that something like this should not happen again. The assistant explained that he was collecting data by analyzing our hero's memories. When analyzing the relationship between a man and a woman, he referred to something in the rain, the Song Kyun-won scandal, the secret garden, and something related to a goblin. After that, he added that according to the model, if the young man had the charm of any of these people, but did not finish speaking because Lee Soo-hek asked him to shut up. But the assistant continued to explain that it was necessary to take this situation as a lesson, and in the future it would be necessary to conduct the most thorough analysis. The artificial intelligence didn't have time to finish speaking because a message arrived, so it told the guy to answer. Taking the phone in his hands, the young man thought that he could write. Perhaps he should say that he deserved a slap in the face, and therefore he was the one giving the treat. However, Baruta didn't like this. He thought that Lee Soo-hek was going too far, although the young man didn't want to hear anything. By clicking on the icon, the young man reported that he had sent the message after all, and therefore all that was left was to wait. All this time, the guy continued to engage in self-flagellation, scolding himself for being tactless, but he needed to be polite. Not much time passed before the answer arrived, but our hero was in no hurry to read it. The young man squatted down and said that his friend had suggested meeting on the first Saturday of the following month, and the resident was glad that he hadn't screwed up after all. But the assistant continued to lecture him about how Lee Soo-hek got slapped on their first date. Although suddenly the artificial intelligence noted that there was still time and asked what the guy was going to do, although he did not understand what was being discussed. But after a minute, the resident noted that he planned to eat something tasty as well as study alone, having received approval. The young man stood in the corridor and looked attentively somewhere. His former classmate was standing next to him. Suddenly, the senior resident called out to the young man and said that it was time for them to go. Otherwise, they would be late. Our hero asked if Hwang Sung-woo would go to the meeting, but he said that he would like to, but his duty was waiting otherwise, and he fell silent. But Lee Soo-hek finished the sentence for him, although not out loud but to himself, because otherwise everyone would think that the guy does nothing all day long. As he entered the hall, the young man realized that he was at the weekly meeting of Taewa Hospital, not the therapy presentation held at the end of the month, but one of the hospital's main events. There was a case with one of the patients observed by Professor Shin Hyun-tae. Although effective treatment was prescribed based on the results of the analysis, the man's condition was not the best. And so this case was referred to the meeting for discussion, which means that, and at this point, the thought was interrupted. However, he then continued his thoughts about how all those people who are involved in internal medicine will gather. Despite their busy schedules, they will be here. And not only senior residents will come, but also doctors, professors, and associate professors. It was amazing, but the first-year resident didn't know if he would be able to say even one word there. Baruta was confident that the boy could do absolutely anything, since he had already made some progress in his studies. After this, the assistant stated that he had made a decision, although it was not entirely clear what it was connected with. And he added that one should not behave as he did yesterday, when our hero ordered himself delicious food for dinner, but there was so much of it that he could simply burst. The young man the night before really didn't want to listen to the artificial intelligence, saying that he wouldn't be able to eat so deliciously anytime soon because he would be on duty frequently and eating in the canteen. And while the Baruta was saying that the food in the cafeteria wasn't that bad, Lee Soo-hyuk said that an assistant who could taste could enjoy jjajangmyeon. After thinking for a moment, the little friend realized that he was being offered noodles with black bean sauce. And at that moment, the Baruta realized how bad the food was in the hospital. And in order for the young man to earn good money and eat more delicious dishes, he decided that no matter what he had to do, the assistant was ready to confront the whole world. However, our hero said that nothing needed to be done. For now, one should just say something at the meeting or remain silent. At that moment, the assistant pointed at Shin Hyun-tae, saying that he was also already rushing to the meeting. The guy felt a little embarrassed when he thought that this man was looking at him suspiciously. The young man felt uneasy also because everyone was talking about how the head of the infectious diseases department was going to take Lee Soo-hyuk to work for him after his residency. Although Baruta immediately asked if the infectious diseases department brings in a lot of money, isn't that the most important thing? After this, the young man said that he did not think that his little friend would start thinking about money so much after one jjajangmyeon, adding that he hoped to earn enough for a chicken with the help of the Baruta. Having patted our hero on the shoulders, the man jokingly said that he was walking around doing nothing. And a moment later, he changed the subject, explaining that if the resident wanted to say something at the meeting, he could do so. And then he warned that to do this, he would need to sit in front and not sit in the back, like many other residents, and if he performed well, he would receive additional annual leave. Entering the room, the guy saw his colleagues who were quickly filling the hall. He also noted that the older residents asked the first-year resident why he had come, and then asked him to move back. Lee Soo-hyuk decided that he would definitely sit in the front, hearing the assistants say that they would shout at the top of their lungs to be heard. But the young man immediately declared that they shouldn't shout. After all, they were decent people, and therefore they needed to show their good side. After this, the two began to squabble again about who was right and who was talking nonsense. And if our hero began to calm down a little, then the assistant explained that he had again conducted some kind of analysis, hearing that this analysis would again turn out to be false. A minute later, the resident was already sitting in his place, leaning on his cane and sighing heavily. The young man wanted to sit in silence for a while, but at that moment his gaze became wary and restless. The director happily announced that he had not expected to meet our hero, although it was useful for him to attend such events. And while the man patted Lee Soo-hyuk on the back, he thought that it was no wonder that the seats next to them remained empty. After a brief pause, Lee Hyun-jong asked if the resident had researched the topic that would be discussed at the meeting and received an affirmative answer. And he immediately asked the next question regarding whether the young man found this incident rather strange. Realizing that he needed to say something, the guy immediately turned to the Baruta, but he offendedly stated that he was constantly making mistakes, and therefore his analyses probably made no sense. Despite what our hero said, his assistant remained adamant, saying that he was not going to provide his analysis anymore, so as not to embarrass himself once again. And then he said that he was tired, and therefore decided to take a little nap and restore his strength. After a few seconds, the Baruta changed his mind, and then noted that the director liked strange cases, while the guy said that he was interested in something, but he did not want to rush to conclusions. With a sly grin, the man said that the young man was absolutely right, and that it would be better to listen to the speaker first. Suddenly, a man appeared on stage, And then people in the hall started talking about the meeting that was about to begin. Standing at the podium, the young man introduced himself, saying that his name was Kim Jin-en. He was the chief pharmacist and a third-year resident. Baruta immediately noted that they say that this person has a difficult character, which was confirmed by Lee Soo-hek. This guy won't say a word even if he gets arrested. He really has an unbearable character. At this point, the speaker said that a 78-year-old patient with anorexia had been admitted to their hospital, suffering from back pain caused by spinal stenosis that had developed 5 years earlier. The man was able to dress and eat independently, but 6 weeks before admission, he began to spend more than 12 hours a day in a lying position, complaining of fatigue. 2 weeks before admission, the man began to complain of loss of appetite and nausea, and the number of meals was reduced by half. Our hero reasoned that all this indicated a general weakening of the body, although the patient was no longer young. Hearing that the patient was hospitalized because he could no longer dress himself, the director thought that this was good, since some people die from weakness without finding out the reason for it. Kim Jin-en continued to say that the chest X-ray clearly showed darkening of the bronchial and lung areas, and the analysis also showed an elevated CRP level, so levofloxacin was prescribed. After 5 days it got better, and then it got worse. A repeat X-ray did not reveal any changes. The body weakened for no apparent reason, and therefore they decided to refer this case to a meeting. At that moment, everyone present noticed someone raising their hand. The director, who was also the chairperson of the meeting, asked what Kim Jin-en himself thought about this. The young man said he thought it might be levofloxacin-resistant pneumonia. Answering the director's question, the resident said that this disease is not a symptom of a systematic weakening of the body, and therefore immediately received a question as to why it was pneumonia. Kim Jin-en began to justify himself, saying that the patient was, after all, 78 years old. But then a remark appeared that the disease could be in an advanced stage. Turning to his colleagues, the director asked who the attending physician was and would also like to hear other opinions. The first to raise his hand was Huang Xiongwu, who was in his second year of residency. Hearing the bearded man suggest lung cancer, Lee Soo-hyuk immediately covered his face with his hand, thinking that this was really stupid since it didn't indicate anything. Lee Hun-jung angrily shouted at the person who answered that he was a second-year student, implying that an intern could have said such nonsense, but not a second-year resident. After looking carefully at everyone present, the director asked who else wanted to speak. The man folded his arms and addressed all the doctors at Taewa Hospital, although he was in no hurry to say what he wanted from them. But the specialist did not finish his sentence, because he turned his head and looked somewhere. His eyes met the eyes of our hero, who was sitting just a few centimeters away from him. The guy looked intently at his boss, but was in no hurry to say anything. Lee Hyun-jung smiled and thought that he had forgotten about his beloved subordinate. Handing the microphone to the guy, the director asked the first-year resident what he thought about it. Reaching for the microphone, the young man whispered something under his breath. And then, standing up from his seat, he looked carefully at his senior colleague and said that he wanted to say something. The hospital director looked closely at the young man, hoping that he would at least voice some interesting idea. Many in the hall immediately began to gossip that this guy was definitely the director's son, although others thought that this man lived for his work, and therefore it was his family. Holding the microphone in his hands, Lee Soo-hyuk collected his thoughts, thinking about how best to convey what he wanted to say. The guy loved intrigue, and therefore was not going to rush anywhere, knowing that they would still listen to him. Realizing that the pause had dragged on too long, the Baruta had already made a remark to his master, saying that it was time to begin his story, since the audience might form the wrong opinion. The young man said that the patient was 78 years old. His height was 163 centimeters. His weight was 62 kilograms, which was a good ratio for an elderly person. The man quit smoking 30 years ago, and a chest X-ray shows no evidence of lung cancer, suggesting it is a chronic condition. And looking somewhere, he added that the symptoms were too strange for acute pneumonia. There was no cough or breathing problems. Kim Jin-en was beside himself with rage, but our hero continued to explain that general weakness was the only symptom the patient was indicating. The director suddenly intervened and stated that these two diseases were excluded. Almost everyone guessed this. But what diagnosis would the resident have made? For a moment, the guy hesitated. It was so noticeable that even Shin Hung-tai became wary, not understanding whether there would be any answer or not. The man finally realized that the resident probably needed data and a presentation to rely on, and so he hurried to hand over the remote. Kim Jin-en, who was watching this, thought angrily about why this guy was being given such privileges. And seeing how our hero was already turning on the slides, he also noted that the head of the infectious diseases department and the hospital director were most looking forward to this guy's answer. Baruda, who was looking at Lee Soo-hek attentively, was glad that his master was not nervous at all, despite the fact that he did not take any sedatives at all. Realizing that the projector was already running, the young man thought everything over again and told his assistant that there was no point in worrying, since he had already stood on a stage before and on a bigger one. Pointing to the board, the young man asked everyone to take another look at the results of the numerous blood tests carried out throughout the hospitalization period. The sodium level of a healthy person is from 135 to 145, and in a man it is 127, but he has no edema or swelling. Desmopressin, previously used to treat nocturia, may have caused hyponatremia. Low sodium levels are unlikely to be related to current symptoms, but suggested discontinuing this medication. Smiling Lee Hyun-jung thought that so far the guy was saying everything correctly. Not all the deviations were related to the current symptoms. The head also understood that a good doctor must study each deviation separately. Lee Soo-hek continued to say that the hemoglobin level was 9.1, but it should be from 13 to 17, which means there is anemia, and the reticulocyte production index dropped to 1.3. This means that the red blood cells are not destroyed, but simply have not yet formed, and accordingly, there are disturbances in the hematopoietic function. Shin Hyun-tae knew that what was mentioned was a common symptom in the elderly, but the boy had to explain why the patient had such abnormalities. Switching the bullets, the resident stated that if everyone present looked at the composition of leukocytes in the analysis, they would understand that it had increased several times, since it was over 28,000. You might think that this is caused by an acute infection, but monocytes account for a whopping 31% of white blood cells. The audience listened attentively to the speaker. Some clearly liked his reasoning, while others were dissatisfied. Hearing our hero say that the hematopoietic process has decreased and the formation of monocytes says a lot, Kim Jin-en began to scold himself for not even taking this fact into account. And a fellow resident of the same age said that no matter how much he thought about it, only one disease came to mind. And then he noted that this was blood cancer. Given the rate at which the disease was developing and the patient's age, it was most likely multiple myeloma. The head of the infectious diseases department immediately asked if this was true, then what tests would need to be done. And the young man immediately replied that it was necessary to do an MRI of the spine, CT scan, peripheral blood smear, and immunoelectrophoresis. Professor of infectious diseases Jang Duk-soo, whose eyes almost popped out of surprise, said that the plan was good when asked what his personal plan was. After kicking the man's leg under the table, Shin Heng-tae thought that the professor was only talking, although he immediately stated that they could not completely rule out the presence of an infection. He added that it would also be necessary to conduct a repeat CT scan of the chest, blood, and sputum tests. The manager raised his hand and said that there was no need to give this matter to anyone, after which he stated that he wanted the patient to be looked after by Lee Soo-hek from the first year, who had laid everything out perfectly and therefore could monitor the progress of the disease. The man thought to himself that no one was protesting, but there was nothing strange about that, since no one could handle it so well. But there was one more thing. The young man has rightfully shown that, despite being a newcomer, he is already at a completely different level. Standing on stage, our hero was proud of himself, and also of the fact that he was able to move towards his goal, which was especially valuable. In a few days, the guy was expecting a serious conversation, although he didn't even know about it yet. Cho Tae-jin walked confidently down the corridor, realizing that he absolutely had to find the young man. Seeing the resident in his place, the specialist immediately began asking him how things were going with the treatment of the difficult patient. Lee Soo-hyuk immediately explained that fortunately, the diagnosis was made in time, and the diagnosis was correct, so the response to chemotherapy was positive. Seeing the uncertainty in his subordinate's voice, the man immediately finished the sentence for him, saying that this man was too old and that this was the main reason for everything. With his head down and sadness in his voice, the guy stated the fact that this man was getting worse. He added that he prescribes an IV with a solution to avoid side effects, as well as steroids. Baruta generally suggested starting dialysis, although the young man himself is in no hurry to do so. Remembering what our hero had seen over the past few days, he understood that overloading his body would not be the best decision. This patient's condition is deplorable, although the staff are trying to somehow alleviate it. But we must understand that most likely, the old man will face a worse outcome, although, of course, we would not want this. With sadness in his voice, the professor also stated the fact that nausea, vomiting, and even diarrhea were not caused by taking medications, since these are symptoms of acute renal failure. And he added that this was a problem. If the diagnosis had been made 2 months earlier, it would have been much easier, because he had heard that before the illness and before being admitted to the hospital, everything was fine with this person. The resident thought that the man couldn't even get to the bathroom on his own, but the assistant said that he had seen something like this before, and therefore believed that there was no point in further treatment. Cho Tai-jin, leaning on the table and folding his hands, was silent. He understood that it was difficult for the guy to say what he had just said. The doctor, who was used to fighting for human lives, would have dreamed of the old man getting better, but his condition said otherwise. Suddenly, the professor asked if the guy had managed to obtain consent to refuse resuscitation of the patient. Hearing that this was not the case, the doctor said that in that case he would get it himself after lunch. And again, with some resignation in his voice, our hero added that everything was clear to him. Looking at the resident, Cho Tai-jin thought that this boy was good, but he had no experience, and he said out loud that getting better was very good, but not in this way. It is always important to do everything for your patient. This is the main mission of everyone who goes into this profession. However, it is also necessary to remember the person's age, the financial situation of his guardian, and smaller details. There was silence for a moment. The professor looked at the young man attentively, not knowing what else to say to him. Then, gathering his courage and looking at the frightened Lee Soo-hek, he asked if he had ever seen a patient die. And while the young man gave a negative answer, the doctor continued to say that the resident had given preference to internal medicine, and therefore should understand that this day would come anyway. Cho Tai-jin didn't want to hurt the boy, but he also didn't want to lead him into a world of illusions, and so he said that the patient had no chance, no matter what his doctor felt. Hearing about the second stage, the professor replied that, given this nuance, the patient should still live, but he is old and his kidneys cannot cope. Increasing the intensity of chemotherapy will only make things worse, and therefore should not be done. And in a more stern voice, he said that the young man must understand that he would not be able to save everyone, and that he also needed to be prepared for this. Our hero was silent, thinking to himself that the specialist was right. He was saying everything correctly, but that didn't make things any easier. Looking intently somewhere, the young man also understood that he did not want to give up. Not now, not in this situation. Baruta, who heard all his master's thoughts, agreed with him, although he noted that there was something else. And smiling, he added, "There is something they have not yet resorted to." So Lee Soo-hek turned to the man and told him the same thing he had heard from his assistant, namely that there was something he had not yet tried. Earlier, Baruta explained that the previously planned bone marrow transplant after chemotherapy was not possible due to the patient's kidney failure, but that it was not the only solution. That is why the young man confidently stated that it is possible to use a transplant of hematopoietic stem cells, which surprised his colleagues. The senior resident continued to sit as he was, because he did not understand what the first-year student was even talking about. The young man was interested in how this boy managed to find out so accurately about the disease, think everything through, and offer the most innovative method of treatment. And our hero continued to say that the functioning of the patient's bone marrow must have been suppressed by anti-cancer drugs, and a large number of bad cells died, although the professor immediately noted that not all of them. The guy said that, of course, not all, but some number would live. At this time, the professor, looking at the calendar, thought that, according to the medical history, a lot of time had passed since the anti-cancer drugs were prescribed. Lee Soo-hyuk continued his boss's thought that it made sense to perform a bone marrow transplant. In this way, immune cells produced in the bone marrow will be able to defeat cancer cells. For a moment, the room was silent again. The young man didn't know what else he could say, waiting for Cho Tai-jin's reaction. And he thought that the transplant of someone else's bone marrow after the use of anti-cancer drugs is a kind of initialization. The essence of this innovative treatment is to remove the patient's bone marrow and replace it with another. But to do this, It is necessary to get rid of not only the bone marrow itself, but also the cancer itself, a condition that is impossible for this patient. It is known that some hospitals are already trying this treatment method, but it is still not official. But the surprising thing is that the first-year student not only knows about it, but has also managed to study it quite well. When the doctor spoke about the risks, the residents said that they were worth it since there were no other options except for this one. There was a donor. Looking ahead, the professor thought that perhaps he was actually giving up too early. Our eyes, in turn, were shining. It seemed that he was full not only of determination, but also of confidence. And so the young man, without a shadow of a doubt, said once again that he wanted to try because they had nothing to lose. Cho Tae-jin looked at the resident attentively. It was difficult to tell anything from his expression. Suddenly, the man turned to Kim In-soo and asked him to prepare an aseptic solution as soon as possible. Turning his gaze to our hero, the doctor confidently stated that they would try to do it. The young man smiled, as did his assistant, and it seemed that he himself did not believe that he had managed to convince the specialist to do something impossible. The senior resident wanted to say something, but was too surprised to say anything. And what could he possibly counter the professor himself with? Understanding Kim. In Sue's confusion, the doctor once again told him what he needed to do, instead of continuing to sit there doing nothing. After a while, Lee Soo-hek stood and looked at his patient through the glass. Baruta said that after repeated administration of the anti-cancer drug, the patient's immunity is 0, and under normal conditions it is impossible to survive in such a state. Looking at the man, the young man said that he really hoped that the transplanted bone marrow would defeat the cancer cells. Although the assistant immediately stated that relying on anything was actually hopeless, seeing that the guy was not reacting to this remark in any way because he was lost in his thoughts, the artificial intelligence addressed him again. He suddenly asked why the young man did not object to him, which was very strange, hearing how the resident said that there was no point in it anyway. However, the Baruta did not calm down, continuing to be interested in why the young man behaved this way, because usually he argues or opposes something, but he certainly does not remain silent. And Lee Soo-hek was thinking at that moment that if he dug deeper and tried to figure it out, maybe this patient was just lucky. And the assistant immediately stated that if we are talking about a bone marrow transplant, then yes, the Association of Hematopoietic Stem Cell Centers will call as soon as the person puts his name on the list of those waiting for a transplant. And then the Baruta switched to why such a topic suddenly became interesting to our hero. The resident stated that when the professor asked for consent to refuse resuscitation of the patient, for some reason he did not want to do it. There was nothing special in the doctor's words, but the young man wanted to try his luck. The artificial intelligence noted that if Lee Soo-hek agreed to this, he would not, since thanks to this, the man would receive treatment. Although the resident understood that in fact it was not thanks to this, but thanks to the bone marrow donor. He added that bone marrow donation and transplantation are not widespread in Korea. Even a patient who could live with healthy bone marrow will die due to the lack of a donor. The guy was sure that if he encountered a similar case, he would definitely be ready to become a donor. The surprised assistant immediately began asking why our hero had such a strange expression on his face. He added that it shows how a young man who always dreamed of becoming a great professor and earning a lot of money now thinks about helping others. Realizing that the guy was angry, Baruta decided to change the subject and said that for now it was not worth thinking about it. It was better to focus on treating the patients that were already there. The young man immediately said that these were indeed wise words that should always be remembered. And the artificial intelligence looked at its owner in surprise, who was clearly up to something. The young man raised his index finger and then began to look at it closely. The resident stood for a moment, looking from his assistant to the patient. A few minutes later, Lee Soo-hek slowly walked towards the exit. However, written on the glass in barely visible letters were words asking the patient to wake up. A couple of days later, our hero and his colleagues were awaiting an examination, which they attended together with the professor. The doctor politely greeted the patient and began asking about his health and how the man slept. Lee Soo-hek was interested in all of this, but he was slightly distracted when his assistant approached him and said that he had noticed something when they were walking here. And pointing to some patient, he added that he had a very strange pulse, which immediately raised alarm. The young man thought that the Baruta was making something up again, but he said that he was developing his skills, after which he asked the young man to turn around unnoticed. The resident did as he was asked, looking where the resident pointed. Our hero immediately noticed the guy lying on the couch, noting to himself how he could have gotten there. Baruda immediately stated that the man's story was in his database, which the young man immediately asked to display on the screen. Lee Soo-hyuk immediately learned that this patient was only 18 years old and had multiple myeloma, a chronic leukemia that had spread to the brain, liver, and lungs. Unexpectedly, the assistant was surprised when his master said that the patient was awaiting a bone marrow transplant, which meant that no treatment was actually being carried out. The orderly looked ahead in horror. He could not believe that there was no other way and that all he could do was wait. Looking again at this unfortunate man, the guy thought that he was still too young. Suddenly, Lee Soo-hyuk was brought out of his thoughts by the professor, who called him by name and asked what had happened and why the young doctor was not listening to the patient. The guy was about to come up with some excuse, but the Baruda shouted that something was wrong with the pulse, which made our hero turn around again. After this, he stated that when the patient's blood pressure dropped, his heart rate increased, which was an extremely dangerous condition. The young man looked attentively at both the patient and the equipment, but it seemed that the resident could not collect his thoughts to begin to act. The young man, his eyes wide with surprise, thought about his plan of action, realizing that someone's life depended on it. Suddenly, our hero screamed, turning to the professor. Fear and a desire to help as quickly as possible were visible on his face. The guy was screaming so loudly that it seemed like the whole hospital could hear him, and the resident told everyone that the patient's blood pressure was dropping. Running up to the patient, Cho Tai-jin immediately asked how much juice was in the body, learning that it was already more than normal. The frightened woman in the room heard the doctor shouting for him to be given a suppressant as soon as possible, although she did not understand what he was talking about. The doctors immediately changed the IV, added some medicine to it, and began the infusion. The professor asked a second later what was happening with the heartbeat, although the senior resident stood as if paralyzed and silent. Hearing that there was no pulse, the specialist angrily shouted why the other residents were standing there and doing nothing, ordering them to begin cardiac massage. Moreover, our hero Cho Tai-jin asked to take a sample of arterial blood. For a moment it seemed as if time stood still, because the young man stood with a syringe, and the doctor was already preparing the electric shocker. However, for some reason, the professor abandoned this idea, throwing down the stun gun and turning to his subordinate. The man, taking off his robe, told the young man to immediately step aside because he wanted to perform the cardiac massage himself. A moment later, the specialist began to demonstrate his skills, but not to show off, but to save lives. In order to help himself, Cho Tai-jin even stood with one foot on the bed, doing everything possible to ensure that the procedure had the desired effect. It seemed as if time had stopped. The unfortunate woman was crying. The doctors were shouting, but there were no particular changes. Our hero immediately ran to the patient to draw blood as quickly as possible. And while the boy was doing his job, he watched his mentor in surprise, amazed by what he saw. Lee Soo-hyuk thought to himself in fear that his ribs and lungs were damaged. And drawing blood, I decided for myself that now it was completely unimportant. It was necessary to resuscitate the patient and then deal with the rest. Having completed the assigned task, the first-year resident turned to the professor, saying that he had done everything, and now it was necessary to conduct an analysis. Taking off his robe, the guy continued to note that he would do the heart massage himself, but it would be better for him to do something else now. Having quickly replaced the boss, our hero began to perform the manipulation with all his might. The guy pressed and released his chest again and again in the hope that the readings would begin to rise and return to normal. With each passing minute, the desire to help grew stronger, but the despair and feeling of helplessness also increased. At this point, Baruda began to say that multiple organ failure is a serious pathological condition and further treatment makes no sense. Looking at this guy, Lee Soo-hyuk thought to himself that this man was very young, which meant he had to live without wanting to listen to his assistant. However, he continued to say that it was too late. Nothing could be done, although the young man insisted that he would still find a way. Baruda didn't want his master to go into illusions, and therefore reminded him that there was no other way. Bone marrow was the only hope and cure. And he repeated again that it was too late, seeing how the resident was shouting at him to shut his mouth and not talk nonsense. Artificial intelligence did not consider it reasonable to remain silent. It reminded that the desire to save in this case is pointless. You can't save everyone, and therefore it is necessary to stop. Despite this, the young man did not want to do what he was told. Looking at his sweaty master, who was trying his best, the Baruda asked him to stop and look around. It seemed as if Lee Soo-hyuk had immersed himself in some world of his own in order to renounce reality, to pretend that it did not exist. But suddenly our hero turned his head and looked closely at his colleagues, who had been standing nearby all this time. They were silent, their faces expressing the same sadness and melancholy that the first year felt, but they held on. The young man didn't want to say anything, and so he simply watched, not knowing how to behave in this situation. A moment later, someone's scream was heard in the room. The woman fell to her knees in front of the couch and began to cry loudly. Covering her face with her hands, she tried to hide from everyone who was in that room, as well as from the grief that had befallen her. With each passing second, this crying became louder and louder, but there was nothing that could be done to help her, and so the doctor stood and simply watched, not knowing what else they could do. Putting on his robe, the professor spoke loudly to Lee Soo-hek, who was still standing over the patient, hoping to do something. The doctor said that it was enough to do cardiac massage. And coming closer to the resident, he explained that the attending physician and another professor had already arrived here, and it would be better for them to step aside. The guy listened attentively to his boss and mentor, but he didn't believe that that was all. The young man continued to look at the deceased guy, whom he could not help in any way, although he wanted to. Standing in the hallway and hearing Cho Tai-jin's question regarding the first year's condition, he stated that he was fine. Smiling, the doctor noted that he was very glad to hear this since this is important. And then he suddenly asked why the young man was so worried, since this was not his patient. Moreover, he was not familiar with this man. Our hero lowered his head and began to apologize, which puzzled the doctor. Continuing down the corridor, the professor told the boy not to worry, as there was nothing wrong with caring for a patient. And turning slightly, he added that the young doctor was waiting for someone who really needed attention and warm words. This was the patient that Lee Soo-hek had led and helped. Having come to his senses a little, our hero was delighted by this, and therefore declared that he was looking forward to the meeting with impatience. After this, all those gathered headed forward along the corridor to the next ward. At this time, the guy thought that Professor Cho Tai-jin was not heartless. It was just that human emotions also had a limit, especially when it comes to the hematology and oncology departments, which are directly related to death. No matter how strong a person is, if he keeps burdensome thoughts, he will break down sooner or later. And if it was not possible to save the patient, it cannot be said that he was simply unlucky. As they approached the room, everyone was silent, each one immersed in their own thoughts. Lee Soo-hek was looking forward to meeting the older man they had given a chance to. He was the one our hero wanted to see the most. Through the glass, the young man saw the patient. He was sitting and looking attentively out the window. By the way this man looked, one could say that he was feeling better. Suddenly, the man turned his head and saw the doctors, who were about to come in to see him. Seeing the smiling patient, the boy heard the professor say that the examination showed that the bone marrow engraftment was going very smoothly. Entering the room, the doctor continued to say that there was a slight increase in temperature, but this was due to an inflammatory reaction caused by the death of cancer cells. Answering the man's question, our hero explained that the body now contains the bone marrow of another person, and therefore it recognizes the current carrier as a stranger, and therefore fights off the cancer cells. The patient laughed, asking if everything was okay with him now. The senior resident hugged the boy and said that everything was fine. But as for Lee Soo-hek, from that day on he was heading to the endocrinology department, which he should probably be grateful for. Having bowed, the resident said that it was time for him to go, and he wished the man a speedy recovery and continued health. Looking at our hero, the patient said that he felt very sorry for this boy, whom he called a poor child. Having laughed, the guy jokingly said that he had been appointed as the attending physician after all, and therefore did not want the patient to disappoint him with tears, and hearing the apology, he added that now another doctor would look after the man. The professor explained that the attending physician would come soon, but for now it would be better for the elderly man to rest a little to gain strength. Only a few minutes had passed, and the doctors were already walking down the corridor, getting ready to continue their rounds. Suddenly, the senior resident asked a rather strange question about what he should do. Turning around, Cho Tai-jin scratched his head. It seemed like he himself didn't know what task to assign to the medic. Our hero and his assistant also watched the professors carefully, waiting to hear what he would say. Laughing, the doctor turned to Lee Soo-hek, saying that he could become a professor of hematology, hearing the answer that it was possible if he wanted to. And then he changed the subject and said that the young man would be moving on to the endocrinology department, where he would also be doing an internship for a month. For a moment, the specialist thought. He remembered his colleagues, as well as the speech of the young doctor, and thought for a moment. Suddenly, Cho Taijin grabbed the young man by the shoulders and told him not to be upset if things were different this time, hinting that the young man would not be as comfortable as he had been before. However, looking at the talented boy, he asked him to do everything possible to show himself from the best side. Removing the bandage from his face, Lee Soo-hek opened his eyes, realizing that it was already morning, and therefore it was necessary to get up. Baruta immediately acknowledged the fact that his master had woken up and joyfully wished him a good morning. The guy was angry about this, but the assistant said, "Isn't there a connection between getting up in the morning and wishing a good morning and a wonderful day?" After this, the artificial intelligence stated that since the resident had woken up, it would be good to look at the data that was recorded the day before, since it was very interesting. Looking at his watch, the young man realized that it was only 6 o'clock in the morning. Of course, for some people this is normal, but on the condition that you did not fall asleep at 2 o'clock in the morning. Covering his face with his hand, the guy continued to say that everything would have been fine if it weren't for them, although he didn't specify who exactly he was talking about. Our hero remembered how the day before the guys offered him just a sip of beer, and while the elder was dissatisfied with something, the bearded man asked if perhaps the boss also wanted to drink a little. Moreover, he said when they would be able to sit like this again. Lee Soo-hek, who was given a can, decided that since everyone was drinking, he could too, although he didn't really like it after what happened to him. Baruta also agreed that it was legal because the young people were not on shift. The guy agreed with this. He understood that if you want to drink, it is better to go and do it. And stretching, he added that if the others had decided to drink, then why drag a first-year student into this matter, who still had duty ahead of him? But the assistant proudly declared that there was no need to be a weakling, adding that he had offered to refuse many times, but as usual, he had only argued. But the young man claimed that he was in his first year of residency at the very bottom of the therapeutic department, although the intellect declared that the young man had a strange worldview. And he added that, based on the results of the analysis, the attitude of other residents towards our hero is quite ambiguous. But Lee Soo-hyuk immediately thought that he knew his assistant well, which meant that the analysis might not be accurate. Realizing this, Baruta stated that he is an artificial intelligence, and therefore constantly improves by learning from mistakes. And he added that he can confidently say that he is doing much better than before. Taking the tray of food, the boy asked if his assistant wanted to say that the residents considered him their boss. The young man did not understand how this was possible, since he was in his first year, but Baruta said that his analysis indicated this. But our hero believed that he, as usual, had messed something up. But the artificial intelligence did not give up, saying that there was no reason to consider the guy as a boss. Perhaps there was some problem in the logical chain. And again, the resident reproached the assistant, saying that because of his chain of logic, he received a slap in the face from the girl he liked. And turning his gaze to the tray, he added that there was nothing wrong with that, since their meeting would take place next week, although Baruta put in a word here too, stating that Ha-yoon didn't feel anything for him. Lee Soo-hek was angered by this statement and ordered his assistant to remain silent. This quarrel could have continued for a long time, but at that moment the young man heard someone call him by name. The professor and director greeted our hero, telling him that he was having breakfast too early, despite the fact that he was not on duty, and then asked if he knew how to leave after all this. In response to questions, the young man stated that he was not actually on duty, but had decided to get up early, although he immediately added that his duty was still ahead. After that, the guy said that Professor So Hai-shok appointed him as his endocrinology doctor. For a moment, Lee Hun-jung fell silent and looked up at his colleague, calling out the name of that same professor. After that, tapping the young man on the shoulder, as Cho Tae-jin had already done, he wished our hero good luck. Although he immediately asked who the young man's supervisor was, he said it was Kim Jin-in. There was silence between the men for a moment, and then the director sympathetically said that he wished Lee Soo-hek strength. Smiling, Shin Hyun-tae said that if it was too difficult, the guy should tell him everything. He would help and figure it out. After that, the director said that no matter how good our hero was, he was still good compared to Shin Hyun-tae's father-in-law, although he immediately asked why the conversation was brought up again, saying that his colleague was simply exaggerating. The man added that whether he was exaggerating or not was of no importance at all. And he said that if he hadn't been a master, he would have been a professor, by the way. Regarding the professor, his father is the dean of Taiwan Medical University. Suddenly, the director began to justify himself, saying that he sends dissertations to the New England Medical Journal when he is bored, and therefore his colleagues are on different levels. Shin Heng Tai shouted that a person who was incapable of even completing a dissertation would live in shame. Lee Hyun-jung did not remain silent and said that his colleague somehow lives. He is a professor at a large hospital, but he cannot pay the bills. Our hero and the director looked closely at the head of the department, who a second earlier had hit the table with force. Suddenly, he announced that he no longer played golf, although it was not entirely clear what this meant. The first-year resident looked at his mentors carefully, unsure of how best to handle this situation. Having become kinder, the director said how this could be, because it is very simple, you just need to move the ball. And he suggested playing, jokingly saying that it was his fault that he had nothing to do at home in the evenings. Moreover, he was not even married. Seeing Lee Hyun-jung back down, our hero was extremely surprised. He never thought that something like this could happen between colleagues. However, the quarrel did not become less significant. On the contrary, now the manager pretended that he was offended, and the director tried to somehow settle it. After some time, the men remembered that there was a resident next to them, and so they switched to him. The head of the hospital told the young man to turn to his colleague since he was better at solving problems. Having almost finished everything, the doctors said that since they had figured everything out, it was time to go to the department. The happy colleague simultaneously told the young man to work hard and show himself to be the best, because that is who he is. Thanks to his mentors, the boy saw how, as they walked away, they began to sort things out again. But this time, the reason for the argument was golf. The resident was surprised, as was his assistant. It seemed that this was something he had not even expected to see. The young man then asked the AWRNI if it thought successful people had freedom, adding that he, too, would like to play golf every weekend. But the assistant immediately stated that it was strange to envy someone. Although the guy has free time, he can play sports, but does not do it. Our hero was embarrassed, although he did not want to show it. The young man was saved by the fact that at that moment his phone rang. Turning on the phone, Lee Soo-hyuk heard a man greet him and say that his name was Hong and Tai. He was an intern from the emergency room, and he wanted to talk to the guy. The young man said that a 35-year-old man, Jae Won-yang, was admitted to the hospital with seizures that began 2 months before his admission. And he added that a neuropsychiatric department was needed, and he called to ask for help, although the young man said that he thought he needed to contact psychiatry. But the intern continued to say that this patient insisted that a shaman should heal him. Rolling his eyes, our hero thought that he needed to go to the rescue again. At that moment, a patient was screaming in the ward. He was saying that he had no problems, he just needed a shaman. Grabbing the doctor by the coat, the man declared that he did not understand how much longer he needed to repeat the same thing. The specialist tried to calm the patient down, ignoring someone's footsteps in the opening door. Our hero stood behind the patient, noticing how the man asked the doctor if he found it funny to hear about the shaman. Heading towards the patient, some doctors shouted that this crazy guy had come to see them again. The young man grabbed the patient and began to ask him to calm down, reminding him that they were in a hospital where they had to behave decently. Watching what was happening, the resident thought that it was now clear why there was a person in the office without an injury. A minute later, the doctor, who had been shaken by the patient a few seconds earlier, was crawling on the floor trying to find his glasses. While handing them to the young man, Lee Soo-hyuk asked fearfully if everything was okay with the specialist. It was Jin Sung, and so the guy addressed him again, but this time by name. Putting on his glasses and rising from his seat, the doctor joyfully greeted his colleague, thanking him. Having come to his senses a little, the young man happily stated the fact that our hero was on duty today. However, there was something else that preceded this event that Lee Soo-hyuk suddenly remembered. While Baruta was noting that the patient was crazy, the caller reported that the patient had hypoglycemia, since his blood sugar level was hovering at 66. The young man himself remarked that this was a low figure, hearing that the man had not eaten before. One might think that this was about diabetes, but there is no record of this in the medical book. Getting up from the table, our hero asked his assistant to name all the diseases that can cause hypoglycemia, although he said that they had not really delved into this topic. And in order to avoid a new conflict, the artificial intelligence declared that it was ready to remain silent, but in exchange it wanted to get chicken for dinner. As he climbed the stairs, the boy complained about his sore leg, which was bothering him a lot. The young man hoped that it would somehow heal on its own, but the Baruda stated that according to the available data, it could not be cured, which the young man himself knew. Despite this, medicine was advancing rapidly, including the development of assistive devices, and so Baruda said that they would find a solution before he died. Entering the department, our hero thought that these words did not make him feel any better, which disappointed the assistant. But Yang Tae, who was doing his job, turned his head slightly because he noticed someone. And so, seeing that the resident had come right up to the table, he greeted him, saying that it was good that he had come. Smiling, the young man introduced himself again, giving his name and saying that it was he who had decided to call a more experienced colleague. Realizing that this man was older than himself, the young man told the Baruda that this man must have studied somewhere else, who confirmed this, adding that they had another resident doctor who was over 40 years old. As the intern walked down the hallway, he explained that the patient was in the treatment room, which surprised Lee Soo-hek. Our hero's assistant did not understand why this was so, since this office is usually used for emergency patients. Returning to the present, the young man saw what was happening to the patient. He also said that the man seemed to have a disorder of consciousness. He thought that he was outside the hospital. Answering the young man's question, the specialist said that this was not quite the nonsense that the resident thought. Doctors managed to find out that this man had previously taken medications, but they were of little help and only worked during periods of exacerbation. Sedatives only helped to get rid of the attack that had begun, but did not reduce the frequency of future ones. Baruda immediately said that it was strange. Medicine in the field of psychiatry had made a big leap in development, and Lee Soo-hek understood that it did not work, so he wanted to study the patient's medical record. The guy knew that it was from medical histories that he had previously managed to learn a lot for himself. While his colleagues were busy with this man, the guy had a minute to find out how it all started. He learned that the patient had been in a coma for some time, and his blood sugar level was below 50. The attending physician diagnosed manic depressive psychosis or schizophrenia. Baruda stated that the man did not talk about this, and our hero suggested that they did not really deal with this man. He was the only one in the department, and during treatment, he was talking nonsense. The young man remembered how, sitting on the couch, when the patient felt a little better, he complained of double vision. Moreover, he also experienced convulsions and foaming at the mouth. The assistant said that if you look at the hospital referral, you can assume that this person was a very problematic patient. He had a lot of neurological symptoms. Lee Soo-hyuk stated that this was definitely a special case. It seemed like all the medications had already been tried, and the artificial intelligence added that there were disorders that did not respond to pills, but this only applied to severe cases. The professor, who came close to our hero, watched in surprise as he talked to himself. Suddenly he asked if they had managed to find anything, which greatly frightened the young man, who replied that he had not found anything yet, but there was one nuance. The guy said that he was inclined to believe that this was not a mental disorder at all. The specialist scratched his head and agreed, adding that the man had severe hypoglycemia and that they needed someone to look at the situation from a new perspective. After this, our hero asked if he could see the blood test and heard approval. The doctor was glad that someone would help him with this problem, since it was actually not simple. Lee Soo-hyuk looked at his boss and thought that he was still shining his radiant smile on everyone. He is the leading gentleman of the university and the hospital, and they say he was born to be a psychiatrist. However, with this good-natured man, things are not so simple because it is worth him to drink. How his personality then turns around 180 degrees and he takes the fun into his own hands? Maybe he should have been born a dog. But the assistant immediately brought Lee Soo-hek back to reality, saying that now was not the time to bother his head with this. It was better to focus on work. And while the guy thought that hypoglycemia was quite serious, the assistant stated that previously the sugar level was 66, and now it had dropped to 40. But otherwise, the results are pleasing, although they do not allow us to clarify anything. Sometimes it is even good when everything is the other way around. Even if it is mental, the symptoms are devastating to that person's life, and the disruption of vital functions will lead to a shift in blood pressure. And so, our hero said once again that the test results were good, At least it was difficult to find deviations in the test carried out in the emergency room. The young man understood that this was all rather strange, although the Baruda said that it was better to think about it later, since now the brain could only boil. At this time, the problem patient was still in the emergency room, unable to say anything clearly, although the attack had ended. Thanks to the IVs that were given in time, the man felt a little better. His gaze became more meaningful and understanding. Realizing that it was possible to talk to the patient, Lee Soo-hek and the professor returned to his room to conduct an examination. In response to the doctor's question, the man said that he felt a little better, although this was already clear, since he could already speak. Baruda stated that the man had come to his senses, but the guy was alarmed. He understood that the medicine could not fully restore his consciousness, and so the resident decided to take another look at the map. The young man turned to his assistant and said that the symptoms changed each time. According to the medical history, the attacks almost never stopped, although they had an enviable regularity. Suddenly, the guy noticed the time that was indicated on the map, but the artificial intelligence itself did not understand what it meant. But after looking at the map, our hero saw other time frames, realizing that this was the time of the attacks, which was always recorded. The resident looked at the screen in surprise, having no idea what this could indicate. However, Lee Soo-hek was unable to think about it properly because the next second, one of the staff members shouted that something was wrong with the patient again. The man grabbed the doctor again, swearing at him and saying all sorts of nonsense. And again, all those gathered rushed to this man, trying to help him in every possible way. What he wants, what they want to do with him. Seeing how the intern easily twisted the patient, our hero assumed that in the past he was a master of sports. In addition, the guy thought about the fact that the attack began 30 minutes after he regained consciousness and immediately asked the nurse if he could take a blood test. When the young man learned that the indicator was 48, he was surprised because the analysis was new, but the indicator had not changed at all. Baruda, who almost always knew what to say, was now himself at a loss, not understanding what this could indicate. Jae-won Yang, looking at the machine, screamed in fear that their patient was losing consciousness. But what scared the man most was not this, but breathing, since the oxygen was becoming less and less with each passing minute. Standing in the middle of the ward, Lee Soo-hek was confused. The reason was that the patient had lost consciousness, and very suddenly. At this point, the assistant told our hero that this patient needed to be intubated immediately to save his life. The young man also said this out loud, and the nurse immediately brought him a device to perform this manipulation. Holding the intubation apparatus, the resident looked at it as if he was seeing it for the first time, not understanding what to do next. Baruda asked in amazement whether his master would be able to cope with the task, but he was too excited to even put two words together. Standing next to the patient, the young man thought that he had only done this once in his life. The assistant closed his eyes and said with resignation in his voice that he had to choose another head. While the young man stood there, hesitating to do anything, his colleagues were talking about the rapidly falling oxygen levels. The guy didn't understand how long he had to wait, and the artificial intelligence said that if the patient resisted the insertion of the laryngoscope, it would get worse. It is important to remember that this is not a put-to-sleep procedure, but simply a manipulation that will allow breathing to be restored. He added that if blood starts to flow, it will greatly hinder further intubation. And while everyone was fussing, the Baruda continued to say that Lee Soo-hek had only done intubation once, but he justified himself, explaining that he was a freshman who hadn't even undergone intensive care yet. The intern reported that the oxygen level had reached 60, but the young man did not understand whether it was worth waiting any longer, hearing the assistant say that the muscles were still tense. The tension grew stronger with each passing minute, especially after the boys started shouting again that the oxygen was running out. Hearing Lee Soo-hyuk want to call the professor, Baruda said that if he was so afraid, the doctor was unable to intubate, and then said how the boys' mentors would react to this. The irritated young man was unhappy with what his assistant was saying. He noted that it was artificial intelligence that had inspired all this nonsense in him. Baruda asked if the young man really wanted him to have such powers, noting that this was not the case. Once again, the thoughts were interrupted by the cry of an intern, who declared that the oxygen level had already dropped to 49. Artificial intelligence said that now we can start, everything will be fine. And a moment later, he added that this probably greatly confused the resident. At this point, the psychiatrist shouted that action was needed, and therefore told our hero to perform intubation. And he added that perhaps it was time to call another specialist who understood this much better. Suddenly, the guy picked up a laryngoscope and raised it up, preparing to begin the manipulation. The guy made up his mind and therefore inserted the medical instrument into the patient's nasopharynx, although each movement was very difficult for the young man. At this point, our hero's assistant said that tracheal intubation is a procedure to ensure the safety of the airway, in which a tube is placed into the trachea. Seeing Lee Soo-hek performing the procedure, the Baruta said to press the tongue and move the instrument a little to the left. And then he said that if a guy wants to break a patient's teeth, but our hero made a remark to the artificial intelligence that this is nonsense. A minute later, the assistant added that there was no need to press so hard on the teeth, but overall the work was done well. Having done everything as it should be, the resident thought that it was good that the patient was not overweight. There were no complications since the neck was long and thin. And the Baruta spoke again, asking if our hero could see what was to the right and left of the epiglottis, noting that these were the vocal cords. Handing the phone over to his assistant, the young man thought that he still had too little experience, but despite this, he managed to complete the procedure. And so he was proud of himself, although now was not the time to think about such things. The intern who was standing nearby immediately finished the manipulation. It was the first time for him. A minute later, the patient lay quietly with his eyes closed. He was still unconscious, although it seemed that his condition had stabilized. And it was true after looking at the device. Baruta said that the oxygen level had returned to normal. After this, Lee Soo-hek asked the nurse to measure his blood sugar level again, and upon learning that it had dropped to 32, he decided that this was very low. Suddenly, the assistant said that this is not an indicator. Taking blood from a finger is not the best idea, especially when the patient has hypoglycemia. So the resident asked the nurse to take blood again, but this time from a vein, to see what the analysis would show. The professor who called out to our hero now confidently stated that this patient definitely did not need a psychiatrist, since there was something wrong with his sugar level, and this was already alarming. And then the specialist asked what the young doctor thought about this, but he honestly admitted that he didn't know yet. This case was truly amazing, since our hero had never heard or read about such drastic changes in a person's condition. Suddenly, the man who had recently been unconscious began to slowly open one eye. Although a second later he opened them wide as if something was bothering him. Lee Soo-hek and the psychiatrist looked at the patient carefully, their eyes showing confusion mixed with horror. The intern who was nearby screamed loudly, noting that this should not have been done. He understood that intubation and a person who twitches are very dangerous things. Realizing that the patient was twitching and trying to get up, colleagues immediately ran up to the man to try to somehow calm him down. He didn't understand where he was. He also didn't know that he had a laryngoscope in his trachea, and so he tried to get rid of the suspicious tube. The doctors understood that this should not be done, but they could do nothing. The distraught patient began to quickly pull out the foreign object. Sitting on the bed, the man did not understand where the blood on his hands came from, although it was evidence of trauma to the trachea during the removal of the tube. Baruta, watching everything, began to curse, and the young man did not understand how he could say such things. The young man immediately began to think about what they could do in such a situation to get to the truth, while simultaneously hearing someone enter the room. Lee Soo-hek and his assistant immediately froze, not understanding who this person was. There was an adult man standing behind him, and behind him was a young woman. The professor ran up to the stranger and began to calm him down, but he was angry seeing the strange picture. He said that there was nothing good. Moreover, it would be much better if he invited a shaman. The doctor made excuses, explaining that they didn't have all the test results yet, and therefore couldn't make a diagnosis, although the man continued to swear, hinting that the doctors didn't know anything. The psychiatrist did not want to let the visitor see the patient, but he pushed the doctor, continuing to say that he had come such a long way and saw similar things. Addressing the man as a father, the professor once again asked him to stop. Now the stranger was stopped by a woman. Putting her hand on his shoulder, she said that they had come to sort things out and added that if nothing helped, then they would look for a shaman. And while the girl continued to note that they were in a large and modern hospital, our hero asked the professor if they were all relatives, hearing an affirmative answer. The man closed his eyes and said with a certain resignation in his voice that a lot of money was needed for the examination. However, the girl looking at the man said that she would pay for everything herself. And starting to shout, she told the stranger to listen to her until all the test results came in. When the uninvited guest left, The girl looked closely at the doctors. She said that they had been to different hospitals and had taken many tests. But unfortunately, they were never able to find out what the matter was. So her younger brother thinks that he needs a shaman. And with sadness in her voice, she asked the doctors to try to get to the bottom of the cause of such a strange condition. Bowing, the experts unanimously declared that they would do everything in their power, since this situation was indeed strange. But before the young people could finish speaking, the intern again turned to the professor, saying that they had problems. Pointing to the man, Jae Wan Yang said that he had another seizure, and again, unexpectedly, just like before. The patient's father, who was nearby, heard that his son was feeling ill again, and again began to say that only something alternative could help him. At this point, Lee Soo-hek was actually at a loss. He didn't understand what was going on, but he wanted to figure out what was wrong, realizing that otherworldly forces had nothing to do with it. Unexpectedly, Baruta said that this man had seizures caused by something other than a brain disorder, and then uncontrolled hyperglycemia. At that moment, the young man asked his assistant to repeat what he had just said, and he was frightened and thought he had sworn, although the young man stated that that was not the point. The frightened artificial intelligence asked again if he had said a swear word, but our hero said that he was interested in what happened before. And he said he was talking about uncontrolled hypoglycemia caused by seizures unrelated to brain disease. Hearing the boy ask for a tranquilizer, the professor said that it would only give a temporary effect. Confident that he was right, Lee Soo-hek said that he thought he knew what the cause was, but the patient should not behave like that during the examination. The surprised specialist asked again if this was really the case, realizing that a diagnosis was absolutely necessary. Even the Baruta, who also did not realize what his master was doing, cautiously asked if the ordinator had accidentally gone mad. To convince the doctor, the young man said again that he could show that he knew what was happening, but that he couldn't do this without an examination. For a moment, there was complete silence in the office as the professor considered what to do. A moment later, the doctor looked in the direction where the patient was, but remained silent. He thought that when you try to talk to a man, he convulses. Because of the convulsions, he loses consciousness, and when he wakes up, he looks completely healthy. The specialist does not see any other way out, although he is not confident in himself, and therefore said out loud that they will do everything as needed. Just a few minutes later, the nurse gave the patient an injection so that a full examination could be carried out. Our hero was worried about his breathing, but his colleague reassured him, saying that this was not the right kind of medication, adding that the man would have to rest for about half an hour. Lee Soo-hek was clear about everything, so he first wanted to go to the CT room, which surprised the psychiatrist. With amazement in his voice, the professor explained that they had already done CT many times, and the results had always remained the same, and therefore he saw no reason to do it again. With a smile on his face, the young man stated that he was not going to x-ray his head, since the cause was not in it, and a minute later he added that he wanted to remove the abdominal area. Not only the psychiatrist was surprised by this news, but also the Baruta, who did not understand why his master was acting independently without his instructions and prompts. The doctors said that the man was having constant seizures, and the resident wanted to look at his stomach. But the young man explained that he would give the appointment and take the photo anyway, adding that they had too little time. The professor decided not to argue, saying that it would be better to take intern Sam with him, who cheerfully declared that he could easily drag the bed. Less than a minute had passed, and the gurney was already racing down the hospital corridor. The guy understood that he wanted to help this man, and therefore he was going to prove his assumptions. The psychiatrist who watched the doctors leave reflected on the fact that there have been a lot of rumors about our hero lately, the first being that he is the director's secret son. The specialist knows for sure that this cannot happen under any circumstances, since he spent a lot of time with this person, and therefore knows almost everything about him. The second thing is that the young man is a genius. Even Professor Choi Nak-pil spoke about this rumor. He said that it is rare, but there are times when professional skills improve after a head injury. And thirdly, this rumor was mainly started by Kim Jin-en and Hwang Sung-woo. But according to them, everything the resident has shown up to this point is an accident, and therefore the young man is simply crazy. And so the psychiatrist did not understand whether Lee Soo-hek had gone crazy or whether he was actually an outstanding doctor with whom they were very lucky. At this time, Baruta was dissatisfied with his master. He swore and said all sorts of incomprehensible things. He asked how the guy could have come to the answer before artificial intelligence, which develops thanks to deep data analysis. The assistant did not understand why an abdominal CT scan was needed, hearing the resident ask if he felt anything strange after what he had said earlier. Baruta thought it was a matter of touch, but the young man noted that it was probably closer to intuition. The assistant, when he listened to his master and everything connected with the premonition, was very surprised. Theatricalizing all this, the artificial intelligence stated that it seemed to him as if the ship had crashed, and therefore it was necessary to escape immediately. And then he asked if there were any cases when our hero successfully transplanted foreign substances into his head, but instead of an answer, he saw a fist. Lee Soo-hyuk asked the Baruta to wait silently and added that he would see his magnificence immediately after the shooting. The intern placed the patient in the chamber, realizing that he needed to hurry because the sedative's effect would not last long. The radiologist, who was watching everything from his office, said that the abdomen was being photographed with a contrast agent. Lee Soo-hyuk clarified that this needed to be done before and after hearing that filming was starting. The young man, before the procedure had even begun, asked Jae Won-yang to hold the patient as tightly as possible, since anything could happen. After a couple of seconds, the process began, a process that our hero had been waiting for with great impatience, looking at the screen. Baruta immediately began asking if the boy thought that something would appear that had not existed before. But there was no answer. It seemed as if the assistant himself had noticed something. The young man smiled and asked the AI if it had seen what it needed, but it only asked what that round thing above the pancreas was. Baruta thought it was cancer, but the resident said it was nonsense and asked if he had ever seen such beautiful, round tumors, not even metastases. The assistant agreed, adding that based on the data, the likelihood of it being a tumor was too low. But until the end, the artificial intelligence did not understand what it could be, and so Lee Soo-hyuk suggested looking at the contrast agent. The guy smiled, thinking that so far everything was going as he had expected. Hypoglycemia is a special symptom, but that was the whole point. And then he answered his assistant that it was not about the seizures, hearing about how they were going to introduce contrast. When the new procedure began, the Baruta did not respond to the eye on the screen, realizing that he had to figure everything out himself. He said that the clot was so bright it meant a tumor with a lot of blood, to which the guy said that it also meant that this place was very actively devouring energy. And then he asked what kind of tumor usually appears on the head of the pancreas and looks like this on CT. Sitting in his chair, our hero urged his assistant on, as he usually liked to do, in order to get on his nerves a little. Closing his eyes, the artificial intelligence asked for forgiveness, saying that he would not do that again, and therefore asked the guy to shut up. A short time later, the psychiatrist met our hero in the corridor, asking with concern if he had managed to find out anything. Seeing the young man beaming with joy, the doctor said that the young man was in a great mood. Therefore, he had definitely found out something. And then Lee Soo-hyuk said that he needed to report this, and the professor understood that the guy was going to call Jin Yen. And as I was leaving, I thought to myself that this Kim Jin Yen would have to work hard. While the young man was looking at his phone, his assistant was trying to figure out which diagnosis best fit all the symptoms. And the young man was already pressing the button on the phone, realizing that he was going to tell everything. At this time, someone's phone was ringing. The person to whom it belonged was angry because he was distracted from important and impersonal matters. In a dissatisfied tone, the young man asked our hero if he was sure that this was a patient who belonged in endocrinology. And in the same indifferent tone, he stated that this man had never been admitted to their intensive care unit, hoping that another department would take him. But Lee Soo-hyuk did not back down, stating that the man was 35 years old and had been experiencing convulsions and seizures that had only gotten worse in recent months. While playing on the computer, Kim Jin Yen stated that perhaps this patient was in the wrong place, but the resident insisted. Realizing that the young man had lost because of the first year, he cursed and began to speak incoherently again. And then he angrily asked our hero if he wanted to die. Lee Soo-hyuk didn't like such an insolent attitude, but the patient's health was important to him, so he remained indifferent and calm. Kim Jin Yen finally spoke again, asking what the man's diagnosis was, as well as how he ended up in endocrinology. Baruta, who until then had no idea what the diagnosis might be, was waiting for this moment with great impatience. And the guy shouted that it was insulinoma, after which the happy assistant repeated it, realizing that if the hypoglycemia continued, the other symptoms would disappear, and only nervous abnormalities would remain. Lee Soo-hek saw that the artificial intelligence was not calming down, so he reprimanded it, telling it to shut up already. The angry Baruta said that the guy had guessed everything based on the data that had been collected by the assistant. But the young man did not agree with this, thinking that he was a genius, more than he himself had expected. A few minutes later, the guy was already calling the head pharmacist, saying that he suspected insulinoma. The third-year student was surprised to hear that the CT scan showed a suspicious lesion. Our hero did not understand why he was not being taken seriously, and also why the chief resident did not want to look into the matter. Time passed, but the line was still silent, which made Lee Soo-hek a little wary, as he didn't understand what was going on. Kim Jin-yen, who was playing a computer game at the same time, didn't want to figure anything out. He was angry that he was being distracted. He was also irritated by the fact that he had never heard such a diagnosis before. Having found something on the internet, the young man realized that it was a benign tumor in the pancreas, but it is very rare. And this was diagnosed in the emergency room, and it was done by some first-year student. Kim Jin-yoon's eyes were filled with anger and fury. He remembered how our hero had humiliated him at the presentation when he had failed to identify the problem related to the blood. Moreover, it turned out that this guy was not the director's son, as some believed, since one of the interns and residents knew that the young man worked part-time as a tutor. The young man thought about how he couldn't report this to Professor So Hai-seok on a day off, much less when he found out that the diagnosis was made by some first-year student. So Kim Jin-yen asked his colleague if he knew how rare the disease was, and was told that he did. And he added that the guy was wrong to imagine himself as part of the staff, saying why Lee Soo-hek was so confident in the diagnosis. The first-year student did not understand what was wanted from him, especially the person who could come to the hospital because he was on duty, but did not do so. However, the senior pharmacist said that if the young man had been sorry for someone's time, he would not have come up with such a sudden diagnosis. And he added that tomorrow before the rounds, our hero is obliged to explain why he diagnosed insulinoma, and is also obliged to make a presentation of more than 10 pages about this disease. The first year immediately said that the first thing to do was to hospitalize the patient, but Kim Jin-yen said in an indifferent tone that this could not be done. Looking at the man, our hero did not understand how this person could be left unattended, realizing that this was a real crime. Now it is necessary to begin primary treatment, which will stabilize the patient's condition. But the chief resident was angry that incompetent people were calling him just like that, without even knowing what was wrong with the patient, adding that it was all because there was no punishment for useless calls. And then he suddenly said that Lee Soo-hek should remember that for everyone, he didn't call him. And with anger in his voice, he noted that if the guy's presentation didn't satisfy him, then things would not be easy for him. Kim Jin-yen continued to do this as he sat in front of the computer, feeling his power and complete impunity. Hearing our hero's standard answers, I thought to myself that they made him very angry. And in order to add more work to the guy, he said that the first-year student independently and without a report requested a CT scan. Of course, that's good. However, no one will accept it, and therefore it is necessary to go to the diagnostic radiology department and get a conclusion. And he added that a resident would not be suitable. A professor should do this. He is the one who is obliged to give an opinion. After all, if the diagnosis is so rare, then a good specialist is sure to be familiar with it and be able to confirm or refute it. Our hero remained silent, but the senior resident was angry and continued to be sarcastic. He repeated once again that the first-year student was obliged to do everything by tomorrow, and he would come and check it all. And without a shadow of embarrassment, he also stated out loud that some poor wretch had gotten too big for his boots and was therefore aiming for his place. And he happily noted that he would see how Lee Soo-hyuk would finally screw up. Looking at his master, who had sat down from exhaustion, the Baruta said that now he understood why everyone considered Kim Jin-yen a bad person. The guy said that it was so. He told him to get a conclusion from the professor of the diagnostic radiology department. They say that the heads of other departments are eager to please her, but in this hospital, the radiology department is the most feared. And he added that he, a first-year student, needed to get a conclusion from the professor, since that meant that he was being sent to certain death. Baruta said that it was much easier with third-year student Kim In-soo. Of course, he is a little cold-blooded, but he never shifts the blame onto others, plus he studies a lot. Although there are rumors that only the strongest remain, in any case Kim Jin-yen is higher, and therefore it is necessary to obey him, so thought our hero's assistant. Although the young man said that it really irritated him. If the tumor on the CT scan is indeed an insulinoma, the man should be hospitalized as soon as possible and surgery should be scheduled. And the resident cannot consult with the surgeon since the patient is not yet in the ward. However, Baruta recommended that our hero first do everything he could do, and since surgery was not yet possible, he recommended administering diazoxide. The young man knew that it was a rare drug, but he didn't understand whether it could be found in this hospital, having heard that Taewa had all the drugs that were used in Korea. At that moment, the doctor came into the office and asked how everything went. Lee Soo-hek told him everything as it was, hearing him say that Jin Yen had always been like this, so it was better not to dwell on it, but to do his own thing and his own work. I understand that the young man is disappointed. The young man asked if this man was in danger, after which he suggested that he be placed in a psychiatric ward. Our hero thought it was better to leave this man in this ward, hearing the Baruta say that the nurses were very experienced, and therefore they would be able to provide assistance. And so the guy said out loud that it was unnecessary for her, explaining that he was on duty and therefore would keep an eye on the man. The doctor, smiling, said that his young colleague could call him if he needed a guardian or if it was necessary to have a conversation with a patient. And a moment later he turned around and, saying that a patient was waiting for him, walked away. And again the young man thought that such a joyful person had no place in such a gloomy university hospital. This man is truly a saint. He is a wonderful doctor and an excellent specialist. A couple of hours after the diazoxide was administered, our hero returned to his patient's room to check on him. Luckily, he didn't have any particular symptoms, which was very encouraging. Baruta also said that the patient was safe. The latest blood sugar test showed 90, after which Lee Soo-hyuk decided to go to the diagnostic radiology department. The AI didn't think it was possible to find a professor there on a day off, but the guy asked what the advantage of a large hospital was. And moving along the corridor, he explained that this is a place where there is always a lot of staff, and at any time. Seeing our hero, the frightened third-year resident asked the young man if he really dared to approach the professor with his question. Baruta immediately noted that such an expression on his face indicated that Lee Soo-hek had gone crazy, but he himself knew this. And he said out loud that he had reasons for this, hearing the resident say that the professor on duty, Kim Jin-shil, had come earlier to look at the patient's ultrasound. Although the next second the guy said that the doctor was actually walking in their direction, the unsuspecting girl walked calmly towards her workplace. Everyone knew that she had been appointed a full professor of radiology this year, and everyone also understood that she had received this position well-deservedly. Looking at how our hero headed towards the doctor, the senior resident mentally wished him luck, knowing what kind of character this woman had. Lee Soo-hek had no choice, so he immediately greeted the professor politely, who turned her head slightly. The young man gave his name and said that he was a first-year student in the therapy department. Pointing her pen at the guy, the doctor remembered him, saying that it was he who diagnosed actinomycosis. The woman had obviously been expecting such a meeting, and so she immediately invited our hero to sit down, after which she asked him what had happened. After looking at the computer, the guy immediately started talking about how he had done a CT scan of a complex patient and therefore wanted to get a conclusion from the professor, since it was important. Hearing the diagnosis made by the resident, the young man did not hesitate to say that it was insulinoma. Smiling, the doctor said that this was a rare enough thing that even she had never encountered, and so she asked to turn on the video to see if Lee Soo-hyuk was right in his judgment. As she sat and waited, the girl thought that professor and part-time deputy director of the diagnostic radiology department of the Taiwa Center, Lee Ha-on, had done something interesting. He is the first person in their country to attempt to cauterize liver cancer without metastasis or tumors with metastasis in other places, especially in the colon, with high frequencies without surgical intervention. He is a very famous person in the radiology community, and he also trained such an outstanding doctor as Kim Jin-shil. That's why he has a strong sense of self-worth. The director repeatedly told this man about our hero, everything he had done. This happened both at work, when it was necessary to look through some important matter, and during breaks, when the doctors were simply resting. And it was not only Lee Hyun-jung who spoke about this, but also his colleague Shin Hyun-tae, who tried to tell about the outstanding young man. However, at some point, when Lee Ha-on was eating and they continued to talk to him about the resident, He held out and put down his chopsticks. After that, he shouted with all his might that he understood everything. He knew that in their department, there was no person as talented as Lee Soo-hek. The director and manager praised the young man so often that the professor's nerves gave out, and so he said what he said. The girl thought that Professor Lee Ha-on was trying to start a competition every time he heard about our hero. Suddenly, the guy's words brought Kim Jin-shil out of her thoughts. She heard the doctor asking her to look at some area. Looking at the screen, the doctor thought that it must have been filmed immediately after the contrast agent was injected. Contrast enhancement showed that there was something in the artery of the head of the pancreas, and the shape was such that insulinoma could definitely be suspected. The problem is that the diagnosis cannot be made based on the images alone. So the girl asked about the clinical symptoms, and the guy immediately stated that the main symptoms at the moment are convulsions and seizures. The young man explained that in the case of chronic hypoglycemia, symptoms of the autonomic nervous system, such as anxiety or hand tremors, disappear. Instead, only neurological symptoms remain, such as seizures, convulsions, dizziness, and delirium. Listening attentively to Lee Soo-hek, the doctor noted to herself that she knew about this. And the young man continued to explain that when symptoms appear, the blood sugar level does not reach 50, the condition improves if you give sugar. Hearing that these were the most important signs, the young man said that, in addition, interesting conclusions could be made based on CT, which is why he decided that it was an insulinoma. Kim Jin-shil looked down and thought for a while. She knew from the records that the patient had been admitted because of seizures and convulsions. And the patient's guardian even thinks that these symptoms appeared because there was no shaman in the hospital. The situation was such that 2 clinics were unable to make the correct diagnosis. And this was decided by a first-year residency student who simply went to help with hypoglycemia. And therefore, we can say with certainty that this young man is truly a genius. Lost in thought, the doctor wondered what would happen if she told Professor Lee Ha-yun about this. He would probably lose his temper. Coming out of her thoughts, the professor asked why the patient was still in the emergency room when he should have been hospitalized. Once again, Kim Jin-shil thought about why this guy came to her, because there were residents on duty who would also do a great job. Seeing the residents' confusion, the girl said that he could safely tell her everything. And a moment later, she added that there were no patients anyway, and therefore she had nothing to do. Lee Soo-hyuk scratched his head and said in an uncertain voice that he had reported the situation, but the senior said that insulinoma was a rare disease. Having repeated the name of the disease, the professor asked what this had to do with the careless attitude towards the patient. The guy didn't understand what to do, since the young man ordered him not to tell anyone that he had called, although the Baruda immediately reminded him that it would soon be June. The aide went on to say that Kim Jin-yong would step down as chief in October to prepare for a specialist exam. This is the most difficult test, so there were many people who did not leave the hospital because of the exam preparation. When the therapy lasted 4 years, now that the system has become 3 years, many of them were suspended even after leaving the hospital. Baruda said that there were enough failures. Kim Jin-yen should become a military doctor. Even if he returned, our hero would stand above him. And tomorrow he will be the only one speaking. If things go that way, then he himself will say that it is insulinoma. Therefore, the young man has no reason to crawl at this man's feet, as he would have to do if he were an ordinary freshman. However, now the guy is able to surpass everyone else because he is special. Then Lee Soo-hek said that the senior said that he couldn't trust the judgment of a newbie. The professor thought that the resident was coming, but the young man said that he would only arrive in the morning. The woman was outraged and did not understand how it was possible to leave a patient in serious condition in the emergency room. Kim Jin-shil folded her arms and wanted to know who this arrogant person was who didn't care about other people's lives. Our hero's assistant said that now was the time to reveal the truth, and so he named his elder. After thinking about it, the girl said that she had heard this name somewhere before, although she could not remember where exactly. And suddenly the girl remembered that when she went out for lunch, one of the residents said that when he was an intern, Kim Jin-yen tormented him. The girl noted that it was good that the patient was in the emergency room, but she was interested in why the guy came to her for the conclusion, and the guy immediately said that the senior resident ordered it to be done, saying that the conclusion from the residents would not work. The professor couldn't believe that the elder was really only going to come tomorrow. And thinking again, the specialist decided that the underdeveloped third-year student had definitely decided to set up Lee Soo-hek, and probably hadn't even thought about the fact that it was an insulinoma. And smiling, she continued to note to herself that, fortunately, this young man was not mistaken. The young man then stated that he had prescribed diazoxide to the patient because the treatment available in the emergency room was limited. The doctor said that this treatment was too little, given that the man had serious neurological symptoms, adding that it would most likely be necessary to provide the patient with sugar. And she added that in their hospital, the best place to do this is in the endocrinology department. In medicine, responsibilities vary widely from department to department, and even the same nurses have different experiences and strengths depending on where they work. Kim Jin-shil immediately told the guy to hospitalize the patient, but upon hearing that he had no authority, she immediately started looking for Shin Hyun-tae's number. The guy didn't understand why he needed to report this to the head of the department, but the girl said that he should be aware of what was happening in his department. Thinking about all this with horror, our hero did not understand when everything had managed to spin so quickly. Placing her hand on Lee Soo-hek's shoulder, the professor told him not to worry, as she would not put the resident in an awkward position. The girl called her husband and asked if he could at least hit the ball and win. But the man complained that today was some kind of bad day, because the director looked like he was going to smash everything around him, thinking that he was being deceived again. After this, the girl asked if the manager knew our hero, and he answered with horror that they were good friends. Kim Jin-shil happily stated that today the guy managed to do something incredible, as always, by the way. And while the director was aiming at the ball, Shin Hyun-tae asked with interest what the intern had done to please him this time. The professor simultaneously looked at his colleague and heard his wife, who was briefly telling him about everything that had happened. Suddenly, Lee Hyun-jung started to swear, saying that he shouldn't talk so loudly on the phone, but the manager justified himself, explaining that he had a very important matter. The man told his wife that this was a very important matter, and therefore he was not even worried about the unsuccessful game of golf, asking why the girl called now. And at that moment, Shin Hyun-tae heard that some third-year student did not allow a new resident to treat a patient on an outpatient basis. The professor was surprised. He did not understand how this could be. But the specialist continued to tell the story of how the impudent man did not even bother to come to the hospital to sort everything out. Kim Jin-shil heard her husband wondering who this person was. When the girl said her name, Lee Soo-hek blushed and tensed up, and Baruta was glad that everything had turned out so well. And looking again at the director, who at that moment was swinging his stick, the manager angrily said that this scoundrel would come to an end. While Lee Hyun-jung was watching his ball fall into the water, the manager was already walking towards the car. The director did not like this behavior, and so coming closer, he asked what kind of manners his colleague had. Frightened, he said that at this rate the man would soon start attacking people, and added that this was all so serious. What was much sadder was that their hospital was literally falling apart. After this, Shin Hyun-tae got into the car, explaining that he needed to go to the medical center to improve discipline. Watching his colleague walk away, the director shouted for him to come back immediately since they had argued, and now they needed to figure out who was right. Nervously biting his finger, Kim Jin-yen tried to understand why his head doctor had called him to the hospital on a day off, and what's more, the head doctor wasn't their department. Turning his gaze to our hero, the ill-wisher asked if it was because of him, and if he had tried to get the boss to ask him to come so unexpectedly. And again, the young man asked if there was a snitch in the hospital. Coming close to Lee Soo-hek, the enemy asked him why he was still going to remain silent, hinting that he was the boss and therefore he needed to be obeyed. Grabbing the guy by the robe, Kim Jin-yen began shaking his colleague, trying to find out what exactly had happened. With a look of doom in his eyes, our hero tried to say something, but could not find the right words. And again, the senior resident angrily declared that the poor wretch did not seem to be going to answer, but wanted to remain silent further. Suddenly, the bearded man came up from behind and now he attacked Lee Soo-hek, although Kim Jin-yen ordered him not to interfere in their conversation. Baruta didn't understand why this man had come, since he was from a completely different department. Although it was understandable, the third-year student simply didn't want to get caught in the crossfire alone. And once again, the arrogant senior resident turned his attention to our hero, wanting to fight with him. But he didn't have time to do this, because the next minute his phone rang. The guy was angry because he still hadn't managed to find out anything. When the young man answered the phone, he realized that it was Shin Hyun-tae calling and told him that he was currently in the staff room. The conversation was quite restrained, because Kim Jin-yen understood perfectly well that now was not the time to show his character. Having finished the conversation, the intern headed for the door, not wanting to linger. Before leaving, he stopped and for a moment looked angrily at where Lee Soo-hek was standing. After a short pause, the young man threatened, hinting that they would see each other later anyway. Once in the corridor, Kim Jin-yen exhaled a little, although he did not understand how serious the conversation ahead of him was. Approaching the headmaster's office, the guy noted to himself that the door was open. Despite this, he decided to knock, hearing that he could come in. Entering inside, the intern politely stated that he had come as the chief had asked, although not him personally. The young man's attention was not drawn to the professor at all. He turned his attention to his wife, who should not have been there. Looking at the woman inquiringly, the guy frantically tried to understand why she had come. After all, she hadn't come to visit for tea. Kim Jin-yen's eyes widened, suddenly thinking that it might have reached the manager because of her, and that was the last thing he could count on. Meanwhile, Shin Heng-tai was asking the chief pharmacist of the endocrinology department to sit down. The young man did as he was told, but despite this, he couldn't take his eyes off Kim Jin-shil. And the head of the department spoke again, now asking the doctor to pay attention to something interesting. The man said that this patient arrived before lunch. The duty officer reported that he had hypoglycemia, and then asked if the senior had heard anything about him. Looking at the head of the department with horror, the guy thought that this was the same patient who, according to Lee Soo-hek, had insulinoma or something like that. And so, looking into the eyes of the boss, he stuttered and said that he had not heard, although Shin Heng-tai immediately stated that they would check it, but later. The professor continued to say that one needs to take a closer look, and then one can see that the blood glucose level before lunch was 4.8 millimoles, which means that the person needs urgent help. And he asked again about the fact that the duty officer saw all this and continued to remain silent, not considering it necessary to contact the senior officer. Now, first-year students are on duty, and second-year and third-year students are always on call in case of incidents. Doesn't that seem strange? Kim Jin-yen lowered his head guiltily. He knew that he had nothing to do against this. The manager did not back down, saying that the young man wanted to say that he could not answer and asked to look at the picture again. This was exactly the CT that Lee Soo-hyuk had requested before lunch. Staring at the screen, the third-year student realized he was looking at a CT scan of the abdomen. Kim Jin-shil suddenly spoke up and said that she had analyzed the image, which showed that the head of the pancreas had a tumor, and if we take into account the contrast, all the signs corresponded to an insulinoma. Kim Jin-yen looked ahead nervously. He silently scolded our hero, not understanding how a first-year student could make direct contact with the professor. The head doctor asked if the doctor had told the duty officer that it was an insulinoma, but she explained that he himself had done a CT scan with a suspicion of this diagnosis, made it himself, and then came to her. She simply rechecked this judgment. Shin Heng-tai asked again if it was true that the young man had not reported this to his elder. Kim Jin-yen grabbed the phone and started searching for something, hearing the manager yelling at the young man. He looked somewhere in horror, realizing that he had done something wrong. The young man saw that Lee Soo-hyuk had called him again that day, but he had simply ignored him, and that was a big mistake. But it wasn't that made him angry. It was the fact that everyone was obsessed with the guy. At this time, the bearded man also shouted at the young man, saying that he didn't like him right away, and even more so after they said that he was the director's secret son. Suddenly, the first-year student's phone rang. It was the head of his department asking the young man to come in. Standing at the door, our hero did not immediately decide to enter, but there was no other way out anyway. Lee Soo-hyuk appeared in the doorway, but he stood there for a few seconds, unable to move. He was surprised that not only his mentor and Kim Jin-yen were in the office, but also the professor of radiology, although there was nothing strange about it, considering the situation. Shin Heng-tai, seeing the young man, was about to greet him with a smile on his face and had even begun to pronounce his name. But he suddenly remembered that now was not the time for pleasantries, and so he made a stern expression and asked if he was on duty on a day off. After this, he asked whether the young man had actually failed to report the patient's condition after he had identified his illness. The resident understood that he would not cover for anyone, and therefore honestly said that he did it and handed over his phone as evidence. The manager immediately began to look at our hero's incoming and outgoing calls, as well as the duration of the conversations. In a stern tone, The man stated that the call to Kim Jin-yong was made at 11:36, and turning the phone over, he asked again whether the young man had called or not. The young man sat there flushed and sweating. He did not expect the truth to be revealed, and in such a way. Jumping up from his seat, the guy was about to start making excuses, but Shin Hung-tae shouted that someone like him had no right to be a boss. And hearing the third-year student's indignation, he added that he should transfer the powers of the chief pharmacist to someone else, and that he himself, starting tomorrow, should begin treating the patient personally. The man was even more angered by the objections, and so he asked if perhaps the resident would then leave, and added that even after the report, he did not come to examine the patient and did not hospitalize him, and therefore a disciplinary committee could be convened for this. A frightened Kim Jin-yen understood that if this was done, everything could end very badly for him. And so, bowing his head, he asked not to do this, agreeing with the manager that he had made a mistake. The man once again told the young man to treat the patients, and as for everything else, he would report it to Professor So Hae-shuk himself. Kim Jin-yen was depressed and upset. He didn't know what else to say and didn't intend to do so. For some time, everyone sat silently in the office. It seemed that the prolonged pause would last forever. But a minute later, the professor announced that he no longer wanted to see the third-year student, and therefore he could go free. Baruta, watching the young man leave, said that it was time for them to leave too, to which the boy agreed. But this did not happen because Shin Hung-tae asked the young man to stay, saying that there was some important conversation. Our hero was interested in what it could be, since they seemed to have already figured everything out. And so the young man began to turn around to sit a little closer to his mentor. But at that moment, the resident's big leg gave way, and he realized that he was flying straight onto the table. Thanks to Kim Jin-shil, who was sitting next to him and immediately jumped up, the guy managed to stay on his feet, for which he immediately thanked the girl. The young man was pleased with such care, although he did not want to be a burden to others. The man who also approached handed the guy some papers and asked him to read them carefully. The resident read what was written carefully but quickly, and did not know how to describe his emotions when he heard Shin Hung-tae asking if the resident was aware of it. And he went on to ask if he had heard that their medical center selects the best students from each department and sends them for a month of internship. The guy was aware of this, although he knew that such a privilege was only given to residents in their third and fourth years of work. The younger ones were considered slaves of the department. The assistant already understood that the beginners were doing all the dirty work, but he just couldn't understand why. In that case, the manager gave these papers to our hero. This is the question the young man asked his mentor, who was looking closely at the first-year student. After this, the man stated that Lee Soo-hek would be allowed to go when he became their second-year student, which shocked both the guy and the artificial intelligence. However, this idea did not belong to the manager, but to the director, who a couple of days ago talked about why such a genius should be bragged about within the country if he could be sent abroad. And he added that he could do it now, but it was against the rules, so it would be best to do it in the second year of work. Although Shin Hung-tae did not understand what the fate of those who would be in their third year of work next year would be. But Lee Hyun-jung explained that it was unlikely that there were any talented guys among them. For example, in the third year there was Kim In-soo, and in the first year there was Lee Soo-hek. Thinking back to the others, he said that instead of giving such a valuable chance based on age, it would be better to give this opportunity to a deserving freshman. The manager said that the problem was that the same person could not go twice in a row. But the director laughed again, saying that there was nothing surprising or unfair about this, since the winner doesn't get everything at once. While sipping tea, the colleague thought that perhaps his friend was so impudent because he himself had published a scientific article in a famous journal at an early age. Returning to the present, Kim Jin-shil asked the guy not to tell anyone about this, since only one person from the department was going. And he added that he and the director believed that there was no one else to send there except our hero, but the others would start to be jealous if they found out. Therefore, it is very important to keep all this a secret, at least at first. The headmaster was sure that everyone knew what an interesting program awaited the students, but it turned out that they had no idea about all the important details, which greatly surprised the headmaster. And so, pointing somewhere, the professor said that this program is directly sponsored by their hospital, so it gives a lot. According to the program, the resident flies to the USA, all plane tickets and hotel are paid for in full by the medical center. Moreover, 100,000 won is allocated for personal expenses, which is about 100 US dollars. Looking at his mentor, the boy, like a little child, was happy that he would fly on a plane, and in addition, he would also live in a hotel in America. Hearing the manager talk about why there was such surprise, as if it was Lee Soo-hyuk's first time flying on a plane, but he confirmed that it was true. Suddenly, the man's expression became serious. He realized that the boy simply did not have such an opportunity since he did not grow up in a family. And therefore, he immediately stated that this could happen in any case, since they provide money for living, and there is plenty of money left for personal needs. Suddenly, the resident began to worry about his English, but the Baruda told the young man not to even think about it. And smiling, he added that he would take responsibility for ensuring that the young man could listen, understand, and speak, hearing that he trusted the assistant only in medicine. Lee Soo-hyuk was afraid that if he relied on artificial intelligence, he might understand something completely different from what people were saying, and what he would say would also be incomprehensible. Suddenly, the young man's thoughts were interrupted by his mentor, who stated that there was one problem. And after a short pause, he added that the young man must definitely have a scientific article. And then he said that with the resident's abilities, this would not be difficult, although the material should be published before departure, but not all journals immediately agree to publication. Baruda immediately said that if we need to go next year, then there really is little time left. Shin Heng-tae said that it would be better if he himself gave the topic for writing, but added that since in infectious medicine almost all articles are supported by practice, it takes a lot of time. Hearing that there are many cases where the results are disastrous, the guy was upset about it. The head of the department continued to say that doctors' articles are divided into two types. Clinical articles use verified data that has already been proven in experimental articles, so their level is significantly lower than that of the latter. And then the man said that he asked the director in Cho Tae-jin, but no one had an idea, although here was Professor Kim Jin-shil. It is considered a scientific article generator, just a machine. The girl, realizing that this was a compliment, said that she had written a lot of works, but that she was not a machine. Shin Hyung-tae said that the specialist said that there was an article that needed materials from internal medicine, but she said that she was still working on a research plan. And looking at her husband, she added that she could quickly write an article if a competent doctor helped her, adding that she could be a corresponding author and give the position of first author to Lee Soo-hyuk. Hearing this, the guy's eyes widened in surprise, as he could never have dreamed of such a thing. The man only said that everything had worked out wonderfully, adding that this trip would be very useful and necessary. Hearing that the guy had to give his best, he said, embarrassed, that he would do everything and even more that depended on him so as not to let anyone down. The manager said that the young man was free to go, but he still needed to have a little chat with Professor Kim. Standing at the door, the mentor called out to our hero. The Baruda began to be mischievous, talking about when they would finally leave this office. Shin Hyun-tae said that if Kim Jin-yen starts saying something to the boy, he must say that he is being personally supervised with special attention by the headmaster and director. And then he said that it would be better if he personally sent it to everyone via email. Seeing how the guy was resisting, although the manager said that Lee Soo-hyuk should simply accept it with gratitude. Our hero's assistant immediately said that the young man's colleagues were treating him strangely, despite the fact that thanks to him, they were relieved of their 100-day duty. After this, the mentor dismissed the resident, saying that he was on duty, but if there was a free minute, he should use it to rest. And a few minutes after our hero left the office, letters began flying all over the hospital. The staff couldn't believe what was written, but it wasn't a joke. The message stated that freshman Lee Soo-hyuk was recognized for his diagnostic skills and diligence. That is why he was chosen by Director Lee Hyung-jong, Department Head Shin Hyung-tae, and Professor Cho Tae-jin, selected to be raised as a talented leader who will head a department at the Taewa Medical Center in the future. In this regard, the management hopes that the entire staff will help this young and talented specialist. Just when rumors had almost disappeared that the young man was the director's son, more influential support from the outside appeared. After a while, a man shouted something to attract attention. He wanted to know if anyone had been hospitalized over the weekend when he had the day off. And while some thought that the professor had gotten drunk again, Lee Soo-hyuk announced that Yang Jae-won had been hospitalized with a diagnosis of insulinoma. The manager looked carefully at everyone gathered, but continued to remain silent. Suddenly, the man turned to someone, but not our hero, and asked where the resident had been over the weekend and what he had been doing. Kim Jin-yen, who realized that the question was addressed to him, began to justify himself, saying that he made a mistake with one patient, and therefore the head of the department removed him from his post. In a stern tone, the professor asked if it was Shin Hyun-tae, receiving a satisfactory answer. The man kept asking why that professor knew about it, and he didn't. And while everyone was thinking to themselves about how Seo Hae-seok didn't answer the call, the guy kept making excuses. He said that Professor Kim Jin-shil from the radiology department found out about the incident, which made things worse. But what was surprising was that the head of the department immediately asked who this doctor, Kim, was. But then picking up the phone, he said that there was no need to answer. He would ask his colleague about it directly. As they walked down the hallway, Shin Hyun-tae asked who their next patient was that they were going to see. However, he did not have time to finish speaking because he saw that someone was calling him and therefore gave the order to the residents to stop for a while. The man did not understand what Professor So wanted from him, but he understood that he could not help but answer, and so he immediately got down to business and asked what had happened. The colleague also did not stand on ceremony, asking how it could have happened that the chief pharmacist of his department was removed without informing him. Shin Hyun-tae immediately explained that the doctor on duty diagnosed the patient with insulinoma, and the senior resident did not even bother to come to the hospital, and on top of that, he dared to lie to him. Seo Hae-seok explained that he was not trying to condemn the decision, but only wanted to understand why he was not informed, since after all, it was his subordinate. Knowing his colleague's reputation, Professor Shin said he had called, but the man had not answered. And then he said that Professor So knew his number, and therefore seeing the missed call, he could call back. And starting to shout, he declared that the fact that he was the manager did not mean that he should devote so much time to his people. And if he did not believe that he had called, then it was enough to open the call list and verify this, adding that he simply had to admit his guilt. Hearing all this, the man became angry and asked again if it was really his fault. Shin Hyun-tae confirmed that this was the case, saying how could a professor be so negligent in his duties? And moreover, why was it impossible to reach him by phone? And he added that they almost had a tragedy. Moreover, the head of the department asked if his colleague knew that other professors were simply ignoring him. Listening to all this, the man became angry. He could not find the right words to respond to the attacks. But Dr. Shin didn't stop there. He said he told him exactly what happened and warned him not to take his anger out on other therapists. And he added that if this happens again, he won't let the specialist get off so easily. Professor So did not understand what was being discussed, nor what he was being threatened with, and so he asked about it. The head of the department said that he had to do what his seniors told him, adding that the doctor would obviously fail the associate professor exam again this year, and therefore it might be better for him to leave the bridge he occupied altogether. Mr. So didn't like all this, and so he asked whether his colleague was ready to take responsibility for all these words. Our hero's mentor did not understand what the professor was talking about. It seemed that he was not aware of what had happened. However, the man decided to resort to blackmail, asking if the manager knew who his father was. But the voice on the other end of the phone said that, of course, he was aware of this. Moreover, he and his father-in-law had been together at his place last week, and he added that he had heard that this gentleman was going to retire. After all, he had worked for a very long time as a director. For a moment, the manager fell silent, probably so that his colleague could understand the meaning of everything that had happened. And then he continued to say, who would look after Professor? So in this case, and again, after a pause, he said that there was no need to create trouble for him, but rather to treat him with respect, while he was still kind, and also there was no need to anger him unnecessarily. Having said that he was hanging up, the doctor did so without any embarrassment. After that, he turned around and asked the residents who their next patient was. An angry Seo Hae-seok, who was still holding the phone in his hands, realized how much he had been humiliated. He remained silent, but turning around, he looked at the one person who was the culprit of all this, and then asked who was on duty the day before. Lee Soo-hek did not understand whether his competitor had managed to get rid of him, but stated out loud that he was the one on duty. After this, the professor asked if it was true that he had made the diagnosis, and then informed the senior resident, receiving an affirmative answer. Coming close to Kim Jin-yen, the professor immediately began to blame him for not notifying him, adding that because of his stupidity, he heard all sorts of things from the head of the department. The young man stood nervously on the floor, realizing that there was absolutely no point in making excuses. Baruta said that the resident looked so pathetic, while our hero thought that they were both terrible personalities. And the boss continued to say that if this happened again, he would personally kill his subordinate. After this, the man was silent for a while. It seemed that he was thinking about his next steps. And it was true because after that, he turned around and asked Lee Soo-hek what he was going to do with the patient. Once again, Baruta was confused. He didn't understand why this man looked like he didn't know, hearing from the guy that he actually didn't know. The young man said that up until that point, they had only used diazoxide to prevent hypoglycemia. But instead of giving any practical advice, the doctor just looked at the young man attentively, as if he didn't understand what was being discussed. That's why Lee Soo-hek decided to explain that it was a drug to prevent the development of insulinoma. And he added that he asked about assistance with general surgery. The tumor is small, and therefore the operation should not be complicated. Hearing the professor ask whether the young man had transferred the case to another department, he thought with horror how such a thing could be said at all, since the disease was related to endocrinology. At that very moment, So Hae-seok said again that the surgeons should do it, and when he heard that the resident was against it, he said that a first-year student should know his place and not argue. The resident understood that in this case he really could not do anything, and therefore asked for forgiveness for his behavior. Turning around and leaving, the chief said that enough was enough talk about this matter and everything was clear, although the guy started saying something about the patient's face. However, the professor only stated why he needed to look at someone's face, since it was not his job. Our hero, who didn't know what else he could say, simply stood and watched Seo Hae-seok walk away. Baruta couldn't understand how this man could become a professor at all, hearing the young man say that life is not always fair. The guy thought that with such a boss he would go crazy or even resort to crime. The young man would like to explain himself to the surgeons, but most of them are busy and therefore he cannot see them in person. At this point, something strange was actually happening in the surgery, as Professor Ryu Jin-soo came to see one of the patients and told him that an operation needed to be performed immediately. But the man jumped up and started shouting that he had no time for this now, because his wife had cheated on him. And just a second later, with one movement of his hand, he easily threw the doctor to the other end of the room. Seeing that the patient wanted to get up, the doctor again shouted that this could not be done, since he had only recently had a lobectomy. And he asked the interns to hold the man as tightly as possible to calm him down. Looking at the patient, I thought how good it was that the tube had not yet been pulled out of his chest. If it had been displaced, an emergency operation would have had to be performed immediately. But it seemed that this man was not going to listen to anyone. He shouted that his wife was dishonest. Scratching his head, Ryu Jin-soo explained that this was all a manifestation of a disease called delirium. Looking around, the Baruta continued to tell our hero that he had to deal with the patient's hypoglycemia. And he added that since there was already time, it was possible to go to the intensive care unit, although the young man sadly said that he didn't even know if he could go there. But the assistant assured that if he was nearby, then there was no need to worry, hearing the guy sarcastically remark that if the artificial intelligence was with him, then everything was definitely fine. Reaching the phone, Lee Soo-hek made up his mind and called the surgery to tell them about his patient with insulinoma, noting that this was an order from the head of their department. The resident on duty stated that since Professor So Hae-seok had already said to transfer the patient, they were not against it. The young man was delighted and noted that he would take care of his blood sugar and everything else that was important for the man to undergo surgery. Hearing that the surgery could be performed that same day, the guy thanked his colleagues. After hanging up the phone, the young man thought that it was necessary to transport the patient to the operating room, located on the 3rd floor, and therefore he should go down at the time of sending to the intensive care unit. At this point, Baruta said that while there was time, it was necessary to spend it usefully. One could study a couple of topics for a dissertation. The assistant assured him that they didn't have much time, and therefore Lee Soo-hyuk shouldn't even think about his social media, to which he agreed. After some time, the young man was already heading to the intensive care unit. As he moved along the corridor, he looked attentively at everything and everyone, but it seemed that he was not pursuing any goal. At that moment, screams were heard from somewhere. Some man was declaring that his wife was constantly cheating on him. One of the doctors rushed past our hero, uttering abusive phrases as he headed towards the patient. Baruta immediately assumed that the person shouting was a person diagnosed with delirium, which the young man also noticed. The assistant immediately asked the guy if he wanted to take a look at the patient, but our hero didn't understand whether it was possible to do so. Just in case, the artificial intelligence explained that delirium is a disorder of thinking, hallucinations, confusion, and severe anxiety, a syndrome that causes a general disorder of the brain. The patient seemed to have gone mad, screaming as loudly as he could, cursing at his wife. The professor, sighing deeply, told someone that it was all delirium. He added that the mental state of this man should be checked, which the doctors were about to do right away. With sadness in his voice, Rujin Su told the doctors to give the man a sedative, but he thought to himself that at this rate they would neither be able to talk to the patient nor prescribe a sensible treatment. At that moment, one of the nurses immediately ran up to inject the necessary medicine. The specialist thought that initially the sedative was one of the reasons for the development of delirium. Despite this, it is impossible to do without it. After looking at one of the interns, the professor asked for a psychotherapist to come and review the prescribed medications, because it would be bad if this person made a fuss again. Looking at everything that was happening, our hero thought that he had seen delirium once. It was when he was doing an internship in the intensive care unit. As he was getting ready to leave, the young man said that they had nothing to worry about. The doctors were probably doing everything right, although Baruda noted that there was something abnormal in this case. The young man turned around slightly, not understanding what the artificial intelligence was talking about. And looking at the man again, he said that sudden delirium and aggression are symptoms of delirium, because that is true. But the Barudu asked his master to first look at the patient's age. Looking at the card, the guy noted that this patient was only 34 years old, therefore he was still very young. And so the assistant stated that delirium almost always occurs in old age. And it was also strange that the patient had a lung transplant. He should have been very weak. And everyone thinks so. No one was alarmed by the fact that the man easily pushed the professor away from himself with just one hand. But muscle strength does not mean that a person is healthy. Our hero agreed with this. Moreover, this patient had something wrong not only with his age. Suddenly, the Baruda asked the young man what time it was, although he did not understand why the assistant was so interested in this. The young man thought for a moment and then decided to look at his watch. Lee Soo-hek informed his assistant that it was 2 o'clock in the afternoon, although he immediately hesitated, seeming to be very confused about something. The reason was that delirium usually manifests itself at night, but not during the daytime. Although these two features alone cannot yet be used to say that this is not the correct diagnosis. Hearing the Baruda's request to take a closer look, the guy thought that he would be stuck in this department for a long time. Even though it was only daytime, the young man had already visited all the patients, had done all the work for 3 days in advance, and so it was possible to study the intensive care unit database. One of the nurses in the ward looked at Lee Soo-hek strangely, although she didn't say anything. The girl thought that the young man was a psychotherapist, but her colleague assured her that she had seen a resident in the therapy department. The intern who was sitting at the computer made a guess that it was our hero. After that, the employees began to discuss that the guy was the director's secret son. The young man was very regal. The guys didn't understand what Lee Soo-hek was doing in their department, since no one had called him, but they decided that it was best to leave everything as it was and not approach this man. But it seemed that our hero didn't care at all, because he was busy with his own business. After looking at the patient, the artificial intelligence found that blood pressure, body temperature, pulse, and breathing were normal, but our hero didn't like something about his chest. Baruda immediately said that if you look at the results of the biopsy of the removed lung, you can see a strain of aspergillosis. A normal adult shouldn't have any problems, but this patient now has a severely weakened immune system. The young man thought that the headache caused by pneumonia was not a bacterium, but a fungus. So the man had a resection. Fortunately, the operating room was sterile. The surgery was performed by a well-known specialist, Kang Il-gu. Baruda immediately said that there was saved data. The guy read it, but no longer remembers anything, although our hero said that it was not important at all now. And while the assistant was talking about this, not the first such case, Lee Soo-hek thought that he was talking about something he had forgotten, but the Baruda wanted to say that he meant delirium. Finally, the young man remembered that he had visited the department at 9 o'clock in the morning and that this patient had been acting up and that it had happened the night before at 8 o'clock, and then the picture had been similar. And so the guy decided that remembering yesterday's situation, excluding age, nothing but delirium comes to mind. In the evening, this man pulled out the pipe, Although before that, the Baruda turned off his consciousness, but not for long. Lee Soo-hyuk immediately came to the conclusion that this man did not have symptoms of delirium, but then stopped short, thinking that perhaps he was just imagining it all. And once again, approaching the man, I decided that everything was normal with the diagnosis. After some time moving along the corridor, our hero asked the assistant when he visited Yang Jae-woon the other day, was he in a stable condition? Because that's true. He said that the tumor itself was small and that he would be able to return to normal life immediately after recovery. Entering the department, everyone again turned their attention to the guy. The local doctors did not understand why Lee Soo-hyuk had come to them again. Looking at the man, the resident realized that this man was still being kept under anesthesia. Baruda said that since the test results of our hero's patient are stable, then most likely he can be extubated in a day. After this, the assistant said that it was time for them to leave, since the young man needed to devote time to his own education. However, before the young man could leave, he heard a wild cry from a man who was screaming that his wife was cheating on him. The frightened interns ran around, not understanding what to do with this patient, who had already become quite annoying to them. Lee Soo-hyuk, who was nearby and could not watch this indifferently, shouted that the man should be given a sedative immediately. He could not remove the oxygen tube from his chest. The staff understood that the doctor would not advise anything bad, and so they did what he was told. The young man thought with horror that the patient had not yet consulted a psychiatrist, and this made him very angry. Baruda also didn't understand something. Something seemed strange to him. It was about time. The artificial intelligence understood that the clock showed 8 in the evening. The patient had a seizure at the same time a day ago, and this can no longer be attributed to a simple coincidence. This is what worried our hero, who no longer understood whether we were talking about delirium, although perhaps this was a simple coincidence. Although delirium usually manifests itself at night, it is not a situation like in Cinderella. It is very strange that the disease manifests itself at the same time. And then the Baruda began to hint to his master that it was necessary to think about what events were happening to this person at the same time. The man is constantly visited. The young man saw his wife, but why does he have hallucinations? In fact, it is just delirium. There is no point in connecting it with anything. It may be due to the rounds since the patient sees demons instead of medical personnel, but most likely the rounds have nothing to do with it. The doctor, who was closely observing our hero, wondered why the young man was not moving. The assistant said that the guy knew too little about this disease, and therefore could not help this person in any way. It would be better to go read the necessary information and rest a little. Only a few minutes had passed, and the young man was already heading to the restroom, thinking about what would be best for him to read. The young man didn't want to make any plans, knowing how many people were usually in this room. Seeing that the room was empty, the Baruda stated the fact that the resident would be alone again, and he, scratching his head, noted that it was usually quite noisy here. The assistant noted that when Lee Soo-hyuk entered, everyone immediately ran to their offices, which the guy himself understood, knowing that they were simply avoiding him. The artificial intelligence looked for positive aspects in this, and our hero found them too, saying that it was good that he wouldn't have to listen to someone snoring. Sitting down at the computer, the resident immediately began looking for information about delirium in order to at least roughly understand what they were dealing with. Hour after hour, the young man tried to find something, and if at first he did it cheerfully, then after the Barude, he began to tell Lee Soo-hyuk not to dare fall asleep. Lying on his bed, the young man shared his thoughts with his assistants, stating that the reason could be that for some reason, the disease began to manifest itself only at a certain period of time. If the patient's life activity had been unstable, he would have died long ago. So Baruda said, they need more data, so there's still a long way to go. And looking out the window, realizing that morning was approaching, he continued to say that it was quiet at night, which meant that there was a possibility that the patient did have delirium. As he left, Professor Sohai-seok said that the others could do whatever they wanted, and he went about his business. Our hero was partly glad, thinking that they had a short day, although the artificial intelligence did not understand why they made such a careless round. No one tried to spend even a minute with the patients. As soon as they entered the ward, the doctors immediately walked around it, and Lee Soo-hyuk only had time to wonder how this was possible. The guy understood that they were all definitely abnormal, of course. This was not Kim Jin-yeon's work initially. But what was wrong with this Hwang Sung-woo? Our hero changed all the recipes out of fear of causing harm, but they didn't even ask about this. something that doctors only think about during work. Baruta encouraged his master a little, saying that he was the only one who could make his rounds normally, and the latter added that that was why he walked in circles all day. The assistant said that it wouldn't hurt for them to go to the right department, adding that So Hai-suk was happy to redirect each new patient to different departments. But others didn't send people to endocrinology at all, coping on their own. Finally, Baruta said that if you compare the guy with others, he is actually a good doctor. This conversation could have continued for a long time, but the elevator doors opened and the young man froze in surprise. Smiling, Shin Hung Tai happily spoke about the fact that their best resident was standing in front of him, which he was very happy about. In response to the professor's question, the young man said that he was going to the intensive care unit. Upon hearing about this department, the doctor immediately stated that it was the most difficult thing that could happen, and then asked if this was really Seo Hai-seok's whims again, which the young man denied. After listening to the story of the patient with insulinoma, the man said that taking care of patients is good, and then praised the guy, saying that he liked the way our hero thinks. A few seconds later, the elevator had already arrived at the third floor, and so Lee Soo-hek walked out, continuing to listen to his mentor say that if something happened, the resident could come to him. At that very moment, the professor remembered something, and so he pressed the button so that the doors would not close. As he exited the elevator, Shin Hyun-tae asked the boy if he was really transferring to a cardiology internship next month, and he answered in the affirmative. After this, the doctor happily added that this time our hero would be the director's doctor, noting that the rest would be explained to him on the spot. Lee Soo-hyuk looked at his mentor in surprise, not knowing what he could say or ask since it was something unbelievable. Having come to his senses a little, the guy immediately shouted that he understood everything. The professor said that initially the attending physician was a second or third year student, but this was the director's personal decision. And after that, he added that a doctor must be able to take x-rays, and the resident immediately declared that he would definitely learn how to do it. Hearing about arrhythmia, the guy nervously thought about the fact that the man was a little over 60 years old, and he had an ailment in an area that the young man did not know at all. Finally, Shin Hyun-tae said that our hero needs to prepare very well. The director has high expectations, as does he, the professor. And again, the doctor noted that his ward should study as diligently as possible because it would not work out well if the director, who personally wanted to see the genius, was disappointed. And when the door was already closing, the man once again very strongly asked the young man to try. Standing in the hallway, Lee Soo-hyuk sighed heavily and closed his eyes. Baruta didn't understand what was wrong with his master. He noted that this was great news, because according to his analysis, Lee Hyun-jung really appreciated our hero. But the young man was sad. He said that now everything could change, since it is difficult to examine a patient who is not in your area of expertise. In addition, the director is a person who has contributed to cardiology textbooks around the world. But the assistant continued to declare that the young man could study, and that was wonderful, although he, lowering his head, said that the Baruta only talked about studying. A few minutes later, entering the intensive care unit, the guy heard the same thing he had heard before. Again, the patient was screaming that his wife was cheating on him. The resident thought it was delirium again. He heard the doctor say to use a sedative again. Looking at his watch, the guy noted to himself that it was 9 in the morning, but at the same moment he realized that it had been exactly the same the day before. But Baruta corrected our hero, saying that yesterday the attack had already happened at 2 o'clock in the afternoon. Therefore, one can conclude that the same thing will happen tomorrow. Lee Soo-hyuk understood that it had never happened before that the attacks happened exactly at the same time. For a moment, the young man had an idea and decided that the problem was in the medications. As he walked to the computer, the resident considered the possibility that there was something wrong with the medications prescribed to the patient. The staff, noticing our hero, again began to gossip that a criminal had come to them for some reason, which meant the rumors were true. A young man approached the girls to say that he had heard something about some news, after which he added that in Sue and he were the same age. And that was why the man said next month and fell silent for a moment. And then he whispered that Soo would be removed from his position as Director Lee Hyun-jung's attending physician. This role will be given to Lee Soo-hek. From this, we can conclude that the young man is definitely the director's son. And then the guys started discussing some rumors, pretending that our hero wasn't around. Suddenly, the young man loudly hit the floor with his cane, so as to let everyone know that he was nearby. The boys immediately fell silent and looked where the sound was coming from. Silence fell over the room as Lee Soo-hek looked at the interns and residents, who looked at him askance. And after that, all the employees did the same as before. They grabbed the phones that weren't ringing and started pretending to be very busy. Our hero had no intention of sorting things out, although he turned to a young doctor who spread gossip about the doctor's attending physician. Approaching the young man introduced himself and stated that there was no need to speak to him so formally and that he only wanted to find out what his colleague needed. Hearing the resident talk about patient Park Tai-soo, the doctor immediately noted that he did not remember him contacting the internal medicine department. But our hero did not lose his head and said that it was not about cooperation. He often comes here and noticed that this patient has delirium, but he finds it strange. Without listening to the end, the doctor immediately began to imagine with horror how Lee Soo-hek would report the diagnosis of delirium to the director, and he would curse and say that this man was not capable of anything. After this, Lee Hyun-jong states that it is simply shameful to treat a patient so carelessly, and therefore such a specialist should not even come close to people with complaints. Our hero had no idea that his colleague was so deep in thought, and so he went on to explain that the patient was now taking voriconazole, which is the cause of the delirium attacks. And he added that if you pay attention to the timing of the attacks, they recur regularly. Voriconazole is most likely closely related to blood osmolarity levels. The intensive care doctor continued to look at the young man attentively, but it seemed that he still did not understand what was going on. Suddenly, the young man came back to reality and looked at the first-year resident with surprise. A couple of minutes before, when his colleagues were actively talking about Lee Soo-hek and the Baruda was talking about some kind of fight, the guy asked him to be quiet, noting that he just wanted to see what medicine was prescribed to the patient. A moment later, the young man asked what the side effects of levofloxacin, metronidazole, and ceftriaxone were, hearing that they could negatively affect the digestive system. The young man was interested in the delirious state, but the Baruda said that nothing like that had been recorded. Then the resident decided to ask about the interaction of these drugs, but the assistant noted that he had no data, and when our hero wanted to scold the artificial intelligence, it said that more work was needed. After this, the young man began to read something again, trying to search for the answer further. Lee Soo-hek lowered his head and said sadly that the Baruda did not have enough data because he had studied poorly and therefore could not find anything useful, although the assistant asked him to raise his head and look at something. The guy understood that it was useless to be sad, and so he did what the artificial intelligence asked him to do. At one point, the resident froze because he saw that the patient was taking voriconazole. This happens exactly 3 times a day after meals, so the timing is perfect and all the data can be reanalyzed. The young man remembered that he had once read about this drug. It is an antifungal agent. The causative agent of this patient's disease was a fungus called aspergillus, and this is the most important medicine. Baruda said there have been reports of voriconazole causing delirium in patients with poor metabolism, which was in a report the young man read last week. This may mean that the patient has lost the enzyme that metabolizes the drug. Our hero can study this separately. Realizing that the cause of the attacks had been found, the young man looked closely at the group of his colleagues who, as before, were actively discussing him. It was at this moment that the Dr. Lee Soo-hek had approached, stood rooted to the spot, not understanding how he could pretend that he had not heard or was busy with something. And so that it wouldn't sound somehow ugly, the young man decided to address the elder as a teacher, which greatly surprised him. In order not to waste time, our hero immediately began to print something out for clarity. After handing the paper to the doctor, the guy explained that it was a report he had read last week, and apparently it contained material about voriconazole and delusional state. The young man carefully read that the medicine had data on delirium in patients with low blood pressure. If you compare the patient's medical record and the prescription given to him, you can see that everything comes down to one thing. A few minutes later, the attending physician came to the professor to show him that their patient's condition was directly related to voriconazole. Lee Soo-hyuk explained here that if you look at a report of a similar case, you can see that he had a poor metabolism. While reading the document, the professor thought that the resident was most likely right. Since the psychiatrist herself said that this was atypical delirium, something was wrong with it. Normally, a specialist would scold a third-year student if he called him because of something a first-year student said, but this is not the case. It seemed like this guy actually helped them a lot with the patient. And then he began to think about the fact that, judging by the rumors, This young resident is the director's son, and even if that's true, there's nothing wrong with that, since the boy is simply a genius. Having patted our hero on the shoulder, he said out loud that in that case he would change his appointment and thank Lee Soo-hek. Switching to a resident from his department, the professor asked what remedy would be best to use in this case. The doctor said that it would be best to ask the infectious diseases department, preferably as soon as possible. Baruda, listening to this conversation, said that he did not change the drug, but simply change the dosage. Instead of giving 500 milligrams 3 times a day, you can give 250 milligrams. Although in a report concerning another patient, switching to a completely different drug, such as Lunasol, allowed the negative effects to be eliminated. The assistant noted that this was not always the case, but given that Shin Hung Tai had noted the wisdom of replacing the product in the comments, it was better not to argue. And once again the professor, scratching his head, timidly noted that now it had become easier for him, since every time delirium set in, he had to resist it. And after a short pause, he continued to speak. If he could do something for the surgical staff, then the young man could contact him. He would come immediately. Baruda asked a rhetorical question about whether it is good to seek mutual assistance, knowing that it is. For busy departments, such as surgery, it is always useful to have backup. As he approached the elevator, the young man thought that tomorrow was his day off, and so he would finally meet Woo Ha-yoon. Our hero's assistant was unhappy that he called the girl by her last name, although the guy stated that it was only his personal business. And a moment later he said that it would be nice if the guy somehow changed his last name so that he could also insert Baruda, which Lee Soo-hek considered crazy. When the elevator door opened, the young man saw his mentor again and timidly greeted him. Standing in the corridor, the man asked if the resident needed anything, since he looked extremely confused. Running up to the young man, Shin Hung Tai immediately began asking how the boy knew, and added that voriconazole causes delirium. The case notes, which he himself had read earlier, testified to this. And after that, he noted that our hero is actually studying hard, and that is wonderful. And again, patting Lee Soo-hek on the shoulder, he told the resident to keep up the good work, adding that he would like to have dinner together sometime. Remaining standing in the office, the guy thought that everything had reached the head of the department again. The man began to expect more, and this led to the young man beginning to feel tension. Baruda noted that there was no point in the owner getting upset and worried. He needed to meet the girl and then study again. And a moment later, the assistant noted that the young man had screwed up at the first meeting, and therefore it wasn't too greedy to expect anything now. But the guy got angry, saying that this doesn't mean he hopes that something will go wrong this time too. The next day at the appointed time, Ha-yoon was already waiting for her new acquaintance, joyfully greeting him. And while the resident waved his hand, the Baruda declared that this time the girl hadn't even dressed up. For some reason, she seemed less attractive than our hero. Standing on the street, the brunette was a little afraid to come closer to the guy, but he again began to apologize for what he did at the last meeting and asked his friend to forget about it. Ha-yoon accepted the apology and then suggested that the young man go somewhere. Approaching the restaurant, the girl noted that she often went to this establishment with her father, and one could say that it was the best. The establishment looked fashionable, and the people in it also matched the status of this place. Standing at the threshold, the guy saw how the administrator greeted them, but he looked somewhere in front of him and was very embarrassed. The chef, who personally came out to greet the guys, said that he had not seen Ha-yoon for a long time. The man led our heroes around the room until he brought them to the right table. And while the girl was sitting down, Lee Soo-hek did not dare to do it, but the beauty explained that her father paid for everything, and therefore there was no need to worry about it. Our hero became embarrassed once again, saying that it was somehow not nice. Although the Baruda noted that the young man's heart almost jumped out of his chest when he saw the price list for the dishes at the entrance. But his friend said that there was nothing wrong with it, and the young man shouldn't worry about it. At that moment, Lee Soo-hyuk thought that this was a green light, although his assistant immediately stopped him from thinking that. Not much time passed, and one of the dishes was already placed in front of the young people. A few minutes later, the Baruda was delighted as the boys were served pasta with scallops, lightly blanched octopus on coals, and fried mozzarella. And while the assistant was delighted with such a high level, Lee Soo-hek noted to himself that one dish cost about $85. The guy smiled and said that it was a wonderful place and that he would like to come more often, but to himself he thought that if only he could, of course. However, the girl did not answer. It seemed that she was so immersed in her thoughts that she did not hear anything. Realizing this, our hero's assistant said that it seemed like Ha-yun was nervous, although it was strange since Lee Soo-hyuk was not someone to be afraid of. Baruta said that it was necessary to ask what was bothering the girl, although the young man did not dare to do so. Unexpectedly, the young man asked what was bothering the brunette, and she only asked him to repeat what he had just said. Knowing that there was no need to be shy, Ha-yun relaxed a little and explained that she had to submit a problem-based learning assignment next week, but it was very difficult. A problem-based concentrated task is usually difficult because the complexity of the problem is significantly higher than the others. When asked if she needed help, the girl replied that she didn't need it. The guy came to rest, not to work, but he said that he had a day off and therefore could look. This answer interested the brunette, but she didn't know whether to show the problem. Taking the tablet out of her bag, the student explained that she herself did not know why this task was practically impossible to complete. Understanding that this was the director's doing, the resident understood that it would not be easy, but he still wanted to see it. After this, the young man began to read about a 78-year-old man who came to the hospital with shortness of breath that had begun the day before his visit. At the same time, the director was telling his colleague about the task he had given the students. He stated that one of the students might figure it out, but Lee Hyun-jung noted in a dissatisfied tone that this simply couldn't be true. However, the doctors probably did not suspect that this problem would be faced by our hero, who was delving into it more and more with each passing minute. Moving closer to the young man, the girl explained that they had also done a tomogram and pointed to a picture of the chest and abdominal cavity. Time passed, but the guy still couldn't come to anything. He saw that they brought dessert, but he didn't have time for it. Seeing the guy's confusion, Bruda said that since the director is a cardiologist, then perhaps it is necessary to think about diseases from this area, but first it is necessary to eat. As he started eating, our hero thought that Lee Hyun-jung was a real genius, and therefore he had to take a truly unique case, and not something banal from his department. Therefore, the young man was sure that the specialist had found some kind of twisted case to complicate the task. By pressing something on the tablet, the resident realized that he needed to go back a step. Ha-yun lamented that the topic was not only very long, but also incredibly complex, and the young man continued reading about how the patient had a series of symptoms 6 weeks ago. This is diarrhea, itching, and fever. They appeared after the man ate frozen salmon. The patient was treated with antibiotics at a local hospital. He probably should have been diagnosed with food poisoning. Immediately after discharge, the patient went to another hospital complaining of a skin rash, so the possibility of a drug allergy was greatly reduced. Having finished eating, our hero said that he also agreed with this, especially since there was no itching. Then the matter was something else. And his assistant said that after the hospital diagnosed cellulitis, they used cefepime and then switched to vancomycin. But if it were a common cellulitis, the problem would have been solved with cefepime, and the symptoms would have remained even after vancomycin. Ha-yun said in a frightened voice that the patient's condition was getting worse, and the young man agreed, saying that he had written down all the medications that could be used. And again, the artificial intelligence said that although they gave 100% oxygen, it was not provided properly, so the patient was transferred to intensive care for intubation. Lee Soo-hyuk knew that infectious diseases that could cause the rash had to be ruled out, although he wanted to see what the spots looked like. Reading other case histories, the young man realized that they were not at all similar to what they had encountered. The girl added that the patient was already in shock during the appointment, so there were no specific complaints, although the physical health section was filled in. Baruta immediately stated that all of this showed that the person most likely had an infectious disease. Opening the photo, the young man added that the man's consciousness was clouded. Suddenly, a red spot caught Lee Soo-hyuk's attention, who stated that they were everywhere. It seemed like there was no place where they weren't, and it was simply unique. The young man thought sadly that he had thought that it would be possible to distinguish the spots. But if you look at them all, it seems that there is no difference between them. Ha-yun, seeing how the resident was trying to solve the problem, apologized for taking his day off, but he happily stated that it was not so because he was interested in the same thing. The girl also thanked the guy for his kindness, adding that he could speak to her freely since he was older than her. Looking at the screen, the young man said something about when it would be convenient for him. The brunette looked at the resident in amazement. It seemed that she herself did not understand anything. Unexpectedly, the waitress approached the table where our heroes were sitting. although she did not dare to say anything. However, the employee then timidly asked if she could take the plates and was told that she could. The girl understood that this was a hint to leave the restaurant since lunch was over, so Ha-yun suggested to her friend to change places. Sitting in a diner that was next to the hospital, the guy kept thinking about the fact that the description said that it goes between the ribs when the patient breathes. The brunette saw how the young man continued to get to the truth, and that made her feel a little uneasy. Our hero said that both lungs were not in order, and the student confirmed that the patient actually died of pneumonia. Lee Soo-hek didn't understand how this was possible, remembering the game, and the girl explained that it was made by a game company under the direction of the director. It looks great, so her father will introduce the launch this year. Looking at the screen again, the guy noted that it was really amazing. If you choose the wrong answer, examination, or treatment, the patient will die. Intervening, Baruta said that the blood test showed that the number of white blood cells was increasing, including neutrophils, which suggested a bacterial infection. The patient has high creatine levels. The assistant added that the man has low sodium levels. They say he had a stroke, so it could be caused by kidney failure. Lee Soo-hyuk thought that even among therapists, if they were told to do it themselves, there would be more who would kill their patients. As he walked across the field, the director heard his colleague calling him crazy, but the man was proud of himself. Meanwhile, looking at the tablet screen, the young man realized that there was a chest X-ray from the local hospital. He said that over the past 4 days, the disease had progressed at a rapid rate, assuming that antibiotics were being used, which was not too fast. Once again, Ha-yun offered her help, saying that the man had also had a CT scan done, which he should take a look at. It was almost the same as on the X-ray. It looked like they did a CT scan at their hospital. Only it was unclear whether there were lymph nodes in the abdominal cavity. They are abnormally located, therefore not malignant, and the fact that lymphadenopathy occurs so frequently suggests a systemic inflammatory reaction. Moving on, the young man thoughtfully said that it was now important to find the reason. The student said she couldn't keep reviewing test results because it would waste time and the patient would die. And she added that she only had 5 lives and therefore they couldn't all be spent. And the guy said that there hadn't been such a function before. Smiling, Ha-yun proudly declared that they still had one more try left. Clutching his head, the young man did not understand what was right and what was not. But the Baruta said that it was necessary to carefully choose the examination. Lee Soo-hyuk thought that at first there was a suspicion of a serious infection, so it was necessary to find out the cause, therefore request a blood test, saliva, PCR for the strain and other things. But this would take a very long time. It is necessary to treat these together, since the young man has not heard of meropenem, and therefore teicoplanin and kidney dialysis should be added first. But a moment later, having pressed the cancel button, the guy decided that now was not the time. Returning to the photo of the rash, the young man decided that perhaps more needed to be learned about it. And while our hero was deep in thought, his companion watched him closely. Unexpectedly, she said out loud that, as expected, the resident was a little different. And then she screamed that Dad said that he copied it for the 2nd semester. Since he knew the problem, he told his daughter to look carefully, since he was interested in this problem. And again, looking at the rash, Lee Soo-hek decided that, as expected, his guess was correct here. Baruta immediately stated that this was not a typical rash at all, and this caught the attention of the young doctor. This is one of the most hated words for doctors. It seems that there is something, but it is no different from I don't know. After this, our hero turned in the direction where the Baruta was located to find out about something unusual. But I came across the surprised face of a girl who couldn't understand anything. Realizing that he had screwed up, the guy immediately began to apologize, saying that he was just lost in thought. Smiling, the student said that there was nothing wrong with that, since she had heard something from Professor Cho Taijin, although our hero did not understand what his new acquaintance was talking about. And after a short pause, Ha-yun added that it was all just very strange. Closing his eyes, the boy heard the Baruta say that he just needed to focus on the problem and analyze it, since the image could not be returned. But the resident reasoned that thanks to someone who was constantly next to him, he became a slightly strange person. At some point, the young man returned to the fact that they continued to talk about the rash being atypical, which the assistant confirmed. And then Lee Soo-hek asked the artificial intelligence if it was possible to consider this as one of its features. The resident explained that the patient had severe pneumonia. That was not the cause. What needed to be focused on most was called the rash. And again, I thought about where atypical rashes usually come from. The assistant said that if the patient is not allergic, it can appear when you come into contact with a substance that can cause irritation. This is a substance from a rough surface. Hearing that this was not it, the assistant suggested that it could appear from a temperature above a certain degree, but the young man immediately dismissed this idea as well. After this, the artificial intelligence suggested that the rash could appear as an allergic reaction to drugs. The young man immediately stated that they had initially thought incorrectly, paying attention only to the phrase that the rash was not accompanied by itching, but it was said that the patient was old. Baruta immediately noted that the symptoms of the elderly may be atypical. If so, it could be an allergic reaction to the drugs, which was initially ruled out. Lee Soo-hek thought that, in other words, it was possible to establish a reaction to drugs with eosinophilia and systemic symptoms. After this, he was silent for a while, as he was again immersed in some thoughts. Looking closely at the young man, Ha-yun thought about how her friend had been sitting in this state for several minutes and hadn't even blinked once. What's interesting is that she had seen something similar several times before. This man behaves strangely, but despite this, everyone considers him a real genius. At the same time, there were also people who were not sure of this, since there is only one step between insanity and uniqueness. At that moment, Lee Soo-hek continued to discuss the patient's symptoms with the Baruta, noting that the reaction to the drugs was not limited to just a skin rash, and that is why doctors were observing the failure of many organs. The disease is treated with high doses of steroids, but if the patient has an infectious disease, there may be irreversible consequences. Steroids can inhibit the inflammatory response, but if used in a critical condition, it will be a robbery by viruses or bacteria. A minute later, Baruta suggested doing a biopsy, explaining that if the patient had eosinophilia, then it would confirm it. And he added that the terrible condition of the lungs could also be a reaction to the drugs. With them, everything is too serious to dwell on them. Suddenly, our hero turned to his companion and said that it would be better for her to first do a biopsy of the blood culture, saliva, PCR, and rash. Looking at Lee Soo-hek in surprise, the companion asked why she needed to do a biopsy. What could she find? The guy explained that if eosinophils are elevated, then there may be side effects from the drugs. And smiling, he suggested that the girl choose this option, saying that he believed that this option would be correct. The brunette was silent, but she thought to herself, could this man really be a genius? Ha-yun said that if she did it alone, the patient would die because of her next mistake. So the young man decided that he would choose the right option on his own. Suddenly, a current graph appeared on the screen, which reflected the patient's condition. The student explained that if a mistake was made, the vital signs would get worse. Our hero looked at the screen attentively, not understanding what the 3 days in question meant. He thought to himself that if it was 3 days, the patient would die before he got the results. So he said out loud that he would first check the biopsy results. And again, the boys looked at the screen in fear, as if someone's life really depended on it. Lee Soo-hyuk said it seemed like he got it right. Baruta immediately stated that it was a reaction to the medication, but Lee Soo-hek was right, and the assistant again stated that the young man enjoyed self-admiration. However, the artificial intelligence did not want to argue at all, because this time the resident was really right. Pointing to something, the guy said that he believed the patient was allergic to the drugs, and immediately added that for this reason it was best to use steroids. Since the girl was afraid to make a choice, she asked her companion to do it. It seemed like time was dragging on forever, as the data loaded quite slowly. A few seconds later, an image of a person appeared on the screen, and the program offered to create a new schedule. The guys were happy because the condition of the lungs was improving, and therefore the patient was feeling much better. While checking the homework, the director did not understand how this was possible. He wondered if his colleague was aware of this. The man had a task in front of him, which indicated that the treatment was complete and the patient had recovered. Baruta couldn't believe that Lee Soo-hek's first day in the cardiology department began with him being asked to collect the student's homework. The guy was only embarrassed by the fact that Ha-yun was the only one who had completed this task, but the assistant stated that the student had no chance of solving the problem correctly, and therefore there was no need to start. Moreover, the young man thought about what would happen if the task based on the current one became even more difficult. The director didn't even suspect what our hero was thinking, since he wanted to get involved with his colleague. Woo Chang-yun didn't understand what Lee Hyun-jung wanted from him, so he waited with great interest to see what Lee Hyun-jung would ask him. However, the principal asked if Ha-yun had done her homework, although the surprised man answered the question with a question. Not wanting to listen to any excuses, Lee Hun-jung said that her father was too soft with his daughter, and it was clear that she was studying well. So what was the point of helping her anymore? The man, who had not understood anything, now heard the question as to whether the professor had managed to solve that difficult problem. With a trembling voice, the doctor said that he had not decided anything, and what was the point in him doing so? The father was happy for his daughter, realizing that she was actually studying hard, but the principal stated that studying does not guarantee that you will get the right answer. And I thought to myself that it was impossible to save a patient simply by sitting at a desk. He had deliberately given a task that no one could solve. And at the lecture, I was going to explain why the guys couldn't save their patient, but suddenly I got the correct answer. And so the director again began asking leading questions regarding this point. Smiling, Wu Chang-yun guessed what the matter might be, but was in no hurry to talk about it. The man knew that Lee Hyun-jung would still get to the bottom of the truth, so he started saying that Ha-yun had gone silent this weekend. And then, with some resignation in his voice, he noted that he didn't want to talk about it, although there was nothing bad in this situation. The man heard his colleagues start shouting, wanting to hear the whole story, and so Wu Chang-yun made his friend promise that he would not get angry. Only in this case, he would tell him everything as it was. The director agreed, declaring that he would control himself, but the professor should under no circumstances hang up. After a short pause, the girl's father said that his daughter had met with Lee Soo-hek that weekend. Lee Hyun-jung began cursing so loudly that it seemed like the entire hospital could hear him, although his colleague noted that the director had promised not to get angry. He didn't hear anyone or anything, but simply said that he couldn't help but be angry. Why would his resident date such a beautiful student like Ha-yun? However, the father himself did not understand what was wrong if the boys became friends naturally. And so, with optimism in his voice, he declared that his little girl could become an ideal intern in the future, just like our hero. It seemed that Lee Hyun-jung did not fully understand what his colleague was getting at, and so he asked what the purpose of the guys' meeting the day before was. Mr. Wu started talking about how it seemed like she showed Soo-hek the task. Turning around and looking at the young man, the director continued to listen to the fact that the guy was a first year, so it was interesting what he would do, but he did not specify what exactly. The young man was embarrassed because the boss's gaze was fixed directly on him, and this was very suspicious. Suddenly, the chief directly asked the resident if it was true that he had solved that problem, looking at the confused Lee Soo-hek. The director didn't want to talk to his friend anymore, so he interrupted him mid-sentence and turned off the phone. And he turned to the guy again, asking him once again if he had solved the problem, but he had to speak honestly. Stuttering, our hero said that it was actually him, and then began to apologize for doing someone else's homework, although he shouldn't have done it. Lee Hyun-jung wanted to know how he managed to cope, because there was a trap. Besides, it was rare for such a disease to act like this, and therefore, as a resident, he managed to find the correct answer. Looking around, the young man thought about how best to explain his train of thought to his boss. After a short silence, the young man said that he had chosen steroid treatment. The man noted with sadness in his voice that this was a fairly good solution, and added that he had brought this problem from a conference on mortality. The conference is held when a patient dies and the disease that led to death was curable. To make sure this didn't happen again, Lee Hyun-jung created a problem based on this case, and much to the boy's surprise, the answer was correct even though he was a first year. The most offensive thing was that if Lee Soo-hek had been there, the patient would have definitely survived. Looking at his watch, the man asked if the guy had anything to do, since Song-seng-nim Kim In-soo had asked for help with cooperation. And after that, he asked the young man to go to class with him, saying that the resident would need to compose a problem and then solve it, adding that it would take a little time. Looking at his mentor in surprise, our hero could not believe that he was being asked to participate in such a serious matter. The director folded his arms and asked why he should be doing this. Although he immediately explained without any anger in his voice that Lee Soo-hek, without expecting it, had ruined his lecture, so now he should take responsibility for it upon himself. And he added that the resident should come up with some case, but as a cardiologist. Lee Hyun-jung said that it was very simple, but even if people could do it easily, the result would still be wrong. Looking at the director with fear, the guy remained silent. It seemed that he was so embarrassed that he didn't know what to say. Looking at his watch, the young man realized that it was now 8 in the morning, and classes would start at 10:30, which meant that he had to come up with an interesting problem and then solve it in less than a couple of hours. And while our hero thought it was pointless, the Baruda convinced him otherwise, declaring that it was a wonderful opportunity. The young man was sure that he would ruin the lesson, but the assistant continued to note that Lee Soo-hek was simply speaking out of fear and uncertainty. And then he added that only a professor has the right to give lectures, clearly hinting at something understandable. Artificial intelligence made it clear that this was a completely new form of testing, which would be simply foolish to just give up on so easily. And while the guy continued to come up with excuses, the assistant convinced him that they had gotten out of worse situations than this. Unexpectedly, Lee Hyun-jung stated that if the resident didn't think it would work, then he'd better mind his own business while he prepared for his lecture. The frightened guy, realizing that his chance was slipping away from under his nose, began to ask not to call him back, allowing him to do what he was told, although the director asked him not to overdo it. Looking closely at the leader, the young man once again shouted that he would not let him down. And with shining eyes, he added that he would do everything in the best possible way. A few hours later, in a state of joyful anticipation, Lee Soo-hyuk told his mentor that he would take all the initiative. Looking at the guy inquiringly, the director did not understand what made the resident so self-confident. And then he caught himself thinking that the young man was strange. He forgot about it because he was shocked by his knowledge. And he remembered when he was a resident, he saw the news that one of the seniors had stabbed a professor with a knife, and he thought with horror whether he was as evil as the one he had read about. Suddenly the man's gaze fell on what the young man had in his pocket. He immediately began to ask what it was, perhaps scissors or a scalpel. Putting his hand in his pocket, the young man said that his boss was wrong. Seeing how the boy was determined to grab the handle, Lee Hyun-jung shouted at him to wait and threatened him if the intern did so, and then immediately fell silent. And then, closing his eyes and raising his hands, he simply began to scream furiously. Our hero did not understand anything, but immediately began to justify himself, explaining that he had only put a small notebook in his pocket, adding that when he was preparing materials for the lecture, he wrote down his main thoughts there. And while the director was trying to catch his breath, the guy thought that this man was acting too strangely, although Baruda noted that the reason was that Lee Hae-suk was a weirdo. That's what everyone thought. As he walked toward the medical school, the resident said out loud that he hadn't been here for a long time, and that was because the school had separated and moved to another building, but next door to the clinic. Answering the mentor's question about whether it was true that the young man had returned here after a long time, he said that it was so, since it was difficult for him to return even there. Lee Hyun-jung immediately stated that he understood that it was a bit difficult for interns, and immediately began to remember the times of his youth. The men walked down the corridor, and the professor kept talking about some early March, going deeper and deeper into his memories. But after a few minutes, our hero's mentor happily said that they were there, adding that he would continue telling his story later. Lee Soo-hyuk smiled, and Baruda shouted for the director not to say anything more, although the guy said that he was looking forward to the continuation. As he entered the room, Lee Hyun-jung noted that everyone was saying that they loved his stories, which he sincerely hoped for. There were already students sitting in the auditorium, each of whom was busy with his own task. Suddenly everyone gathered, looked closely at the resident, surprised at what such a young doctor was doing. The guys immediately started gossiping about who this person could be, and someone said that he was that weirdo who had an accident. Our hero was not at all embarrassed by this. He was already partly accustomed to this attitude, and therefore he went up to the table and put his notebook on it. At this moment, the resident turned his attention to his friend Ha-yun, who was also present in the class. The brunette immediately turned to the young man, but she did it informally, as if he was not a teacher, but just a friend. After that, he asked what the young man was doing here. If Professor Lee Hyun-jung always comes alone, he never changes his traditions. The man standing behind her said that everything should be done without deception, although the blushing Ha-yun did not immediately understand what he was talking about. At this point, our hero began to connect his tablet, which he also brought, to begin the mission. The director looked closely at his charge but remained completely silent. After looking at the presentation, Lee Hyun-jung thought it was a bit difficult, but on the other hand, his students had studied a lot and should be able to handle it. After this, he stated that he wanted to review a number of homework assignments in the next lesson and study the third period of this case, and now he asked everyone to split into groups and sit down in their seats. And folding his hands, he asked to read the information on the latest case and discuss what tests needed to be done. Then he introduced Lee Soo-hek, saying that this guy would tell about an interesting case and asked if anyone knew him. Ha-yun, who was proud to be friends with such an outstanding resident, immediately announced this. Turning back to the boy, his mentor said that they shouldn't waste precious time, but rather start the lecture. Getting up from his seat, the guy immediately told about a patient with a number of complaints that go away after some time without any treatment. The director, who was listening to all this, looked attentively at the young man. And our hero continued to talk about how a couple of days ago, the patient began to choke, even when he was motionless, after which he was hospitalized. Lee Hyun-jung thought to himself that this case was completely different from the previous one. This time the patient had diabetes and for some unknown reason also had difficulty breathing. And again, the guy said that the patient was taking vildagliptin and glycoside to treat diabetes, adding that those who don't know their purpose should understand that these are insulin secretagogues. And while the young man continued his explanations, the director smiled, realizing that the task was superbly thought out. When the patient was admitted to the hospital, he complained of difficulty breathing, which became worse when he lay down. The patient did not complain of chest pain or palpitations. As a result of an external examination, the patient was found to have a buzzing sound in the lower part of the lung and swelling. All the students who listened attentively to the lecturer immediately decided for themselves that he was talking about pulmonary edema. Pointing to the board, our hero asked what tests would need to be done on such a person, told the guys to discuss it all among themselves and write it down, and then hand in their work. The first to start the discussion was Ha-yun, who said that the lungs may be filled with water, and therefore a chest X-ray should be performed. Joining the conversation, the student said that a blood test was also necessary, noting what the guys thought about BNP, which should have an increased value in case of pulmonary edema. Hearing this, the others decided to perform all the above manipulations. Baruda, looking at the students, asked if it was difficult, but our hero, smiling, said that he would find out when everyone finished. Having received the results, the young man immediately began to read all the tests that the future doctors were going to take from the patient. The director did not understand what would happen next, but he did not know why so many tests needed to be taken. While typing something on the computer, Lee Soo-hyuk said that the boys needed to look at the board. The young man immediately asked the students what they thought about this photo, and they all shouted in one voice that it was pulmonary edema. Our hero said that this was the correct answer, adding that the NT-proBNP indicator had increased to 2,800. After this, the resident wanted to know how the future doctors were going to treat the disease, hearing different answers. And a minute later, he said that everything that the students were offering was treatment, but it led to the patient dying. The astonished young people looked attentively at their teacher, not understanding how this could have happened. They could not understand at what point they had gone astray, or why this treatment protocol had not had the desired effect. The director thought that there was no chest pain or heart palpitations. After hearing this, it was necessary to exclude a number of diseases, the most serious ones being heart disease, infarction, angina, and arrhythmia. Suddenly, Lee Hyun-jung smiled. He immediately understood what was being said, although he was in no hurry to say it. Getting up from his seat, the guy said that most likely the guys still didn't understand anything after hearing an affirmative answer. And he added that he would explain everything in detail so as not to miss anything. Lee Soo-hek began by saying that the students had determined that the patient had pulmonary edema. But it is unclear what influenced such a disease, given all the nuances that were mentioned earlier. The director reflected that in order to diagnose any disease, there is a plan that must be followed, a plan of thinking about why the person got this particular disease. But perhaps the students don't know about this. And so the guy continued to talk about the fact that the patient had diabetes and was taking the drug vildagliptin. Therefore, we can come to one important conclusion. It was quite possible that the patient had kidney failure and suggested looking at the test results he had mentioned earlier. The guys thought that was the problem, but the resident said that problems with kidney function do not occur in 1 or 2 days. It had been years since the man had taken this diabetes medication. The amazed Lee Hyun-jung did not understand whether this was a real case. If so, where did the guy manage to read about it, and rightly noted that there was no place where he, the director of the clinic, would be better. And our hero continued to ask the young people to think carefully about what the reason was if the man had diabetes for about 10 years. And he continued to say that if the students see problems with the patient's internal organs, What will they do first? Staring at something, our hero thought about when your father Woo Chang-yun from the endocrinology department, and then stopped his thoughts for a moment. Turning his gaze to his friend, the guy finished his thought that in that case you should know more. Ha-yun, in turn, looked at the teacher in surprise, not understanding what she should do in this case. Suddenly, the student jumped up from her seat and shouted that there were complications. And while Lee Soo-hek said that this was the correct answer, the Baruda stated that he believed that the girl would not guess, while at the same time our hero suggested considering the possible complications in more detail. With each passing minute, the director watched what was happening with increasing interest. He knew for sure that diabetes has several complications. Among them, two organs that are checked. The first is the kidney, and the second is the eyes. If there are problems with the kidneys, then there is a chance that there are problems with the eyes as well, because the blood vessels involved in the functioning of the kidneys are thicker than the vessels in the eyes. If the large vessels are affected, then the thin ones are too. That's exactly what Ha-yun said. Hearing this, the guys said that he probably didn't need to explain this nuance, since the guys were already in their 4th year. Even though everyone said out loud that everything was clear to them, there were those who did not understand it. So it was necessary to start from the very beginning to determine what was wrong, and so the guy asked what pulmonary edema looked like. Some people were shouting that it looked like incomplete kidneys. Others were saying that heart failure could be causing the swelling. There were also people who noted something about the right side of the stomach. Lee Soo-hyuk rejoiced, stating that all of these nuances were absolutely correct, and then asked if there was anything else in the test that he should add. Raising her hand, Ha-yun said that in addition to what they had discussed earlier, she would like to add the electrocardiogram that needed to be done. Then our hero said that it was necessary to do a blood test, but only to detect a heart attack. It would not be a bad idea to check the cardiac muscle enzyme as well. After this, the young man quickly began to enter this data into the computer. And Lee Hyun-jung was thinking that his protege was actually an oddball. The young man wanted to write down everything he had just told the boys. This was necessary for clarity, and therefore our hero asked the Baruda not to interfere with him, since today he is a teacher and must do as they do. In conclusion, the resident said that he would insert the picture, and that would be the end of it. Heart muscle enzymes, which are indicators of a heart attack, have increased significantly, and an increase in the ST segment is observed on the electrocardiogram. This is a very important indicator of myocardial infarction, which the man did not complain about. Looking at all the pictures, as well as the test results that the guy had memorized, everyone present said in surprise that the patient had a heart attack, but not pneumonia. After this, Lee Hoo-seok asked if the patient really had this disease, what the treatment should be. Our hero could have given a hint, but he didn't want to do so, wanting the students to think about it themselves. However, they turned around and looked closely at the director, who was still watching the lecture attentively. After that, the guys unanimously declared that cardiovascular angiography and installation were necessary, which was the correct answer. Pointing to the image again, the surgeon said that it was clear that the first left artery was the most important and that the coronary artery was blocked. And he added that if the artery is cleared, the patient can not only be cured, he will live a full life. After this answer, complete silence reigned in the room. The students looked attentively at the teacher, and he at them. Suddenly, the young man spoke up, asking what everyone present could learn from this incident. This question was answered by Lee Hyun-jung, who stated that in patients with diabetes, chest pain may disappear as a symptom of myocardial infarction. And smiling, he asked again whether his judgment was correct. Our hero also smiled, saying that this was absolutely true. With sadness in his voice, the professor added that this was a very important lesson, since there were many cases where the golden hour was lost, and since the man had diabetes, many of his blood vessels were damaged. The blood vessels in the nerves are also damaged. Then you are insensitive to pain. In particular, embryos whose internal organs are not developed do not feel blood. And then in a more stern tone, he asked if everything was clear to the students, who should understand that the absence of chest pain does not necessarily indicate a healthy heart. If you think like that, you can kill the patient. Closing his eyes, the man said that in fact something like this had happened before. The director wanted everyone to understand one important detail. One should not rely entirely on what the patient says, since this could harm the doctor. And a minute later he added that it was a very useful and instructive lecture given by the wonderful resident Lee Soo-hek. After these words, the guys began to loudly applaud their lecturer. And then he started clapping himself, saying that the guy really deserved it. adding that he did not expect everything to go so well and interestingly, which confused the young man. On the way to the hospital, Lee Hyun-jung said what he said a little earlier, that the lecture went great and our hero did a great job. And while the resident was thanking him, the professor continued to note that these were not just words. The young doctor had talent. This was not just an examination. He was able to find the necessary information and then conveyed it to the others. After this, the director noted that the spring season had already passed and suggested making some kind of announcement. And he added that the young man was going to do something with Professor Kim Jin-sil, so why not report it? And the young man immediately remembered that the professor had proposed joint research on liver cancer. Baruda immediately stated that he would have some other idea, although Lee Soo-hek noted that if what he came up with didn't work, the doctor would insist on his own. And while our hero was once again thanking his mentor, he noted that the work would go to a good scientific journal. The guy thought to himself that other people would think they were proud of this publication, but that was not important at all. Upon entering the hospital, the director continued to talk about how they would then need to write a paper together. He was not a specialist in gastroenterology, but he knew roughly what needed to be done. After that, he said out loud that it was already too hot for a walk, but he thought to himself that the young man was a genius, and therefore he would be able to write everything that was needed. Our hero likes summer, but Lee Hyun-jung decided to joke, saying that summer is a great time for cardiologists. The resident suggested that cardiovascular disease was decreasing during this time, although the professor said he was not sure that this was actually the case. The men would have continued their conversation, but they heard loud shouts that a patient had been admitted. The staff were arguing among themselves, and then the senior doctor shouted that they needed specialists. A few minutes later, more staff came running and took the man to the treatment room. One of the young men looked closely at the patient, noting that the guy was truly unhappy, although it was unclear what this was connected with. The professor did not interfere in this matter, since he was not called, and therefore continued to observe what was happening. He suddenly asked his companion if the medics were really heading to the MRI room. Hearing the answer that the victim probably had a head injury, and the person running next to him was a neurologist. Hearing this, Lee Hyun-jung said something thoughtfully, but the young man couldn't understand his mentor. He confidently stated that he had a bad feeling about the man who was being wheeled out on a gurney. Meanwhile, the medical team was heading towards the examination rooms. The director raised his hand and looked carefully at his watch. The man said in a frightened tone that if he didn't have a meeting scheduled for now, he would like to go and see it. And then he added that the young man should go and see what would happen there, although Lee Soo-hek said that he was sure that it was neurology. But the boss said the guy should look at it, using his name if necessary, and then tell him. At the same time, he added that if everything is fine and nothing will bother the young man, then there is no need to report. Otherwise, you should listen carefully to what the neurologist will say. As he left, the professor said that talking about finances was not fun, and therefore he wanted to leave as soon as possible. Patting the intern on the shoulder, Lee Hyun-jung repeated once again that he needed to go. If our hero had any problems, he just needed to report it. The young man thought to himself about why his boss had asked him to check this case. And he, in turn, thought that after he looked at it, he understood that the prognosis would be bad. It was a stroke, accompanied by loss of consciousness. Stopping, the boy heard the Baruda say that he had saved visual information for him. The young man still didn't believe that this was somehow possible, but the assistant stated that he had to thank Tewa Electronics. From the pictures that were there, Lee Soo-hek could only note the pulse, which was at 62, and there was also noise. Looking at the screen, the guy said that he didn't see one number in the pressure, but the artificial intelligence immediately added that perhaps it was not there. Therefore, the systolic pressure was below 100, which is logical in the case of loss of consciousness. The patient was breathing, so oxygen saturation was 100. Scratching his head, the young man said he felt like an internal medicine doctor. At this time, several doctors were sitting in the MRI room, each looking at the other rather askance. Entering the office, our hero said that he saw the patient when the gurney passed by him. It looked quite sad. The specialist explained that the patient had lost consciousness, and that this was a bad prognosis if consciousness was shaken by a heart attack or bleeding and fell silent. But the young man continued his thought, albeit to himself, that this usually leaves irreversible consequences, and in many cases leads to death. At this point, the intern announced that a video was appearing, and therefore it could be viewed. Sitting down next to him, the doctor said that the patient was apparently having a heart attack. And while the young man was lamenting, putting his hand on his head, our hero was thinking that he probably shouldn't get involved with the director. Baruda immediately stated that it was a microinfarction, but perhaps it was not the cause of loss of consciousness, although the resident did not understand what he was talking about. However, the artificial intelligence asked to look closely at a certain range, adding that a microinfarction would not cause loss of consciousness. Looking closely at the screen, our hero thought, not knowing what to do. And Baruda continued to talk about the low level, loss of consciousness. Most likely the reason for this condition lies in something else, although the guy did not understand what exactly. And then he said that it was impossible to draw a conclusion based only on an MRI of the head. The information was limited and other tests needed to be prioritized. The assistant thought it would be a good idea to first check the other organs that could have caused the loss of consciousness. The young man was silent, but at the same time he was looking attentively somewhere. At the same time, while talking to someone on the phone, the neurologist said that the patient had been hospitalized. Lee Soo-hyuk reasoned that the organs that can cause loss of consciousness are, first of all, the heart. And although there was no mention of pain in the patient's chart, it cannot be overlooked, since the case that the guy described in the lecture was the same one that led to the patient's death. Baruda said the heart needs to be checked first because there is too little information. A moment later, our hero was already asking the neurologist whether this patient had had an ECG. He said that it was quite possible, but now it was not so important. There were other priorities. Lee Soo-hyuk scratched his head and noted that the attending doctor had other things on his mind, although the boy didn't understand how he could request an ECG, especially without notice. The artificial intelligence swore, saying that our hero is a doctor, since he also has a license from Korea. And then he remembered how he himself was an intern who didn't know a lot and missed even more valuable things. Baruda immediately stated that the young man actually knew little at the time, and this phrase offended the young man, who nevertheless tried and studied. Having changed the subject, the assistant stated that in any case it was necessary to check the ECG or that it was absolutely necessary to do it. In a confident tone, our hero first asked whether the doctor had seen the patient's cardiogram, and hearing a negative answer, said that this examination needed to be carried out. The neurologist did not understand why his colleagues needed this, and so he said that the young man himself had seen the video, and therefore the patient needed to be taken to the ward immediately. Lee Soo-hyuk was not going to stop, saying that the area of the microinfarction was recognizable, so it was necessary to confirm this disease. It was not a lesion that could cause loss of consciousness. The elder didn't like this, and he began to explain that firstly, the young man was not a neurologist, and secondly, he was still in his first year, and therefore shouldn't argue with his elders. And starting to shout, he declared that the frames don't matter. The most important thing is the location. After that, the doctor grabbed Lee Soo-hyuk's hand, saying that this wasn't even his patient, but he was still getting involved. Only a moment passed, and the angry neurologist was already dragging his colleague somewhere. Having thrown him out the door, the young man shouted that the neurology department would take care of everything, and that the first-year student had better leave. Closing his eyes, the boy said that he would hardly have been angry if someone had wanted to help, but he was glad that at least he had not been beaten. Baruda stated that he was telling the truth. Moreover, he believed that this man also knew that the area was small, and our hero added that he could not leave it just like that. Suddenly he remembered that he had left his cane inside and that it could be his salvation. The assistant was wondering what the resident was going to do while he picked up the phone. Looking at the AI, Lee Soo-hyuk said that they definitely needed to get the ECG, but he didn't know how to do it. At this point, the intern continued to hold the intubation tube so that the patient could breathe without problems. And a minute later, they began to wheel the patient out into the corridor, as the neurologist had discussed. The doctor looked closely at the intern, who was looking suspiciously somewhere. He saw a resident approaching them and asked why he hadn't left the department yet. Lee Soo-hyuk had no intention of leaving. He told the doctor that it was not that difficult to do an ECG, asking him to confirm this analysis again. The young man added that a microinfarction was not enough to cause loss of consciousness, but the neurologist said that he had to give the man medicine first. It seemed that our hero was going to go all the way. Trying to get through to his colleague, he continued to note that it was impossible to give the medicine since it was not entirely clear what was happening to the patient. The young man looked with horror at the guy who was trying to prove something. But at that moment, someone's voice sharply addressed the third-year student. All those gathered immediately turned in the direction from which they heard the voice. The director, who was standing nearby, said in a stern voice that the neurologist had immediately done an ECG. Sitting in the office, the speaker said that the oncohematology and gastroenterology departments had recorded a surplus, while the infectious diseases department had barely avoided a deficit. Everyone gathered, including Lee Hyun-jung, was bored as they listened to this information every month. Suddenly, the director's phone rang. He understood that his ward was calling, and therefore he could not help but answer. Hearing the young man's voice, the man immediately began asking what had happened, and he immediately told him that there was news about a difficult patient. The cardiologist listened to the resident until the end, and then loudly shouted that if the patient had heart problems, then he definitely had to be there. The colleagues looked at their leader in surprise and could not understand anything. Realizing that Lee Hyun-jung was already at the door, the crowd immediately began asking where he was going. Hearing that he had an urgent patient, with indignation in his voice, the director said that if someone heard that he was not trusted, they might think that he had already run away before under the pretext of being sick. At that moment, everyone shouted in one voice that it was true, that it had happened before and more than once. However, the person who had to deal with the money said that there was no need to shift the blame, but to decide what to do with the deficit. Lee Soo-hek, who was talking to his mentor and heard everything that was happening, said that the patient was in trouble. The man warned that he was heading to the emergency room, but might hear some details on the way. The young man said that it was indicated that the man had lost consciousness, and when he was discovered, he was taken to an ambulance, and less than 3 minutes had passed when they found out that he was okay. Therefore, it cannot be said that the golden hour has already passed. The MRI of the brain showed signs of ischemic stroke, but the cardiologist was interested in whether there were signs of irregular stroke. The young man said the symptoms were not extensive enough to cause loss of consciousness when asked about the small range. And so he continued to say that the scale is small, and compared to a heart attack caused by blockage of blood vessels, the boundaries are rather vague. Thinking about it, the professor decided that this was all quite strange. Our hero also confirmed this, saying that he suspected a right ventricular infarction. If so, then the symptoms were more likely related to a decrease in blood pressure than to chest pain. Lee Hyun-jung explained that there are several reports describing cases where a lack of blood flow to the brain caused ischemic stroke. After that, I asked the guy to book a room for cardiovascular angiography, and I must say that the director gave the order, and he himself would be there in a couple of minutes. These few minutes passed quite quickly, and so the doctor asked the third-year student to do what our hero asked. Seeing that the young doctor was standing rooted to the spot, the manager repeated once again that he should immediately bring the ECG machine. Realizing that it was necessary to move, the neurologist immediately declared that he would do everything as he was told. Answering the mentor's question about the pictures, the guy said that the examination had just ended, and therefore it would be better to look at everything in the office. Hearing this, the man said that it would be best for them to go there. For a moment, the doctors were silent. Our hero looked attentively at the professor, but did not know what to say to him. Within a minute, Lee Hyun-jong turned his head as if he was looking for someone. And it was true, because he met the gaze of the young neurologist, who had already returned. The frightened guy thought that he considered all the rumors to be lies, just laughed at it and quickly forgot about it. But it turned out that the rumors that Lee Soo-hek is the director's son are not fiction, but the real truth. Under the pretext of family ties with the boss, he would have immediately taken pictures, especially since he himself felt unwell after the MRI. The doctor was going to give the patient medicine and immediately wanted to send him to the department to do an ECG. The silence was broken by Lee Hyun-jung, who addressed the third-year student menacingly. The young doctor's eyes widened in surprise. He was sure that he would be punished. But a moment later, the director changed his anger to mercy, asking the neurologist to keep an eye on the patient while they went and looked at the images. Although the manager immediately noted that since the guy was not an intern, he would be able to do an ECG, and therefore instructed him to handle this task. After that, the cardiologist turned around and headed towards the MRI room, hearing our hero trying to call out to him. Still looking attentively at Lee Hyun-jong, the senior resident said out loud that he had gotten away with it this time. Hearing this, the director turned around and asked what the young man wanted. Realizing that Lee Soo-hyuk was walking too slowly, the man asked where his cane was, hearing that he had left it in the office. Handing the cane to his patient, the cardiologist kindly called the young man forgetful, saying that he always leaves his cane somewhere. Within a few minutes, the men were looking for the recording they needed. Baruta told the boy which pictures were the clearest and most informative, and he repeated the same to his mentor. Seeing Lee Soo-hyuk quickly searching for the images, the director couldn't help but notice, saying that it seemed as if he was from the X-ray department. The guy realized that he was actually looking for everything suspiciously quickly, and so he thanked the cardiologist and just stood there, looking at him with a confused look. When the first high-quality image appeared on the screen, our hero said that it would be strange to claim that the condition worsened due to a blockage of an artery in one place. He added that the cell damage that would occur with a complete blockage was too small, hearing Lee Hyun-jung say that the problem was most likely with the blood flow or oxygen supply to the brain. After this, the resident suggested that there was a problem with the heart, which the mentor appreciated. The orderly who appeared in the doorway greeted him and reported that he had come as requested. Getting up from the table, the manager told our hero that they should go to a patient who needed to have his heart checked. And a minute later, he said that Lee Soo-hyuk could contact neurology and ask them to examine the patient. If the assumption was confirmed, he would intervene personally. After leaving the office, the cardiologist asked the intern what the test showed. After receiving the results, Lee Hyun-jung began to carefully read what he saw. Without saying anything, he simply handed the paper to our hero. The young man looking at the sheet thought that this man liked to check others, especially since deciphering an ECG is one of the most difficult tasks for a resident of the surgical department. But Baruta said it was as easy as drinking a can of soda and then deciphering it. And it's been 10 years since artificial intelligence could do that. A minute later, Lee Soo-hyuk said that, firstly, the ST segment is elevated in the first segment, and secondly, the amplitude in the third segment is higher than in the second. Answering the director's question about what it could be, the resident, embarrassed, said that based on these data, it could be said that there was a heart attack in the lower part of the heart. Looking at his watch, the man asked again, if it was the lower part, then which lobe, hearing that it could be either the right or left ventricle. But Lee Hyun-jung didn't finish there. Now he wanted to know how this could be recognized. The young man thought for a moment and then said that the sensors should be swapped. And doing what he just said, he continued to note that they needed to be placed on the right. It seemed that Lee Hyun-jung had simply gone crazy, since what not every cardiologist could do was currently being done by a first-year resident. Looking at the intern, the young man asked to stop and not go any further, since he heard some noise, adding that they still had to wait for the elevator anyway. At this point, the ECG began to produce a new result, taking into account the change of sensors. Looking at the indicators, the Baruta happily reported that there was nothing complicated. And therefore, the resident said that in this part, the ST segment also goes up, especially in several sections. And vice versa, in the first section, the indicators are unclear, and in the second, they decrease. Lee Hyun-jung asked about the diagnosis, and our hero immediately stated that he suspected a right ventricular infarction, but the director immediately asked what to do in such a case. The guy explained that if the golden hour had not yet passed, a stent had to be inserted, otherwise it could lead to heart failure or even death. The boss was happier than ever, and so he announced that Lee Soo-hyuk would be his assistant today. The frightened resident asked how this could be, since there should be a highly qualified specialist in his place. But the manager replied that the diagnosis was made by a young man, and therefore it was entirely his merit. And a minute later, he added that if that was the case, then he was obliged to take the assistant's place. The third-year student was amazed beyond measure. It seemed as if he had never heard anything like it before. After that, the director asked if Lee Soo-hyuk had reserved an office. The guy said in a confident tone that the emergency cardiovascular surgery room was just free. Entering the elevator, our hero immediately pressed the desired floor, hearing Lee Hyun-jung, with a thoughtful voice, state that the problem was not in the technology, but in the lack of people. For a moment, the men were silent, lost in their own thoughts. Suddenly, the director began to nervously press the button. He complained that he asked to make the speed higher, but no one paid attention to it and where the entire hospital budget was spent. The young man thought to himself that this man was strange, and immediately the Baruta began to whisper to him that he wanted to diagnose the man when he gained experience in psychiatry, which made the resident very angry. After some time, everything was ready, and so the team of surgeons prepared for the operation. They immediately began to loudly greet the leader, who, declaring that this was unnecessary, suggested continuing the necessary preparations. At this time, Lee Soo-hek thought that when he was an intern, he was treated like a bag of sand, and during his internship, he was completely ignored. After all, success in a career is very important. Having handed the guy some kind of suit, the mentor told him to definitely put it on, adding that some people don't think about it, and then they have problems in the mail department. And while the man was addressing the third-year student, our hero was thinking that he was already limping. The last thing he needed was some more intimate complications. At this moment, Lee Hyun-jung was already giving orders to the junior staff, including Choi Jung-yeon, who had previously kicked Lee Soo-hak out of the office, and the intern standing next to him. The neurologist, glancing sideways at the manager, remarked to himself that if the manager simply called him neurology anyway, then what was the point of asking his name? In order not to waste time, the first-year student had already begun to remove the patient's clothes. At this time, the Baruta commanded, telling the young man to carry out the treatment in a specific place, explaining that there was a blood vessel in the right thigh, which the young man was well aware of. The assistant did not hear the barbed remark because he was glad to be heard. The manager, meanwhile, continued to praise his protege, noting that every surgeon should be able to do such things. The men were making final preparations before they began. Seeing someone trying to turn on the lamp, Lee Hyun-jung shouted loudly not to do so, otherwise neurology and the intern would become castrated. But the young man said that he didn't even think about doing this. There was just some light glow that was there before. Laughing, Lee Hyun-jung asked the neurologist and intern to switch places, telling someone to keep pressing the ambu. Baruta, looking at the director, said that this man was too relaxed, considering that in front of him was a patient with a myocardial infarction. At that moment, the chief shouted that the wire had passed very easily, adding that the guy was slightly better than the specialist from their department. Moreover, he was never friendly. A moment later, the man asked to do some kind of closing by pulling something from the edge. Lee Hyun-jung was amazed by this device and said that it cost several million won. The hospital did not want to buy it, but he had to lie down several times to get them to buy it. Our hero thought to himself that it felt like this wasn't a metaphor, but that the man literally did it. Baruta immediately confirmed that such a person could very well have done it. Suddenly, the guy looked at the picture, realizing that the coronary artery, which should branch from the aorta to the right and left, only branches off in one direction. The director, who was looking at all this seriously, said out loud that it was a question of an anatomical variation. Baruta said that such an expression refers to a conclusion that is confirmed by a certain probability, and these are cases that do not exceed 10%, but this probability must be kept in mind before starting the operation. Lee Soo-hyuk thought with horror that according to the ECG results, the right coronary artery was blocked. But when the wire was inserted, it turned out that it was not there at all. That's why the guy said out loud that they could first check the left artery, to which the manager immediately agreed. The cardiologist thought that there was only one blood vessel. The slightest mistake and the entire vessel could be blocked, and therefore said to do everything very slowly. For a moment, the director froze, as if something was bothering him too much. Our hero had this appearance because he understood that the vessel was too short. Baruta immediately said that such a thing is practically never encountered in practice, and a moment later added that he had never heard of such a thing. The young man also thought that he had never heard anything like this even in scientific reports with multiple examples, but the assistant stated that this was not so. Lee Hyun-jung was thinking at this time that he had inserted a wire into the right artery, but he didn't think that the length would be less than 5 centimeters and that he might have to call a thoracic surgeon. In such departments, they believe that in such cases, an urgent operation is necessary. Although the director argued that a regular stent could help, and therefore he became an enemy of the association. Besides, from a medical point of view, it is already too late. The man thought with horror that perhaps the wire should have been pulled out when a single vessel was discovered and an operation performed with an incision in the chest. Unexpectedly, the resident suggested calling the thoracic surgery department to perform an open operation. And he added that if we don't say who is currently carrying out the procedure, perhaps they will help, although the situation is not the best. But the guy was inclined to think that it wouldn't hurt to try, and he added that he would report everything immediately after he made the call. Sitting in front of the computer, the doctor saw that he was receiving a call from the procedure room, not understanding who it could be. Lee Soo-hek immediately introduced himself, and the doctor in turn began asking if the first year had screwed up. At this time, the director was thinking about first pulling the wire back to where the coronary artery branch passed, but it was unclear whether it was worth trying again or not. The problem is that the patient is getting worse. Even if help arrives, it will be necessary to administer anesthesia, treat, cover with sterile gauze before the operation, and this alone will take about half an hour. But then Lee Hyun-jung's thoughts switched to his protege, who wanted to say something but was distracted. Not much time passed, and our hero returned to report the call and say something else. The guy timidly said that it had something to do with their patient. For a few seconds, the young man hesitated to say anything, thinking about how best to voice what he had intended to say. In turn, the mentor did not know how to react to the resident's words. Despite this, Lee Hyun-jung stated that he was willing to listen to the young man, and therefore he could speak. And without waiting for our hero to say anything, he declared that they, of course, called more specialists, but if they started doing an open operation now, the outcome might not be very good. Lee Soo-hek said that if you look at the case that happened in 1994, you can find exactly the same anatomical variation in the patient as now. Then the patient was also taken to the emergency room unconscious with a right ventricular infarction, exactly the same case. Only in those days, interventional procedures, that is, the insertion of a stent, were quite a rare occurrence. As soon as the patient was brought in, he underwent open surgery with bypass. By the time the man was brought in, a lot of time had already been lost. They hadn't had time to do other examinations and had immediately sent him to the operating room, so the anatomical variation hadn't been checked. The director said out loud that the doctors there were confused too, but they thought to themselves that he thought the problem was in one thing, but it turned out to be in something completely different. If he was confused now, what happened then with the other team? After the patient's death, doctors received permission from relatives to perform an autopsy to examine the anatomical features. If there are similar patients in the future, these records will certainly help in treatment. Thus, the confirmed anatomical structure, together with detailed drawings, was included in the report of this case. What was on those pictures completely coincides with the peculiarity of this patient. The cardiologist stated that this was not a mutation, but a completely possible anatomical variation, which the young man also understood. Answering the question about where to insert the wire, the guy said that the branch from the fork on the left to the top, if you go down lower, they will be twisted. In the pictures, you can see a thickening exactly in this place. The man understood that the wire had to be inserted in the opposite direction and decided that if the resident had not named the year of the study, he might not have attached any significance to his words. Moreover, 20 minutes have already passed since the beginning of the procedure. The patient has already had a heart attack. If we delay any longer, it will not be possible to save him. If you try to do everything now, the chances of saving lives will be much higher. Suddenly, Lee Soo-hyuk shouted that he saw a Ben, which was confirmed by his mentor, who said that there was no need to hesitate. The guy thought to himself that he had, of course, given a little hint, but the director did not hesitate for a second, pushing the wire through such a narrow place. Looking at the screen, our hero thought that the wire could not have passed through the place that in the pictures looks like a broken thread. The reason is that this is the clogged thread. While wielding a stent, Lee Hyun-jung happily spoke about the man's survival, and a minute later he shouted the same thing, but only so that absolutely everyone could hear. At that moment, a specialist from the thoracic surgery department entered the office and asked in surprise whether his colleagues had already finished. Still delighted, the cardiologist pointed to the last image, saying that everything was visible on it. The surprised doctor could not believe that one coronary artery diverged into 3 branches, and that the left vessel was completely twisted. The man honestly told himself that he had never seen anything like this even in textbooks. And after that, he asked whether even in such a state the professor was able to pass the wire into another vessel, despite the fact that the vessels were so tightly twisted, and he thought to himself that this was just madness. A moment later, Lee Hyun-jung said that there was a similar case in 1994, and therefore it is not worth only doing operations, it is useful to read interesting books in your free time. After this, the leader began to talk in detail about when it happened, in which city, and also what followed. Watching what was happening, our hero's mouth opened wider and wider in surprise, while the Baruda said that this man was a real charlatan. The director stated that in such cases, they perform an open operation, but the colleague is aware that with an anatomical variation, the complexity of the manipulation increases. Besides, the incision and decision-making are just a waste of time. Therefore, at that time, the patient did not survive, adding that he did not want to point out the shortcomings of thoracic surgery, asking if his colleague understood. The man thought to himself that they usually do things themselves, and their department finishes everything for them. Realizing that it was already evening and the job was done, Lee Hyun-jung said it was time to transfer the patient to the intensive care unit. A few minutes later, the mentor asked the young man if he had started something with Professor Kim Jin-shil. The amazed guy asked if there was any talk of a study next year and added that he had suggested conducting one experimental study. While typing something on the computer, our hero heard someone telling him that he was making so many appointments. It was Lee Hyun-jung, who added a moment later that the resident was doing quite well. Seeing the prescriptions, the director was surprised, since the guy prescribed his favorite drugs. But Baruda said that this was the result of a comparative analysis of the prescriptions that the boss had written over the past month. He, in turn, simply looked at Lee Soo-hek again and smiled. When asked by the man whether the experiment would last long, the guy explained that it would not take much time, but Mr. Kim was always busy. He added that he would most likely be able to start at the beginning of winter, although the man did not understand why it was taking so long, since Kim Jin-shil was simply a dissertation writing machine. Unexpectedly, Lee Hyun-jung suggested that our hero write another report while it was still autumn, adding that the young man was still a first-year student, and therefore no one would probably ask him to put forward a thesis. And then he suggested adding the current case, which greatly surprised the young man. Baruda didn't understand what was going on, but he liked it very much. And then he asked if this would help the resident become a professor, but he said that it would not really, since there were many reports that were never included in the dissertation. And while the assistant was trying to convince our hero to refuse, the boss asked his protege to find that story from 1994 in order to make a reference to it and write a report on the topic of not a mutation, but an anatomical variation. If you do that, you can write a whole textbook, and this phrase shocked both Lee Soo-hek and Barutu. Looking at the smiling director, the guy couldn't believe that he was telling the truth, which he didn't like at all. The young man was embarrassed, but still asked if it was true what he had said about the textbook, which the man immediately confirmed. He explained that even if the materials were borrowed, these were only 2 cases. The report would be about anatomical variations, especially since no one had mentioned that study before. Lee Hyun-jung honestly admitted that this was an unknown topic for him too, and that this should definitely be included in textbooks. If it is written in an interesting way, it can be published even in the most famous scientific journal. Upon hearing the name, our hero was in shock. He couldn't believe his ears that such a thing was even possible. The reason is that it is the medical journal with the longest history. It is respected all over the world, so it will be an honor for every doctor if his work is published. Often, what was published in the magazine was actually included in the textbooks, and now such a story could be written by a first-year student who still could not recover from the shock. Pointing his finger at Lee Soo-hek, the director said that he was probably planning to become a professor, and if so, this would definitely help him, adding that Shin Hyung-tae had never been published in the magazine before. Only the mentor asked not to say anything to his colleague, explaining that he was a very envious person. As he was about to leave, Lee Hyun-jung asked the guy to come to his office in 10 minutes so that they could immediately jot down the theses and make a plan. The guy was surprised. He didn't understand how this was possible, but the manager assured him that there was nothing complicated about it. Just take one look to figure it out. Looking after the man as he left, the Baruda said that this man had taken our hero seriously, in whom he completely believed. The young man himself knew this, as well as the fact that there were rumors that Lee Hyun-jung had written his dissertation while relaxing in the gazebo on the golf course. It was still a long way off, but still, the guy felt a little like he was getting a little closer to the title of the best medic in the world. Printing out the research history, the young man was glad that he hadn't erased it. Otherwise, he would have spent several minutes searching. When the resident learned that dissertations were required for the internship, he decided to save everything interesting on the hard drive. Even if Baruda remembered it all, it would be difficult to collect the information in one pile. Entering the reception area, our hero was warmly greeted by the director's secretary. The girl walked the young man out and offered him his favorite Americano. And he just thought to himself that most of the residents had no idea where the director's office was, but he was already here, at home. Hearing the guy coming in, the man immediately offered him a seat. Seeing that Lee Soo-hek had brought the story they were talking about, the director became happy and asked him to pass it on to him. Looking through the information, the man said that it was all written by the former chairman of the Society of Cardiovascular Medicine. Reading every word, the cardiologist said that it all matched exactly. Moreover, this was submitted to the International Cardiology Association. Such a reference will be more than enough. Pointing to the computer, the manager stated that he had already sketched out something in general, which amazed Lee Soo-hek, who noted to himself that about 10 minutes had passed since they parted, and the man had already done so much. The guy was a little embarrassed, but Baruta said that this was the best, and then reminded our hero that at least they had each other. After reading the beginning, our hero's assistant declared that this was something amazing. The grammar was top-notch. The use of appropriate words, it was simply top-notch for such work in English. The guy wasn't very good with languages, and then he got a little embarrassed, although the artificial intelligence said that it would quickly translate everything. Lee Soo-hek stared at the screen in silence for a while. The director looked at him attentively while drinking coffee. A couple of minutes later, the young man said that the director knew a lot about coronary artery dissection, and the introduction would probably be ideal, and he immediately declared that the resident was wrong to pretend that he didn't speak English well. In order not to seem like a fool, our hero proudly declared that he had started learning the language because he was going on an internship. Getting up from his seat, the man suggested leaving the introduction as is, without changing anything. The boy saw how quickly his mentor typed. It seemed like his thoughts were coming out of nowhere. After this, the supervisor asked to add the main content and wanted the resident to try writing a conclusion and a detailed review. Hearing that the submission period would soon end, Lee Soo-hyuk asked when he could submit the final version of his work, knowing that sometimes it would take weeks to complete. Lee Hyun-jung was a little confused and then asked if the young man wanted to start writing immediately. The young man was so surprised that his eyes almost fell out from this feeling. Our hero was sure that it was a joke, but Baruta said that the analysis carried out showed that it was true. The resident was scared. He didn't believe that this was possible, but his assistant asked for 5 minutes to check everything thoroughly and give a possible option. Lee Soo-hyuk knew he needed to stall for time, but he had no idea what he could talk about with his boss. The first thing that came to the young man's mind was to say something about the dissertation that he and Professor Kim were going to write, although the man found this topic strange. Baruta immediately began to scold his master, saying that this was a bad topic for conversation, but the boy stated that he simply did not know any other topics for conversation. Hearing that the director was experienced and smart, he immediately began to laugh, saying that it was true. Looking at the cups, the young man suddenly declared that, heart be told, he wanted to write about liver cancer. The man immediately said that it was interesting, that it was absolutely necessary to write a dissertation on such an experiment, but he didn't understand what the resident was getting at. The young man said that if this were done electronically, it would require considerable funds. At this point, the Baruta began to ask if his master would finish soon, since he himself had already finished the analysis. And without waiting for permission, he said that there is information on the topic of coronary artery dissection in textbooks and a lot of material on reports, so we can get started right away. Unexpectedly, the director said that the resident could use his research grant, and Lee Soo-hek could be listed as the second author. Then there would be no problem. Becoming serious again, Lee Hyun-jung asked when the young man was going to start writing the paper. In a voice filled with determination, our hero declared that he would do it right now. The guy already had a laptop in front of him, as well as sketches. All that was left was to finish the work he had already started. The man thought with horror that he had simply asked, and the young man was already ready to start working. And this despite the fact that he himself began to write well only when he became a professor. The director did not believe that such a thing was even possible, although he could not doubt it. It's possible if this boy is smarter than Lee Hyun-jung himself. Baruta stated that he had just fine-tuned his style again, and that everything was perfect. The assistant said that sentences would begin to appear in the young man's voice, which he would have to type. And a moment later, the resident began writing about how taking into account anatomical variations during coronary angiography is extremely important for predicting the patient's condition. Lee Soo-hek noted that this sentence was familiar to him, and the artificial intelligence said that there was nothing strange about it, since it was made up of expressions that were found in the dissertations the young man had read. Having seen the finished piece, the manager was delighted, and he thought to himself that it was rare to meet a person who was able to produce something useful when he was first asked to write a paper. Usually, most of them bring reports that look like dissertations. But in contrast to their amazing skills in reading texts in English, almost all of them are mediocre in writing. Many even bring some proposals that are far from English. But how well our hero writes, his sentences and paragraph structure, all this corresponds to the standard methodology of writing scientific papers. The young man thought while writing that the sentences were too dry, but Baruta said that in a dissertation this is normal. The guy didn't know that this was true, since his assistant translated everything for him, and he himself hadn't really studied anything in the original. Surprised, Lee Hyun-jung reflected on the fact that the more the resident wrote, the better he did, and his logic was generally excellent. The man said partly in jest about publishing in a magazine, but with a job like this, it will actually become something absolutely real. Breathing a sigh of relief, our hero said that it all took about 15 minutes, and the Baruta, without modesty, declared that it was an ideal text, even though it was written by him. Hearing the boy say that he was finished, the mentor thought again that it was something unrealistic to write such a work in less than half an hour. Lee Hyun-jung knew that no one would actually believe this because it was simply impossible. Once again, the man thought about how that day Shin Hung-tae and the professor's other senior colleagues had called the man a monster. He thought they were exaggerating, but now he seemed to understand. I began to understand what it meant to see in front of me a real monster that was impossible to even imagine. The director smiled sincerely, thinking about how funny it all was. That's why he decided to definitely take on the intern Lee Soo-hek and educate him properly. The specialist knew for sure that this guy could become an excellent doctor, one of the best. Not understanding why the mentor was silent, the young man turned to him, but he said that the work was written so well that there was no need to even correct anything. Hearing how Baruta said that it would be impossible for it to be written like that, Lee Soo-hek automatically repeated it, but after realizing that he had said something wrong, he simply thanked the director. Looking askance at his assistant, the young man began to scold him, but the artificial intelligence merely stated that he had written perfectly, and therefore there could be no corrections. Unexpectedly, Lee Hyun-jung laughed and said that he was such a genius that he came up with the idea of writing a report on the topic of arteries. The guy sat there blushing, silently proud of himself, although there was nothing to be proud of. Having finished arguing with the Baruta, the young man noticed that the work had been sent somewhere. Seeing the surprise on the resident's face, the mentor explained that he had submitted a research paper to a journal, although Lee Soo-hek did not understand what the conference would be like then. But the man calmly explained that who sends the original dissertation to participate in the conference? You can just send them the main theses. The frightened resident couldn't say a word, but his boss encouraged him, saying that there was no need to worry. Anyone could submit work. The main thing was that it was accepted. A minute later, the man was already calling someone, asking how many theses had been sent. And while Lee Hyun-jung was talking about wanting to throw in another text, our hero was thinking that, most likely, the conversation was being conducted with the professor who was entrusted with the role of academic director at the conference. If it is the director of the therapy conference, then it is Professor Woo Chang-yun, who was just talking about giving a lecture. At that moment, the young man remembered Ha-yun, so cheerful and happy, he thought that this was fate. Although Baruta immediately told the embarrassed guy that this was the most ordinary coincidence. And while the director continued to say that this was a report from a resident, our hero's assistant stated that he knew nothing at all about feelings or relationships. Realizing that the leader had named the speaker, the young man looked at Lee Hyun-jung in fear. The professor who listened to Lee Hyun-jung couldn't believe what he was telling him, because it actually seemed unbelievable, or even impossible. The cardiologist happily said that he would send the abstracts and asked his colleague to book a larger lecture hall. And again, the man was amazed. He asked if it was true that no one had spoken about this before, and now this topic would be fully disclosed. Woo Chang-yun closed his eyes and thought that he had seen the young man's work, but performing at that level was something completely different, and therefore not a good idea. Although a moment later I thought about what if this was true and the young man would be able to reveal such a complex topic. Lee Soo-hek froze, his expression once again showing horror, as he knew that there would definitely be a stir after this report. Realizing that arguing with his colleague was useless anyway, the professor declared that he would do everything as needed. The director was pleased to hear this, and so he reiterated his hope that Woo Chang-yun would do a great job. A few weeks later, all conference participants were heading to the event. Sitting on the bus, the director spoke contentedly about how this wonderful day had finally arrived. Covering his head, the colleague said that the manager should think about his reputation, but he noted that no one knew what contribution he had made to this conference. Woo Chung-yun noted that he knew very well how difficult it was for Lee Soo-hek, since he never left the mentor's office, and he thought to himself that this poor guy had to please the director. But the man didn't care. He continued to tell that the young man had learned the report well, which he personally edited, adding that the resident was a real genius. Hearing Lee Hyun-jung lament that the person sitting next to him was not Lee Soo-hyuk, the colleague replied that the man must have gone crazy and forgotten why they were on the first bus. And he added that this was necessary in order to give the speakers at least a little rest. Looking ahead, the boy heard his neighbor offering him something, but the young man had no time for it. The doctor sitting next to him pointed to the eggs, noting that they were not fully cooked, but tasted simply excellent. Looking at the food, Lee Soo-hyuk thought that he didn't want to listen to the noise all the way because he hadn't slept because of his duty. Baruda immediately said that it was so unfortunate to meet Professor Cho right in front of the bus. Suddenly, the young man shouted that our hero even peeled eggs perfectly, asking if there was anything he did not do very well. As he started eating, the man had to be distracted by a phone call, as it was Kim and Soo calling, although his colleague did not understand what he was doing in the hospital and not going to a conference with the others. In answer to the question, the guy explained that, firstly, he was on duty, and therefore he would only be able to go the next day, and secondly, he didn't have a report anyway. And then he said that Professor Cho's patient, Kim Sung-won, had been admitted by ambulance. He had myelofibrosis and was complaining of abdominal pain, and so the doctor decided that the specialist should know about it. After thinking for a moment, the young man confirmed that it was his friend, but he did not understand why his stomach hurt. Baruda immediately stated that they knew this patient because he was in the database, and this happened after the rounds with Cho Tae-jin. The patient has chronic idiopathic myelofibrosis. The prognosis is not the most favorable. Therefore, according to preliminary estimates, he has about 5 years left to live. The professor thought to himself that nothing terrible had happened, but asked out loud if there were any results from the examination. The guy said he would do everything, but not a single professor was there because everyone had gone to a conference. Unable to bear it, the young man cursed. He was irritated by the fact that in the summer everyone had vacations and holidays, so in the fall they put one conference after another. At that moment, the bus passed by the medical center. Seeing this, the doctor thought about getting out. But how would it look because he had to give a report on the first day? Pulling himself together, Cho Tae-jin said to take pictures first and once everything was ready, to send the results to him immediately. After thinking for a while, our hero decided that there was no cure for myelofibrosis. The only way was to monitor the condition and suppress the symptoms. The patient was not that old, and so the guy thought that it could be something else. At this point, the professor turned to the young man, asking if he remembered his patient, to which Lee Soo-hek replied that of course he remembered, especially since he had recently been to an appointment. The man said that even then the patient complained of abdominal pain, but it was minor, so he did not think that it could be something serious. Baruda immediately stated that the patient's spleen had been removed, and therefore the problem was not in it, but he had taken steroids a year ago. At this point, Cho Tae-jin suggested that it could be an infection due to complications from the steroids, which our hero agreed with. A few minutes later, the doctor received a call saying that the images would be sent to him by email. In turn, the doctor on duty said that there was a narrowing in the ileum, mesenteric masses were observed, and then both he and the radiology doctor on duty suspected tuberculosis. And while the young man was getting out his laptop, the doctor said that they wanted to give him medication that would help cope with the symptoms. Lee Soo-hyuk remained silent. He didn't want to interfere in something that he wasn't asked to do. Taking out his laptop, the professor eagerly wanted to look at the test results and the images he had received. Lost in his thoughts, the specialist said that he understood what the duty officer was talking about. Less than a minute later, the doctor said it was definitely tuberculosis. And he thought to himself that anyone would have seen such a disease in those affected areas. Suddenly, the Baruda proudly announced that the diagnosis was incorrect. Lee Soo-hyuk didn't understand why he was so confident, so he asked about it. But a moment later, the guy closed his eyes and smiled, telling his assistant that for some reason he suddenly had a sense of déjà vu. Just a few months ago, while solving a problem, our hero was sure that the patient had cancer, but the problem turned out to be completely different. Realizing that artificial intelligence knows almost everything, The young man asked it to tell him a little about its assumptions. Baruta was pleased with this attitude, and therefore he said that this was where it should have started. And then the assistant asked the resident to look at the medical history, saying that the man had undergone a splenectomy, and it was performed as an enlarged spleen. After this, our hero suggested that it increased because there was an increase in hematopoietic activity outside the bone marrow. Hearing the boy's thoughts, Baruta even cried, saying that the young man had finally begun to think and analyze, and that he admired this. No matter how many TB patients there are in Korea, this patient only received steroid treatment for 3 months, much less any record of suspected TB. Based on the illness he currently has, Lee Soo-hyuk decided to think logically. Suddenly, the boy turned to the professor, who was carefully studying something. Without waiting for an answer, the resident boldly asked if he still thought the patient had tuberculosis. At this moment, Cho Tae-jin was so stunned that he felt his heart pounding. He once wanted to convince Lee Soo-hyuk to go into hematology, even though he was originally supposed to work for another professor. He even laid down on the floor at a professor's meeting, but he still couldn't do it. Looking at the guy in surprise, the doctor thought, even if it wasn't accurate, he had a feeling that the resident would be able to understand his personal reasoning. Rumors immediately started circulating on the bus that he had not only sat down with the first-year student, but was consulting with him. The young man immediately said that in shape, it looked like a tuberculosis lesion. But if you look at the examination results, you can see that something is wrong. The professor immediately said that the level of inflammation was low. The man had been taking steroids, plus he had chronic myelofibrosis. The guy said that judging by the narrowed part, the inflammation was limited to only this area, to which Cho Tae-jin replied that tuberculosis can affect organs segmentally. But the young man did not calm down, noting that the professor did not see anything strange in these narrowed areas. I listened to the resident. The specialist thought about what he was suggesting he look at a specific area and then scolded himself for not having thought of it himself. Looking closely at the image, the doctor could not understand what he had missed or what Lee Hoo-sek had been able to see. Finally, the young man turned his attention to the part of the digestive system in which hematopoiesis is possible, and our hero said that this is exactly what he was talking about, and also the area of hematopoiesis is narrowing. The professor realized that clots for blood formation had formed in this place, and after the removal of the spleen due to bone marrow fibrosis, the extrahepatic hematopoietic effect could increase. This may be why the patient experiences abdominal pain, but does not have blood in the stool. At this point, the other residents sitting on the bus did not understand how the first-year student knew everything. Cho Tae-jin was so happy that he said that he should thank the young man, saying that if he could, he would have given up his seat at Lee Soo-hyuk's conference. But the director was quicker. Hearing the duty officer, the doctor realized that the patient was currently being given an anesthetic. And just a moment later, the professor expressed his assumptions that it was not tuberculosis. He added that Lee Soo-hyuk was next to him, who helped him figure out what was happening. After studying the pictures, they came to the right conclusion together. With sadness in his voice, the young doctor said the name of our hero. When Insu heard that the patient had an extramedullary hematopoietic process, he was very surprised. After discussing everything that was happening with the duty officer again, the young man said that he certainly knew what needed to be done and therefore could treat the patient. At that moment, Baruta looked attentively at our hero, and he at him, and both were silent. Looking at the phone, Kim In-soo started cursing. He didn't know what to do, thinking that maybe steroids could solve the problem, although he wasn't sure that would work. The young man understood that he did not know how to treat this disease. He was simply used to talking to younger people this way, so he spoke to the older one in the same way. Lee Soo-hyuk knew that his senior colleague didn't understand anything about treatment, so he wrote him a message saying that the professor had told him to prepare everything for radiation therapy. Silently looking at the desktop, the doctor understood that Cho Tae-jin had nothing to do with this message. And he thought to himself that he had been in therapy for 3 years already. And he knew very well that Tae-jin was not the type to call back. And turning around, he decided for himself that he would let Lee Soo-hyuk be the professor, since it was precisely such people who should deal with difficult cases. After some time, the doctors were brought to the city of Jeonju, to the Ramada Hotel. While stretching, our hero's neighbor said that he had arrived at work at 5 in the morning because of a conference, was very tired, and didn't even take a nap on the bus. With bags under his eyes, the young man thought that he was the one who hadn't slept. hearing the Baruda telling the boy to hint to the professor that he needed to undergo a polysomnography to check for snoring. He added that if you sleep on your back, you may experience a serious degree of apnea. As they got off the buses, the professors began to share their impressions of the city. The first years sitting in their seats were so relaxed that they seemed to be in no hurry. In response to Cho Taijin's question, Lee Soo-hek said that he would be giving his report at 11 o'clock, hearing the young man say that the largest hall was occupied at that time and that there were always a lot of people. A minute later, the director approached the guy, wished the resident good luck, and told him to attend as many lectures as possible, saying that they would be useful to him in the future. Baruda immediately declared that the young man should immediately go to other conferences. But before our hero could go inside, the bearded man immediately called out to him. A few days before, the second-year students were talking about how Lee Hoo-sek would be expelled after the conference, and therefore there would be no need to worry about him anymore. Returning to the present, the resident told the first-year student to do more useful things than listen to other people's lectures. The guy had to get badges for everyone, hand them out, and then head to the banquet hall to show other visitors the way. He added that when the time comes, the young man will be able to read his report and return to his direct duties. Our hero didn't like this. He thought that if he were more brazen, he would immediately contact the director, but he didn't want to distract him unnecessarily. Lee Soo-hyuk understood that the ordinary freshmen were busy with ordinary things, so one of them was standing with a camera. The second one is at the computer because he is writing something down. The third one actively welcomes the guests and asks them to follow into the hall. Having looked around, Baruda said that all the dirty work is done by first-year residents. Our hero decided that this is convenient for the organizers. There is no point in spending money on employees if there are residents. After finishing with the badges, the guy heard how he was ordered to go to the entrance to greet the guests. He added that the doors were too wide, so Jin Sang would be on one side and Lee Soo-hek on the other. And it was also very important not to forget to take pictures of everyone. After this, our hero received his camera, which he could not part with for a minute. Assessing Ji-san, the young man thought that they had not seen each other or communicated for a long time. It seemed that he had lost a little weight. The young man asked how he was doing, and he said that he was fine. He worked in the infectious diseases department with Shin Hyun-tae. When asked whether this man treats the residents well, our hero's acquaintance said that he is not Lee Hoo-seng, and therefore they treat him well if they don't scold him to death. The guy didn't understand what happened to his friend, but Baruda said that Yuji-san had a wealthy family and that he also dreamed of becoming a professor. And he added that if you think about it, our hero is like an unattainable high wall for him, which he cannot approach, and the reason is his assistant. Artificial intelligence also said that there is no need to feel guilty because luck is also an ability. Looking at his master, the Baruda thought that he was smarter than many others. Even without the help of his abilities, the young man is often praised, therefore, in many ways this is his personal merit. Despite everything that had been said, the resident still felt a slight sadness. Unexpectedly, Professor Woo Chung-yun greeted the boy and said that Ha-yun had noted that the boy was an excellent lecturer, adding that he would like to have lunch together after the event. After that, Pa Kuk-kin came up to him and also asked the young man if he remembered him and suggested that they go to a business lunch together. Not even a few minutes had passed when a woman approached our hero and said that she was eagerly awaiting his report. Before Lee Soo-hek could catch his breath, they started greeting him again. Looking at the guests in surprise, the guy heard the Baruda say that 5 professors had already offered to have lunch with him, and it was worth considering that all these people work in the best clinics. But the orderly did not understand who he was, that everyone was interested in him, although the assistant proudly declared that he was the guide of the great Baruda. Suddenly, our hero heard someone ask the guest to do something in turn. It was Ji-san who was talking about everyone taking their places. At this moment, Shin Heng-tae put his hand on the intern's shoulder and asked what he was doing, noting that the performance was coming up soon, and therefore the young man should be in the hall, not here. Grabbing his friend by the arm, the professor pulled him inside, saying that the speaker's seats were in the front row. Realizing that the young man was forced to stand at the entrance, the man became angry, saying that he would definitely count the senior residents later. And then he declared that the most important thing now was the report, adding that the director was already inside, and therefore there was no time to waste. People were already gathering in the large banquet hall. It seemed as if the event was brimming with grandeur. As he walked through the hall, the young man heard everyone around him discussing his limp, talking about why the guy was walking so slowly, which irritated him too. Baruta said that the leg needed to be healed quickly, and although our hero didn't know how to do it, the assistant stated that they had recently read about research in the field of nerve regeneration. A moment later, Lee Soo-hek said that while he was lost in his own thoughts, he had already managed to reach his destination. After that, Shin Hyun-tae started telling the guy to sit down as quickly as possible. Suddenly, many people's attention was focused on someone or something, but they remained silent. And just a minute later, all these people began to greet our hero, talking about how pleased they were to meet him, how the director of the Taewa Center bragged about him, and also how they were waiting for his report. It was surprising and unexpected. But at that moment, someone shouted from the stage that a presentation was taking place, and then they asked for silence in the hall. The gray-haired man looked closely at the young man, and he thought that this man had also noticed him. Suddenly, the guy's thoughts were interrupted by Shin Hyung-tae, who asked if the resident needed to repeat anything, and the artificial intelligence stated that the young man should pretend that he was a genius. Smiling, Lee Soo-hyuk happily reported that he had all the necessary information in his head. Cho Tae-jin didn't understand how it was that the guy really had images flashing in his head, and he said in all seriousness that, to be more precise, he had carefully calculated the time. Taking a deep breath, Shin Hyung-tae stated that he wished he had a brain like a freshman. Cho Tae-jin followed his example and said that geniuses are lucky. Our hero stated that he was not that lucky. At this time, Baruta was saying that since the young man had started, he could learn the dissertation by heart, but they would be scared if he started muttering it under his breath. At this point, the host announced that they were continuing and that a staff member from Taewa Hospital was about to come on stage, after which he faltered. Reading that it was a first-year resident of the therapy department, the professor couldn't believe it. But the director told Kim Geng-rae that everything was absolutely correct. The older man didn't understand how this was possible, but his colleague assured him that he would change his mind as soon as he heard the guy and added that the topic was also not bad. But the professor noticed that no matter how good the topic was, he was not going to let a first-year student present his report on the very first day, although he also realized that a plan for the presentation had been drawn up, and therefore it was impossible to deviate from it. And just a minute later, the presenter introduced our hero again, but this time loudly and with expression. The surprised guest did not understand why the first-year students were treated with such respect, thinking that the hospital had gone completely crazy. Our hero's colleagues took him by both hands and began to lead him onto the stage. It looked as if servants were escorting their emperor. Embarrassed, the guy thought that he shouldn't be led by the arms, and the Baruta said that the young man had never been so nervous in his life. Standing on stage, the young man calmed himself down, forcing himself to pull himself together and begin his performance. Finally, the resident introduced himself. At this moment, Professor Kimu Gen-rae was surprised for the second time. It was strange that the first year's voice sounded so calm. When Lee Soo-hek announced the topic of his report, everyone fell silent, preparing to listen to what they would be told. But the boy hesitated. He was afraid that everyone would think that he was an impudent freshman. Although the Baruta said that as soon as the young man started, everyone would stop thinking that way. And at that moment, the guy started talking about how everyone simply needs to memorize this, that anatomical variations are not just a topic that should be taught in anatomy lectures. In some cases, they have a direct impact on the prognosis during the treatment of patients. And among them, our hero wants to note special cases. This is a variation of the coronary arteries. The professor, who was watching the resident closely, thought that his movements were attracting even more attention from the audience. The director was also pleased, thinking about the fact that his protege was speaking exactly as he had rehearsed. And our hero continued to say what Lee Hyun-jung, who had absolutely no idea how to save the patient, had told him for the first time a few weeks ago. Despite the fact that the guy walked while he spoke, it didn't disturb anyone. But on the contrary, it seemed that every word was adjusted to the rhythm of his walking. Woo Chong-in understood that not only did the doctor's voice and manner of speech sound pleasant, but the content of his report was also good. Listening to the young man, one gets the impression that he is a specialist who has spent his entire life treating the cardiovascular system. What was also surprising was that the professors, who had been amazed for a few minutes, now could not take their eyes off the stage. And Lee Soo-hek continued his report, laying everything out on the shelves, explaining everything in such a way that no one had any questions left. At this moment, Kimu Gen-ryo thought that until now there was a theory that in the case of coronary artery variations, there was nothing more to investigate. But it was at that moment that the boy's cane hit the stage so loudly that everyone's attention was once again riveted on the lecturer. And after a short pause, he added that there is at least one type of anatomical variation that has never been heard of. After which he stated that it was time to move on to the main part of the report. The guy said that a report on this case was presented in 1994 at the University of California, at which time the patient became ill, and so he was sent straight to the operating room. During surgery, an anatomical variation was discovered that was not known at the time. After the patient's death, an autopsy produced a schematic diagram of the heart and coronary artery, which all spectators were able to look at. But our hero did not stop there, saying that 3 coronary arteries come from one branch, after which the audience gasped again. A moment later, the young man turned on another slide on which he continued his story. Although after just a minute, those gathered began to raise their hands, and Lee Soo-hek thought to himself that he knew perfectly well why this was happening. That is why he said that such an unusual case was not only found in the report from 30 years ago. And again, he said that if you turn to simple mutations, you can find dozens of different reports on this topic. But an identical case with an anatomical variation was recently discovered at Taewa Hospital. Pointing to the pictures, he said they were taken by director Lee Hyun-jung during an operation a couple of weeks ago. And again, everyone gathered was surprised. Most could not believe that this was possible, since it was something very unusual. The speaker stated that such a species is not just a mutation, but can be called a rare type of anatomical variation. Based on the words of the resident, everyone understood that the director of the center, who had already achieved many results in medicine, would become even more famous. This information will soon be included in textbooks, and the name of this young man standing on stage, the name of Lee Soo-hek, will also be listed there. Smiling, the guy happily announced that his speech was over and thanked everyone who attended the meeting. Lee Hyun-jung looked at his protege carefully, realizing that he had given his all and done as much as he could. The guy stood on stage for a while, realizing that he might start being asked questions. Professor Kimu Gen-rae wanted to say something, but he was speechless from surprise. The specialist could not remember the last time he heard such an interesting and informative lecture. But what was most striking was that the report was read by some first-year resident. At this point, the second presenter turned to the professor, stating that the time for questions would soon be over, and therefore it was necessary to hurry if one wanted to make it in time. The man was in no hurry to ask anything himself. He gave this opportunity to others, who had already begun to actively raise their hands. Looking at Professor Choi Woo-sik from the Kyungbu University Hospital, our hero decided that he would ask provocative questions, especially since he has a strained relationship with Lee Soo-hek. This man had it all written on his face, although I still wonder what question he would ask. And then the doctor said that the presentation was suspiciously good, and therefore, is it true that it was the young man who led the research related to the report? Or was it under the supervision of the director of the Taewa Center? And he added that if the second option is correct, then why was it necessary to appoint a guy as a speaker? The young man knew for sure that his report was excellent, so the professor tries to cling to at least that. At this moment, Lee Hyun-jung spoke up and said that everyone present needed to understand one thing. And he added that he hadn't intended to say that, although Lee Hoo-sik was not interested in that, but in the fact that his mentor had somehow gotten a wireless microphone, which meant that he had prepared well. The director stated when the question of the operation arose, the person who remembered the 1994 report and advised choosing a certain method is our hero. Thanks to him, the patient survived. Although the idea to write the report belonged to Lee Hyun-jung, but the content was completely written by the resident. Moreover, he did it in half an hour. And while the public was amazed, the director continued to say that he vouched for his words. And all this was the result of the excellent system of Taehwa Medical University, as well as the excellent conditions in which doctors work. After this, the man addressed all the doctors in the room, saying that if they wanted to become a specialist in a narrow field, the doors to their center were open. The audience did not understand why this advertisement was needed, and the professor asked if other people had employees like Lee Soo-hek. If not, he suggested that Mr. Choi close his mouth and sit down in his seat. After a while, our hero came down from the stage full of self-confidence. Woo Chang-yun, looking at the guy, thought that he was even better than he initially thought. Perhaps he should really invite him to work at Asen Hospital. A professor working in Chilson thought that the better the hospital, the better the treatment of the staff, and therefore they need a young man like our hero. However, the men did not know what to offer the young man and whether 10 billion won would be enough for him. The professors agreed on one thing: no matter what, this resident should definitely be taken on. Shin Heng-tai, watching everything that was happening, noted to himself that there was some kind of ominous atmosphere in the hall. Turning to Lee Soo-hek, the professor suggested that he leave the room immediately, although the boy did not understand why there was such a rush. Standing in the corridor, the man thought that if he left the guy in the classroom, the others would tear him apart like hyenas, although the resident was wondering what to do with the professor's offers for lunch. Suddenly, another professor's voice was heard behind him, asking what the rush was about. Shin Hyun-tae didn't like this, so he asked a counter question about whether the conference director had the right to just walk out during a lecture. Having said that Professor Geng was still in the room, the man immediately asked whether Lee Hoo-seok had forgotten about the upcoming lunch, which infuriated the guy's companion. At that moment, another professor came out of the hall and calmly explained that the young man had promised to have lunch with him. And he added that there was nothing strange about this, because they had already agreed with the doctor about plans for the future. And to make his words seem even more convincing, the young man pointed to his pocket, in which a thick envelope was visible. Shocked by this turn of events, the guy did not know what to say, and therefore, stumbling, tried to say at least something. Shielding his own employee with his body, Shin Heng-tai stated why this resident should suddenly discuss his future with strangers. And while the professor was declaring that Mr. Shin was not Mr. Lee's father and therefore could not make decisions for him, others were discussing the situation without understanding what was going on. The men understood that the professors were dealing with an ordinary freshman, but he deserved to be fought for. It was already clear to everyone that the young man was actually very talented and had a great future. At this moment, the doctor from Chilsung asked if Mr. Shin could promise Dr. Lee Soo-hek a professorship right now. A colleague said that this would be promised immediately after the guy became a specialist. He is a first-class doctor. However, the man did not stop, saying that this is why the Taewa Hospital has been standing still lately. But in their center, the guy will be able to immediately get a position as a professor. And he added that this will be without any specialist qualifications. You just need to enroll in a master's or postgraduate program. And looking at his surprised colleagues, he added that naturally Lee Soo-hek would receive a scholarship covering all tuition costs. The stunned Baruta said that the owner was being asked to jump over the heads of everyone who now works in Chilson, and the guy was only thinking that such a thing was possible several decades ago. And while others started to say something, Pak Kuk-chin said that the situation with the resident had already been approved by the board of directors. After this, the man turned to his colleagues but immediately made a correction, stating that they were not his colleagues. Suddenly, Ha-yun's father cleared his throat and spoke. Woo Chung-yun stated that they planned to give our hero a professor position at Asen Hospital, adding that he swears by his position. And once again, a verbal brawl began between the professors about who needed the young specialist more and why no one was doing anything about it. But a moment later, someone's loud voice, which shouted that he swears, drowned out everyone present. It was Lee Hyun-jung who said that everyone who was not the hospital director should step back. The men were surprised that this man could swear by his position, and he continued to say how dare they covet their Lee Soo-hek, and even arranged to meet him for lunch. The surprised young man looked attentively at his mentor and did not understand what he could say to him. Lee Hyun-jung thought to himself that this was a national treasure, and therefore, if they didn't want their employees to be poached by some second-rate hospitals, they should value the genius that the first-year student was. The director pounced on everyone and shouted that if anyone tried to touch the guy, they would deal with him personally. People watching the show said that hospitals were like an auction at the moment. One of the professors asked why Lee Hyun-jung was acting this way, since he was not the young man's father, and therefore he had the right to choose where to go and what to do. Park Kuk-jin noted that as a professor, a man should take a serious attitude towards a future resident. In this regard, Chilson Hospital is much more advantageous than Taewa. They can provide all kinds of support. Hearing this, Woo Chung-yoon explained that their clinic was no worse, because they were part of the Mirai Group companies and were even planning to build a separate building for outpatient treatment. Baruta immediately told his master that her proposals were good because these hospitals were actually worthy competitors. On the other hand, the artificial intelligence was attached to Taewa, but he didn't understand whether the director was going to end the argument there. Finally, the man sighed and began to make some kind of speech. First, he said the name Lee Soo-hek, although it was unclear what it meant since everyone already knew the resident. And a minute later, Lee Hyun-jung stomped his foot on the floor so hard that it seemed like the entire hotel heard him. But he shouted even louder so that everyone gathered could hear, and he shouted that the boy was his son. The professors who had been arguing the loudest among themselves now looked at each other as if they were trying to find some kind of salvation. Involuntary witnesses of this action also could not believe their ears. But the one who was most shocked was our hero, who stood to the side and did not know how to react to this untrue statement. And so that no one doubted this phrase, the man repeated once again what he had already said earlier. And then he added that he himself would make a professor out of him, and therefore hands off the young man. Everyone was silent. The men didn't know whether they should say anything at all in this case. Shin Heng-tai turned to the director with horror in his voice, but the director calmly said that his colleague knew everything, but he did not understand what had happened to his friend. And turning around, he added that the therapist knew perfectly well that Lee Hoo-seok was his son. Shin Heng-tai understood that now the corridor was full of not only residents, but also professors who heard the noise and came out to see what was going on. Indeed, colleagues were already gossiping about the fact that Lee Hyun-jung had always said before that he was married to his knowledge, but he hid his son. It had been 2 years since Mr. Shin became the head of the internal medicine department at Taiwa, and he thought he had endured enough hardships. But he didn't think that he still had a fight ahead of him, and a rather serious one at that, which depressed the man even more, since he didn't know what to tell him. Grabbing the guy by the shoulders, the director began to ask him for forgiveness in front of everyone for forcing him to hide his true origin. And then he joyfully declared that now everything was behind him, and therefore the young man could boldly call him Dad. Lee Hoo-seng did not understand how this man played his role so convincingly. Baruta also stated that this was the first time for him and was not subject to any analysis at all. And so he stated that he would first try to analyze the possible privileges if the young man really was the director's son. While the artificial intelligence was doing its job, the young man stood, spellbound, looking at his mentor. The man smiled but thought to himself that the guy had fallen into a stupor again, something he was used to. While hugging Lee Hoo-seok, the newly declared father said that they needed to hug each other even more tightly, which looked quite strange. At this point, Baruta started talking about how if the guy was recognized as Lee Hyun-jung's son, the chances of him becoming a professor were almost 100%. And after that, he added that this is just a fairy tale. This is something one can only dream about. After a short pause, the artificial intelligence stated that in this case, the young man would have to renounce his biological parents. But is that normal? Our hero said that he didn't know their names or their faces, didn't even know if they were still alive, and whether there was any point in their existence. And so the guy understood that he was on his own in this life and could do whatever he wanted. And then the thought came to him that even though the director was a bit eccentric, he could at least call him a father once, and nothing would happen. Baruta said with hope in his voice that it seemed like there really wouldn't be any problems. A moment later, the frightened young man made up his mind and called the stranger father. Lee Hyun-jung continued to play his role masterfully, happily announcing that the resident was his son, of whom he was very proud. The professors, watching everything that was happening, said that this was true, although the director was so proud that he was not married and devoted his life to science and saving the lives of patients. While Lee Hyun-jung was patting his son, others again did not understand why the man was so careful to hide the boy's presence. At that moment, everyone gathered understood why the resident was so smart, because he had Lee's blood in him, and they were all gifted. And they remembered how Lee Soo-hek himself looked a bit odd several times, and now everything came together perfectly. Taking the boy by the hand, the director proudly declared that the young man was his son, and everyone should remember this. And if so, then he will take full responsibility for himself. He will make a professor out of the young man on the best terms. The men were silent, only occasionally exchanging glances at each other. One of the professors sadly stated that he did not know about the existence of a descendant who certainly took after his mother. Returning to the meeting room, visitors were actively discussing what had happened just a few minutes earlier, saying that the emotions were greater than those from watching a TV series. Doctors understood that this topic would be discussed for a very long time. And while Lee Hyun-jung held his supposed son tightly, Shin Hyun-tai, who was behind him, covered his head with his hand in lamentation. The man finally found the strength to turn to his friend. Although he didn't know what to say, but he thought to himself whether he really had to do this. Hearing the director speak proudly about his son, the colleague asked why he didn't think about his reputation at all and how the board of directors would react to this. However, the director didn't care. He stated that the most important thing was the development of medicine, and their resident was a real nugget. For a moment, the professor thought he wanted to talk about the consequences again, but changed his mind, noting only that he warned as best he could. Hearing Lee Hyun-jung suggest our hero go and have lunch, he asked shyly what he should call the man now, hearing him say whatever he felt comfortable with. And smiling, he said in all seriousness that he could even call him father, since from that day on he would treat him in exactly that way. Lee Soo-hyuk sheepishly noted that he would call his adopted father the director for now, which Shin Hyung-tae didn't like because he didn't think it would go that far. Entering one of the most expensive restaurants, our hero looked around in surprise, realizing that this was the highest class. Baruda immediately began to complain that the owner had never taken him to such places, and the owner only noted that he was a resident and therefore could not afford such a thing. After that, the artificial intelligence said that the guy would have all this and even more when he became a professor. Hearing the young man talk about the need to try, the assistant declared that he was doing everything in his power. Looking at the set table, Shin Hyung-tae asked his friend if he really intended to make the young man a professor when they returned. He, of course, stated that this was so, adding whether he had seen the face of Pak Kuk-chin, who had certainly planned everything in advance. After this, the men began to discuss some case from their practice, while the Baruda asked the intern to try all the dishes. Remembering the envelope with money, the guy asked his assistant with embarrassment how much money could fit in there, but he asked him not to think about it. Suddenly, the director shouted again. He declared that he would not tolerate humiliation any longer, and therefore, first of all, he was going to get a professor's position for our hero. The surprised colleague timidly said that the board of directors would not like all this. But Lee Hyun-jung shouted that they simply didn't know his abilities, and yet he was better than any specialist. Suddenly, the man said that his nephew still needed to be made a professor, although his colleague did not understand what he was talking about. Understanding that the manager had spoken this way about his adopted son, Mr. Shin noted that everything was now clear to him, although the young man himself could not get used to such changes. After that, Lee Hyun-jung asked everyone to extend their hands so that the plan about the professor would work. Only a couple of seconds passed, and the men already joined their hands together in such a way that a petal was formed. It sounded like a toast that said they should do everything possible to make the resident the best of the best, to make him lucky. The men were actually serious. They were all in one accord. So another turning point came in the life of our hero, but be that as it may, he was still a resident. Answering the phone, the guy knew that after returning from the conference, everything had fallen into place, and he had to go on duty again. And so the employee explained to the young man that one patient had a high temperature and was taking immunosuppressants, so the intern called Lee Hoo-seok. Baruda said that if this is the case, then there may be more diseases under suspicion than in an ordinary person, but first it is necessary to check what kind of immunosuppressants the patient was taking. The resident walked confidently through the hospital so that everyone who worked in the department could hear him. Rumors of his extensive experience working alone and being the son of the director have now proven true. Surprised people said that this guy was awarded the title of the genius son of a genius director. And so now all people did was whisper behind Lee Hoo-seok's back. However, if earlier the young man was considered a little crazy, now everyone believed that he was a real hero, like a comic book hero. A couple of minutes later, the resident was already asking the doctor on duty whether he had done an ECG and ABGA, and if not, he asked him to do it immediately. The young man understood that he needed to carefully read the medical history in order to understand what the problem might be, which is what he did. It turned out that it was a 53-year-old woman. Her name was Sun Gyeom-suk. She had a kidney transplant a month ago. She has late-stage renal failure. Perhaps this is a rejection by the body. Baruda said that on the other hand, the kidneys are functioning normally, and the fact that the indicators are a little low is normal. This happens often after transplantation. Therefore, the assistant believed that all this had nothing to do with the elevated temperature, although it would not be superfluous to conduct additional research. The woman was prescribed cyclosporine and mycophenolate, and again, artificial intelligence declared that these were the necessary medications. And again, Baruta said that 2 days ago, the patient complained of severe weakness. Although her temperature did not rise above 38 degrees, the woman's blood pressure is 94/64, pulse is 116, although she said she had hypertension. The pressure was low, and so the guy decided to first clear the vessels. When he arrived at the ward, the young man saw an intern standing next to the woman. Lee Soo-hek immediately asked that the patient be given a normal saline solution of 300 at full speed. The guy didn't understand what the problem was yet, but he hoped that this might help. He thought to himself that the main symptom was weakness, but that was obvious anyway. And he was also confused by the fact that with a height of 163 centimeters, his weight was only 39 kilograms. Our hero thought that if the woman had lost weight very recently, then there was a chance that her problem was not the one that was discovered in the ambulance, but was older. Baruta added that it should be kept in mind that this may not be an acute infection, so it is worth monitoring the patient. As he began his examination, Lee Soo-hek noticed that the area of the operation was slightly red, but the area where the tube was inserted was especially suspicious. Apart from this, no other deviations are visible, but it is difficult to say that there is absolutely nothing strange. The young man thought again that the patient was being given immunosuppressants that could suppress typical symptoms. All that was left was to wait for the examination results. Suddenly, our hero was called by another doctor, who brought the ECG results. They showed that the ST segment was higher than normal, but the blood test showed that the myocardial enzyme levels were not that high. Baruta was more inclined to have a heart attack than a heart infection, although that may have been due to the spread of infection throughout the body. The resident thought sadly about what would happen if things continued like this, and at this point he interrupted his thought. But then I decided that while they were doing a urine test, I needed to do a tomography of the abdominal cavity, since the redness was somehow strange. The doctor on the phone told another specialist that Lee Soo-hek himself had ordered the procedure, after which the person on the other end of the line said that the procedure room was always ready for him. Returning to his colleague, the young man stated that he would transport the patient himself. The young man wanted to go and get the urine results himself, but the Baruta said that it was already difficult for him to walk, and so he persuaded our hero to wait in the ward. All the guy could do was just sit by the computer and wait, although at that moment he heard his assistant asking him not to despair. He added that he meant his legs, explaining that he was also looking for a way to cure them. Studying the urine analysis, our heroes realized that hematuria was detected, and the indicator was high, which means that there was a urinary tract infection. And while the ordinator was talking about some kind of infection, the Baruta added that the situation was far from the best. It is possible that the donor kidney has become inflamed, and if so, even if the infection is stopped, the woman may develop kidney failure again. Seeing that the patient had been taken out of the office, our hero's assistant said that there was little hope for the results, since no contrast agent had been used. It was clear that there was also fluid around the area where the tube was inserted, so Lee Soo-hek assumed it was pus. There was little good news, although the chest x-ray was clear, although it was impossible to predict when and how pneumonia might appear. And so to begin with, it was decided to hospitalize the woman. Afterwards, the young man ordered that the patient be given vancomycin. But our hero was not worried about this, but about the fact that even if hospitalization was scheduled, it would take a long time before she was sent to the ward, and now it was necessary to take care of every minute and act wisely. Unexpectedly, the Baruta suggested that his master perform the manipulation himself, stating that his hands were sore, not his legs. The assistant explained that 1 centimeter would be enough. It was not even an operation, but a procedure, especially since the young man already had experience with various procedures under the guidance of artificial intelligence. The resident was scared. He had no idea how he would do what surgeons usually do, and even alone. But on the other hand, sitting at the sick woman's bedside, Lee Soo-hek understood that it was dangerous to waste time. The young man turned to the woman, who was conscious and pressing on her stomach, asked if it hurt. Hearing that the woman was in pain, the guy said that he would help her. It would be a little unpleasant, but then everything would pass. Looking at everything that was happening, the second doctor did not understand what the resident was going to do. And less than a minute later, Lee Soo-hek asked for a drainage kit to be brought to him for the incision, after which he said that a second doctor would assist him. The boy heard the doctor ask in a trembling voice if the resident was going to do it right there. and he thought to himself that he couldn't show uncertainty in front of his patients. Heading towards the intern, the second guy said that this young man also does operations, hearing that he is definitely a genius. A minute later, all the necessary tools were already lying in front of our hero. Realizing how prompt the doctor was, the Baruda stated that Lee Hyun-jung was a strong personality, which our hero confirmed. Having limited the place of insertion of the tube, the assistant said that the incision should be made at the place of insertion, and this is not difficult. After this, the artificial intelligence commanded that this place be smeared with betadine in a circle, slightly increasing the radius. Suddenly, the Baruda told the boy to tell the doctor to take the gauze and wait. As the doctor inserted the needle into the area near the wound, he warned the woman that there would be a slight tingling sensation. Then the artificial intelligence explained that it was necessary to make a 1 centimeter long incision with a scalpel and insert it to a depth of about half a centimeter. After doing what was necessary, Lee Soo-hyuk discovered a small amount of bleeding, which he was fully prepared for. At this point, the guy asked the woman if it hurt and added that he was getting to the most important part. The frightened doctor looked at the stomach, which our hero asked to press lightly. The doctor was amazed as he saw how much fluid was coming out of the wound. At that moment, the patient also said that she felt a little better. Colleagues standing nearby and watching all this were amazed at how the young man managed to make such a delicate cut and hit the right spot. But they were not interested in this, but in how brilliant this man was. Everyone was sure that he was much smarter and more talented than the director himself, which was hard to argue with. Looking at the result of his work, the resident himself was surprised at how much pus came out, since he did not expect this. Looking at the extended tube, the young man said that they had decided on the ward. After this, Lee Soo-hyuk told the patient that she would be sent upstairs and given antibiotics there, and that he would visit her after a while. Baruda immediately reminded the doctor that he needed to call Shin Hung-tae back to report what had happened. A few seconds later, the man's phone, which was a little busy, rang. Hearing the young man's voice, the professor immediately called him his nephew, adding that he was glad to hear him. The guy thought to himself that he still couldn't get used to the way they called him and how he should call the director and the manager. The man did not understand what had happened, but the resident immediately said that there was one patient he would definitely like to report. After hearing the short story, Shin Hung-tae immediately asked how things were with the lungs. Our hero explained that they were clean, but inflammation was found in the area of the kidney transplant. He and the doctor drained the incision, and about 32 milliliters of pus came out. And he added that, judging by the urine analysis, pus was also found there, and the head of the department immediately said that it was a urinary tract infection, but why was the donor kidney the source of the infection? The professor asked out loud whether the woman had been given antibiotics, but thought to himself that this could be considered the worst-case scenario. Having heard that the patient had been given vancomycin, the head of the department assured them that tomorrow they would start with this particular patient, adding that if something happened to her during the night, they should call him immediately. Entering the woman's room, Lee Soo-hyuk noted with sadness in his voice that she again had a temperature of 38.2 degrees. The guy assumed that Mrs. Song had pneumonia, despite the fact that she had been given an antibiotic the day before. Shin Hyun-tae, who didn't understand anything, asked if they had done a culture test after hearing a positive answer. And again the man said out loud that it would take at least a week to get results. But he thought to himself that in such a state it was very dangerous, since critical changes in the body could begin in 5 days. The professor suspected an infection, and therefore suggested changing the antibiotic to imipen, transferring the woman to a ward, intubating her, and checking the condition of her organs every 15 minutes. Realizing that this needed to be done regularly, the young man understood that he would have to replace the nurse. After some time, everything was done. Seeing how well Shin Hung-tae began to praise our hero, saying that he can do everything. Baruda, who was nearby, declared that he could do absolutely everything, since he was the best artificial intelligence in the world. When our hero did not react to this remark, his assistant thought that there was nothing strange about it, since an important conversation was taking place. After some time, Baruda continued to say that the young man was excellent at prescribing medications himself, and he only noted that he had seen patients in intensive care many times, and therefore knew everything. However, the assistant was not bothered by this, but by the fact that the diagnosis was never made, although the resident hoped for an impen. But the next day it turned out that the drug did not have the desired effect, which indicated that the diagnosis was incorrect. The patient was diagnosed with pneumonia, and her condition rapidly worsened. The guy was worried. He knew that he didn't understand what was going on. But at the same time, it was also impossible to blame everything on immunosuppressants. It seemed like a dead end, not only for the first-year student, but also for the head teacher. Suddenly, the artificial intelligence spoke up and said that it knew exactly what they had missed. And looking at the owner, he added that this was not an ordinary patient, since she was taking immunosuppressants. And he added that it's not hard to guess that, compared to other people, her immunity is greatly weakened. At this point, Shin Hyun-tae said that perhaps these were some kind of super bacteria that no one could have imagined. Lee Soo-hyuk, who did not have time to listen to his assistant's words, said that he agreed with this statement. And again, the Baruda interfered, noting that he did not exclude such a possibility, although the young man suspected that the matter was something else. In any case, this is what the Baruda hinted at. This was true, since the assistant did not understand why the patient needed to be immunosuppressed. Hearing the young man talk about a kidney transplant, the intellect declared that it was so, but there was something else. There was something special about the transplant, although the guy couldn't quite figure out what it was yet. Bruda continued to explain that Mrs. Song had received a kidney transplant, and on the day of her hospitalization, the results of tests showed that it was this kidney that was the cause of the infection. This reasoning led Lee Soo-hyuk to think that the woman could have somehow become infected in the operating room or intensive care unit. At that moment, it dawned on our hero that now everything was clear to him. The young man told his assistant that until now he did not fully understand the main cause of the infection. The astonished Baruda immediately began to shout that their resident was actually very talented. And a moment later he added that, first of all, they should think not about the operating room, but about the reason for the kidney donor's infection. And this is something that Lee Hoo-sok only guessed about now. The level of treatment by Taewa specialists is famous and recognized throughout the world. So how could an infection have occurred in the operating room? This is unlikely, and therefore the artificial intelligence suggested carefully reviewing all the necessary information regarding the donor. The young man decided that there was no time to waste, and so carefully touching his mentor, he immediately said that he suspected the cause of the infection, but only the donor. Interrupting the conversation, Shin Hyun-tae noted that this was exactly it. They suspected the infection in the operating room, and therefore it was some kind of super virus. But suddenly the resident said that he assumed that the problem was not in this, but in the donor himself. At first the professor dismissed the idea, but a second later it dawned on him too. And Lee Soo-hyuk continued to say that if it really was a superbug that even Imapen was not effective against, then the chances were very slim. But if the reason is different, then you can try to find it and apply treatment. Although nothing really helps against superbacteria, it is really hard to believe that the infection could have happened this way, because the transplant department is a very responsible one. And Shin Hyun-tae thought to himself that when he heard the guy, he wondered why he didn't come up with this idea first. Realizing that the young man wanted to know everything possible about the donor, the professor remembered that the transplant had been performed more than a month ago. This means that it will no longer be possible to carry out additional tests. Although, based on the results of the donor's death, it will be possible to determine the cause of the infection. Looking at our hero, Shin Hyun-tae once again thought that this man's logic could only be envied. Taking the phone in his hands, the man thought that, according to hospital rules, information about the donor is strictly confidential. At that moment, Professor Ryu answered. The head of the department apologized for having to interrupt the call, saying that a very important matter had come up. And then he began to talk about the fact that he had one urgent matter. The man wanted to know if there was any way to get information about the person who donated a kidney for patient Song Gum-suk. He understood perfectly well that this was all top secret, but he appealed to the fact that without this data, there was a high chance that the patient would simply die. Mr. Ryu was silent, but after a few seconds, he said that he would send all the necessary information by email. Not much time had passed, and our hero was already looking through the materials on the donor, noting that they were in complete disarray, perhaps because the patient had died in another hospital. Baruda immediately asked Lee Soo-hyuk to open all the windows so that he could conduct an immediate analysis. From the data, it was possible to find out that the man was quite young, only 24 years old. No diseases were detected, but it was strange that he was found in the river. He drowned near the Seongsu Bridge and was taken to the hospital by ambulance, although at that time his heart and breathing had already stopped. On the 6th day, brain death was diagnosed, and with the consent of the relatives, it was decided to donate the organs. It is noteworthy that during his stay in the hospital, the man's temperature rose 3 times. Nothing was found in the urine, blood, and sputum tests, and this upset the Baruda. However, the young man immediately stated that there was no need to regret anything, and a minute later he happily announced that he knew the reason. Our hero's assistant did not understand where he was heading, but Lee Soo-hek said that he was going to the laboratory diagnostics department. The resident wanted to look at the patient's data samples. Most likely, after the culture study, his samples were not thrown out. Approaching the right door, the artificial intelligence stated that this was true, but there were a number of nuances. The guy had no intention of delaying, and so he decisively knocked on the laboratory window. Our hero introduced himself and noted that he had come about samples that had recently been sent for analysis, although the employee had explained that they would not be ready before the deadline. But then Lee Soo-hek said that he didn't come for results. Seeing the worker's impudent behavior, the Baruda immediately suggested complaining to the manager, or even better, to the director, although the young man did not want to do this. And so he asked if he could see some of the remaining samples, hearing that some were stored for a month. The resident continued to insist that he literally needed a look because the patient's life depended on it. Coming out into the corridor, the employee asked the patient's name and number. Our hero did not have time to answer the question, because at that moment someone called out to him. It was Professor Hong Chung-gi, who studied with Shin Hyung-tae, and what's more, they wrote their dissertation together, so they have a very good relationship. The young man greeted the man, which surprised the man, but Lee Hoo-sang explained that he had known him since his student days, and he continued to say that he was very impressed by the dissertation on rickettsia. It was very useful in treating patients. In turn, the professor noted that they say that the young man is the director's son, adding that the young man is actually smart. After that, the man wished the guy luck, saying that perhaps they would write a dissertation together, since there were a lot of useful materials in their department, although Lee Soo-hek himself knew this. As he was leaving, Mr. Hong asked everyone to help our hero in every possible way. The specialist left, and the young people continued to stand in their places, unable to recover from the shock. Answering the doctor's question about whether the resident was really the director's son, he sheepishly said that it was true, but he didn't want anyone to be scared by it. A moment later, Dr. Kim said that he would immediately bring everything they had in the lab in terms of samples. Baruda immediately scolded his master, noting that he would not use his connections. But Lee Soo-hek did not understand what was wrong with that, since the doctor himself had volunteered. Not much time passed, and the doctor returned with samples, and also said that if his colleague needed anything, he just had to call him. Our hero's assistant was glad that everything turned out this way. He said that if they had gone searching themselves, it would have taken a lot of time. But the authorities helped them, and the authorities are a good thing. Moreover, artificial intelligence said that if the young man is already so valued, then what will happen when he becomes a real director? The young man was busy with his own business, and therefore did not listen much to the Baruda. The resident said that at first glance it was ordinary pus. If you look without any suspicion of discovering something unusual, most likely nothing will be visible. When asked what Lee Soo-hek was looking for, he said that the assistant could look for himself. Suddenly, both the young man and the artificial intelligence had an epiphany. The problem was a fungus, or more precisely, Pseudosporium, a bacteria that lives in dirty water. They are often harmless, but can cause infection if the immune system is weakened. But suddenly, Baruda stated that even if this is not the case, the cause of the infection could be, and again fell silent, and then continued that it could be the donor, who was a drowned man. It turned out that the disease report contained the results of a case analysis, but the artificial intelligence could not possibly think that it was related to an organ transplant. Most likely, the donor was infected before he died, and this was not checked in a regular culture test. They simply indicated an elevated temperature for unknown reasons. Then the patient's son Guillaume-suk received a transplant of a charged kidney, and then she was given immunosuppressants since the infection had progressed further, so antibiotics did not help. Jumping up from his seat, the young man asked Dr. Kim to clean it up if it wouldn't be too much trouble. The excited guy explained that he had discovered something important, and therefore he needed to run to the patient. Sitting in the office, Shin Hyung-tae scolded himself, not understanding what kind of illness the patient had, and also how she should be treated. At this moment, the professor heard the voice of our hero. The man immediately asked the boy if he had found anything, receiving a satisfactory answer. Lee Soo-hek said that he found something interesting in the pus samples, If you look at the green color, you can identify bacteria. The joyful professor screamed like a child, realizing that they had finally managed to find the cause of the woman's illness. Therefore, it was decided to replace the antibiotic with voriconazole and closely monitor the body's reaction. However, after a couple of days, the guy complained that his eyes would soon pop out of his head since he did not understand what he needed to find this time. Barudu urged her to find a dissertation related to the patient's illness, although the young man said that this was precisely why she was prescribed voriconazole and, moreover, continued to be given immunosuppressants. Artificial intelligence said that voriconazole fights scedosporium in a normal situation, but we need to think about another case. The resident was silent for a moment, and it seemed as if he was truly lost in his thoughts. Suddenly, our hero remembered something, saying that it was similar to their situation. The assistant also confirmed this, saying that the diagnosis was made later, but the patient was saved, and voriconazole and antifungal drugs were prescribed. That same day, Lee Soo-hek spoke with the head of the department, and the next day, the patient's oxygen saturation increased. The guy also reported that his lungs were clear, which meant that the medicine had started to work. Shin Heng-tae couldn't be happier with the young man. Not only did he diagnose scedosporium, but he also thought of prescribing a rare drug, echinocandin. The professor sincerely stated that the resident had saved the patient, but he thought to himself that even Chang Duk-soo, who had spent so many years in the infectious diseases department, was very surprised. And this despite the fact that the young man is only a first-year resident. Lee Soo-hek wanted to relax, but Baruda said that now was not the time for that. The young man did not understand what was going on, but the assistant said that, in addition to the kidney, the man had donated his liver, heart, and lungs. Hearing this, our hero was amazed, realizing what all this could mean. The artificial intelligence did not shut up, declaring that those who received these organs were also in danger. This meant that the resident once again had to take on a difficult task. At that moment, Lee Soo-hek began to curse angrily, although the manager did not understand what was going on, continuing to praise his favorite. Hearing the boy say that he understood something, Shin Heng-tae noted that there was no need to worry because they had solved the main problem, and the other patients were also stable. But at that moment, the young man said that this was connected with the donor because his organs had been transplanted to 3 more patients. A moment later, a nurse who was in the operating room of the main building was already answering the call. The woman explained that Professor Ryu was looking through a microscope, although the head of the department continued to insist that he be called immediately. The professor who finally answered the call stated that he was connecting the vessels and would therefore call back later. However, Shin Heng-tae shouted that this was very important and the patient's life depended on it, and therefore they simply had to listen to him. The colleague did not understand anything, but decided to listen to his friend, who would not waste his time for no reason. The man heard his comrade asking about the patient, Song-guk-suk. Moreover, he asked how she was feeling, realizing that the situation was not the best. Having said that the woman was fine, the man shouted that the pathogen was scedosporium bacteria. The doctor did not understand what was being discussed, but Shin Heng-tae explained that these were fungi that were very rarely found in the human body. He added that the attending physician, Lee Soo-hek, has begun looking into the cause of death of the donor who donated organs to this patient, and it turned out that the young man drowned in the river, and the fungus actually lives in dirty bodies of water. The head of the department said that first the donor became infected, and the patient received a transplant of an already infected organ. For a moment, Professor Ryu fell silent. He began to understand the meaning of his comrade, who was hinting at only one thing. Shin Hyun-tae stated that he was aware that other organs from the deceased were also transplanted. He added whether the surgeon had a list of patients who had undergone transplantation. This is important, since they are all at risk. The nurse, seeing the doctor's condition, began to ask what had happened to him, but he said that nothing terrible had happened. A minute later, Mr. Ryu asked the nurse to open his email on the computer. Shin Hyun-tae and Lee Soo-hyuk heard the doctor commanding his assistants to open what he needed, and they were all tense. Only a few minutes had passed, and the doctor was asking if the head of the department was still on the line. He added that all 3 had undergone surgery in their hospital, after which he began to name the numbers of people who had received donor organs. The frightened professor said that he had written everything down and sincerely thanked his comrade. Mr. Ryu asked his colleagues to check that he had not mixed anything up, saying that when he finished the operation, he would do it himself. A moment later, the mentor asked our hero if it was true that the phone numbers were valid. Lee Soo-hyuk dialed the first number and asked if the person was a relative of Mr. Ji Komi-sun. Upon hearing that this was the case, he stated that he worked at Taihua University Hospital and therefore wanted to know where the lady was. Hearing that the woman had died a week ago, the young man was surprised and fell silent. The relative explained that after the operation, she returned to her city, then her temperature rose. She was hospitalized in a local hospital, but as the head of the hospital thought, they did not understand anything there. Baruta saw the state our hero was in, but said that they had no time at all, and therefore they needed to hurry. At this moment, the manager was already dialing the number of Miss Yu Su-yen's relative, explaining who he was. The professor was nervous, but he heard that the patient was alive, but was in the clinic with a fever. The woman said that the patient was at Taihua Hospital, hearing that there was no need to go anywhere because the head of the hospital was already on the way. While holding the phone, the man simultaneously told his client that they needed to hurry. On the way, Lee Soo-hyuk managed to call Mr. Bae Yun-ju's relative, asking where he was. As the young man pressed the button, he heard himself being told that the patient was in the emergency room of their hospital, and so he stated that he would be there in a couple of minutes. Standing in the elevator, the men separated the patients. Shin Heng-tai ordered the resident to immediately administer voriconazole, since the disease was probably very advanced. The doctors looked in amazement at the button in the elevator that indicated the floor, hoping to get to the department as soon as possible. As soon as the number 1 lit up on the board, our heroes immediately jumped out of the elevator. The head nurse ran into the ward screaming to find Miss Yu Sun-yin. The young man did the same, but he called for Mr. Bae Yun-ju, whom he was supposed to help. One of the doctors, realizing that the professor could not find anything, asked who he needed. Lee Soo-hyuk followed the same example, stopping the doctor. He asked him where Mr. Bae was, finding out that he was in another wing. Despite his sore leg, the boy ran like never before, realizing that the patient's life depended on it. The resident saw that the man had a fever and was having trouble breathing, a very serious condition. The most important thing was that the patient was alive, which meant there was a chance to cure him, and so the young man shouted at the top of his voice for the patient to be given an injection of voriconazole. Speaking at the event, Lee Soo-hyuk said there was 1 fatality as a result of the infection and 3 cases where treatment was successfully completed with voriconazole, echinocandin, and combination therapy. While the principal was saying that the guy was a real genius, Shin Hyun-tai was surprised at how a first-year student could make such a diagnosis. The men didn't understand what they would do without this resident, who also lectured amazingly, as if someone had prepared scripts for him in advance. Hearing compliments from the Baruta, the guy said that he simply read everything that the assistant had prepared. All the listeners leave the hall, they listened to the morning lecture, and now they were getting ready to go skiing. It was an unusual conference considering that doctors have no time for entertainment. Such a meeting is organized especially for professors of large hospitals. As he struggled up the steps, the Baruta complained that his owner couldn't skate. But his owner said it wasn't a problem because the hotel had an excellent sauna. Meeting his colleagues in the corridor, Lee Soo-hyuk began to listen to compliments again. The one he admired most was Cho Tae-jin, who honestly admitted that he had never heard of such a bacterium, and therefore learned a lot of new things for himself. At this point, the director asked what the guy wanted to do, noting that they were going to the sauna, which was in high demand. And while the artificial intelligence was suggesting that the young man refuse, he thought to himself that this was a great idea. A few minutes later, our hero was already moving along the corridor, but something strange caught his attention. There were men standing there, looking closely at the guy, thinking to themselves about who he was. Hearing how one guy met Lee Soo-hyuk, he was surprised, but Baruta explained that they were future first-year students and they would soon come to work at the hospital. And he added that one shouldn't think only about professors, but also look at those below him. And the young man thought that the assistant spoke as if he lived by too high standards, not noticing weaker people. Raising his hand, the resident said it was nice to meet you, hearing the stranger ask his future colleague to address him informally. A moment later, the guys declared that they had all entered the therapeutic department because they respected our hero. After that, the most important one, the one who first greeted Lee Soo-hyuk, stood and smiled at him. The surprised guy didn't know how to react to this, and therefore was a little embarrassed. The young man wanted to know where the rumors came from that he was so outstanding, But the student explained that everyone was saying that the young man tutored a lot, worked part-time, and therefore could not devote much time to studying. But he was still a genius. At this point, the Baruta made fun of the owner and said that if Lee Soo-hek worked less and studied more, he would be in first place in academic performance, knowing that this was a lie. And while our hero was saying out loud that they were only gossiping about the truth about him, the student was shouting that, of course, everything was true. The guys kept saying over and over again that they were very happy to work under the guidance of a resident who showed only his good side. At this point, our hero's assistant told him to treat the guys, adding that the best friend is the one who talks little and treats a lot. Realizing that the director had given him a card, the young man offered his new acquaintances a little snack. One of the guys was so happy that he even started to overact a little, expressing a whole storm of emotions. As the students walked down the hallway, they asked where they were going, and Lee Soo-hek suggested going to his room, saying that they could order something delicious there. The surprised Baruta had never heard of such a delivery and therefore was very surprised. And then he immediately declared that the ringleader's name was An Dai-hong. He was 27 years old. This man was an intern in March. Perhaps our hero made an impression on him then, while the other first-year residents could do nothing. At this point, An Dai-hoon began to explain that he originally wanted to go into dermatology because he was interested in everything related to hair. Hearing about this, our hero assumed that his future colleague was probably a good student. The frightened young man immediately began to talk about how there were no geniuses like Lee Soo-hek in their class, adding that he was only second. And a moment later, he added that he decided to enroll in therapy in March, when the resident diagnosed the patient, and that's when he decided that therapy was the best thing that could be. Realizing that our hero was having some bad thoughts, the artificial intelligence told him not to perceive people as a means to something. But the young man didn't like it, and so he asked his assistant not to talk about it, because he was just a computer. Upon entering the room, the guys immediately began to say that the resident lived in a luxurious room, the kind they give to professors, but he said that he was simply reading an interesting report. And just as Lee Soo-hek relaxed a little, the interns began to praise him again, noting that his speech was simply amazing. A few minutes later, while eating, our hero again had to hear a number of points regarding the fact that in the company of such a wonderful person, food seems tastier. Baruta went crazy from these compliments and therefore asked the owner to do something, although he himself understood this, but could not decide. A few minutes later, the guy stood up and opened the door with one hand. Standing with his back to his new acquaintances, our hero did not dare to do what he wanted. The young people looked attentively at their future mentor, who found the strength in himself and said that it was already late. And turning around, he continued to say that he would like to study a little, and immediately asked the interns if perhaps they wanted to too. The guys were surprised by such zeal for studying. They did not think that Lee Hoo-sek was speaking seriously. Some were a little disappointed by this statement. An unexpectedly joyful An Dai-hoon shouted that it would be an honor for them to practice together. The young man thought to himself that this man was crazy, which was confirmed even by his assistant, although he added that he was also diligent. Taking his bag, our hero asked the artificial intelligence if he had said something wrong, hearing that he always said something wrong. A minute later, the guy quickly pulled out his laptop. After placing the projector on the table and opening the laptop, gifts given by the director, Lee Soo-hek was ready to turn on something very important. And while the biggest guy thought that bringing a projector was a great idea, the rest thought it was complete stupidity. And at this time, our hero had already turned on the laptop and even opened some folder. The young man decided to explain that these were records for 1 year. He did not include any patients who were too mild, but all recurring diagnoses were recorded. The documents describe in detail what examinations were carried out and what diseases were suspected. Answering the question about when the guy managed to do it all, he said that whenever he had a free minute, and he thought to himself that he almost died while putting it all together. As for the Baruta, he was glad that these recordings existed, because thanks to them, he began to work much better. A moment later, Lee Soo-hek said that he would send these materials to everyone by email, and the guys would study on their own. If they had any questions, they could contact him, but only until midnight. And then he added that he would give all the materials, but only for March. And he scheduled a meeting with the interns in a week at 10 in the morning in the office. The resident stated that he wanted to see how well the youth had absorbed this data, and only then would he give the materials for April. An Dae-hong thought with horror that if they didn't study, there would be no more materials. The guy was going to try hard to become Lee Soo-hek's favorite student. Suddenly, the young man said he agreed after hearing his mentor ask him to leave his email address. Everyone else looked at each other attentively but remained silent. Although a minute later, they also stated that they would do the same as An Dae-hun. Seeing off the boys, our hero said that there was a lot of material and therefore it was better to start from today. And I thought to myself that since the interns had come to therapy, they needed to try hard. Already standing at the door, the resident told the young people not only to read everything, but also to learn the most important points. Having slammed the door with relief, our hero told the Baruda that now at least he wouldn't have to study alone. Sitting on the sofa, the young man began to ask the artificial intelligence to give him permission to watch just one episode. But he categorically stated that if Lee Soo-hek was going to have fun, then how could he become the best therapist in the world? Covering his head, the young man shouted that he was also watching TV series in his memories. Although the assistant immediately came up with an excuse that he was doing this solely for scientific purposes. Having started to whine, the resident said that he had given a report today, although the artificial intelligence again noted that the report was not a study. Clicking on a folder, our hero heard the Baruda say that he had collected a few dissertations. The young man noted that research at the molecular level is very difficult. It is not just clinical medicine. But the assistant stated that recently research has been conducted in this area, although judging by these materials, medicine in their country is still far behind in terms of research. Although there is nothing strange about this, since billions are spent on one study, and he immediately stated that after visiting the States in the summer, the guy will understand how things are with them. Answering the phone, some doctors said that just recently everything was fine with the patient. Hearing the caller talk about breathing problems, the doctor scolded him, saying that it was necessary to express himself in correct medical language. However, it was not possible to find out anything for sure, and so the young man said that he would come soon. Looking somewhere in horror, the guy thought that he wanted to be like Lee Soo-hyuk, who makes diagnoses almost instantly. Covering his head with his hand, the doctor said out loud that his head was simply spinning. The patient was only 23 years old, but he was already suffocating, and the young specialist had no idea what to do about it. As he was heading to the department, the young man heard someone calling him. The girl reported that she had done an arterial blood test. Coming closer, the doctor thought that the brunette was an intern in the emergency department. He understood that it was difficult for him, but much more difficult for her. Reading through the test results, the doctor remained silent, hearing the new girl ask what he could say about this. The young man was getting scared because he didn't see any particular abnormalities, thinking that it could just be rapid breathing, but then why was the patient in such a serious condition? With rapid breathing, muscle tissue does not penetrate between the ribs. The intern looked attentively at her companion, who did not know how to please her. But after a minute, the girl began to smile, as she recognized the familiar sounds of footsteps. The young doctor also heard them, and had already turned his head in the direction from which the steps were coming. The boys turned around at the same time and bowed to our hero, loudly greeting him. Looking at the young people, the guy thought that they had scared him a lot with their strange behavior. Realizing that the new employees were not going to raise their heads, the Baruda immediately stated that this greeting was one of complete respect. Lee Soo-hyuk understood this, but he embarrassedly said that he shouldn't have done this, and he thought to himself that it felt like he was openly mocking them. The young man happily said that Ha-yoon was now online, but she timidly replied that they hadn't seen each other for a long time, adding that she had been a little busy. Having stated the fact that the interns were assigned to the emergency department, our hero said that they would see each other often, and therefore suggested that they all have lunch together. At that moment, someone called one of the doctors, and Ha-yoon quickly ran to the department, and the young man only thought that the interns in March are slaves of the emergency room. There was an awkward silence for a moment, as no one could think of anything to say. Looking at Sam, Lee Soo-hyuk asked if it was true that he had arterial blood samples, hearing an affirmative answer. Realizing that the man was embarrassed, the Baruda proudly stated that if it weren't for him, his master would look the same. Having heard that the cause was hyperventilation, the artificial intelligence did not agree with this. Because the patient had shallow breathing, the frequency of inhalations and exhalations was close to 40, and hypocapnia was not detected. And turning his gaze to the unfortunate man, he added that this resembled pulmonary edema, and therefore everything needed to be checked thoroughly. Approaching the young man, the resident greeted Kim Sun-jun and asked him if the symptoms had started about a week ago. Hearing that this was so, the doctor again inquired whether there might have been something strange. The patient tried to say something but continued to cough, but Lee Soo-hek was interested not only in this, but also in a kind of bald spot on the guy's head. And while the patient began to tell what had happened a year ago, the resident noticed strange redness around the cheeks. Finally, the young man told that about a year ago he suffered from tuberculosis. But Baruda immediately stated that this had nothing to do with the rash and hair loss, and that the reason was something else. And so, a minute later, our hero asked whether the young man had ever been diagnosed with diabetes or high blood pressure, hearing that this was not the case. Turning to Sam, the doctor asked him to write out a referral for an X-ray while he examined the patient. The young man decided to start with palpation of the frontal lobe, using 5 types of data that he had managed to accumulate over all these months. When Lee Soo-hek began his examination, he immediately told his assistant that there was a lot of fluid in the chest. He added that, as expected, it was necessary to get an X-ray as soon as possible. The absence of a high temperature could indicate tuberculosis. The patient, who had heard that he was being asked to lie down, suddenly began to talk about how it was difficult for him to breathe, as he felt severe shortness of breath and some kind of heaviness in his chest. After examining the abdomen, the resident immediately noticed an enlarged spleen, and the artificial intelligence immediately stated that it was imperative to take into account systematic diseases. At that moment, Sam arrived and said that everything was ready, but our hero asked the first year to take the patient himself, saying that it would take him a very long time to walk. The frightened young man began to apologize, although he immediately declared that he would do everything as needed. The patient looked at the scene in amazement, believing that Lee Soo-hek was the head doctor and no less, since he was treated with such respect. But it didn't matter at all at that moment, because the main thing was to start feeling better. As he went to the examination room, the young man thought that he needed to trust the specialist. After a while, Sam ran to our hero and said that he had already arrived, although Ordinato explained that nothing was ready yet. The first year asked if he should tell the patient that nothing was clear yet, but at that moment, the test results came in. Lee Soo-hyuk knew that the lungs were indeed full of fluid, as was the pericardium, hearing Baruda say that it was pericarditis, which could be caused by tuberculosis. First, we need to remove the fluid, because there is too much of it. The pulse is about 110 beats. If this guy's heart continues to beat like that, then nothing good will happen. After consulting with his little assistants, the boy decided that he could remove the liquid using ultrasound. A moment later, our hero was already asking Sam to bring an ultrasound for echocardiography, adding that there was no need to notify the head of the department about this yet. The intern was surprised, since the second-year student was going to use such an expensive and complex device on his own. And looking again at my actual boss, I decided that he was simply a genius, and that said it all. A few minutes later, the device was already at the disposal of the resident, who was in a hurry to begin the procedure. Lee Soo-hyuk warned that at first there might be a feeling of coldness, but then it will all pass and it will become much better. The patient, who had difficulty lying down, said he hoped so. Taking a special needle, the doctor once again warned the guy that he would feel a burning sensation. While undergoing the procedure, our hero heard the patient complaining of discomfort, although he had been warned about it in advance. Having completed the manipulation, the resident told Baruda that he had managed to pump out about 100 milliliters of fluid, to which he replied that this fluid in the pericardial sac was causing a lot of discomfort. Suddenly, all the symptoms disappeared. The young man declared that he felt great and asked if he was cured. The resident thought that the liquid was cloudy, but not thick, and at the same time noted that the guy would have to be hospitalized to figure out what was wrong with him. Otherwise, everything could happen again. Our hero was sure that it was not tuberculosis, but rather some kind of viral disease. And he added that it would be best to observe the patient's condition for at least a few days. Perhaps nothing would happen during this time. Besides, Lee Soo-hek knew for sure that it would not be difficult to transfer the patient to another department if necessary. The next day, the AI reported that the records showed that Kim Sung-jun was stable. On his way to the wards, the resident met Sam, who began to bow again, which greatly embarrassed the young man. But he understood that it was unlikely to be possible to correct this. And just a minute later, the intern reported that the material from the pericardial puncture was sent for analysis yesterday, and he would leave the results here. Sitting down at the computer, the young man wanted to read the results as quickly as possible in order to understand what to do next. Pointing to something, the Baruda immediately declared that the probability of tuberculosis was 0. It was clear that this was some kind of systematic disease, and the artificial intelligence also reminded that the patient was losing hair and had some strange redness. In addition, the spleen was enlarged, the guy is young, and therefore some autoimmune disease can be taken into account. Without taking his eyes off Lee Soo-hek for several minutes, the intern thought that it was impossible to get into his boss's head, although he really wanted to do so. Even though this guy is a genius, he certainly doesn't consider himself one. While typing something on the computer, the young man realized that he needed to request an analysis to detect autoimmune diseases. Suddenly, the orderly looked at the Baruda in surprise, although he had not intended to say anything to him. At this point, Lee Soo-hek began to tell Sam that if he looked at the results of yesterday's test, he could see that the ADA index was too high. Therefore, it was not tuberculosis. However, the patient is anemic, has a low white blood cell count, and has an enlarged spleen, so I wonder what the intern thinks about this. The young man looked away in fear, although our hero noted that there was nothing shameful for a first-year student to suspect an autoimmune disease. And then he added that the doctor's orders indicated that the test should be taken, and therefore there is nothing wrong with that either. Unsure of what to do next, Sam asked if he needed to change the antibiotic, perhaps change the treatment regimen, after being told that none of this was necessary. He added that according to the results, the likelihood of infection has decreased, but drugs for autoimmune diseases cannot be used. It is better to give the patient steroids. And then he said that if the diagnosis is correct, then the body's response will be detected, and if not, and then Sam said that if not, then the patient will be teeming with viruses. Lee Soo-hyuk confirmed this with bitterness in his voice, and thought to himself that the previous patient had died from this. He recalled that he didn't know the disease was caused by bacteria, so he used steroids. In other words, he silently watched as the man was eaten by viruses. Baruda said there was nothing they could do now. It would have been better if he had come earlier, although the patient was old and had underlying health conditions, so no initial symptoms were detected. That's why he said that we need to be careful with immunosuppressants. But it's not too late to make a decision based on the results while maintaining antibiotics. The guy understood that he couldn't allow this to happen again, and he said out loud that he was finished with the appointments, and therefore it was time to examine the patient again. It didn't take more than a few minutes for the doctors to be in Kim Soon-young's office, greeting him. Our hero thought to himself again that this young man looked a little better than the day before. The young man wanted to say something, but switched his attention to something else. It was an ECG machine, so Lee Soo-hyuk knew that someone was performing the procedure, even though his pulse was within normal limits. The only thing that scared the resident was that the improvements might start to weaken over time. On the other hand, Baruda immediately said that these improvements are minimal, and it is quite possible that the ECG was done incorrectly. Our hero was absolutely convinced that there was no point in rushing to conclusions, since anything could happen. Answering the doctor's questions, the patient said that he felt better than ever. He had no fever, and there was no cough. But the resident was troubled by the fact that the hair loss and rash remained unchanged. At that moment, another intern who had arrived at the appointed time knocked on the door of the room. He explained that this was a daily checkup and that blood needed to be taken for analysis. Kim Sun-jun was not happy about all this, but he understood that he had no other choice. Hearing that the test results would be in after lunch, the young man was worried. He didn't understand what was happening to him, but he knew for sure that his parents would be very worried. Suddenly, the artificial intelligence spoke up, reporting that treatment progress showed that things weren't so bad. Lee Soo-hek understood that it was necessary to calm the patient down, and therefore stated that there was no need to worry. This was all necessary to check the general condition. He added that if something abnormal happens and your health suddenly worsens, you should definitely report it. A few hours later, Sam was hurrying somewhere very quickly. The intern arrived much faster than our hero, who entered the room a few minutes later. Headmaster Shin Hyung-tae approached Kim Sung-jun's bed and introduced himself and said that the test results had arrived. The man had already started to say something, but looking at the resident, he decided that it would be better if the one who had performed the diagnostics spoke. Although the level of anti-nuclear antibodies is low, but the anti-double-stranded DNA antibodies are floating and C4 is separated, and after that, Baruda said that it is definitely systemic lupus erythematosus. The frightened patient asked what it was, and the resident explained that the disease was completely incurable, but that recently it had been managed well. The joyful young man immediately asked whether guys with such a disease are exempt from military service. Listening to Lee Soo-hek say that while the exacerbation is ongoing, then of course, they are exempt. With melancholy in his voice, the young man immediately declared that he should not have come at all. The artificial intelligence thought to itself that this young man clearly does not understand what a chronic disease is. A minute later, Lee Soo-hek spoke up and said that there was still enough fluid in the pericardium, and in addition, the chest X-ray showed pulmonary edema, so they needed to stay in the hospital and start steroid treatment. Kim Sun-jung didn't understand what would happen to him, but the doctors said that everything would be fine. He just needed to follow the prescribed treatment. And while our hero was thinking about how it was time to get some rest, his assistant asked him if he really thought that getting rid of lupus was that easy. But he didn't get a chance to rest because a day later, the resident received a call saying that his patient was suffocating. The duty officer explained that the previous night had passed calmly, but in the morning the condition had worsened. The guy didn't understand how this was possible, but he realized that he needed to figure it out, and so he said that he would come soon. At this time, a small consultation was already taking place in the department, where the current situation was being discussed. The manager wanted to know how it all started, and a frightened Sam reported that at first everything was fine, but then it got bad. The man didn't understand how this could happen, and so he thought for a moment. Realizing that something had to be done, Professor Min Keng-jong from the rheumatology department inquired about the OAM results. Sitting down at the computer, the intern shouted that the hematuria and proteinuria continued, but he carefully monitored the test results. Afterwards, the professor asked Lee Soo-hek how the chest X-ray was going, but he apologized, saying that it had not been done yet. A few minutes later, everyone gathered approached the computer to get a more detailed look at the test results. The resident understood that there were no significant improvements, and the Baruda said that the diaphragm line had dropped a little. The young man looked at this with horror while Min Keng-jong said that the swelling was simply terrible. The head of the department said out loud that it could be kidney failure if lupus had affected the kidneys. Lee Soo-hek agreed with this. He said that when acute inflammation occurs, the kidneys are often the first to suffer, which is reflected in the patient's urine test results. The young man said he believed it was necessary to increase the dose of prednisolone to 60 milligrams and add hydroxychloroquine. But he immediately shouted that he had expressed himself incorrectly, since he should have initially asked Min Keng-jong, who had stated that he agreed with the appointment. Shin Hang-tai also agreed with the appointment, but immediately said that a kidney biopsy was needed, which could be done as soon as the patient's condition allowed. The men understood that a biopsy was also needed to understand which medications were worth using and which could make things worse. Our hero noted a minute later that he wanted to inform Professor Kim Jin-shil, which amazed Sam, who did not understand how a second year could communicate with a professor on her day off. The head of the department immediately noted that they had already noted the plan, but he wanted the patient to be monitored especially carefully over the weekend. The professor said there was no need to worry about it because the boy would be under constant supervision. When Sam was left alone with Lee Soo-hek, he began to say that it was all because of him. Although the resident said that it was not so, he was a more experienced doctor and therefore should have noticed the deterioration the day before. The guy immediately began to blame the Baruda for this, but he said that he could not conduct an examination, he only gave advice. At this point, our hero thought that the general condition might not be the cause, but simply a symptom. Suddenly, the guy was brought out of his thoughts by a female voice that greeted him loudly. The young man was embarrassed that the professor had to interrupt his day off, but she said that it was no big deal, adding that she wanted to know who could test the sample. Hearing about her husband, who was taking part in the treatment, the woman thought that he was some kind of VIP patient, but it turned out that he was an ordinary boy. Smiling, Kim Jin-shil said that there was nothing strange about this, since both men wanted to get to the truth and help others. Not much time passed, and the girl was already performing some kind of manipulation. Turning to Sam, she asked him to press on the sacral area, saying that if it was lupus, then most likely that. Suddenly, the doctor said that she was in a hurry somewhere, and therefore, if our hero wanted to tell her something, now was the time to do it, although he modestly noted that she had already done a lot. And leaving, she added that it would be best for them to talk about the dissertation next time. Lee Soo-hek was a little embarrassed, but he didn't say anything as he watched the professor leave. Continuing to press, the resident thought to himself that this young man was doing an excellent job of the task at hand. A few minutes later, the hero was already calling the head of the department, who said that he would immediately check the test results. And as for taking medications, he wanted to leave everything as is. And he added that if something happens, he should definitely call, since he will be located close to the clinic. Baruta said that it would be better to move the patient to the ward, and as for the resident, he needed to eat. Not much time had passed, and the young man was already happily gobbling something up. He told the intern that it was very important to eat well and a lot, otherwise it would be difficult to maintain the existing schedule. The young people hoped that they would be able to sit quietly for at least half an hour, but at that moment the phone rang. Lee Soo-hyuk hoped that nothing bad had happened, although he knew that was probably not the case. And this was true because the attendant was shouting that the patient's blood pressure was rapidly dropping. A few minutes later, the doctors were already rushing into the room with all their might. Realizing that Lee Soo-hyuk couldn't run properly and was limping, trying to gain some speed, Sam offered to support him a little to get there as quickly as possible. Leaning on his colleague, the guy thought that the patient's blood pressure was 90/55. There are many cases when problems with blood pressure suddenly arise. It was unclear whether this was due to bleeding that had developed after the kidney biopsy, or whether the underlying problem had never been fully identified. Baruta also didn't understand why the pressure was dropping, but he knew for sure that all possible reasons needed to be considered. Even the slightest possibility cannot be ruled out, since it could cost a person his life. After a couple of minutes, the medics finally managed to reach their destination. Hearing the command from another doctor, Lee Soo-hyuk knew that he should go to the procedure room. The only good thing was that it was not a code blue, meaning the situation was not yet critical. It was also good that there should be at least one specialist in the procedure room. Realizing that there was no need to hurry so much, the young man asked Dae-heng to go ahead, saying that he would come soon. Our hero hurried as best he could, although it couldn't even be called a fast pace. The Baruta also noticed this, saying that he needed to speed up or the guy relaxed in the rehabilitation center. The young man was angry about this and said, "How can you say something like that to a person with crippled legs?" But the assistant did not stop, continuing to note that when a person is angry, he becomes faster. The speed can increase by 11%. Lee Soo-hyuk finally managed to reach the right office. Looking at the frightened intern who was holding the instrument in his hands, the guy realized that he did not know how to use this probe. Baruta told our hero to check the patient's vital signs since An Di-hun can't help in this situation, and added that last year was much better. The resident was surprised by the artificial intelligence's conversation, but he stated that it had already begun to speak like Lee Soo-hyuk. Looking closely at the device, the guy noted to himself that the pulse, which was at 136, was very high, although the pressure did not drop any further. Our hero was also confused by the fact that the body temperature and breathing rate were normal, although the assistant stated that it was necessary to sort things out before the patient got worse. A minute later, the doctor began listening to the sick man's lungs. The problem was that the breathing was intermittent. Realizing that the situation was becoming more confusing, Baruta said that he would conduct an analysis of the situation. Suddenly, the artificial intelligence declared that the patient had a dull sound in the right lower lobe, and the probability that the cause was pulmonary edema was 98%. The young man thought that the cause was pneumonia, but the assistant dismissed this idea, adding that the respiratory rate, like the temperature, was normal. If this was clear, then what caused it was completely unclear. After looking at the biopsy wound, the guy realized that it had nothing to do with it. Besides, the wound was clean, and pulmonary edema does not occur with such a simple manipulation. Baruta immediately stated that the patient's pulse was twice as high as that of a healthy person, considering that the young man was unconscious. The resident knew that heart problems could not be ruled out, and therefore decided that it was imperative to request an ECG. Although a minute later the interns were bringing the diagnostic device, although Lee Soo-hyuk asked them not to hurry. The resident told the intern that an ECG needed to be done immediately, saying that the machine was in the duty room and therefore it should be brought in. The radiologist who heard all this did not understand why they started with an electrocardiogram, if in such cases they always do an X-ray. At the same time, he did not argue, because he looked at the guy as the director's son, with whom it was better not to argue. As he ran away, An Dae-hong shouted loudly that he would bring everything his boss told him to. After some time, the ECG device was already standing on the table. Starting the procedure, our hero gave instructions to his assistant. At some point, the young man swore he saw it all himself, and the Baruda confirmed that some T-shaped wave was inverted to VOE4, 5, and 6. The young man was not sure what the problem was, but the assistant said that it was unlikely to be a heart attack and that the patient's age and underlying medical conditions should be taken into account. And again, the nuance was that, firstly, the guy's very young, and secondly, he has ordinary lupus. It is not diabetes or even high blood pressure. With some anger, our hero thought to himself that something was wrong with his heart, and therefore he could not lose another minute. Gisanim, who was a radiologist, heard Lee Soo-hak asking him not to leave, and so he noted that he would stay as long as necessary. Screaming, our hero suddenly asked for an ultrasound to be brought to him, after which he said to do an analysis of all the organs of the body and then a blood test. And looking at Sam, he added that a brain natriuretic peptide test was also needed. Mesmerized, the first-year student thought that it was hard to believe, even to see with his own eyes what a talented second-year resident looked like. Of course, what else can you expect from a genius? From the director's son. While talking with the head of the department, our hero asked him to look at the ultrasound results, hearing that he would come soon. After a couple of minutes, the ultrasound that Lee Soo-hyuk requested was ready. The resident, who was not going to waste a minute, immediately began to perform the manipulation. The doctor was confused by the fact that the heartbeat was strange and the overall movement was imprecise. Baruda immediately intervened and said that according to the analysis, there was not a single area that was functioning well. It didn't look like a heart attack. The central processor is less functional during echocardiography. Covering his head with his hands, the young man began to whisper something incomprehensible under his breath. But recently the young man thought of something, turning his gaze to the patient. The reason was that the cardiac output was 15%. This number indicates heart failure. Fortunately, he is young, too young to stand on his own. The ECG result was very strange. The ultrasound showed a distant heartbeat. The probability of a heart attack is very low, and this is despite the fact that the person did not have cerebral shock, pheochromocytoma, or cerebral hemorrhage. Suddenly, the resident cursed out loud, but to himself he thought that this was broken heart syndrome. There was no doubt about it. If myocardial function deteriorates, as in this case, then the most likely outcome of the disease is death. Jumping up from his seat, the doctor ordered that dopamine be added and that the director be called and asked to come to the intensive care unit. Answering An Dae-hoon's question about what kind of illness it was, our hero shouted on the go that it was broken heart syndrome and the ejection fraction was 15%. Sending the patient to a new department, the guy listened to the intern say that according to the tests, everything was within normal limits. Only the production of myocardial enzymes was increased. The young man shouted that they could do nothing about it, hearing that the liver was still enlarged. Lee Soo-hyuk became even more angry. He knew that if the patient remained in this state for a little longer, it would lead to multiple organ failure. Baruda calmed the young man down a bit, saying that they would analyze the optimal treatment method based on the current situation, so he would remain silent for a while. Running down the corridor, Shin Heng-tae nervously asked his subordinate what happened, as the director had called him and told him that he needed to run to the department immediately. The guy immediately explained that the patient's blood pressure dropped when he examined him, discovered pulmonary edema, and also that a segment in the heart had fallen. He thought that the cause was in this organ, and therefore doubted that it was broken heart syndrome. Hearing what other manipulations the resident had performed, the director thought to himself that it was impossible for a second-year student to perform such a thing. And if everything was okay with this young man's legs, he would definitely have been taken to the cardiology department, since he is very talented. The manager irritably asked what they should do in such a situation, and our hero did not understand whether the Baruda would remain silent, since without him he did not know what type of treatment to choose. The young man began to call his assistant, but he continued to do so as he sat silently. Suddenly, the artificial intelligence opened its eyes, noting that it still needed one more minute, and seeing the confused Lee Soo-hyuk, he told him to somehow get his mentors to talk, because he loves to talk and knows how to. The guy understood that he couldn't look like a fool, and so he thought about what really smart things he could do. Suddenly, the young man said in a confident tone that they needed to prepare for intubation and adjust the ventilators in advance. Realizing that the assistant was still processing the data, I thought to myself that I had intended to give instructions slowly, but it didn't work out that way. That's what it means to be a first-class specialist. The men who were looking at Lee Soo-hek realized that he was frozen again, so they turned to him. The professors simultaneously asked what treatment to prescribe in this case. The guy himself understood this, because they had previously observed that heart failure was only 15%, but if it continued like this, the patient could die within a week. Our hero stated out loud that treatment for systemic lupus erythematosus should continue, and the director asked if anything else needed to be added besides steroids and immunosuppressants. And then he added that other medications could put a strain on the heart, so only 60 milligrams of prednisolone were administered, although the director did not understand whether this would be enough. Realizing that something else needed to be said, the young man said that the first thing to do was to check the blood pressure. The director said that everything was happening too quickly and that the medical staff could do nothing about it. But Shin Hyung-tae stated that this guy is so young, every time he makes his rounds, his guardian thinks that the patient will get better. Lee Hyun-jung added that information was received that the time was within the standard. No one thought that the patient would be diagnosed with broken heart syndrome. But the head teacher started shouting again, saying that the young man was not a professor. He was smart, of course, but still a second-year student. The director didn't want to listen to anything, explaining that the guy was very talented and would soon become a professor, after which he began to get angry that his friend was calling him unofficially in front of his subordinates. Without waiting for an answer, Lee Hyun-jung loudly declared that he needed to think about the current situation. The manager also noted to himself that they did not know whether this poor fellow would survive. This is the main problem, which was the same even for the talented Lee Soo-hyuk. At this moment, the Baruda opened his eyes and joyfully announced that his analysis had come to an end. The assistant stated that he had managed to read some things from the downloaded database and had found the relevant literature, although it had taken quite a long time. After thinking about it, the artificial intelligence said that this is the best option for now, but there is a nuance. And after that, he said that there was a high probability that immune resistance would occur. The guy understood that his assistant had come up with some kind of risky treatment and therefore said that there could be no mistake. Suddenly, something like an artificial heart appeared in front of our hero, and so the young man asked in surprise if such a thing even existed. And while the mentors were arguing, the young man had time to calmly listen to the Baruda. Lee Hyun-jung was at this point proving his point that there were no obvious symptoms. But his colleague insisted, saying that he was the best in his field and therefore should know about such a case like no one else. Hearing such statements, the director said that Shin Hyung-tae did not respect him at all, believing that he had lost his form as a good doctor. The man was not afraid of anything, saying that this is exactly what he thought. A minute later, the director decided to leave, saying that he needed to look for some information, and Shin Hyung-tae scolded him, since the patient was on the verge of death, and the man went to read something. At some point, the professors noticed the resident who was standing behind them. Lee Soo-hek literally pierced them with his gaze, and so both of them asked in unison what had happened. The young man told the Baruda that he could no longer watch these people argue, and at the same time he praised his assistant for his excellent work. The young man said that he had previously read a study presented by the IO clinic. If stress cardiomyopathy was caused by lupus, as in the patient, when cardiac output drops to 15%, the chance of cardiac arrest within a week is 90%. He continued that it is rarely mentioned that one needs to be careful in such a situation, but this is what the clinic he is talking about has encountered. However, our hero wondered how to use ECMO, but it will be difficult since first you need to convince the guardian. Hearing some expressions that were incomprehensible to them, the men asked what it was. It turned out to be extracorporeal membrane oxygenation, a device that provides long-term support to the heart and lungs, helping the patient's organs during treatment. The director understood that if he used this device, the heart would receive very little load. Lee Soo-hek said that the patient lost consciousness, his heart rate may have dropped. Considering all the previous indicators, the situation has worsened. The director, having listened to his charge, looked at him attentively, but remained silent. He suddenly said that they could take the risk, but they had to call the guardian first. Lee Hyun-jung was ready to personally take responsibility for what would happen. And a minute later, he added that he didn't think the guardians would be against it, since the situation wasn't getting any better, and therefore they had nothing left to lose. Hearing that our hero suggested putting the patient on the heart transplant waiting list, Shin Hyun-tae said with horror that if the heart's functionality was not restored within 2 weeks, it would mean irreversible damage. Lee Hyun-jung noted that ECMO will be used for exactly this amount of time. If the condition begins to improve, it can be abandoned. Sitting in his chair, the director said he had to call a thoracic surgeon, realizing that with ECMO, everything would not be simple. Realizing that standing in such a situation was pointless, the mentors told the resident to sit down. At this point, the director spoke again and asked who the person was who was with them. The guy didn't wait to be introduced, so he shouted that his name was An Dai-hong, and he was a first-year resident. The manager didn't understand why this man was there, saying that they don't give serious cases to newbies. Embarrassed, the young man explained that he had originally been his patient, but Lee Soo-hek, given the complexity of the case, began to actively help him. The director said with joy in his voice that An Dae-hoon is an intern and our hero is a professor, and it all looks like the professor is looking after the intern. Lee Hyun-jong understood that his protege was simply being modest, and so he said that being under the command of such a young man was a real stroke of luck, which even the new resident confirmed. Gathering up his courage, An Dae-hoon shouted that he joined the internal medicine department because he wanted to be like Dr. Lee Hoo-sek and was very proud of his decision. Looking at the guy, everyone present noted that he was very energetic. Suddenly, the principal asked if it was true that the first-year student was the student who asked to set up a Soo-hek fan club in the hospital. Our hero looked at his mentor and the first-year student in surprise, not believing his ears. Baruta, listening to the boss's explanation that it was a good idea, but they couldn't do it, suggested that our hero conduct a clinical trial in the hospital because it was full of crazy people. The young man was not clear about this fan club, but his assistant said that according to the rules, 10 applicants must apply to participate in the hospital club. The young man couldn't believe that there were so many people wanting to come to their hospital. The question was who all these people were, which was also interesting to artificial intelligence. And then he added that it would be best for the guy not to think about the girl Woo Ha-yoon, who has been very busy lately. A cardiologist came unexpectedly and immediately asked where the patient for ECMO was. After performing the necessary procedure, the doctor told the attending physician not to worry, as they would check the operation of this device daily. Looking at the patient, our hero said out loud that he would really like this young man to get better. The director said that waiting is more important, especially in the therapy department. Shin Heng-tai, in turn, said that today is Saturday. Everyone worked well. Because of the patient, you can't leave, but you can rest. Left alone with the elder, An Dae-hong sincerely thanked him, hearing that it was unnecessary since being a beginner is always difficult. The young man was angry that the resident did not accept compliments, saying that he deserved great respect. And then he added, who can show disrespect to Lee Soo-hek, who is so brave? To change the subject of the conversation, our hero offered his colleague a snack, saying that they hadn't even had time to have breakfast. Hearing that the first year had completely forgotten about food. The young people were about to go to the dining room when the Baruta called out to his master. With a serious look, he said that he wanted to say something very important. The guy looked at him warily because he couldn't understand what they were talking about. Lee Soo-hek implied that this might somehow concern the patient, and therefore asked not to delay and lay out everything that was known. The artificial intelligence said that the young man was fine. The question was whether the employees would go to the staff cafe. Having confirmed this, the assistant said that this was a big problem, although our hero did not understand what was wrong. Finally, the Baruta said that the owner had forgotten that there was terrible food for dinner on the weekends. Recalling how last year the tired young man ate with pleasure everything that was prepared in the canteen, the assistant declared that it had a terrible taste, since he could even smell it. It was unclear why the staff did not want to improve the cafe, because there are a lot of staff and everyone goes there to eat. The artificial intelligence immediately announced that it was offering to place an order because if the young man put something disgusting in his mouth again, he would go on strike. A minute later, Lee Soo-hyuk would suggest to his colleague that they order something delicious, perhaps pizza, in honor of the fact that they had done a great job with the task. Less than half an hour later, the fragrant pizza was already standing in front of the doctors. Enjoying this dish, the Baruta said that he was very glad that he was treated to something completely new. And he added that the taste of greasy cheese pizza is an unforgettable taste, from which one can even die. Although the young man immediately began to say that the assistant was talking some kind of nonsense. The young people hoped that they were shopping in a calm environment. But at that moment, An Dae-hun's phone rang, and he said that they were calling from the emergency room. Our hero's assistant began to get angry and indignant, but Lee Hoo-sek told him to stop acting like he was a living person. While answering the phone, the first-year student heard the duty officer say that a patient with a fever had been brought in. After this, the guy asked our hero if he should go first and check how serious the condition was. Standing in the elevator, Baruta lamented the fact that they had not taken pizza with them, although he understood that when cold, it was not as tasty as when freshly made. A moment later, the artificial intelligence began to say something to its owner again, but he only closed his eyes. At this point, the conversation was interrupted because the doors swung open with a bang. Running out into the corridor, Ande Hun shouted that he would still go first and check everything, although it was a little wild. Looking after the first year, the guy thought that it wouldn't help anyway. Speed isn't always important. The AI agreed with this, and therefore said that Lee Soo-hyuk should train this person well so that he could make useful notes. And it was true, no one knew what would happen tomorrow. Moreover, studying at Taewa Medical Center is not easy. As he approached the observation deck, the young man saw his colleague waving at him. The guy immediately explained that the girl was 21 years old and had been hospitalized a week ago with suspected appendicitis and had undergone a laparoscopic appendectomy. Our hero suspected a surgical infection, although the first year didn't know for sure, adding that the fever had started along with nausea and vomiting 3 days ago. A test conducted at the hospital where she was operated on showed liver dysfunction, and so the patient was brought to them today. Lee Soo-hyuk understood that if it was a normal infection, it would progress within the normal range without causing liver failure. Approaching the girl, the guy addressed her as Kim In-soo and immediately turned his attention to the patient's dry lips, which indicates fluid loss. Baruta immediately stated that jaundice was not detected, but petechiae were visible on the ankle. When checking the blood test, it was necessary to find out the reasons for their appearance. Our hero was also confused by the fact that the girl was too pale, but the assistant explained that this did not look like anemia. The probability that hemoglobin was decreasing was more than 95%. It was very important to listen to the girl's lungs, which the guy did, although he immediately realized that her breathing was fine. A minute later, the resident pressed on the patient's abdomen, who immediately said that she felt a little pain. Realizing that he needed to move on, our hero moved to the lower abdomen, realizing that the pain there also remained. The abdomen is soft. The pain subsides when you remove your hands. This area of the abdomen is elastic without bloating. The AI said that there is a small chance of infection after the surgery, and the color of the fluid coming out of the drainage tube is normal. Looking at the man, Lee Soo-hyuk honestly said that it was difficult to say what caused the fever right now. And he added that to begin with, they will conduct a basic test and look at the results. It is very important to understand what is wrong, since there are petechiae. Since the girl had an operation, he will do a CT scan of this area. With severity in his voice, the man stated that he understood everything and agreed with everything. Hearing Ande Hun's voice, our hero thought that the girl would soon be diagnosed, and then adequate treatment could be prescribed. The first-year patient brought back test results, which showed that the patient had pancytopenia, an enlarged liver, and in addition, there was a possibility of increased bleeding. Fortunately, the D-dimer is not elevated, but if things continue like this, the patient's life will be in danger. After listing all the symptoms, Baruta said they needed to think about hepatitis caused by viruses or toxins. It is also important to remember that the surgical site may be the cause of infection. All of the above symptoms are possible if sepsis has developed. Sitting in front of the computer, our hero tried to find out what medications the girl was taking. Perhaps pancytopenia was caused by taking the drugs. Having learned that they used a first-generation drug, they decided that most likely it was not the cause. But in addition to this drug, they use a completely different type of drugs. The recommended drugs are aztreonam and levofloxacin. The young man thought that perhaps he could try using hepatotonics. If there is no clear diagnosis, it is recommended to try different methods of treatment. An Dae-hun watched his mentor and remained silent, thinking that he seemed so cool when he was thinking. A major problem was disseminated intravascular coagulation disorder, which is progressive and requires close monitoring and platelet transfusion when necessary. Returning to reality, the young man said that he would call the head of the department, and An Dae-hun needed to tell the patient that she would be hospitalized. The first year said that he understood everything, but he thought to himself that often second years throw away their notes and abandon patients. But he heard that Lee Soo-hyuk was very talented and had a wonderful character. Only a minute passed, and our hero was already calling Shin Heng-tae. The frightened manager immediately began asking about what had happened to the patient. hearing that he was stable and that it was not his fault. The young man explained that he had called because a new patient had been admitted to the emergency room, which did not make the professor happy at all. The young man began to talk in detail about the girl, as well as about the health problems she was having. The guy said that since she has pancytopenia, the level of liver enzymes and LDH is elevated, which means that bleeding diathesis may occur, and petechiae are already visible. With horror in his voice, the mentor asked if the resident really suspected disseminated intravascular coagulation after hearing a positive answer. Taking a deep breath, the man said that in this case, mandatory hospitalization was necessary. After that, Shin Hyun-tae asked who would be responsible for the patient, our hero or his first year. After hanging up the phone, Lee Soo-hyuk told the assistant that An Di-hoon's skills are good. As soon as a patient comes in, he rushes to him even if it is a serious case. The young man himself understood this, while the artificial intelligence praised its master, saying that he himself always took care of his patients. The young man thought that all this was happening because a Baruda had appeared in his life. And he replied that there was nothing bad in his experience, of course. He found things that would have passed him by, and besides that, he made the most accurate diagnoses. Closing his eyes, the guy thought that the artificial intelligence was partly right. It actually cared about many. And smiling with satisfaction, he thought that they were the only patient of his who had not died, which made him especially happy. Standing up from his seat, Lee Soo-hyuk, charged with positive energy, said that their teamwork was excellent, so they should continue to save people. Suddenly, the Baruda ordered his master to sit in the chair, reminding him that he must wait for the manager, who was already on his way somewhere. Our hero didn't even have time to think about anything before Shin Hyun-tae appeared behind him and immediately asked how the patient was feeling. The guy replied that it was good, although there were practically no signs of the disease. Since the cause was unclear, the young man contacted a donor center for a transfusion of blood components. Studying the test results, the head confirmed that these were petechiae. The number of platelets was reduced considering the patient's age. This was very little, and therefore the man became interested in whether the girl had any chronic diseases. Lee Soo-hyuk noted with embarrassment that the medical record only listed a recent appendix operation. The man said out loud that it couldn't be a chronic disease, but he thought to himself that since the operation required general anesthesia, a preoperative examination was necessary. At that moment, a first-year student came in and said that the test for viral markers done at the hospital was negative. A couple of minutes later, the joyful head of the department came into the girl's room and introduced himself. Seeing another doctor, the patient's relative was scared, but Shin Hyun-tae quickly assured him that everything was fine. Baruda immediately said that the head of the department's ability to calm people down was simply superb. The professor's experience had not been wasted. Unexpectedly, the doctor asked our hero what he thought, although the young man did not quite understand what was being discussed. But then the resident stated that, given the patient's age, it could be lupus erythematosus, a disease that causes pancytopenia and bleeding diathesis. He added that it was difficult to rule out the possibility of drug-induced pancytopenia, as doctors had used antibiotics that could have caused it, so they stopped the drugs. Shin Hyun-tae praised the young man, noting that such a possibility definitely exists. Turning away from his relative and leading the manager away, Lee Soo-hyuk still wanted to say something. Unexpectedly, he said that it could be blood cancer, which destroys cells, and the mentor agreed, adding that blood cancer could be the cause of appendicitis. That's why the guy asked the hospital where the patient was staying to send a sample. Shin Hyun-tae smiled and thought that this resident was much better than his former colleagues, although he immediately corrected himself, saying that perhaps they were the same now. Suddenly, the doctor caught himself thinking that perhaps he was overestimating the young man. And at that moment, Lee Soo-hyuk added that he also ordered a peripheral blood smear test for examination, which surprised the head of the department so much that he couldn't even say a word. The doctor said they were going to change the antibiotic and start using heparitopectomy, which the resident confirmed, adding that the latter procedure had no clinical evidence, but he still wanted to use it. Realizing that the situation was similar to the recent one, Shin Hyun-tae noted that they would do things differently this time and would not need to use ECMO. Realizing that the man had 2 difficult patients in the department, he said that he definitely would not be able to go home today. And leaving, he added that he could be found in the laboratory, so if something suddenly happened, our hero could confidently call. Baruda immediately stated that it was so interesting that his master worked as hard as his boss. and he said that he should work even harder, and if suddenly the guy decided to die, he would stop him, since he was responsible for the health of his body. After a while, the artificial intelligence howled so loudly that it was impossible not to hear it. Moreover, standing over the sleeping guy, he also shouted that some bell was ringing. Lee Soo-hyuk cursed as he rose from his bed, albeit very quietly. Our hero's assistant said that his hair was no longer so disheveled, but the young man only said that he was simply used to it, because the Baruda does it all the time. Fortunately, there were no patients at night, so I managed to sleep well. Hearing this, the artificial intelligence was happy and said that it was time to go to the patient. The young man made his rounds, and he did so very carefully and thoroughly. As he walked down the corridor, the resident told the Baruda that the good thing was that all his patients were okay. The only problem is the ECMO. They will have to leave everything as is. The echocardiography that the director performed showed practically no changes. The assistant immediately stated that there would be no changes during the week, and he would like this too, but there are no precedents. Suddenly, our hero started talking about the patient in question. But at that moment, An Dae-hoon suddenly asked for some reason if it was true that Lee Soo-hyuk had a cough. The guy looked closely at his colleague and remained silent, not knowing what to answer him. The frightened first-year student said that the boss didn't look very well, although the young man immediately said that he had been up late reading his colleague's work. Lee Soo-hyuk tiredly said that they were not living in the Joseon dynasty, and so the aspiring doctor just needed to say hello, and added that the guy just needed to relax. But he continued to say that he could not do this. If he wanted to express his gratitude and respect to his elder, he could even kneel down. Sitting down at the table, our hero said that it would be better for them to simply check the test results. It turned out that the peripheral blood test was normal. With the exception of anemia, everything was normal, and this was very pleasing. The young man was most worried about this test, because if this is so, then the diagnosis associated with cancer is very small. After this, our hero began to say that the patient's liver was enlarged and so was the LDH. The levels were almost 50 times higher, which is why Baruda said that this was strange, as was the fact that the iron content in the blood was elevated. This means that red blood cells are being destroyed, which is where anemia comes from, and therefore it is important to find out what is the cause of this condition. The AI said that the current list of symptoms was fever, liver failure, high LDH and ferritin, and therefore it needed to run an analysis. An Dae-hong, who was sitting next to the second-year student, saw that he was deep in thought, and so he did not intend to disturb him. The assistant told our hero that nothing was ready yet, and therefore he could not give the result. Suddenly, Baruda announced that he had already completed his analysis. He quickly added that it took him time because the data is very sparse, and medical research on these topics is the same. Hearing how the young man began to argue, the Baruda immediately declared that the young man had become impudent. Lee Soo-hyuk didn't like this, so he simply asked the AI to tell him everything it knew. The manager, who was standing behind him, heard the boy turn to someone and ask if he should do it. Approaching An Dae-hoon, the man asked what was going on here, as he still did not understand to whom the question was addressed. The young man stated that he was also interested, but his mentor closed his eyes and then said that strange phrase. Hearing Shin Heng-tai remark that the boy was in that state again. Realizing that this could drag on for a long time, the manager went somewhere. But a moment later he returned with a chair that he had brought for himself. The man told the first year that when Lee Soo-hyuk behaved like this, it was better to leave him alone. And when he finished, he would come up with some brilliant idea. After some time, our hero suddenly opened his eyes, although he himself continued to sit. Cursing, he began to say that something was good, although his colleagues could not understand what he was talking about. Shin Heng-tai asked what was going on, although the first year himself didn't know, since he had never seen anything like this before. The young man said not to chatter in vain, and then turned to the manager, who was both confused and frightened, thinking that the ward was addressing him specifically. Without waiting for an answer, our hero was already holding a syringe in his hand a minute later. It seemed like the guy was somehow mesmerized because he was silent and staring at one point. The frightened professor thought that in addition to the surgical kit, Lee Hoo-seok had also taken a syringe with him for some reason, realizing that it would hardly be useful in the infectious diseases department. For some reason, the professor suddenly remembered Lee Hyun-jong, although he himself did not know how it happened. Suddenly, the manager shouted at the first-year student to follow our hero and carefully watch his every action, although he was afraid to do so. Less than a minute later, An Dai-hong called out to the young man who was already heading somewhere. Lee Soo-hyuk, as if nothing had happened, stated that he had been with him the whole time and then told him to help him. At this time, Shin Hung-tae continued to sit in front of the computer, confused. He asked himself why he left, although he did not specify when or from where. And then I thought about how he had reacted very sharply before. But nevertheless, he was a little nervous. Maybe it was because he hadn't gone out for a while. Approaching a door, the professor opened it. His gaze was extremely suspicious. Entering inside, he looked carefully somewhere, asking himself what would happen next. At this time, Baruta said that the patient is currently not reacting to antibodies to autoimmune diseases, including lupus, meaning the likelihood of developing an autoimmune disease is low. In addition, the viral markers that are usually carried out before the operation and those that were prescribed the day before showed a negative test. The assistant added that he analyzed the patient's list of problems, taking into account both these facts as well as the symptoms. Lee Soo-hyuk said that the peripheral blood smear analysis showed the cells were in normal shape, although the artificial intelligence noticed that the problem was not in the formation of the cells, but in the fact that they were being destroyed. He added that there is a high probability of histiocytosis, but to confirm the diagnosis, a bone marrow examination should be performed. Sitting in the chair, the young man said out loud whether he would really have to do this, surprising his colleagues with his statement. Baruta added a minute later that the study needed to be done as soon as possible, because if treatment was not started on time, the patient could die, and said he was 90% sure of the diagnosis. Opening his eyes, the resident said that if his assistant said so, then the probability was 100%. Jumping up from his seat, the young man began to swear loudly. After this, our hero hobbled towards the girl's room. But before Lee Soo-hyuk could reach his destination, An Dae-hun immediately called out to him. Forgetting that there was someone else next to him, the young man immediately corrected this oversight, declaring that since a first year was already here, he would help him. Only a few minutes had passed, and the doctors were already looking closely at the patient. Answering our hero's question about how the patient slept, she replied that she hardly slept a wink due to the rise in temperature. The girl explained that besides this, there was a man standing next to the curtain, although her father told her that there was no one there. The young man noticed that his breathing had become more frequent, although the oxygen content in the blood was normal, which meant that there might be a suspicion of fluid in the lungs. Artificial intelligence stated that this was possible because the disease progresses quickly, and if the patient had actually seen someone, perhaps she was delirious, and therefore it was necessary to speed up the diagnosis. And while the resident was thinking about prescribing a bone marrow examination, a man approached him, and he asked if the professor who was there the day before would come, since he believed that his daughter's condition was serious, hearing that the head of the department would come, but after conducting another analysis. With anger in his voice, the patient's relative began to shout that she was not being treated at all, but was only being prescribed endless tests. Lee Soo-hyuk began to make excuses, saying that they couldn't prescribe treatment without a diagnosis, which again enraged the man, who said that the girl had a high fever, but no one was doing anything about it. Once again, the resident noted that they needed to run one more test because the underlying diagnosis was suspect. Baruta told his master that the man was not so much angry as worried, and therefore it was better to calm him down. And so the guy explained that the examination they wanted to conduct now was the most important one. He understood the need for additional examination based on yesterday's tests. It follows that it is very important to perform this test in order to make an accurate diagnosis and prescribe treatment. He added that the later the diagnosis is made, the later treatment can begin. After some time, when he entered the laboratory, Shin Heng-tae was greatly confused by something. He saw our hero standing in front of a microscope and carefully examining something. Lee Soo-hyuk was so engrossed in the process that he didn't even notice that there was someone in the office. The manager did not understand why our hero needed this instrument, noting to himself that this microscope was for educational purposes, so one side was always empty. Considering that the instrument was paired, the man approached from the other side and also looked at the glass, not understanding whether he really saw bone marrow in front of him. Shin Heng-tae didn't think that the guy would come to the ward so early to take bone marrow. This man was already brazen in his first year and became even more stubborn in his second year. For a moment, the professor was even frightened, deciding that this young man might actually be a monster. Baruta, who had already analyzed everything, said that the cellular proportion was 30%, which meant it was not oncology, although Lee Soo-hek said that it was too early to breathe a sigh of relief. There was a large number of proerythroblasts in the blood, which often happens with parvovirus infection. In rare cases, the infection can cause histiocytosis in acute hepatitis. Hearing this, the manager screamed loudly in surprise. The surprised resident asked when the mentor had managed to arrive, but he replied that it had happened just a couple of minutes ago. But Shin Hung-tai was interested in what the young man was muttering under his breath as he looked into the microscope, hearing the boy say that he would explain everything in detail. With his arms folded across his chest and a stern tone in his voice, the chief declared that he was listening attentively. The patient's list of problems includes elevated temperature, impaired liver function, pancytopenia, elevated IDH and ferritin levels. And while our hero was saying that he was scared of pancytopenia, the professor noted that this was precisely why he had ordered additional testing due to the suspicion of an autoimmune disease, blood cancer, or the consequences of antibiotic treatment. The young man added that the results did not confirm any of the three suspicions, and therefore it was necessary to look for another cause. Lee Soo-hek immediately said that ferritin was elevated, but no abnormalities were found in the peripheral blood smear, which meant that the destruction of red blood cells was occurring for some other reason. Shin Hyun-tai said so the resident thought it might be histiocytosis and decided to check the bone marrow. The young man confirmed that this was so, and therefore concluded that the diagnosis was histiocytosis, although the chief thought to himself that he had not understood anything. And the guy went on to explain that in a normal bone marrow state, phagocytosis is observed, as well as a large number of proerythroblasts, which indicates histiocytosis caused by parvovirus infection. There are also suspicions of hepatitis, which only confirms the fears because parvovirus can cause acute hepatitis. For this reason, our hero strongly recommends treatment according to the HLH 2004 protocol. With horror at the case of his ward, the manager thought about what this was. How could some boy know about this? A minute later, Lee Soo-hek said that treatment in the infectious diseases department would most likely be difficult, and therefore suggested transferring the patient to the oncohematology department. The man stated that he would immediately contact Tai Jin, who would not be against it, especially if our hero volunteered to be the attending doctor. While the horn was ringing, the professor was thinking that such a quick diagnosis of histiocytosis had never been made in history, and if the patient later had to undergo a bone marrow transplant, it was all thanks to Lee Soo-hek. At that moment, a colleague answered the call, and so the man switched to what he had to explain. Shin Hyun-tai briefly explained what the girl's symptoms were and what they suspected, but the doctor did not understand whether they had carried out a comprehensive diagnosis. The specialist did not understand why, if this did not happen, they made this particular diagnosis, since such a disease is not easy to detect. The professor found it difficult to believe that his colleague had managed to discover this disease on his own, and especially in such a short time. The manager shouted and said that Cho Tai-jin had guessed correctly, and that it was actually Lee Soo-hyuk who did it. But the specialist was not confused by that, but by how this guy could know about such things. Although he immediately answered the question that this young man is a genius, and therefore there is nothing strange about it, and he added that he is the best doctor in Taewa Hospital. Now this is no secret to anyone. Looking in the direction where our hero was standing, Shin Hung-tai admitted that this was indeed the case. The man himself was surprised at how this happened, but the fact remains. A couple of days later, when they saw Lee Soo-hek in their department, the doctors whispered that this young man had diagnosed histiocytosis, and they added that if it weren't for him, the patient would have definitely died. Rumor had it that the headmaster himself, Shin Hung-tai, begged this guy on his knees to tell him what the HLH protocol was, since he didn't know, and since he didn't know, no one else knew. Listening to this gossip, our hero wondered why his boss had to kneel before him. Baruta said that perhaps he was truly on his knees in his heart, since the best doctor at Taewa Hospital was now not Lee Hyun-jong, but his adopted son. And he happily declared that of course all this was possible only thanks to him. A minute later, the guy asked the assistant to be quiet for a bit, since he had already come to the patient. Before he could reach the ward, the young man saw Ha-yoon rushing towards him, greeting Lee Soo-hek. The girl apologized for disturbing the resident, knowing that his working day was already ending. And a moment later, she added that there was one urgent patient who needed to be examined. But it seemed that our hero did not hear what his colleague was saying, since he was focused on the fact that she had washed her hair and now looked simply magnificent. Heading to the examination room, Baruta said that when the guy was an intern, he almost never washed his hair and generally didn't take care of himself. A minute later, the assistant asked his master to examine the patient as soon as possible so that he could go and eat something tasty. With some resignation in his voice, the young man said that the artificial intelligence had already told him everything in advance. On the way, the girl explained that the patient had been complaining of discomfort for 2 days. He had gone to a hospital near his home, taken one nitroglycerin tablet, but he had not felt better, so he had come here. Lee Soo-hae didn't understand why he needed to take an angina pill, not understanding whether the guy really had pain in his chest. The intern added that the young man also suffers from epilepsy, so he has been taking phenytoin at a dosage of 300 milligrams for 14 years. Hearing this, the Baruta immediately noticed for himself that this was childhood epilepsy. After that, Ha-yun handed over the results of the ECG to the resident, which was done immediately. The artificial intelligence immediately noticed that not only did the girl graduate with honors, but she also worked well. According to the conclusion, this is not a heart attack. The pulse is 90, the heartbeat is rapid, but the patient did not exercise. This means that he has severe pain or there is bleeding. The girl again started talking about the ECG being normal, but Lee Soo-hae was interested in the overall clinical picture. Having reached the right room, the intern pointed to some young guy. Coming closer, the doctor noticed that the young man did not have muscle spasms. He had severe pain, and in addition, his eyes were located far apart. Lee Soo-hae decided not to delay and immediately introduced himself. Our hero asked if there was anyone in the patient's family who suffered from heart disease and heard a negative answer. But a moment later, the guy explained his answer, saying that he was an orphan. Hearing that the patient grew up in an orphanage, our hero became dejected, immersed in his own thoughts. Answering the question about what kind of pain, the guy explained that when he sits quietly, everything is not so bad. But as soon as he starts moving, it becomes unbearably painful and his head spins. After hearing this, the resident thought that the pain was so severe that this unfortunate man could not even straighten up, although, given his age, this was simply impossible. Thinking about it, Lee Soo-hae suggested that it might be an aortic dissection, and his assistant agreed. That's why the young man asked his friend to call the thoracic surgery department and have an echocardiogram done. And he added that the internist should explain that based on the clinical symptoms, there is a suspicion of aortic dissection, then the doctors will immediately come down when they hear about it. The surprised girl looked closely at the proudly standing doctor. She did not understand how he could make such a complex diagnosis so easily, but she did not argue. Looking at how Ha-yun easily communicated on the phone, the guy thought that usually interns didn't like to do this, but with her, it was a completely different matter. After a few minutes, having moved the apparatus as close as possible, the resident asked the patient to lie down, although he said that it would be very painful. Hearing that it wouldn't take much time, the young man nevertheless did what he was asked to do. When starting the manipulation, the doctor warned that the patient would feel a slight chill, but this was normal. Baruta immediately said that the area around the aortic roots was slightly dilated. There was reflux, an abnormal heartbeat, and therefore everything pointed to aortic dissection. Our hero's assistant said that for more accurate data, it would be a good idea to also do a transesophageal ultrasound of the heart, but the guy replied that he didn't know how to do that yet. The guy was sure that this would be enough for his colleagues. If they needed more data, they would conduct the examination themselves. Lee Soo-hae realized that he had established the cause, and therefore the therapist's task was completed. Baruta was sure that the young man would leave now, but he wanted to find out the reason for this condition, because the patient was only 18 years old. Both the resident and the Baruta suspected that there were some congenital diseases, but it was unclear what exactly. After that, the artificial intelligence suggested conducting a full examination. There was still time before colleagues from the department arrived. The young man understood that this was so, and therefore decided to start with the throat. Within a minute, the patient stood up to do what he was told. Unexpectedly, our hero noted to himself that the uvula was divided into two. Lee Soo-hae knew that he was reading something like that, while Baruta was saying that it was likely a result of a congenital disease that caused the weakening of connective tissue. Concentrating, the resident stared at one point, trying to remember something. Just when an idea came to the guy's mind, he heard a voice asking where the patient was. A large guy was looking at our hero, and next to him were some other young residents. Standing up from his seat, our hero asked in a calm tone whether the guys from the thoracic surgery department had arrived, although he himself knew that this was so. The young man thought to himself that he had come across this upstart, but he introduced himself out loud and stated that he had been told that there was a suspicion of aortic dissection. At that moment, the artificial intelligence noted that this guy was jealous of our hero. But the resident had no time for this, and so he immediately got down to business when asked whether a transesophageal ultrasound had been performed. Smiling, Lee Soo-hyuk calmly replied that he was doing a classic study. The surgeon immediately began to say that in order to accurately establish such a difficult diagnosis, it was necessary to carry out this manipulation. But the resident probably did not know this. He added that the second-year student should have first called specialists from the cardiology department and not called them straight away. The guy defended his position, saying that aortic dissection is obvious, and according to the rules, it is necessary to do a CT scan as quickly as possible and send the patient to the operating room if the echocardiography showed an accurate diagnosis. The colleague thought to himself that he had been wrong to pick on this young man. After all, everyone had told him that he was a genius, but other residents had come with him, and he needed to avoid embarrassing himself in front of them. Starting to shout, the young man declared that everything was correct according to the rules, but how could a repeater have such confidence, especially since the patient was only 18 years old? The other residents understood that their cardiologist was wrong, and they remembered how during rounds with Lee Hyun-jung, his son, as everyone assumed, always looked at the echocardiogram and therefore could not have been wrong. Our hero was silent but smiled, realizing that he was still right. For a while everyone was silent. The patient looked attentively at the doctors. Each of Lee Soo-hyuk's colleagues had their own opinion on this incident. Unexpectedly, our hero explained that the patient had hypertelorism, an increased distance between paired organs and bifurcation of the uvula, and given the dilation of the aortic roots, only one syndrome remained under suspicion. Only with it, aortic dissection is a fairly common occurrence, and this is the most common cause of death. Looking at each other, the first-year students tried to understand what syndrome they were talking about. The cardiologist, looking down, forced himself to think about what the young man was hinting at, and he simply stated that everything was correct. This was exactly the syndrome that everyone was thinking about, fully understanding that no one even roughly understood what they were talking about. When asked, our hero was reluctant to say the title, hearing his angry colleague asking if Lee Soo-hyuk thought he didn't know the title. Playing the role of an unfortunate guy, the young man noted that he was simply confused about whether he was pronouncing the name correctly and therefore wanted an older man to tell him how to pronounce the name correctly. The orderlies realized that their boss was in trouble, and so one turned his head away, while the other thought to himself about why he had gotten involved in this at all. At this point, the Baruda complimented his master by telling him that he was holding up well, hearing that it was all thanks to him. Suddenly, the artificial intelligence started talking about the fact that maybe this circus was enough, because the guy wouldn't argue with this person forever. Judging by the rumors, there was a high probability that he would stay to work in the clinical department. Taking a deep breath, our hero decided that his assistant was right, and so said that it was Loeys-Dietz syndrome, asking again if he pronounced the name correctly. The colleague stated out loud that everything was correct, but thought to himself that he had once heard something similar from the professor. In a friendly tone, Lee Soo-hyuk asked if it was right that the patient needed to be moved to the operating room as soon as possible and have a CT scan, hearing that it was. The guy thanked his colleagues, noting that if they performed the operation, he would also do everything to help and provide information related to this disease. Our hero's opponent turned away. He could not believe that the diagnosis could be made based only on the images. Baruda immediately asked why the young man asked about advice, since this man didn't need it, and he replied that of course it wasn't needed, since the professor would be conducting the procedure. He added that the assistant should have known that the thoracic surgery department at their hospital was one of the best in the world, and it was all thanks to Lee Hyun-jung. Suddenly, Ha-yun, whom he had completely forgotten about for a moment, addressed the young man. Embarrassed, the girl began to say that the resident was so cool and immediately asked about the syndrome. Lee Soo-hyuk blushed. He didn't believe that this beauty could like him, although he was pleased to hear such words. Looking at the brunette, the guy thought that she graduated from university with honors, works well, notices everything, makes appropriate notes, and is also careful and precise in everything. And such a girl like the most ordinary resident. Answering the beauty's question, our hero said that this syndrome is somewhat reminiscent of Marfan syndrome, but much more serious. After that, Ha-Yun began to ask why this disease occurs. Realizing that there were a lot of people around, Bruta said that this was not the place to stand and talk in the middle of the department. Moreover, if you stand there and just waste time, the intern will feel uneasy. Suddenly, the young man asked the girl if she needed to continue working and if she was afraid to work in the ambulance, hearing that her working day had already ended. In an awkward tone, Ha-Yun noted that the resident had already started his day off, and she had called him to a patient, but the young man only shook his head, saying that there was nothing wrong with it. Moving along the corridor, our hero noted to himself that his friend was trying to adjust her step to him, which meant that she was very good. The artificial intelligence noticed that she was wonderful, but don't fool yourself. And then he said that the owner's face turned red, and therefore, from this nuance alone, a lot can be understood. Hearing Li Hu-seik say that he naturally had such red cheeks, Baruta angrily shouted that it was complete nonsense. A minute later, the young man asked his assistant to be quieter, although he did not understand why this was necessary. The girl walking next to him addressed her friend by name. And then she asked what the young man was doing in the evening. Baruta knew that Ha-Yun and Lee Soo-hyuk were destined to be together. If the owner was treated well, it meant that he was treated well, and vice versa. If the guy was scolded, it was the same as scolding an artificial intelligence. The young man said that he had no plans. He just wanted to unwind a bit. And so the girl asked if her colleague would like to have dinner with her because she herself had not even had lunch yet. Suddenly, Baruta intervened. He said that if the guys were going together, they should listen to him. There was a Korean restaurant opposite the hospital. Lee Soo-hyuk immediately suggested it to Ha-Yun, saying that there were different dishes, everyone could choose according to their taste, and added that the food was a bit bland. The girl answered honestly that she had never heard of such a place, but she thought it was good. And what's more, she liked the short name of the restaurant. The guy didn't understand how his assistant knew about this place, but he explained that he had recently overheard a conversation between the director and the manager, and therefore saved this information. And while the young man was asking why he needed to remember something like that, the artificial intelligence continued to say that the men said that the food there was delicious and they were real gourmets. Baruta added that he would give advice, since he had analyzed all the TV series and films that were in the owner's head, although the young man immediately recalled last year's unpleasant incident. And while the assistant was explaining something, our hero, like his friend, managed to change clothes and were ready to go to dinner. The boys were silent as they walked down the street, which was awkward, so Lee Soo-hyuk turned to his assistant, asking him to give him at least some advice. Time passed, but the conversation did not go well. The young people walked side by side, but each seemed to be on his own. Suddenly, the assistant said that usually in such cases it starts to rain, and the guy hugs the girl. At this point, Ha-Yun said that they still hadn't finished talking about Loeys-Dietz syndrome, which she wanted to know more about. An artificial intelligence that saw its owner talking about diseases thought that if an ordinary person on a date talked about genes, they would simply run away from him. But it seemed like this statement was not about Ha-Yun, who continued asking questions. The guys got so carried away in discussing this syndrome that they forgot that they were not at work. The girl was interested, and therefore was ready to hear about it again and again. Hearing that there might be aortic torsion, Ha-Yun sadly noted that in this case the prognosis is not very encouraging. And while the guy was saying that everything wasn't so bad, since there was a great treatment available, a restaurant appeared on the horizon. At this point, the artificial intelligence jokingly stated that it doesn't even notice how time flies around young people. Returning to the hospital, Lee Soo-hyuk told his assistant that they had dinner together, and then he walked the girl to the dormitory. Baruta said he couldn't do the analysis because once the genes were mentioned, it would be the end of it. It would be the norm. The young man didn't understand why the artificial intelligence didn't like it, because the atmosphere was good. Ha-Yun was happy, and he happily declared that he himself was sure that this was indeed the case. Although the assistant immediately said that it was better not to expect too much anyway. And he added that the owner has problems with his leg, and this is very disadvantageous for a relationship with a girl. Looking at his legs, the young man agreed with him, and the Baruta noted that he continues to search for research materials related to the leg, but at present, treatment is not yet possible. The artificial intelligence said it was worried about Lee Soo-hyuk getting burned. After that, he began to give a long lecture concerning unhappy love, as well as what happens to people after that. The resident didn't want to listen to this anymore, and so he said that he understood everything perfectly well himself. They were just friends. Sitting down at the computer, the young man wanted to figure out what the CT scan had actually shown, realizing that he was right, and after the operation, it would be possible to say for sure. At that moment, our hero thought about how the operation was going. Lee Soo-hek really wanted to be in the operating room. He knew he could do it, but he felt uncomfortable walking there with a stick because it could be very distracting. At this point, the assistant said that if the aorta had dissected so much, a reconstructive operation would be necessary. Usually, such manipulations take about 8 hours. Realizing that this was a long time, our hero decided to sleep. Despite the fact that the rays of the bright sun fell on the guy, he still continued to sit with his eyes closed. Suddenly, someone addressed the young man by name, and so he immediately opened his eyes. Sitting on the bench, the young man saw his mentors, as well as Ha Yun, who was standing next to them. Lee Soo-hek didn't understand what these people were doing together, and they in turn didn't understand why he was sleeping on the bench. With joy in his voice, the resident explained that he himself could not understand it. Looking ahead, the guy fell silent. It seemed that something was bothering him greatly. As he walked towards his colleagues, the young man heard a question about what had happened to him. At this point, the assembled group began to discuss some game in which someone was constantly cheating, which was the wrong tactic. At this moment, the director invited our hero to play golf with them. And although at first the guy was not ready for this, after a moment he said that he wanted to try at least once, believing that it was very interesting. Suddenly, Lee Soo-hyuk opened his eyes, realizing that he was lying in bed. Having risen, the young man said out loud that it was just a bright and colorful dream that had nothing to do with reality. After this, the guy fell silent, realizing that the Baruta was not with him, and therefore there was no one and nothing to say. Looking down at his feet, the young man thought that if he had sat a little further back then, if he had chosen not therapy, but a completely different department. But after a minute, our hero began to smile, telling himself that this was not so, because then he would not have met the Baruta. Some time passed, and the resident was already sitting at his desk, looking through something on the computer. The guy was interested in the operation, and judging by the records, it ended about 3 hours ago. The artificial intelligence that was nearby was carefully reading something, but was silent. However, instead of telling him what interested him so much, he asked what was happening to the young man. A minute later, the resident began to smile, although he did not explain anything. The guy said that Baruta didn't say anything when he was sad. Perhaps he was becoming nicer every day, although he replied that the results of the operation were more important now. But realizing that the work could not be postponed, Lee Soo-hek decided to return to the notes. Suddenly, the artificial intelligence said that 6 centimeters of the ascending aorta had been restored, and the valve had also been restored, and other important details had been made, which means that Taiwan is the best clinic. Our hero, in turn, said that cardiologists determined that even with the naked eye, the expansion of the aorta was visible. The young man was worried that there was still no record of the genetic test, although Baruta said that this was normal, since the operation was only completed at night. The young man decided to leave a note just in case so that no one would forget about it. At that moment, someone behind our hero coughed loudly. After reading about Loeys-Dietz syndrome, the director asked if they really had such a patient, although Lee Soo-hek was sure that the boss would be the one to perform the operation. The resident looked closely at the manager, not knowing what to say to him. However, the expression on this man's face clearly indicated that he should be the first to know about such cases. Our hero immediately said that he was going home and saw this guy and made the diagnosis based on the survey. Moreover, during the operation, it turned out that the dissection was almost along the entire length of the ascending and descending aorta. Hearing that there were special signs on the face as well, Lee Hyun-jung thought about it. The orderly also did not know what else he could say, as did his assistant. A few minutes later, the secretary was already talking to the director. The woman said that the man had a meeting scheduled at the outpatient department today. Hearing Lee Hyun-jung say that they should start without him, the assistant said that it was simply impossible that they would discuss it without him. The manager continued to note that his presence would not change anything, but to himself he thought that he would nod off again. And he added that finances should be handled in the business planning department. Why talk about money in the outpatient department? He has no time, so he goes to deal with important patients. Knowing that the secretary could be bribed, Lee Hyun-jung said that he would buy her ham and mozzarella sandwiches and bring her coffee. After this, the man quickly hung up, saying once again that he had a lot to do. Suddenly, there was silence in the room. The doctors looked at each other. Although a minute later the director asked to take him to the patient, Lee Soo-hek began to explain that the guy was not with them, but in the thoracic surgery department, because as it turned out, the operation was performed there. The man didn't want to listen to this. He said that they had performed the operation and cardiology or therapy would take care of the rest, because no one looked after the sick better than they did. Moving along the corridor, the professor told him to show the way to the young man. Hearing that the young man was on rounds, which Lee Hyun-jung had completely forgotten about, it seemed to him that his adopted son had already grown to be a specialist. With some resentment in his voice, the young man said that he was supposedly the son of the manager, but the manager was not at all interested in him, hearing that Lee Soo-hek was doing just fine without him. Cho Tae-jin, answering the director's call, heard a question regarding his whereabouts. The happy doctor said that he was going on rounds with the director's son, adding that rounds with his participation go very smoothly. But a minute later, there was no trace of joy left, as Lee Hyun-jong announced that the professor would be making rounds himself today. The young man immediately began to be indignant, saying that this was not the way to act, but the leader insisted. The man didn't like his subordinate's attitude, so he started saying that Cho Tae-jin was starting to get impudent, just like Shin Hyun-tae, and so the conversation was over. With joy in his voice, the director said that everything was settled, and therefore we could go. Continuing to move along the corridor, our hero told in more detail how he guessed the diagnosis. The boss didn't understand why they didn't order an examination right away, and so he said that since people were coming to them, the symptoms couldn't be ignored. The boy was silent, and the Baruda forced his master to listen attentively to every word of his name father. And while the man was talking about statistics, the artificial intelligence said that personal experience was important, not general statistics, which it did not follow. And Lee Hyun-jung, who loved to tell various stories, immediately began to talk about the differences in symptoms. Realizing that the resident was actively supporting the conversation, the director asked if the young man was also obsessed with evidence-based medicine. And he added that if you think about it, he is also a supporter of it, but you need to be able to sometimes take a step back and look at the whole picture. After that, the boss asked if Lee Soo-hek had a fever, he would immediately run to the ambulance, hearing the answer that he would first take medicine. Next, if the symptoms still persist, go to the local clinic. However, if the temperature is above 40 degrees, of course, call an ambulance immediately. Finally, it dawned on the young man, and he said that the difference was in the degree of symptoms, especially when it came to Taewa Hospital. Lee Hyun-jung said that usually they try not to go to their hospital right away. If a person came to them with dizziness, it means that his symptoms were very different from the usual. And he added that the resident had seen a patient with autolithiasis when he was an intern. He was constantly vomiting. But not everyone has such symptoms. Most people just feel dizzy, and they all go to a regular ENT doctor, and only a small part comes here. Lee Soo-hek looked at the mentor carefully, as did Baruda, who was recording everything into the database. The director continued to state that if a person had already come to them, it meant that he had something serious, and if this was not taken into account, the patient could be lost. And while the guy was saying that one could learn a lot from the manager, the junior medical staff looked at something in amazement. The nurse who arrived first asked what Lee Hyun-jung was doing, and he replied that he had come to visit a patient. He added that he wanted to visit the one who had suffered an aortic rupture. The employee explained that the operation was completed at dawn and that they were currently finishing cleaning up. Not much time passed and the doctors were already in the ward. It seemed that our hero was amazed and at the same time confused. The AI asked if the young man hadn't seen such cases when he was an intern, hearing that it wasn't his patient last time. Baruda immediately realized that the resident was experiencing completely different emotions. Suddenly, the director asked if a genetic test had been done, but the nurse said that no such order had been received. The employee heard Lee Hyun-jung's order to do this, but she didn't understand how she could bypass the attending physician. The manager said he would take responsibility and immediately said that we needed to contact the Social Security Service, understanding that he would sort out the financial part of the issue. After thinking for a moment, the director asked why they didn't make an angiotensin inhibitor, since he had seen this entry in the notes. The nurse explained that the attending physician was sleeping, and therefore he had not yet had time to do anything, and the patient had been brought in at 5 in the morning. With anger in his voice, the professor said that there could be no excuses. The doctor must first examine the patient and then prescribe treatment, and therefore the medicine must be given immediately. Once again, the frightened employee asked how she could do this without records. Lee Hyun-jung said that the doctor was sleeping, but he is a professor of cardiology and knows this disease very well. If you don't give an injection, there will be a relapse. The embarrassed girl, with some resignation in her voice, declared that everything was clear to her. As he was leaving, the man asked if it was true that the samples had been sent to the pathology department and had been sent from the operating room, but the woman asked if the samples hadn't been taken from the intensive care unit. The director gave the nurse another order and told Lee Soo-hek to go with him to the pathology department. Looking after the men, one of the employees said that it was not for nothing that there were rumors that their boss was strict. Hearing that when Professor Wang was in the department, there were clashes every day. There was no boxing ring in the department, but they were constantly swinging their fists. The young employee couldn't believe that this was actually true. And then she asked what her partner would do. She would probably wait for the attending physician, but she said that she decided to do as the director ordered her. And a moment later, she added that Lee Hyun-jung often did the wrong thing, but he was a first-class doctor and had never made mistakes in his medical conclusions. It was not for nothing that he was called a genius, and therefore one should do as ordered. Our hero thought that his adopted father wanted to find samples from the emergency room, but he said that he wanted to look at the patients, which was strange because there were no patients in this place. The man asked Cholen to open the door and show them some samples. He said that there was a meeting going on, but the manager said that he would call while the meeting was going on. The young man watched everything that was happening carefully and smiled. The orderly heard the employee give up, saying that he would open it now, and Lee Soo-hek at that moment thought that before him was an outstanding person in every sense. Although Baruta assumed that the man became director because he fought better than everyone else, which could well be the case. Coming out of the office, the man said that they were currently having a meeting. With his arms folded, Lee Hyun-jung said that his colleague had probably forgotten who had helped him publish an article in a famous scientific journal, and that instead of going to the meeting, the man was hiding behind some kind of meeting. Hearing the management arguing, Baruta said that he remembers this manager. When our hero was published, this man's name was in the report. The pathology department is distinguished by its depth of anatomical knowledge, and there was also a lot of material on this topic. At the same time, our hero's assistant said that this doctor did not make a huge contribution to anything, although he himself understands this, judging by the conversation. Moving down the corridor, the director said that they had a patient number, they needed samples, and they could look at it themselves under the microscope. A minute later, the men were already standing at the cells, and the manager headed towards one of them. Seeing that his colleague was taking too long to dig around, Lee Hyun-jung asked what happened and why it was taking so long. In his defense, he said that he himself had not looked for the slides for a long time. Hearing his adopted father say something about deep-rooted evil, Lee Soo-hyuk thought that this expression was most suitable for the director. But the artificial intelligence, which this time was on the leader's side, noted that he was a very strong person, possessing abilities and status. Baruta jokingly asked if the young man would become like that when he was promoted, remembering how he loved to give orders and point things out. Realizing that the owner had blushed, the assistant noted that the young man probably didn't want to become like that, although he remembered how he had given orders to everyone. Closing his eyes and blushing again, the orderly thought to himself that giving orders was, of course, very convenient. And Baruta continued to say that he had to be friendly, he would help with his abilities, Lee Soo-hek should just behave normally, then he would be able to rise to the top. The irritated director, realizing that his colleague was dilly-dallying, began to urge him on, saying that they were wasting their time. At that moment, a young doctor appeared behind the men and asked if it was true that the manager wanted to look at the patient's samples. If so, it would be better to go to the laboratory room. Having made sure that the specialists were sitting at the table, the department doctor noted that he would return with samples in a minute, and then he hurried away so as not to keep his boss waiting. Our heroes, who had nothing to do at the moment, saw someone who surprised them. It was the manager, and coming closer, he said that everyone knew that the meetings were not that important and there was nothing to discuss there. The same people gathered every week. With a displeased voice, Lee Hyun-jung noted that despite this, his colleague did not want to open the door for them. The man didn't answer, but simply looked attentively at his boss. And after a few minutes, he noted to himself that Lee Soo-hek and Lee Hyun-jung were the best combination of geniuses in their hospital. The man was interested in what these two were up to. If they were writing another report, it would be a good idea to act as a co-author. Baruta immediately informed his master that the manager wanted something from them, although he himself had already understood it. And he added that he still had to be polite with this person. No matter how respected a Professor Lee Hyun-jung was, he had less than 10 years left until retirement, and by that time he needed to learn to stand firmly on his feet. With some sadness, our hero thought that there was still Shin Hyun-tae, as well as his friend Cho Tae-jin, but they would not be able to hold him as tightly as the director did. That's why it's important to become a professor with connections, because a hospital doesn't rely solely on the abilities of its doctors. The young man was surprised at how Baruta knew so much, but he said that he found out while watching one of the TV series. Although Lee Soo-hek understood that the artificial intelligence was simply obsessed with him, although the assistant immediately stated that the series is a series, but he sees what the guy sees. Suddenly, the director began to explain that they had a patient with suspected Loeys-Dietz syndrome. There were no results of the genetic test, and therefore they wanted to look at the samples. The surprised head of the department thought that this was a case for a report, but Lee Hyun-jung said that not every topic requires a dissertation, but that this case was very interesting. This disease has been known for a long time, and therefore it is not so difficult to determine it. After this, the man fell silent. Our heroes also did not know what to say in this case. The colleague thought that he would still have a unique chance, remembering how, as a resident, thanks to the director, he was able to become a full-fledged professor. Moreover, he would like the leader's adopted son to become the same. The artificial intelligence, noticing the falseness in the man's eyes, declared that he was trying very hard to be polite. After some time, the samples were delivered, and so Lee Hyun-jung asked the young man to adjust the microscope, saying that he was not very good at it. Our hero also had problems with this, but the assistant told him to smile, noting that he would do everything. However, the head of the department, who was very skilled in handling such a device, had already volunteered for this role. Just looking through the microscope, the man was surprised. It seemed that he saw something unusual there. At this point, Lee Soo-hek spoke up, noting that this was a cross-section of the aorta, and some abnormalities were already visible. He added that the microscope magnification is now 40 times, and to begin with, he will try to increase it to 400. And then he said that the medial myxoid degeneration is very clearly visible. Lee Hyun-jung immediately asked if the resident had made a mistake in his assumptions. And while our hero remained silent, the head teacher did not understand how it was possible for a second-year student to say everything so accurately. The man wondered if he brought all the residents from the first to the fourth year here, would anyone be able to determine so quickly and accurately what this man had found? Definitely not, because he guessed even faster than the professor. Looking at the director, his colleague said that the young man had identified everything correctly. Lee Hyun-jung laughed as he said that his protege understood pathology. Hearing the surprised professor ask if the director had taught him, but he said that he himself knew nothing about it. This was impossible, which the leader himself understood, and therefore said that his protege was a real genius. Not much time passed, and the men were already moving slowly along the corridor. The director said that he didn't think that this syndrome could be seen so easily. The young man agreed with him out loud and thought to himself, he checked everything that needed to be checked and immediately left, without even looking back. And while the director continued to note that the disease was curious, the resident said that the prognosis was not entirely good. Lee Hyun-jung himself understood this, and therefore said that he did not know how things would go further, but it was necessary to quickly make a diagnosis and prescribe treatment. After answering the phone, the boss said that he had to go to meetings again. Suddenly, the man stopped and swore loudly, which amazed and shocked our hero. The director asked if he had told Lee Soo-hek that he had been sent confirmation regarding the boy's trip to the States, and he added that Shin Hyun-tae was supposedly planning to go next month, and that's when the young man would go. Suddenly, our hero screamed, "How is this possible?" It seemed that he had never been so surprised by anything in his life. The manager didn't understand this reaction, and the guy explained that they were talking about August, not spring. Hearing that the young man had even planned his vacation around this event, Lee Hyun-jung stated that he would have to rethink these plans because when else would he get the chance to go to the United States? And then the adopted father said that there was no need to worry about anything. The head of the department would decide everything about the vacation himself. Hearing that this person was also aware of it, Lee Soo-hek breathed a sigh of relief, although the leader didn't understand it. Without waiting for an answer, the man said that the young man was leaving in 2 weeks, asking if the boy had ever been abroad. After this, questions began pouring in about his passport and visa, which caused the young man even more surprise. The secretary, who understood that the boss was still not there, called him and asked when he would be there. However, the director said that he needed an assistant, and therefore she should come to them, and not he should go to his office. Lee Hyun-jung told the girl to take the keys to his car and urgently go to the visa center, which surprised the guy even more. Realizing that the young man would be in the States in a couple of weeks, the Baruda asked him if he was looking forward to this event. Blushing, our hero joyfully declared that of course he was waiting. Not much time passed, and the dissatisfied secretary was already standing in front of the doctors. Lee Hyun-jung was angry that the girl became his assistant and began to frown in front of the bosses, and she said that the boss was not fulfilling his duties. After hugging the guy, the director said that in 2 weeks the resident would be flying to the States. He had neither a passport nor a visa and needed the girl's help, and added that the young man had recently undergone a medical examination, so there shouldn't be any problems with that. The secretary asked again what was needed, and the boss said that she could probably solve the issue, although she did not understand why Lee Hyun-jung could not do it himself. And then the manager found a convenient excuse. He remembered that he had a meeting. Having told the girl to take care of the young man, the man walked slowly towards his office. Lee Soo-hek felt uneasy. He wasn't used to having someone bother him, but the secretary said that the director was always like that. And she added that it's actually not that difficult. First, you need to sort out the visa. The guy understood that they needed to go to the embassy, which he said out loud. And at that moment, the girl understood why exactly Lee Hyun-jung asked her for a favor. Suddenly, our hero froze in place and then asked what happened. His current assistant said that she had completely forgotten that the resident did not have a passport, and so she decided that they needed to go to the Gangnam District Administration, where the document would be made in 3 days. And adding that there was just enough time, she pulled the keys out of her pocket, declaring that they would go in the director's car. Going down to the garage, a beautiful white, stylish car appeared in front of our hero. Baruda said that the car was very luxurious, and the young man thought to himself that being a director was good after all. Within a minute, the artificial intelligence was saying that a guy could buy such a car. He should try to become a director at 40 years old. After this, the Baruda said that his goal was to make the owner the best therapist in the world, and therefore one should not forget about this. At that moment, the girl said that it was time to hit the road. 2 weeks later, Lee Soo-hyuk was already packing his things. Looking through the passport, he noted that the document was issued to him for 10 years. Hearing how the Baruda spoke about exemption from the army, the young man thought that he guessed about exemption not only from conscription into the army, but also from civil defense. And all because the injury had a positive effect. And while the artificial intelligence was talking about something, the guy noticed the phone that was ringing. The young man was reluctant to answer since he was not on duty, and moreover, he needed to have a good rest before the journey. Adding fuel to the fire was Baruda, who declared that no one could call Lee Soo-hek, which angered the young man, who did not leave his room because he was constantly studying. The assistant, defending himself, stated that even before his appearance, the resident had no friends. Realizing that it was An Dae-hun calling, our hero decided to answer, knowing that this man was a kind person and respected the young man. Before starting, the first-year student apologized several times and then asked if the boss was sleeping. Our hero thought that the problem was with the patient, but his colleague noted that this was not the case at all. Suddenly, An Dae-hun announced that their fan club had prepared a farewell gift for the resident, which surprised the young man. The first year added, they are currently in front of the duty room. They would be grateful if Lee Soo-hek would go out into the corridor for a while. If he doesn't want to, then the souvenirs will be lying by the door. The embarrassed hero said that there was no need to leave anything. It was not difficult for him to get out. As he moved towards the door, the resident thought that his colleague had opened this fan club after all, but it made him feel so uncomfortable. Baruda said that in An Dae-hong's eyes, the guy looked worthy of respect. The young man understood that he had managed to save everyone he had taken on, but that was only an indicator for 1 month. Opening the door, our hero saw in front of him the guys with whom he communicates best. Lee Soo-hyuk couldn't believe his eyes when he saw Hyun. Pointing to the girl, the first year said that she was the deputy head of their fan club, and the brunette noted that for now there were only 2 of them. It was amazing, and it really struck the young man, who certainly didn't expect this. The brunette said that the state of Iowa was a village. It could be boring there in the evenings. She knew that she was in school. The young man worked part-time in a comic book store, which he really liked. And she added that she had bought a few interesting stories and therefore wanted the guy to read them. Although Baruta had said that he needed to read dissertations, not some stories. After that, Andahong came up and noted that the resident knew English well, but he decided to buy him a phrase book that might come in handy. Taking the gifts, Lee Soo-hyuk smiled sincerely. He felt proud, but at the same time embarrassed. A minute later, when the guy regained his gift of speech, he thanked his friends for such wonderful gifts. The next day, the young man was already sitting at the airport, waiting for his flight. While reading the comics, the young man said that these were very interesting stories which, unfortunately, he had not read for a long time. Our hero thought that the guys were trying so hard to please him. Perhaps he had something to hope for. And while the Baruta was saying that Ha-Yun was strange, the intern continued to think about receiving a gift from this girl, although he could not imagine such a thing. The artificial intelligence added that a lot had happened during this time, but the guy did not understand what was meant. But the assistant said that he wanted to check the mental state of his master in order to give him advice. The young man didn't like this, and so he suggested going to registration. Suddenly, the AI asked Lee Soo-hyuk if he regretted coming to therapy. At this point, Shin Hyun-tae was saying that he was wondering how his ward was doing, hoping that he hadn't taken off his shoes at the entrance to the plane. The director stated that the boy was not a small child, but the head of the department noted that he was simply worried about the resident, since many things were probably new to him. Lee Hyun-jung stated that there are no students who live in such difficult conditions as this young man. Only recently did people find out that he was from an orphanage, and then he injured his leg. The guy is smart, but the circumstances in his life were not the brightest. After that, the manager asked his colleague if he thought that Lee Soo-hyuk's strong point was in his brain, but the director said that he didn't see anything else for now. Although he immediately said that if you think about it, in such difficult conditions the young man was able to enter a medical university, then he injured his leg. Maybe some kind of shadow hung over him. The man believed that his ward would get everything he wanted. Standing in the hall, the young man asked the assistant if he had been worried about this all this time. But Baruta only said that he was simply concerned about his master's mental state. The AI said that it needed to make the guy the best therapist in the world. It couldn't let the resident stop halfway. Our hero said that the thought of giving up everything sometimes crosses his mind, especially in the mornings when he sees his leg. But still, now he can dream of becoming the best therapist in the world. So what regrets can there be on this account? The assistant decided not to say anything. He just smiled. And then he said that we shouldn't forget that while he is here, everything can become reality. Realizing that the conversation had dragged on for too long, Lee Soo-hae said that now was the time to go to registration. The empty podium in the large hall indicated that a speaker would soon appear on stage. The doctors talked among themselves, asking each other what the meeting was about, and that there were practically no free seats. Someone said that Lee Hyun-jung's performance was simply great, and those who don't listen to him don't even have the right to call themselves doctors. Others added that the meeting was dedicated to the internship report, and it seemed like everyone was in for another travel story, although last time they talked more about going to various restaurants. Cho Tae-jin thought about the fact that clinical residency would now only last 1 month. Our hero's friends looked at the stage with bated breath, expecting something. Suddenly, Shin Hyun-tae told everyone present to welcome the man who had returned from a month-long internship at the University of Iowa. And he added that this was the well-known doctor Lee Soo-hyuk. Baruta asked the owner with joy in his voice if he was ready to break the scene. Within a minute, the guy came out on stage, introduced himself, and started talking about who he was. The young man continued to note that in his speech, he would talk about his experience of studying in the USA, adding that no one would be bored. He guarantees that. Just a month ago, our hero found himself in the small state of Iowa, which many compare to a village. Stepping onto the stone sidewalk, Lee Soo-hyuk thought that although this university was located in a very quiet town, somewhere in the middle of the states, it was still quite prestigious in the country. If we look exclusively at medical schools, this particular one is among the top 10 medical universities in the United States. Having flown many miles, the young man was standing right in front of this establishment at that very moment. However, the delight was replaced by some sadness, since the building turned out to be very low, And the Baruda also added that it looked somehow old-fashioned. There were no people on the street either, although, considering that it was Sunday, this could well have been the case. The guy honestly said that watching it like this in real life, he somehow gets scared. At this time, the stranger told the girl that if she went on an internship, she would be able to have fun while away the time. She only added that Eva and Chicago are close enough, so you can safely go to the city every weekend. The young man stated that such an internship is something like a reward, and therefore it is necessary to take advantage of the moment while you can. Lee Soo-hyuk, who witnessed this conversation, thought that it seemed like the guys had already been sent to this internship. If you fly somewhere, you won't be able to just have fun. You'll have to try and gain knowledge in order to go again. After some time, our hero approached a small house and stepped onto the threshold. Opening the door, the young man noticed that it smelled of dust. Baruda added that it seemed like there was mold in the room. People with weak immunity could get sick in no time. The guy said that it was far from an assassination attempt, and the artificial intelligence said that its owner's immune system was in perfect order, so there was nothing to worry about. Having looked around the clean and cozy kitchen, the young man noticed that the house was quite large. It looks like everything you need is there. You can, of course, do some cleaning, but it will take a lot of time. As Lee Soo-hyuk boarded the bus, he thought about how supermarkets closed early and that he needed to stock up on groceries. Our hero knew that the university in the state was the leading organization, and the assistant added that this is why they had to travel so far, since the infrastructure was not very well developed. Looking at his watch, the young man thought sadly that they had been driving for half an hour already. Finally, the young man realized that the university was right in front of him, which made him a little happy. Baruda immediately added that all the buildings that were in front of the hospital were very similar to these, and if you think about it, it's quite logical. The guy was in anticipation. He hoped that he would learn something new in this place, hearing how the artificial intelligence said that it was not in vain that they came here. The next day, while walking around the university hospital, Lee Soo-hyuk thought that there were 2 research centers here, and not using them would be a big mistake. Our hero's assistant said that everything was in one building, and the building was constructed thanks to Pfizer. It is clear that this pharmaceutical company financed the construction, and a lot of money was spent on it. The young man was so engrossed in thoughts about the therapeutic department that he didn't even hear anyone addressing him. The old man came close to Lee Soo-hyuk and said that it was his first time with them. The astonished young man immediately confirmed that this was true, saying that he came from Korea. The doctor asked a strange question about which Korea exactly the guy was from, but he didn't get flustered, saying that, of course, he was from South Korea. Baruda immediately said that he needed to get an autograph from this man, because he was Dr. Commons, a well-known specialist in otolaryngology circles, and our hero immediately remembered that his name often appeared in textbooks. A minute later, the resident asked the doctor's name. He was surprised that they knew him and asked a counter question about whether the young man was an otolaryngologist. Lee Soo-hyuk said that he was a therapist, but he was interested in otolaryngology and added that he was going to arrive at 10, but wanted to take a quick look at the hospital, so he arrived early. Smiling, the doctor said that it was immediately obvious that the guy was Korean because he was punctual. Kamins, proud of being recognized, offered to show the young man all the most important things, which flattered our hero very much. Turning around, the specialist said that the young man had good English, although his pronunciation needed some work, but his accent was not bad, and the young man spoke fluently. While Lee Soo-hyuk thanked him for the compliments, Baruda gloated, noting that the guy had spent a long time learning the language. At the end of the tour, the young man said that it was interesting, and the Baruda immediately added that the pizza here was delicious, but it was only sold at lunchtime. As he left, the doctor said that it was time for him to go to the outpatient clinic, but they would see each other again, and finally asked the intern's name. The man said again that he understood everything and wished the newcomer to their hospital good luck. Looking after this specialist, our hero thought that on the very first day, such a great man helped him get settled in. And moving on, he continued to reflect on the fact that he had some kind of good feeling. A minute later, the young man met a blond man who asked who Lee Soo-hyuk was, and he immediately explained who he was. Looking sadly at his colleague, the young man said that he understood everything. And a moment later, he muttered under his breath that it was a shame that in 1 month, those who arrived had not really learned anything, but everyone continued to come from their backward countries. The frightened guy didn't understand what the blonde was whispering, but the Baruda studied the movement of the lips. Suddenly, the artificial intelligence fell silent and its eyes widened. The assistant immediately repeated all the words that his American colleague had said. Baruta was angry. He shouted how this man had the right to call a country backward that created such a great mind as him. And while the artificial intelligence continued to be indignant, the blonde asked the guy to come up to him, asking if he spoke English. Lee Soo-hyuk stated that he spoke perfectly well, while the stranger remarked that it was the first time he had seen an Asian so confident in his to speak English well. A minute later, the man finally introduced himself, saying that he was a third-year resident and his name was Steve. Before he could say his name, our hero heard his new colleague ask him to follow him. At that moment, the young man's assistant remembered that the director had mentioned this Steve in his letter. Both of this doctor's parents are employees of the University of Iowa. They have lived here all their lives in the state's usually high school, university, hospital. Everything changes. He is just a country boy. Our hero understood that, having lived his whole life in one place, his horizons would hardly be broad. And the Baruta continued to be indignant that they looked down on him. Taking a deep breath, the guy thought that he just came here to study. But if he was treated with such disdain, he did not finish the sentence, because the assistant said that he would not leave it that easily. He added that they would see what a doctor would do with a doctor from a backward country, although Lee Soo-hyuk assumed that they would definitely not kill him. Entering the chief's office, Steve immediately introduced the resident who had come to them for an internship. Upon seeing this man, our hero immediately realized that this was Lee Hyun-jung's friend, whom he constantly praised. And he remembered that this man even changed his schedule a little so that their meeting could take place. The professor thought to himself that he looked like a very ordinary young man, and then said that his name was Allison. Hearing the doctor say that their system and the Korean one were very different, and therefore they would have to learn a lot, the young man was very happy. He said that before his arrival, he had read many of his research works, and therefore it was a great honor to meet him in person. And he added, for example, this is a December article published in an American collection on cardiology, which is called and fell silent for a moment. Baruta immediately suggested that these were factors in the development of cardiovascular diseases in the next 5 years, and it was she who had a great influence on the guy. Our hero thought to himself that it was almost impossible to understand the characteristics of professors in university hospitals, but if they all had one thing in common, it was that they adored the readers of their articles. The surprised professor asked again if it was true that Lee Soo-hyuk had read this work. The guy enthusiastically said that there are not many scientific papers containing 100,000 characters, and added that Ellison's work examined such a wide range of variability. The man liked the compliments, but he honestly admitted that this work took a lot of his time and energy. At this time, a man was sitting at a computer in some room. The professor immediately explained that they had a laboratory there, and when time allowed, he would show everything to the resident. Hearing that it would be an honor for the young man, the doctor said that he had to undergo an angiography, and therefore it was time to go. But before leaving, he asked Steve about our hero's schedule, and he immediately said that he had been assigned to personally supervise the treatment of patients by Dr. Hank from the oncohematology department. After saying goodbye to Lee Soo-hyuk, the professor said that they would see each other tomorrow at the conference. A minute later, the resident had already left the office and entered the corridor. Suddenly, Steve asked if it was true that our hero had read the dissertation only because it was necessary to come to their clinic. And he added that the young man was good, and Professor Ellison was still a bore, but it was already clear that he would definitely not scold the intern. The young man thought to himself that he had already read so many of these dissertations that they were getting on his nerves. Baruta knew that Lee Soo-hyuk had to prove himself, so he insisted that the boy show his worth as a real educated therapist. Entering the office, the blonde said that Dr. Hank would be present personally and, without finishing his sentence, began to introduce our hero. A middle-aged man shook the resident's hand and said he was pleased to meet him. Shaking his hand, the young man immediately said that he would not disappoint the doctor, while the Baruta said that this man reminded him of a bandit. Sitting down in the chair, Hank got down to business and therefore asked where their first patient was, learning that he was waiting in the normal ward alone. The man said that they would then go and examine Mr. Thomas, and while the residents went first, he would have time to study the medical history. Before leaving, the doctor said that he had faith in the intern, but asked him to be careful, to which the artificial intelligence replied that they were real jokers. Looking around, Lee Soo-hyuk thought to himself why there would be so many operating room-like rooms in the outpatient clinic, thinking that this was a distinctive feature of their countries. Entering the ward, Steve met the patient, and our hero did the same. The blond man said over his shoulder to the resident to look at the medical history. Baruda immediately said that there was a suspicion of melanoma, a fairly rare type of cancer. Although our hero remembered that susceptibility to skin cancer depends on a person's race, and added that if you look at it that way, the location of the melanoma itself is quite strange. At this point, Steve said that he wanted to examine the inside of the nose first, and to do that, he needed to administer anesthesia. The young man noted to himself that for the simplest examination, his colleague washed his hands, put on gloves, and even administered anesthesia. And while he was being examined, the guy noted to himself that their hospital is not considered backward, but everything they do is aimed at saving lives, and they care about people's comfort. Steve realized that the patient was not bleeding from the nose, and there was no discomfort in the ears, noting that there was something else that needed to be looked at. After inserting the probe into the nasal cavity, a second later the image appeared on the screen. The guy immediately asked the Baruda if he remembered this color. The assistant remembered it, but decided to check the database to be sure. Steve was looking at the monitor at this time. It seemed that he did not notice anything there. After a while, Lee Soo-hek and his mentor for the day were slowly walking down the corridor. The blonde rubbed his head as if he was in some kind of confusion. Unexpectedly, he turned to our hero and then asked if the guy knew the disease that the patient had, hearing an affirmative answer. A second later, the doctor looked at his younger colleague in surprise, as if he had said something incredible. Looking at the satisfied Lee Soo-hek, he asked him the same question again. The young man explained that he entered the clinic without knowing the diagnosis, since this was his first appointment, then replied that he knew what melanoma meant, but that was not the point. But he sees what is next to this person's nose for the first time, and therefore doubts arise. Steve asked the guy if he had seen anything like this, and he replied that he had not only seen it, but had also read a lot about it. Turning around, Lee Soo-hek triumphantly noted that the patient had extremely characteristic symptoms. After that, the young man began to shout about what a wonderful method of treatment it was, although the blonde could not understand anything. Standing in the office, our hero said that Dr. Steve was very smart, which Hank confirmed. After this, the man immediately asked his subordinate to tell him about the results of the examination. Looking at the frightened blonde, the manager stated that he had conducted an examination, therefore he had come to some conclusions, and they were worth telling about. The young man stated that the patient had melanoma, although Hank said that he knew this himself, since the city hospital sent them an extract from the medical history with the diagnosis. And again, the blond man began to say that the nosebleeds had started about 6 months ago. The congestion had appeared a month ago, but the boss didn't want to listen to this, since he himself knew all this. A frightened Steve said that he also found melanoma in his nasal cavity. Their size is about 2 centimeters, and he does not know the thickness. Hank shouted with anger in his voice that the most important thing was the thickness, but that was precisely what they hadn't checked. Putting his feet on the table, the doctor asked about the prognosis of the disease. Embarrassed, the third-year student began to say that, in his opinion, the prognosis was favorable if the melanoma could be removed. The director started cursing again, saying that the attending physician had not even been able to study the patient's medical history, and he only made excuses, saying that he would study it at the first opportunity. Getting up from his seat, the man added that in September the boy would already be a fourth-year student, but he had not learned anything new during that time. At that moment, Hank's attention fell on our hero, whom he had completely forgotten about. The specialist thought to himself that this guy didn't know for sure, but it wouldn't hurt to ask. Opening the door, the doctor heard that melanomas in the inner nasal cavity are a rather rare disease. Until recently, they were considered more of a case from practice. Suddenly, Hank turned around and looked closely at the intern. The guy smiled because he answered even the questions that he was not asked. And it is interesting that he even came up with a treatment method. Lee Soo-hek was so pleased that he was able to stand out and show what he knew on the very first day of his internship. A minute later, the guy said that there were now enough cases from practice, so now it was not such an unknown disease. Nodding his head, our hero's immediate superior said that this was so, and asked him to continue his explanation. The resident added that melanomas spread from the left side of the nasal cavity, which is a typical picture of development. According to the medical history, the bleeding began 6 months ago, which means that the disease began to develop at that time. Hank was very surprised by how confident Lee Soo-hek was. It seemed to him like he was reading a report. And the young man continued to say that the depth of melanoma cannot be determined by eye. It would be good to do an MRI before taking a biopsy. Luckily, the city hospital did not take a biopsy from the patient, so they will be able to take intact tissue, adding that the biopsy results will need to be removed from the operating room later to prevent artificial metastases from appearing. Steve, who was listening to this story, could not believe that the intern could know about something like this, considering that even he did not know. A minute later, the young man added that these melanomas were not formed under the influence of ultraviolet rays, and therefore the prognosis is not very positive. The resident said that it was good that the patient was under 60 years old, because it was during this period that the disease manifested itself. But if we turn to all existing cases, he fell silent. But then he went on to say that the chance of survival over the next 5 years is only 40%, and therefore our hero believes that the patient should know about this. Looking at the guy in surprise, Hank asked him again to state his name. Smiling, the young man joyfully said his name, hearing the Baruda nearby shout out his own. A few minutes later, the director was trying to remember who from Taewa Hospital was the most frequently published, hearing the hint that it was Professor Cho Tae-jin. Answering the boss's question about whether our hero was in his 4th or 3rd year, he proudly declared that he was a 2nd-year student. Clutching his head, the man could not hide his emotions, and therefore shouted that this was something incredible. After this, the doctor asked what the young man was doing on the weekend, and upon hearing that he was resting, he began to say something about tactlessness. And then he announced that there would be a small party on Saturday evening where the therapists from their hospital would be, and so he invited the guy to drop in on them. Surprised, the resident wondered if he was really being invited to an American party. For a moment, the young man thought he decided that if he could make friends with the Americans, he immediately fell silent. But at that moment, the Baruda declared that this party would surely have a lot of delicious food, including barbecue, meat, and other delicacies. Suddenly, our hero stopped himself, saying that it didn't matter, and Hank said that everyone was cooking very tasty, and therefore it was definitely worth a visit. Moreover, he could let Lee Soo-hek down. The doctor added that he would introduce the guy to other doctors after hearing gratitude for both the invitation and the new acquaintances. After some time, our hero enjoyed a huge and juicy burger, which you definitely won't find in Korea, at least not of this quality. Baruda, watching his master eat with gusto, closed his eyes with pleasure. Hank said it was all very cool, although the guy claimed he was speaking according to protocol. The man jokingly said that it seemed like the young man knew the entire protocol for oncohematology by heart, adding that he specializes in a non-standard type of cancer, and protocols on this topic are constantly changing. Residents are completely unable to keep up with all this, but this does not apply to our hero, who would like to work in this field. The specialist realized that the young man had not yet made up his mind, judging by his hints. And Lee Soo-hyuk confirmed this, saying that he is still thinking about it. But the doctor was not going to stop. He said that the resident knew the methods of antifungal treatment very well, although here the guy also said that it was simply out of politeness to the patients that he studied these topics so deeply. He added that the chance of saving a patient depends on how hard the therapist studied. Baruda noted that his master was a wonderful actor, and so began asking where he got such a wonderful script. Having turned on the actor in itself, the artificial intelligence began to loudly complain and shout something. The specialist patted the young man on the shoulder and asked him what his plans were for the evening, but Lee Soo-hek just laughed sheepishly and said that he himself didn't know. Turning to Steve, the boss asked what the interns were responsible for, but he simply stated that there was no afternoon medical practice planned for the first week of the internship. When asked why, the young man said that as an intern, you usually have to get used to the time difference, settle into the hospital, and learn where and what. Surprisingly, many forget the way to the hospital, which did not apply to our hero, who said that he did not need repeated instructions. Realizing that the guy was different from others, the boss invited him to a multidisciplinary conference. This proposal surprised not only Lee Soo-hek, but also Steve, who did not believe that such a thing was even possible. A couple of hours later, cancer specialists gathered in a small conference room to discuss the diagnosis and treatment of a particular patient's disease. As Hank walked towards the hall, he said that he was sure that Taewa Hospital was good enough and that it also hosted conferences. But the countries were different, so there would definitely be differences. First of all, it is about the system because there are 8 professors in the room. Our hero's assistant immediately stated that if you look at the schedule, Everyone speaks for half an hour, therefore the event will take 4 hours. Having moved the chair, the specialist invited the resident to sit down, not on the edge, but between other professionals. I examined the doctors. The guy couldn't understand how they had time to work if they constantly took part in such conferences. Moreover, this is a very ordinary working day. Suddenly, our hero was brought out of his thoughts by a voice that said that the conference was open and they would discuss Thomas, a 67-year-old patient. At this point, the doctors began to talk in unison about CT. Someone stated that the operation was unsafe. Others noted something about otolaryngology. Looking at all this chaos, the young man did not think that this was a joke. This is how treatment planning for all patients happens. On the other hand, Baruda liked the approach because it didn't matter who the treating doctor was, since the best specialists were involved in the discussion. Unfortunately, this cannot be done in Dewa, but it has its advantages. But here, two people had to refuse treatment because their insurance could not cover it. In their center, even if a patient has no money at all, they will not leave him without treatment, all thanks to a system where you can achieve maximum effect for a minimal cost. While the young man was pondering this, the speaker said that next they would discuss Ben, a man of 42 years old. About a year ago, the patient developed a tumor that he often touched. During the examination, his voice changed and he complained of periodic suffocation. The ultrasound results revealed tumors on the thyroid gland, 2 tumors in total, one of which was papillary carcinoma. The woman asked if there was a reason why the tab was not performed on the left tumor and was told that the patient had scar tissue in that area, making it difficult to insert the needle. Those gathered realized that the man had been injured, but the tumor was quite large, and so everyone wondered whether it would be okay to affect the recurrent laryngeal nerve during the operation. The female professor asked not to rush. First of all, she would like to perform a laryngeal resection. Then you can do an endoscopy of the vocal cords. The patient is quite young, works in sales, and therefore there are good chances. Lee Soo-hek listened attentively to everything they said, but the Baruda definitely didn't like it. He shouted that if this continued, the patient would die. Artificial intelligence said that papillary thyroid carcinoma is not a common occurrence. Many scientific papers have been written on this topic. They explain that if the tumor is no more than 1 centimeter, surgery and subsequent monitoring of patients are permitted. Hank folded his arms and wondered if a tumor that size could paralyze his vocal cords. At this point, another doctor suggested performing a complete thyroidectomy. But our hero's boss insisted on watching the video again because he didn't really like the situation. The assembled people turned on the projector, but they were sure that they would not see anything new there anyway. Suddenly, Lee Soo-hyuk raised his hand, which was something very surprising for everyone. Seeing that the owner was scared half to death, the artificial intelligence asked him to breathe, although the resident thought he was in deep trouble. First day of internship and also attending a conference. However, if you remain silent, the patient may die, and this cannot be allowed under any circumstances. Suddenly, a voice was heard behind our hero, asking if it was true that they had already met in the morning. The gray-haired Professor Commons smiled and watched the young man closely. The female doctor asked if her colleague knew this foreigner, but here he only asked to give the resident the opportunity to speak, adding that this young man seemed like a smart guy, and therefore it would be interesting to listen to him. And while the man continued to say that Mr. Hank would not have brought anyone in vain, Lee Soo-hek was glad that someone was already standing up for him. Now Hank spoke up. He explained that they had one patient in the morning. The intern had demonstrated high erudition in the field of oncology, and therefore it would be good to listen to his opinion. The guy was pleased. He thought that luck had finally begun to follow him, although Baruda said that it had been with him from the very beginning of their acquaintance. Before starting, the boy asked to hear the medical history again. Hearing one of the doctors say in an irritated voice that the man had developed a tumor a year ago that had not been treated. The young man wanted to know about previous hospitalizations, but the young man replied that it did not matter, although the resident insisted that it should be included in the general medical history. Embarrassed, Lee Soo-hek asked to read at least a brief summary of everything that was known. The dissatisfied doctor said out loud that he would do everything, but thought to himself that she was on the side of this intern, Kamens and Hank, and therefore he could not disobey. The specialist said that about 10 years ago, the patient was hospitalized with symptoms of fever and enlarged lymph nodes. After this, he was diagnosed with the Epstein-Barr virus and given the appropriate treatment, after which no further illnesses were detected. Upon hearing this, our hero immediately stated that it turned out that he had a history of Epstein-Barr virus. Hearing this, Hank seemed to understand why the resident had returned to this story. But Lee Soo-hek continued to say that if you go back to the video, you can see hypertrophied lymph nodes in the upper left corner of the thyroid gland and their regional enlargement of the second degree. The female doctor thought that the video showed a lymph node, but the guy suggested taking a closer look to see if it was a ruptured thyroid capsule. In papillary thyroid carcinoma of such a small size, capsule rupture is a typical symptom. For a moment, the young man fell silent, but only to say that all this could be an accident, but they were all doctors and even some were scientists. So instead of relying on chance, you should pay attention to factors like these. It would be more reasonable to assume that the cancer that formed in the upper left lymph node penetrated under the thyroid capsule and metastasized deeper. This also explains why the vocal cords were paralyzed. Even such a small size caused damage to the recurrent laryngeal nerve at this level. After listening to the end, another specialist said, "If you think about it, there is something on the video that looks like non-Hodgkin lymphoma. Of course, you can't make a diagnosis based on one video, but it's worth thinking about." When asked whether a CT scan or MRI was done, one of the doctors stated that such procedures are not performed for thyroid cancer. After this, the doctor began to praise our hero, saying that he had not really read the medical history, but had told so much and then asked his name. A little embarrassed, the guy introduced himself, saying that he came from Korea. He then clarified that he was a second-year resident at Taihua University Hospital. After thinking for a moment, the professor realized that truly outstanding doctors worked in this clinic. Suddenly, Hank spoke up and said that the treatment plan had to be changed because surgery would not be possible. After this, everyone gathered began to discuss where to begin the examination, as well as what manipulations to perform after that. Shrugging their shoulders, some professors said that there was a chance that in such a case of papillary thyroid carcinoma, something unusual might be discovered. But even if this is true, everything that was said earlier is not meaningless. What is surprising is that an ordinary resident came to this conclusion based only on a video and an unusual tumor. After some time, Steve, greeting our hero, decided to greet him in Korean. Baruda immediately said that it was not bad, and Lee Sun-hak decided that this man was really trying. Having decided that the pleasantries were over, the young man asked if it was true that he had to visit the pulmonology department today, hearing a satisfactory answer. Smiling, the young man said that yesterday they had just sorted out the outpatient clinic. The day before, Steve had to justify his mistake. He said that it was all about the training system. Their intern was good, of course, but he was not a genius. Hank agreed with this, saying that no matter how successful individual learning is, there is a limit to everything, and the overall system is very important. And he added that, despite the fact that Steve is missing something, this is not a reason to relax. It is necessary to go and study. Having visited the head of the department, Mr. Epps, our hero, again heard a compliment from him. The man said that he had already heard about the intern. A moment later, he added that it was the first time he had seen Hanks praise anyone so much. The professor immediately said that it would be a little uncomfortable, but he would have to put it on, although he did not specify what exactly. A minute later, the doctor handed the resident a thick mask. The guy thought to himself that he felt very stuffy in this mask. Before that, he had only worn the most ordinary masks. Baruda, on the other hand, was glad that they were given these protective masks, saying that in Taihua, they don't think about the health of doctors. Hearing this, Lee Soo-hyuk didn't understand why even an artificial intelligence would need a mask, but he stated that they were almost one. Entering the doctor's office, they asked the man if he had come to the hospital because of a cough. Hearing him say that he had been treated for a year, but to no avail. The patient called the local doctors charlatans, who only dreamed of sending him to the university clinic sooner or later. While Steve was looking through the documents, Baruda said that this man resembled a criminal from a TV series. Lee Soo-hek said that such people in this hospital were most likely not uncommon. Moreover, they had long been accustomed to them. Fortunately, there is security outside, but I wouldn't want to resort to their help. A minute later, Steve turned to our hero and asked him to examine the patient. The doctor explained that there are signs of interstitial pneumonia, but even after a year, the lung function is not so bad. But it is reduced, which is not normal. The young man asked, "So of course there is a reason," hearing an affirmative answer. The intern didn't know the answer, but the Baruda already guessed it, and so he said that it was worth asking a few questions to make sure that his thinking was correct. The patient looked at our hero in surprise, not understanding what he wanted from him. Lee Soo-hek was also a little scared. He didn't understand what was the best thing to do in this situation, but the assistant said that he needed to trust the guard just in case. Realizing that there was no other way out, the guy asked the name of the patient, whose name was Jesse Atwood. Hearing that the man could simply be called Jesse, our hero inquired where this man worked. The patient said in an irritated voice that his medical records stated that he worked in a supermarket. The guy, looking closely at the teeth, noted for himself that some were downright black, which the Baruda also noticed. He also said that he had seen similar symptoms in cases from practice when describing the use of methamphetamine by smoking, even though this is the USA. But such people should not work in supermarkets. A moment later, returning to the questions, the intern asked what exactly the man did for work. The man looked menacingly at the guy and wanted to say something, but could not find the right words. Suddenly, he started yelling, screaming that it shouldn't be that important, adding that he was in the hospital and they were asking questions like they would at a police station. And while our hero was saying that it was important, a guard ran into the room and the Baruda said, "One can understand that this man is not aggressive, but simply scared." Hearing Lee Soo-hyuk say that the patient's illness and his occupation might be related, the patient said that he was the only one around him who coughed. But the guy went on to explain that not everyone who smokes has a chance of getting lung cancer, but smoking is one of the causes of this disease. This could be a similar case. And so the young man once again asked the patient to explain in more detail what exactly he does at work. For a moment, the room became completely quiet. The patient, looking down, was thinking about something. The resident understood that he couldn't press in this case, and so he asked the question again in a calm tone, hearing that the man only worked on Fridays, Saturdays, and Sundays. And just a minute later, Lee Soo-hyuk asked if it was true that the worst coughing fits happen on Fridays, which the patient himself confirmed. The guy continued to say that at this moment a man can feel a slight tightness in his chest. Surprised, he said that this is all true. The patient did not know how the young man could have found out about this, but he only said that these were all symptoms of a possible disease. Steve and Jesse looked at our hero in amazement, not understanding how he knew so much. And so he asked what his diagnosis was. Although at that moment the senior doctor was wondering how an intern could look at an x-ray, talk to the patient, and immediately make a diagnosis. Interstitial pneumonia is not a disease that would be easy to diagnose, and the intern at this point said that before he gave the diagnosis, he wanted to ask one question. Putting his hand on his chest, the man said that if this helps get rid of the annoying disease, then he will answer all questions, and very quickly. Lee Soo-hyuk asked what exactly the patient did on his work days, hearing him angrily shout that he had already explained that he worked at a supermarket. Looking closely at the patient, the intern quickly said that lying would not help cure the disease, but would only make it worse. Covering his head with his hands, the man began to wail, say something about the doctors, accuse them of something, but then he said that he had heard something about medical confidentiality and knew that doctors took some kind of oath, which the young man confirmed, saying that they shared information only for medical purposes. Pointing to the security guard, the patient asked that the man leave, noting that he would not cause trouble and could be trusted. Pointing to a tattoo of a cross, the man vowed to remain quiet. Looking at each other, the doctors realized that they could give the order to the guard, hoping that nothing would happen to them. Approaching the patient, the man said that according to protocol, he had to conduct a search, after which he would leave, but if something happened, he would return again. This strange picture was displayed on someone's monitor in real time. And watching the recording was Dr. Epps, who was saying out loud that something really strange was happening. After some time, having finally waited for his subordinates, the professor asked why they had taken so long to conduct the survey and why it was impossible to resolve everything sooner. Looking through the report, the specialist said that the survey was not conducted by Steve, but by Dr. Lee, who seemed to have done everything very competently. Happily confirming this, Lee Soo-hyuk said that he would tell them what they had found out if it could be done. The patient's report contains a list of medications that the patient took during the year after the cough was discovered. Expectorants, antihistamines, bronchodilators, all of these medications contain steroids or antibiotics. Of these, only bronchodilators really helped. The improvements were minimal, but they occurred during periods of taking the medications. This man's pneumonia is a little different from interstitial pneumonia. He had no response to steroids at all, but another X-ray showed typical symptoms of interstitial pneumonia. A decrease in the respiratory function of the lungs is also noted. We can say that the patient really has interstitial pneumonia. but only bronchodilators help. This is not a very positive reaction, but the X-ray is quite good. The professor said that the results were quite normal, but they just didn't fit in with his stories. But the guy said that the conclusion said that the severity of the symptoms changes over the course of a week, in which case it is not just pneumonia, but a disease provoked by the influence of something. And then he added that the complication occurs on the day of the collision with the cause of the complications. But there are no coal mines in the area, and there are no remains of coal, soot, or anything under the patient's nails. Asbestos could have been the cause, but in the U.S. its danger has been identified and all locations have been closed after being asked again whether this is true. Steve, surprised, couldn't understand how the intern could be aware of even such things. And just as Lee Soo-hek began to say that, of all the remaining options, only one remained, Epps interrupted him and asked what the patient looked like, since it was completely unclear from the photograph. The man has a slight tremor in his hands, which is quite unusual for his age. There are fallen-out teeth, and this is clearly not a consequence of caries. The loss is associated with a reaction to chemicals. The professor already understood that this was a drug addiction. The young man only noted that they were all addicted. Our hero said that such people use marijuana to one degree or another, which greatly surprised Epps. Suddenly, the chief admitted that he was selling marijuana, which was completely unimaginable and which greatly surprised the residents. And while Lee Soo-hek was thinking about Reng Yen, the Baruda said that with a cough like this, which can't be treated even with medication, this was to be expected. Finally, the intern said that the patient had cotton fibrosis. He suddenly remembered Steve's reaction, as well as Jesse's, when he was told the cause of the illness. This disease affects workers in textile factories without proper ventilation, but has become rare in recent years, largely due to the fact that all factories are equipped with modern equipment. But one of the reasons is marijuana, a hemp cultivation facility, cannot get a license, and that is the reason. Looking at the computer screen, the specialist thought it was pneumoconiosis. There have been cases of this disease occurring among marijuana users, and all of them have been labeled as case reports. But now doctors have encountered this for the first time, so they couldn't immediately determine what was wrong. And looking at the intern, Mr. Epps thought that this young man somehow understood everything at once. The doctor said that marijuana-induced pneumoconiosis was not very common, and then asked if Lee Soo-hyuk had encountered the disease before. With surprise in his voice, the young man said that he had never worked with patients who used marijuana before. For a moment, there was an awkward silence in the room. No one knew how to break it or what to say. After some time, the satisfied Baruda said that they had done a great job, and it was nice to see the amazed faces of his colleagues and boss. Our hero was embarrassed, and his assistant continued to say that the guy alone would never have figured out what was wrong. The resident understood this, but he was still worried, even though he knew that he was not alone. The young man remembered the animalistic look of the patient whom he had told to stop contacting the cause of the disease, although the patient began to attack Lee Soo-hek, declaring that he was nobody to tell him what to do. In order to avoid getting into trouble, the resident even had to lie that he was already leaving for Korea because he was very scared. Suddenly, our hero was brought out of his thoughts by Steve, who called out to his colleague. Smiling, the doctor asked if the intern would mind if they went out for lunch. Our hero did not expect such a turn of events, and therefore looked embarrassedly somewhere, but not at his immediate superior. A few hours before, Steve recalled how phenomenally the young man made diagnoses. It looked as if he was an outstanding professor. Somehow, this intern doesn't miss a single disease, which is basically impossible. Moreover, Lee Soo-hek immediately prescribes a treatment plan, confident that these prescriptions are correct. And therefore, one could say that this resident was a genius, or even a walking encyclopedia. Looking at Steve, the intern was tossing and turning. He didn't know what was the best thing to do in this situation, since he didn't really want to go, but it was also impolite to refuse. As for the young man, he knew that he had to learn the secret of his foreign colleague's success in order to become the best. For a moment, our hero thought he hoped for help from his assistant, but he too seemed not to understand that in this case it would be better. Suddenly, the guy thought to himself that he had heard that senior students always dine alone. Baruda immediately stated that residents do not invite anyone to lunch. Doctors, perhaps, but only once or twice. And while Lee Soo-hek was mumbling something under his breath, the artificial intelligence suspiciously declared that this man had something in mind. At this point, Steve announced that he knew a great place for burgers. Less than 10 minutes had passed, and the local resident's car was already racing to its destination. In the car, Baruda again started talking about how staying in the States longer wasn't such a bad idea. But Lee Soo-hek was not interested in this. Picking up the phone, he thought how a resident could have so much free time, which was wild for a Korean. Although there was nothing objectively wrong with this, which the artificial intelligence also noticed, stating that working hours here are half the working hours in Korea. Students study when it suits them, professors write good papers and teach well, and the university hospital actually feels like an educational institution. And then the Baruda loudly declared that they, that is, the Koreans, or more precisely the residents, were a training slave camp. Hearing that the young man did not like this, his assistant stated that it was true, but further conversation was saved by the fact that they had already arrived at their destination. Steve was quick to say that he guaranteed it was the best burger joint in town, and Baruda was already saying he was looking forward to it. As they walked inside, the young man pointed to a seat by the window, saying that there was a free seat there, as if it was just right for them. Sitting down, the young man noted to himself that the view was actually good. Suddenly, our hero's colleague started saying something about how perhaps it would not be difficult for an intern to do something. And then, more confidently, Lee Soo-hyuk asked if he could tell him how his education was going, adding that if their education system was worse, he would like to continue studying, but using a different method. This was surprising since the man from whom our hero came to study asked to be taught, although the Baruda also said that there was nothing strange about this. The artificial intelligence confidently noted that this person should be decisively rejected because he has been behaving disdainfully from day one. But a minute later, he changed his mind, explaining that Dr. Nayo is a doctor of medical sciences and Mr. Anderson is developing artificial intelligence. The name of this device is Hicks, so we can tell Steve that it was trained using artificial intelligence. But the most important thing is not this, but that you need to ask the young man to show this Hicks. Looking at the resident, our hero's assistant was almost certain that he would not be able to refuse and would not refuse. And after that, he asked the owner because he himself probably wanted to look at the device. A minute later, Lee Soo-hek was telling his colleague that he, like all the students, was taught using domestic artificial intelligence. And he added that if the resident wants to get advice, then for starters, it would be a good idea to look at an American device of the same type. This put Steve in a difficult position. On the one hand, it was not his place to decide such issues. On the other hand, everyone was saying that the project was closed. Besides, it was unclear how it was possible to learn from artificial intelligence. And while the Baruda was saying that the guy was worried, our hero was thinking that showing the device would probably be quite difficult. The artificial intelligence immediately added that they would not just go to look at the device, admire it, and leave. Our hero's assistant said that he needed to get into Lee Hyun-jung's head. He is not only a good thinker, but also a strategist. Getting up from his seat, the agitated resident announced that he needed to make one call. Lee Soo-hyuk said that the food would get cold, but the young man said that the burgers at this place were delicious even cold. Looking at the Baruda, the young man's expression sank. He thought that asking for something like that was too much, and then he asked why one artificial intelligence would look at another. Suddenly, the assistant started talking about how he had learned that he was an American, although this was not true at all. But then Baruda continued to say that he had 98% of the owner's slang. But he also remembered something, namely that the people who created him shouted that the Americans would fail. Forward Taihua. All those nice people at first glance, every one of them, wherever you looked, turned out to be Americans. The artificial intelligence did not understand why its developers wanted the Americans to lose. But a minute later, he declared that Hicks was much better than he was. At this time, Steve, who had stepped aside, called Hank to consult with him. However, after hearing what Lee Soo-hek was asking for, the doctor could not understand why a foreigner needed to look at this machine. Hearing a subordinate talk about the Taihua Medical Center using artificial intelligence for training, the man said he had not heard of such a thing, although he assumed it might be a secret. The resident said that anything was possible, since the guy was acting extremely cautiously. Remembering Cho Tai-jin, who modestly said that they had mediocre doctors and the hospital was the most ordinary, Hank thought that these people could not be trusted very much. A minute later, the professor went to his senior colleague to tell him everything that Steve had said a few minutes ago. The doctor said that this man was quite strange, but at the same time he was literate and intelligent. A moment later, the specialist added that he had heard that Lee Soo-hek had some kind of illness. Hank noted that he himself did not know, however, realizing how talented the young man who had come to them was. He instructed their resident to find out everything he could about the education system from this intern. As a result, Steve managed to find out that the Taiwan Medical Center uses artificial intelligence for these purposes, which greatly surprised Ellis, who had never heard of such a thing. A colleague noted that the director of the clinic is Lee Hyun-jong, and he is not the kind of person who will just tell everything so easily. Thinking about it, the man remembered this person and said that this was true. However, Lee Soo-hek seems naive, and therefore he will tell everything, Steve said, as soon as the guy saw their artificial intelligence. The young man will give all the necessary recommendations. Jumping up from his seat, Ellis shouted that it was sheer suicide to show such a device to a foreign resident, no matter what he promised. But a second later, the man thought that Hicks was, of course, a secret, but at Harvard he was given the status of a failure. Even if the treatment process had not been successful, Hicks should have been able to cut down on the financial costs of treatment, but the training alone had cost him fabulous sums. What is surprising is that the diagnosis is correct, but the process of diagnosis was extremely inconclusive. If the diagnosis is wrong or there is no result, it can be corrected. The process was extremely confusing, but getting the diagnosis was truly wonderful. And now Hicks is the cause of multi-billion-dollar spending, and Tai Hua is using artificial intelligence for educational purposes. A joyful Steve ran into the diner and shouted joyfully that he had succeeded. The young man wanted to say something about permission, but seeing Lee Soo-hek eating a hamburger with gusto, he changed the subject. He asked if it was tasty and received a satisfactory answer. The young man said to himself that as soon as he tasted this burger, the restaurant seemed to be transformed. And Baruda added that the sauce in the cutlet was so wonderful that all the cutlets he had eaten before seemed like a joke. And while our hero's assistant continued to praise the sauce and other seasonings, Steve said that according to Hicks, everything was decided. After that, the guy offered to go to the laboratory, which made Lee Soo-hek very happy. It seemed like the Baruda wasn't listening to what the boys were saying because he kept talking about the bun on the hamburger. Upon hearing that they were allowed to look at the device, the artificial intelligence pretended that it was not that important. And a moment later, with modesty in his voice, he said that it was just a joke. Baruda knew he was about to meet his kindred spirit in some way, the great Hicks. And then he immediately came back to you for food, offering to order another hamburger, although the guy said that he was about to burst. Sitting in the car, our hero sincerely said that he really liked it. They ate wonderfully, and the artificial intelligence noted that it would be nice to go to this establishment again before leaving. The guy apologized for the fact that they had to go to the hospital again, saying that he didn't want to bother him. But it wasn't hard for Steve, especially since he was planning to drop by Professor Hank's lab anyway. Baruda added that our hero copes with the task perfectly, looks at ease, like a person who is only interested in medicine. And a moment later, the artificial intelligence suggested that this might be due to the fact that the young man was actually dim-witted. Sometime later, while parking next to the lab, Steve said that they had already arrived. The young man continued to say that this is where most of the research regarding therapy is conducted. Looking at the luxurious building, Lee Soo-hek was surprised that one building was allocated exclusively for therapeutic research. The inside was as beautiful as the outside. Everything was very modern and stylish. The guy was surprised by the fact that there were a lot of people here, who were most likely laboratory employees. Our hero understood that the Korean medical community would probably have a hard time keeping up with this level. Baruda suggested testing their research skills upon returning home. But before that, he wanted to enter all the data he could find into the database, adding that Lee Soo-hek might get a headache from this, and therefore he needed to be prepared for it so as not to faint. The resident looked at his assistant with horror, wanting to say something, but at that moment a joyful Steve announced that he had obtained a temporary pass for the employee. Watching his colleague fall down somewhere, the guy rushed to help, asking what happened. But the young man said that sometimes his leg causes problems, but in general, everything is fine. As he stood up, the intern said he didn't need help. He just needed to move a little slower. A few minutes later, the boys were already walking through the checkpoint towards the offices. However, suddenly the metal detector started beeping, which confused the guy, who thought it was his stick, but it turned out that it was all in his head. Approaching the security guard, the young man explained that he had a head wound, after which he handed over a certified medical certificate. After some time, the colleagues were again moving along some corridor. At this point, Baruta stated that he had reconstructed his vision as three-dimensional and installed it in his head. Entering the first laboratory, Lee Soo-hek saw Professor Ellison, who greeted him, saying that he was very glad to see the young man as his guest in this place. The guy heard the question about whether he would like to see Hicks, adding that he not only wants to but dreams about it. And after that, he said that he hoped that after this, he would at least be able to somehow help his colleagues. The professor asked without hesitation what about the professionals at their clinic, since he had never heard of a teaching method that used artificial intelligence. The guy thought to himself that, of course, this is how it should be, although the Baruta stated that it was people who took care of the dissemination of this information. Lee Soo-hyuk said that it was a secret, although the method was extremely effective, and added that wouldn't it be great if there were many highly qualified doctors all over the world? And then he said that this should be kept a secret. If his teachers found out about it, he would be in trouble. Professor Ellison admitted that besides them, only Dr. Hank knows about this, but he is a master of keeping secrets. A few minutes later, the men entered the legendary room, the very one where Hicks was located. Struck by what he saw, the intern's eyes widened in genuine surprise, as did his assistant, who had not expected anything like this. A minute later, the young man asked if he could see how the device worked in action. Pointing his finger at something, our hero fell silent. The doctors did not understand what the foreigner was going to do, since no one was using this device yet. Standing still, Allison thought that all this was done by technicians, and so he didn't know what to do. The project has been on hiatus for a long time, and now Hicks can only be helped with a power outlet, and even that won't be enough. Suddenly, the professor asked if the intern by any chance knew how to operate this device, because all their specialists were on vacation. At this point, the Baruta began to name some numbers that angered his master, and then he added that the young man might have forgotten everything, or rather, didn't know at all what and how, but he is still an artificial intelligence. The artificial intelligence asked to leave this matter to him, since the programming language is his native language. Not much time passed, and the young man was already sitting in front of the monitors, getting ready to start doing something. Baruta said that if there were technical specialists here, they would obviously have done it a little differently, but these three are behind him, as is Lee Soo-hek, who doesn't understand anything about such things. Laughing, the intellect continued to say that he knew there would be nothing much to do here. Our hero's assistant also didn't like the fact that he sat with a serious face, saying that he should be a little simpler. Realizing that time was passing, the young man asked with a thoughtful voice which buttons he should press, hearing that the Baruta said to strictly follow his command. A moment later, the resident did just that, realizing that any mistake was unforgivable. At one point, the artificial intelligence found itself in its usual environment, watching a huge amount of literature run past its eyes. For a moment, the Baruta hung there, seeming not to notice anything special. After that, he said that this was the part of Hicks that was responsible for determining the diagnosis, although the assistant did not understand what it was. While setting something up, the guy asked if it made things easier for the Baruta. The next minute, Lee Soo-hek's eyes widened, and he asked why these people were making such strange diagnoses. It was somehow abnormal. Looking at the doctors, he said that he had the same questions. He couldn't believe that before him, it was the best artificial intelligence for making a diagnosis. He said that it couldn't be used to treat patients at all because there were too many errors, and added, "Do they know anything about treating people at all?" The resident smiled as he looked at his assistant, who had been so vocal in his criticism of the apparatus. The guy then said that it was all thanks to him, hinting that his knowledge helps many sick people. Lee Soo-hyuk stated that their Baruta is not half artificial intelligence, but thanks to him, it became what it is. Ellison, tired of being kept in the dark, asked what was wrong, but the young man noted that everything was a little different, but otherwise everything was fine. And while the professor was saying something, our hero asked the assistant what to do next, because they came here, did some work, and didn't really get anything. The artificial intelligence, in turn, began to explain that they had received a database created by world-class scientists. It looks like they won't be able to connect to the main server because it will have been decommissioned long ago, but at least the data entered at Iowa State University is still there. Baruta added that he would extract as much information as he could, so the resident would have to do less research on his own. After this, the assistant said that the young man should tell everyone that he still needed a little time, and after that they could act. Lee Soo-hek explained loudly that he understood everything now. The system was a little different from the Korean one, and he was confused, but now he seemed to understand it a little. The resident said that he would try to check whether it was possible to install here the educational program that they use, hearing gratitude from doctors. Time passed, but nothing happened. The picture did not change. The doctors continued to do what they were doing as they stood in their places. From time to time, the specialists only heard the young man muttering under his breath, something about doing something right and then doing something wrong. Realizing that the doctors had come close to the table because they were tired of standing at the door, the boy asked the Baroud when he would finish because he could no longer play his role. But the assistant scolded him. He said that the young man probably hadn't seen the spy movie where time dragged on forever. Lee Soo-hek was angry about this and yelled at the AI, saying that this was not a movie but real life, and therefore asked it to hurry up. Suddenly, the young man turned his head. His gaze was murderous, and now the Baruda was shouting at him, saying that this was unnecessary. Frightened, Steve began to wonder what had happened to Dr. Lee. Perhaps he was unwell or needed some help, although this was not the case. The terrified trainee had no idea what lie to tell. But just then the Baruda pointed out that it was best to leave it at that, because they had done all they could, hearing the young man say that they had survived. The artificial intelligence explained that now it was the resident's turn to point out what he was capable of, because the doctors would ask what the young man had done and what had come of it. At that moment, a professor approached and asked the foreigner what he was doing. The young man was so scared that he couldn't utter a word. He had no idea how to get out of this difficult situation. A minute later, Lee Soo-hyuk started lying about how he had logged into the system, but when he started studying it, it turned out that absolutely everything was different. The guy continued to say that he would hardly be able to help in any way. The systems were too different, and it was difficult for him to establish a pattern. Allison, realizing that he couldn't just let the intern go, asked him to stay and help them, and then said that he wanted the foreigner to tell them something useful about the education system. Our hero was surprised and shocked at the same time. He looked closely at the men, but was confused. Baruda immediately drew an unflattering photo in his head, saying that he too was a little scared. And again an oppressive silence hung in the room. The professor looked attentively at the ordinary young man, and he at him. Laughing, the young man said, "Doesn't artificial intelligence develop skills through deep learning? A similar method they use in Taiwan." Those present did not understand anything of what was said, and Lee Soo-hek continued to say that their residents studied like this, read, studied books, and repeated materials until they lost their pulse. Allison understood that everything was wrong, because then what was the purpose of artificial intelligence? But the intern, jumping up from his seat, continued to note that they had no other methods, only these, but they all worked. And already in the corridor, he shouted that he urgently needed to go to the toilet because he had already been sitting for too long. The professor looked closely at Steve, who was standing in the corner and did not know what to tell him now. After this, the man stated that the secret system consisted of repeating the material until the pulse was lost. Sitting on the veranda, the medics talked about whether Dr. Lee would come, and Hank said that he would pick him up personally because the young man did not rent a car. Colleagues understood that it was somehow connected with his sore leg, adding that the other day he went to the supermarket by bus. For a moment, Allison considered that if the intern became disillusioned with the university hospital for this reason, it would cause them problems. Now, this man is a smart doctor, but after some time, his name may go down in history. Sitting in front of his laptop, Baruda claimed that there were about 1,000 cases left to study. The irritated young man said that at least he would have to study less personally. If Lee Soo-hyuk stays in Korea, there won't be much of a threat, but if he moves to some American hospital, trouble can be expected. Looking at Dr. Hwang, who was frying meat, the professor asked if he wanted to talk to the Korean, who would be arriving soon. The man already knew about our hero, and therefore was happy about it, and Allison at that time said that this would be a great opportunity for everyone to get to know each other and get to know each other as best as possible. Returning to the grill, the gray-haired man laughed and declared that anything was possible, and therefore when he arrived, they would definitely talk. Approaching the house, Lee Soo-hek froze. His mouth dropped open in surprise as always, and he blushed. Looking at the huge and beautiful house, the Baruda asked how much the doctor had bought it for, since housing in the USA is quite an expensive pleasure. And while Hank was showing the way to his guest, He continued to look in amazement at the charming garden and the same view. The artificial intelligence also liked it very much, and therefore it began to swear because it could not find decent words to describe its delight. For a moment, our hero's assistant once again reminded him that his vocabulary consisted of what was in the young man's head. Approaching Mr. Ellison, the intern politely greeted him and apologized for being late, although this was unnecessary since the owner of the house had brought him here anyway. Without wasting any time, the doctor introduced the young man to his colleague, Dr. Huang, who was doing research in their laboratory. As he left, the professor said that the men could talk among themselves for now, and he would go get some barbecue. Smiling, the specialist asked if it was possible to speak to them in Korean, since there was nothing yet, which the young man was very happy about. A few minutes later, the professor was already talking about how, when he had just defended his thesis, this center was barely in its infancy, and at that time he was teaching at the Asen Hospital. Hearing that a colleague had come to the States for an internship and settled here, our hero couldn't believe his ears, and so he asked if such a thing was even possible. The man explained that in the States, most people can get a job with a letter of recommendation. If you try hard enough, you can achieve anything. Suddenly, the Baruta spoke up. He shouted, "Could they really live in such a luxurious house and also enjoy such a barbecue?" Mr. Huang, who was so enthusiastically talking about himself, did not understand why Lee Soo-hyuk suddenly froze. It seemed as if he was completely immersed in something of his own. Perhaps this was due to shyness, but he decided to continue and said that it had been 7 years since he had been working as a professor. He came for an internship, liked it, and decided to stay. The man added that he works from 9 to 6, leaves work on time without delays, and takes part in similar types of parties every weekend, which caused the guy wild surprise. Baruta immediately began to whisper in his master's ear that they should not go back. This was their chance and their opportunity to live much better, to become more successful. Lee Soo-hyuk thought that not everyone had such a schedule, that it was some kind of advantage, but the professor laughed, saying that this applies to absolutely all specialists. And he added that this man received twice as much as he did, which made the young man's eyes widen even more. Having finished his meat and putting his fork on the plate, the young man thought that this was a country one could dream about. Objectively, the guy understood that the attitude here was much better than in Tewa. But the next moment, the Baruta said that there was one thing, although Lee Soo-hyuk couldn't understand what it was. Pointing to Dr. Huang, he said that no matter how well he spoke English, he still kept himself apart from everyone else. Looks detached and lonely, as if constantly lost in his own thoughts. But the guy understood that he was only a second-year student, and therefore there would still be time to worry, hearing how Baruta said, if he developed at the same pace, but everything would definitely work out. At this moment, a man turned to Professor Huang and said that they had not seen each other for a long time. It turned out that it was Ronnie who had just arrived to see the people from the laboratory, and he was told that he could find such an outstanding person here. Laughing, the man thanked the young man for the money for the research. Hearing that the results would be out very soon, the guest noted that this was all, of course, very pleasing, but he came here for another reason. Suddenly, Ronnie looked somewhere and fell silent. It was difficult to understand what caught his attention. The professor realized that the young man did not recognize Lee Soo-hyuk, and so he corrected this oversight and immediately said who our hero was, and explained to him that the man in front of him was the chief manager of the Pfizer Research Center. And this is the main sponsor of most of the professors who are present at this party. The man thought that there was already an intern in front of him, but the guy corrected him, saying that he was just a resident. Ronnie liked the young man's potential, and to strengthen his faith in him, Huang noted that, judging by the stories, the guy has incredible diagnostic abilities. Hank and Allison are simply crazy about this intern. Upon hearing this, the young man began asking if the resident had any interesting current research. Our hero understood that he had nothing special to tell, although the Baruta intervened and said that there was something that could attract attention. Ronnie heard Lee Soo-hyuk talking about a thesis, and he thought to himself that it was probably some kind of case study or publication in a scientific journal. At that moment, the young man said that he had actually published in the most popular scientific journal. It was hard to believe, but it was true, and even Huang felt uneasy about it, since research was a completely different element. Laughing, the young man explained that it happened by chance and he was just lucky, adding that the work was probably of average quality for such a publication. Ronnie, thinking, thought that this could not be an accident and asked out loud If this is not a case from practice, then what kind of study is this? Upon hearing that it concerned anatomical variations of the coronary arteries, the manager immediately asked the young man to forward him a link to the article, saying that he would definitely read it when he got home. And so Ronnie said that if our hero had time on the weekend, he could come to Chicago. One of their laboratories was located there, adding that the young man would be interested in taking a look at it. And after a minute, he said it would be good to meet in a week if Lee Soo-hek didn't mind. Taking a business card out of his pocket, the young man said that this was the number of the person in charge, and therefore the young man should call him immediately upon arrival. And while the man wished everyone a good evening, the young man could not believe that he had in his hands the card of the general manager of such a company. Baruta was talking about how he felt this was an important person, and they didn't have him in their database. Embarrassed, a minute later, the young man asked his colleague if he knew someone named Henry. Laughing, the man said that he was an interesting person, and therefore he should give the resident a good tour. This information did not shed any light on who the man was, but rather it raised even more questions. A week later, walking around the company, Lee Soo-hek thought that even the dormitories at the Pfizer Research Center were here. It seemed that they would see a lot with the Baruta during this month. The AI grimaced and abruptly stated that it didn't like Henry because there was something wrong with him. Asking what the assistant meant, the guy heard that he simply had some kind of premonition and added that it would be nice to know what kind of director he was of this company. But after a minute, he said, the young man saw what everything was like here, how much everything there was in the hostel. There was a swimming pool and a fitness club. Moreover, if you go up to the roof of the building, you can find a bar there. But then the Baruta changed the subject again, saying that it was time to find out who this mysterious Henry was. There were two strangers sitting at the bar, actively discussing something, glancing at the bartender. The hall was quite crowded. It seemed that this cozy place was always filled to capacity. There was a man standing in the cafe who clearly interested Lee Soo-hek. Watching everything from around the corner, the guy nervously asked the Baruta if this was the place for them, and he said that there was no need to be shy. There was nothing wrong with what they were going to do. Standing in the middle of the establishment, the young man thought that talking to strangers, and especially to foreigners, was quite strange and awkward. But the artificial intelligence insisted that in this place, one could find many useful connections, which would be very useful in the future. And a moment later, he added that Ronnie's Rolls-Royce was shining so temptingly. Although the orderly could not understand what business the Baroud had with someone else's car, the assistant thought that our hero didn't like this brand of car, but that wasn't the point. And in general, Lee Soo-hek didn't want to discuss it anymore. The man standing at the entrance began to ask how he could help the guest, but he refused help. And a moment later, pointing to the tables, the administrator asked the young man to sit down in any free seat. After some time, the young people were already asking our hero if it was true that he was from the University of Iowa. The guy said that it was so, adding that he was attracted by the Pfizer company as the best in the world, and that is why he came to study. The guys talked about how all the employees put in all their efforts to achieve the best research results. Even the head of the company does not shirk from this. Baruta warned his master to be vigilant, considering that the young man had drunk a little, and he himself understood this perfectly well. After this, the resident asked about Director Henry, saying that he was personally invited by Mr. Roney, but he was not here. The surprised young people couldn't believe their ears and asked if Lee Soo-hek really knew Ronnie Goodman personally. Embarrassed, the resident said that he was familiar, but only slightly. And he added that he doesn't really know anything about Henry. It seems to him that if he behaves incorrectly, he will cause trouble for Mr. Ronnie. The girl hesitated a little. It was clear that she wanted to say something, but did not understand how best to express herself. And then she quickly replied that Henry was a real weirdo. You never knew what to expect from him. While enjoying the beautiful view, Lee Soo-hyuk said that he finally felt like he had actually come to America. Baruta thought about this, and therefore said that sometimes it is useful to look at such a view and just enjoy it. But after a minute, the artificial intelligence said that it was enough to think about all the nonsense. It was better to focus on the information received, although it was difficult to do because the guy had been drinking. The assistant, hearing that the young man wanted to get some sleep, began to lament, saying that his brain was not the best anyway, and if he slept even more, he would forget everything, because he also had problems with his memory. And telling the intern to pull himself together, he began to declare that they were collecting information on 52-year-old Henry. This person is divorced, has no children, currently lives alone, does not drink. There is no information about friendly relations. Lee Soo-hek immediately said that at first glance he was an unremarkable loner, an inveterate workaholic who appeared in the laboratory every day. Trying to remember at least a little more, the guy thought for a while, looking into the distance. Gurney originally majored in biomedical engineering. The young man from the cafe said that he had heard that the man had previously been involved in creating artificial organs, which was considered too premature, after which he was already at Pfizer. Already in this company, he became interested in cardiovascular diseases and also takes some pills, although there is no doubt that he is healthy. Hearing the question about whether this man was hiding anything, Susan thought about it. She was Henry's colleague and knew a lot about him. Having slammed her glass on the table, the girl declared that this man is very stubborn, gets angry when someone complains, does not listen to others, and has his own opinion about everything. Baruta said that this was a typical revelation from a subordinate to a boss. The employee got angry and said that there was another thing that really irritated her. Wherever Henry went, he always turned on something like ASMR. Not understanding what it was, Susan clarified that it was the sounds of paper folding and the like. Even in the lab he does that. It's really annoying. There was not a single time when the boss simply sat in silence and did his job. Standing on the balcony, our hero asked his assistant if it was perhaps something chronic, but he said that the medical examination had not revealed anything like that, and Susan probably didn't know. It was clear that ASMR could not be considered a mental illness. The Department of Mental Medicine had not published a single paper on this matter. Lee Soo-hyuk sat down and said that it was late, and he wanted to sleep, although the artificial intelligence continued to say something about mental problems. And just a minute later, Baruta said that tomorrow there was no point in wasting time, that they needed to come to Henry and talk to him directly. The next day, standing in the corridor of the research center, the man asked our hero if it was true that he was Dr. Lee. A little embarrassed, the guy confirmed that this was so, and then said that he already realized that the director was standing in front of him. While sipping coffee, the man spoke as if he had heard that the young man had written a very interesting paper, adding that the coronary arteries of the heart are always a wonderful topic for research. And while our hero was saying something about studying this topic, Henry abruptly turned his back, saying that they were busy people and therefore there was no time to waste. First of all, the man stated that the intern would most likely prefer a tour of Chicago itself and not of the lab. As he walked down the hallway, Lee Soo-hek understood why his colleagues spoke about Henry like that. He was actually a complicated person. Approaching the checkpoint, the Baruta said that perhaps this man was experiencing some discomfort, although it was necessary to determine the cause of this condition. Handing over the document to the guards, our hero said that he had had an operation on his head. Hearing this, Henry's expression somehow changed, although he remained silent. This did not escape the notice of the young man or his assistant, who were a little embarrassed by this fact. A few minutes later, entering the office, the man announced that they had come to his laboratory. Taking the remote control from the table, the director began to turn on something. A minute later, a box that looked like a safe appeared in front of our hero, but Henry said nothing about it. He just kept pressing the button silently, waiting for something to happen. The man finally broke the silence, casually mentioning that they were conducting additional research on Viagra. Realizing that the young man was not reacting to this remark, the boss asked Lee Soo-hek where he was looking so curiously, and then he suddenly asked if the man by any chance had any noise in his ears, or perhaps some kind of ringing. This statement greatly surprised the manager, and so he asked why the intern had such an idea. The guy explained that Henry looked like he was in pain, and from the very first time they met, when the man went through the metal detector, he frowned, perhaps because the beeping sounds irritated him. The man thought to himself, even if something like that was visible, why should there necessarily be noise in his ears? And said out loud that he could have been drinking all night, and therefore in the morning, there would be increased sensitivity. But the resident continued to say that Henry looked too neat for a man who could drink all night. Even his beard was neatly trimmed, and the doctor did not smell of fumes. The principal was surprised that some second-year student was talking like that, and so he said that maybe it wasn't a hangover, but that he just had a stomachache. And again, Lee Soo-hek said that the man always drinks coffee in the morning. And that ASMR the boss turned on as soon as they walked in, although in this case it's more likely just white noise, since tinnitus is usually much louder in quiet places. The manager was about to counter this remark, but at that moment our hero spoke again. He said that when you look at a person who is uncomfortable, you usually immediately understand what is wrong with them. Looking closely into Lee Soo-hek's eyes, the supervisor said that judging from the words he said, the intern looked more like a detective than a doctor. Smiling, the guy said that the diagnostic process is somewhat similar to the investigation process. Sitting down on the chair, the man wanted to say something, but then changed his mind. At this moment, the young man came closer to Henry to ask him something again. Politely turning to the director, he asked him how long this had all been going on for. Looking at the leader again, Lee Soo-hek asked again what he had said earlier. A minute later, Henry said 20 years, which amazed not only the young man, but also the Baruda, who said that it was good that he had not been diagnosed with a mental disorder. The guy decided to ask if the man could hear well with both ears, and he said that it made no difference to him. After that, the director said that he had had his hearing tested 3 months ago. Everything was fine with that, and the same applies to the MRI results. For a moment, an awkward silence hung in the room again, which no one could break. Finally, Henry politely said that tinnitus is a manifestation of hearing loss, and isn't it caused by nerve damage that compensates for hearing loss? The director explained that his hearing was fine, and so he had an MRI scan in the hope of finding other causes. The Pfizer Research Center had all the necessary equipment for this. But everything is perfect. There is no hernia. There is no pain in the throat, and there was none. After thinking about it, our hero stated that in this case, the ringing in the ears cannot be caused by diseases of the musculoskeletal system, and therefore could it not be a consequence of stress or depression? With calm in his voice, Henry said that, looking at his expression, one could have assumed that, before coming to Pfizer, he had been on vacation, resting for a whole 6 months. Moreover, the man traveled to Thailand, ate his fill, went for massages when something bothered him, and simply relaxed, but the ringing remained. Baruda frowned, and the same was true for Lee Soo-hek, who didn't understand what could be the reason for this strangeness. The AI suggested that it might be the ringing that everyone hears, but the guy said that he didn't hear anything. The different degrees of ringing can be related to the patient's posture, but the manager's is quite good. Our hero's assistant saw how he began to panic, and therefore said that there are no symptoms without a reason. Unexpectedly, the Baruda suggested that the young man ask the man if he had any concomitant diseases or anything like that. And just a moment later, the young man asked the question he had heard from his assistant. Henry thought for a moment, then remembered that he suffered from insomnia. Lee Soo-hyuk guessed that this might be the reason for the ringing, hearing the director swearing, saying that the ringing had ruined his entire life. The guy understood that there might be something else, and so he asked in a frightened voice if these were all health problems. The head of the company immediately added that he is absolutely healthy, as multiple examinations have shown. He added that he had not made any changes. His diet had been constant and unchanged for 20 years. Our hero understood that once he started, he couldn't stop, and so he asked about medication, seeing how the man clenched his teeth in anger and irritation. Jumping up from the table, Henry shouted for them to stop interrogating him, declaring that he was not going to fool anyone. If he had figured out what the problem was, he would have solved it long ago. He added that he had consulted several doctors who had some knowledge of tinnitus, but they had found neither a cause nor a cure. And with a hint of sarcasm in his voice, he added that some resident had to help him for some reason. Covering his face with his hand, the leader suddenly began to ask for forgiveness, saying that he had lost his temper a little, although our hero immediately began to apologize, noting that he was the only one to blame. Having come to his senses a little, the man admitted that he was shocked. There was no doctor who would notice that he had ringing in his ears, and therefore this is something amazing. And he added that he thinks that's all. As he said, he did a lot of research on this matter. But his case is extremely strange because there is no cause and no cure. Coming close to Lee Soo-hek, the director reminded him that he came to the lab for a tour and not to treat others. Henry said that there was no need to pay attention to his illness. It was something that did not prevent him from living. A minute later, the man looked at our hero, who stood up from his seat and walked off somewhere. Realizing that the intern was looking very intently at something, the manager asked what happened and if the guy was feeling well. Looking at the various bottles that stood on the table, the young man asked if Henry was taking any medications. hearing that these were ordinary food supplements, omega-3, and vitamins. And at the very end, he said that he was also taking aspirin, which for some reason aroused the interest of the resident. And he added that there have been a number of research papers written about its positive aspects. Haven't they? Some of them were funded by their company. Taking the tube, the man continued to say that he had been taking it for a long time, began to eat less, and no longer had any problems with digestion. The young man was silent and looked attentively at the man, and he again asked what had happened to his guest. Suddenly, Lee Soo-hek asked if the boss was drinking aspirin all the time, and he confirmed it, adding that, firstly, it was good, secondly, it was cheap, and thirdly, he worked for a pharmaceutical company. A minute later, the resident said that constant use of aspirin could result in ringing in the ears. Taking the phone in his hands, the young man said that there was a study in which short-term ringing in the ears was identified as a consequence of taking aspirin, or rather, it can appear during the use of this drug. And handing over his phone, he added that it had not yet been published. It was still in electronic format. Looking at the article, Henry was amazed and said that there wasn't that much information. The man wanted to say that it was not the best magazine, but the guy said that it was not the most famous, but it published the best articles on similar topics. He added that, in addition, this is a multi-center study, and Taiwan Medical Center also took part in it. A minute later, the director was already looking at Lee Soo-hek and wondering how an intern could know about such things. Out of the blue, the guy said that if Henry stopped taking aspirin, the tinnitus might stop. Sitting at home, our hero was relaxing and enjoying the silence. Looking at the black screen of his phone, he said that no one had written to him today either. Baruta said that 4 days had already passed. Even if there was no improvement, they would not get worse, although the young man said that his mood was still bad. Artificial intelligence added, how can one even call a diagnosis that Baruta participated in a failure? And it's all strange because it was he who remembered about the side effects of aspirin. Our hero just did as he was told and nothing more. The argument could have continued for a long time, but at that moment Lee Soo-hek's phone rang, so he answered it. On the other end of the line was the voice of a man who decided to identify himself to avoid confusion. The frightened boy didn't understand why Henry was calling him, but he said it was about aspirin. The director was in no hurry to explain. He simply said that he had stopped taking the drug from the day the young man said so. After this, the man began to direct the resident, although he could not understand what he had done, since there was probably no effect. And laughing with joy in his voice, he reported that his tinnitus had completely disappeared. Lee Soo-hek, hearing this, was as happy as a child. Moreover, he blushed again because it was very pleasant to hear this. And Henry went on to explain that he felt as if the fog that had filled his head since the morning had finally cleared. Putting aside all inconveniences, the director said that if it were not for the intern, he would not have seen any further meaning in life. Realizing that Lee Soo-hek was hinting that the director would have started the research himself, he said that this would never have happened because aspirin had been studied a long time ago. The young man was glad that everything turned out this way, and so he said so directly. The man had no intention of remaining in debt, so he said that if the boy became a research fellow next year, he would not have to worry about research expenses. Hearing this, our hero smiled, realizing that this was something he could simply dream about. But the director did not stop there, saying that he was inviting the intern to a conference in Hong Kong that would take place next year. Initially, it is aimed at researchers with experience, but there will be no problem if a couple of professors come there additionally. Henry said that this was the least he could do for Lee Soo-hek, and told the young man to make the most of his remaining time in Iowa. As they walked down the street, the resident told the Baruta that, judging by Steve's words, they were expecting some very interesting patients today. It was nice to listen to Henry, but it was time to focus, especially since his time at Iowa State University was coming to an end, and so he would soon have to return back to Korea.